Xiao Bufan acquired a remarkable system, yet required him to engage in the field of traditional Chinese medicine to unlock its potential. Determined, he resolutely embraced the role of a traditional Chinese medicine practitioner. It was only upon commencing his duties at the hospital that the system finally activated. Ding! The medical path rewards diligence. Traditional Chinese medicine check-in system successfully activated. Ding! Check-in successful. Congratulations, host. You have obtained the complete compendium of traditional Chinese medicine proficient level. Ding! Check-in successful. Congratulations, host. You have acquired pulse diagnosis advanced. With the system in play, the remainder depended solely on his ingenuity. Chapter 1. Medical Path Rewards Diligence. In Jianglin Province, within the traditional Chinese medicine department of the 5th Hospital of Shiyuan City, Xiao Bufan stood amidst a cadre of doctors and nurses, listening to the department head, Director Wang Tiansheng, deliver a morning address. It was Monday, the date designated for the departmental meeting, a customary practice that transpired weekly. Yet, Xiao Bufan found himself disengaged, distracted by the blue display before him, which indicated a progress of 99. 99. His heart raced with anticipation. He was on the verge of activating his system. Just a mere 0. 01 remained. Who could resist such excitement? It was noteworthy that Xiao Bufan had first received this system at the tender age of 16, but activation had eluded him until he was prompted to pursue a career in traditional Chinese medicine. Consequently, he resolutely chose to enroll in the provincial traditional Chinese medicine academy during college applications. Years had passed since he graduated, and now he was a doctor at the 5th Hospital's traditional Chinese medicine department. Today, at this very moment, the system's progress bar had finally reached 99. 99. He was moments away from achieving 100. With unwavering focus, Xiao Bufan disregarded all else, fixated solely on the blue interface. All right, the meeting concludes here. Everyone is dismissed. As Director Wang's words echoed, the medical personnel dispersed, returning to their respective duties. Ding! At that precise moment, the blue display in front of Xiao Bufan hit 100. Concurrently, a mechanical prompt resonated in his ears. Ding! The medical path rewards diligence. Traditional Chinese medicine check-in system successfully activated. Would the host like to check in immediately? Finally, it had activated. A smile of joy illuminated Xiao Bufan's face as he eagerly commanded the system. Check-in system. Sign me in at once. Ding! Check-in successful. Congratulations, host. You have obtained the complete compendium of traditional Chinese medicine in obstetrics and gynecology proficient level. What on earth? Obstetrics and gynecology? Proficient level? Xiao Bufan's expression shifted, and the smile vanished from his face. This was perplexing, for during his studies at the academy, he had focused on internal medicine, never having ventured into obstetrics and gynecology. Thus, his practice at the hospital was solely in internal medicine, leaving no room for gynecological consultations. Even if he mastered the art of gynecology, the likelihood of being called for a consultation was slim. It seemed the system could have bestowed upon him any number of skills like pulse diagnosis or inquiry. Why obstetrics and gynecology? Suddenly, a surge of immense knowledge flooded his mind, akin to a whirlwind of information embedding itself in his memory. Once Xiao Bufan fully absorbed this newfound wisdom, he realized his earlier short-sightedness. Obstetrics and gynecology, while a clinical discipline applying traditional Chinese medical theories to treat women's physiological ailments, encompassed fundamental theories of traditional Chinese medicine, including yin-yang, 5 elements, organ and meridian theories, qi, blood and body fluids, disease etiology, as well as diagnostic principles and treatment methodologies. Clearly, obstetrics and gynecology merely highlighted one aspect of traditional Chinese medical theory, which was vast and intricate. Moreover, Xiao Bufan discovered that the system categorized traditional Chinese medical skills into 7 levels: primary, intermediate, advanced, proficient, master, national physician, and the ultimate level, holy hand. Typically, students who graduated with a foundational understanding of traditional Chinese medicine will be classified at the primary level, while attending physicians might reach intermediate or advanced levels. Only department heads and expert physicians could attain the proficient level, and those revered as national physicians would generally possess mastery in their craft. Such esteemed practitioners might show proficiency in 1 or 2 national physician-level skills. But to excel in all was virtually impossible, given the vast array of medical skills within traditional Chinese medicine. As for the holy hand level, it was a concept rarely encountered. According to the system's classification, the holy hand level referred to those capable of achieving miraculous results, akin to legendary figures such as Hua Tuo, Sun Ximiao, and Zhang Zhongjing. Indeed, to reach that level of expertise was tantamount to wielding the power of life and death. Truly, traditional Chinese medicine is far more complex than I initially perceived. With a resigned sigh, Xiao Bufan stepped back into his consultation room to commence his work. It was Monday after all. While the patient load in the traditional Chinese medicine department was typically modest, there were still enough patients to prevent the doctors from facing starvation. Having interned at the 5th hospital for 6 months, he transitioned to a full-time position and had worked there for nearly 2 years. Now approaching 25, he remained single. Although attractive nurses populated the department, romantic relationships between doctors and nurses were rare, a significant taboo within the hospital. After all, who would wish for their conversations to revolve solely around patients and ailments? Over the course of 2.5 years, Xiao Bufan had cultivated relationships with his colleagues and had even earned the title of attending physician earlier this year. Otherwise, he might not have had the standing to consult patients in his office. However, it must be noted that the patient volume in the traditional Chinese medicine department was inherently less than that of Western medicine, meaning that even as an attending physician, Xiao Bufan's daily patient interactions remained limited, compounded by his relatively youthful age. Many patients, upon arriving at the traditional Chinese medicine department, will immediately request a different physician upon noticing the doctor's age. After all, in the eyes of most patients, a practitioner of traditional Chinese medicine must possess a certain level of maturity to be deemed credible. Chapter 2. The hospital is experiencing a power outage. In the outpatient room, Xiao Bufan sat before his computer, diligently organizing the knowledge of traditional Chinese gynecology that occupied his mind. He appeared to be in a trance, his expression devoid of sorrow or joy. Suddenly, head nurse Qin Zuru approached him, lightly tapping on his desk to rouse him from his reverie. "Dr. Xiao," she remarked, "did you not pay attention to what the director mentioned in the morning meeting? Why are you still sitting here in a daze? Shouldn't you be preparing? Preparing? Preparing for what?" Xiao Bufan replied, momentarily taken aback, seemingly bewildered. With a knowing glance, Qin Zuru pouted slightly and chided. "I knew you weren't listening to what the director said during the meeting. You'd better get ready." "Huh? What did the director say during the meeting?" Xiao Bufan looked at Qin Zuru with a puzzled expression, as if he had completely forgotten the director's words. Qin Zuru smiled and explained during the meeting, the director announced that the entire Northern District will experience a power outage for the day, and our hospital is no exception. Therefore, the director instructed us to prepare for incoming patients from the Western Medicine Department. What? The entire Northern District is going to be without power for a day? Xiao Bufan felt a wave of shock wash over him, his mind struggling to comprehend the situation. If the hospital were to lose power, what would happen to the patients in the Western Medicine Emergency Department? Surely, they cannot be left without oxygen. Qin Zuru, perceiving the concern in his eyes, chuckled and continued, "You need not worry about the Western Medicine Emergency Department. They have backup power. The director merely wants us to be ready to accommodate the patients who come for routine consultations." At this point, Qin Zuru paused momentarily, then waved her hand. "All right, you should get ready now. Once the power goes out, I will arrange for a nurse to assist you. After all, if the hospital loses power, we won't be able to use the computer for registration and billing. Everything will have to be recorded manually. Therefore, if the power does go out, every doctor capable of seeing patients will need a nurse to help with the documentation." With a sudden thud, the hospital experienced an unexpected blackout. Wow, it really went out. Xiao Bufan stared in disbelief at the now darkened screen of his computer, blinking in confusion, struggling to grasp the reality of the situation. After all, such power outages in hospitals are a rarity in modern society. However, with the entire Northern District affected, there was little that could be done. Moreover, the backup power prepared by the 5th hospital was limited, sufficient only for the emergency wards and operating rooms. As for the other Western medicine doctors, they would likely be unable to treat patients. This was perhaps one of the greatest differences between Western and traditional Chinese medicine. Once Western doctors are separated from their necessary electrical medical equipment, they are rendered incapable of performing any examinations, whether blood tests, urinalysis, imaging, or ultrasounds. Consequently, they are left unable to consult with patients. In an instant, the Western medicine department became a flurry of chaos. All the doctors resembled headless chickens, unsure of how to proceed with patient care. "Dr. Chun, the power is out, and we can't perform any examinations." "Fine, if it's out, it's out. Didn't the director already say in the morning meeting that if it truly went out, our emergency department would cease operations for the day?" What about the patients outside? Many have already paid but haven't been examined. We will inform those who register that they can choose to visit other hospitals for treatment, and we will refund their registration fees in full. If they wish to continue their treatment here, they may return tomorrow. Of course, they can also visit our traditional Chinese medicine department, as they typically require fewer medical instruments for examinations. All right, I understand. I will notify them right away. After some discussion, the emergency department doctors swiftly implemented the protocols laid out during the director's meeting. The patients who had rushed to register early in the morning were left stunned by the sudden power outage. Fortunately, the hospital quickly made arrangements. Some patients opted for refunds, some chose to return the following day, while others headed directly to the traditional Chinese medicine department. After all, many patients had traveled from rural areas or slightly more remote towns to seek treatment. For these individuals, it was preferable to consult with a different doctor than to make the arduous journey back. Before long, a group of patients from the Western medicine department made their way to the traditional Chinese medicine department. Witnessing the influx of patients seeking consultations, head nurse Qin Ziru promptly instructed her staff, "You all remember what I said earlier. Each of you should assist a primary physician and ensure that every patient is registered without exception. Also, if a patient has registered, keep their registration slip safe. If they haven't registered, collect the registration fee before proceeding with the consultation, and remember to accept cash only." Understood, head nurse. The nurses responded in unison before turning to assist their respective physicians. Meanwhile, Xiao Bufan remained in his consultation room, lost in thought. Suddenly, a woman entered, accompanied by a girl of about 17 or 18, holding a registration slip. "Doctor, hello. I brought my daughter to see you. Could you please examine her?" "A consultation?" Xiao Bufan snapped back to reality, taking the registration slip from the woman with a smile. "May I ask what ails your daughter? I'm not quite sure what's wrong. She hasn't had her period for several months. Yesterday, we had tests done at the Western medicine department, but there was no sign of pregnancy, and they couldn't ascertain her condition. So, we thought we'd try traditional Chinese medicine." The girl's mother pulled her daughter to sit before Xiao Bufan, articulating her daughter's symptoms with clarity. Hearing this, Xiao Bufan smiled slightly. "Given the power outage, we cannot conduct any further examinations for now. Allow me to check your daughter's pulse first." "Yes, of course. Thank you, doctor." The girl's mother nodded and encouraged her daughter to extend her wrist. Chapter 3. The girl's amenorrhea. As Xiao Bufan placed his hand on the girl's wrist, he immediately sensed a pulse that was exceedingly faint. The pulse felt as delicate as a strand of hair, yet it carried a subtle roundness. In that moment, Xiao Bufan's brow furrowed ever so slightly, and he quickly realized that the girl's condition was not straightforward. It is known that typically, a woman's pulse only exhibits a smooth, pearl-like quality when she is pregnant, commonly referred to as slippery pulse. However, the girl's mother had already mentioned the girl had undergone both a pregnancy test and a blood examination, and she was not pregnant. Thus, the presence of a slippery pulse warrants careful consideration. After all, while a slippery pulse may indicate a potential pregnancy, it does not universally signify this condition. In fact, both pregnancy and amenorrhea can exhibit a slippery pulse. The Huangdi Neijing states, at 7 years old, a girl's kidney qi flourishes and her teeth and hair grow. At 14, when the Tiangui arrives, the Run and Tai Chou meridians become active, and menstruation occurs regularly, leading to the possibility of childbirth. The term Tiangui refers to what we now understand as the menstrual period. Typically, it is normal for a girl to begin menstruating at the age of 14. At this age, the Run meridian has begun to open, and the Tai Chou meridian is relatively vigorous, hence the arrival of menstruation. Furthermore, it is said, at 6 or 7 years, the 3 yang pulses weaken. The face becomes sallow, and hair begins to turn white. At 7 sevens, the Ren meridian is deficient, the Tai Chou pulse diminishes, the Tiangui wanes, and the pathways close, leading to deterioration and infertility. This implies that women generally begin to experience a weakening of the Ren meridian around the age of 49, at which point they are likely to enter menopause. Menopause signifies a closure of the pathways, rendering women unable to conceive. Of course, with the advancements in modern living standards, the age of menopause has been delayed compared to ancient times, and there are rare instances of women in their 50s still conceiving. However, this is merely an exception rather than the rule. If menstruation abruptly ceases for an 18 or 19-year-old, barring pregnancy, it is highly probable that amenorrhea has occurred. Amenorrhea and menopause are entirely different phenomena. Menopause is a normal physiological development that occurs at a certain age, while amenorrhea is a pathological condition. From a Western medical perspective, its causes may be genetic or due to congenital defects, such as empty sella syndrome or polycystic ovary syndrome, among others. However, traditional Chinese medicine attributes amenorrhea primarily to kidney qi deficiency, weak qi in blood, and stagnation of qi in blood. Had Xiao Bufan encountered this pulse pattern in his earlier days, he would have struggled to discern the patient as condition. Yet now, his expertise in comprehensive gynecology of traditional Chinese medicine has reached an advanced level, rivaling any specialist in the field. Consequently, Xiao Bufan quickly determined that the girl was suffering from amenorrhea. However, relying solely on the pulse diagnosis was insufficient. He needed to examine her tongue and inquire about her recent conditions. After a moment's thought, he said to the girl, "Please open your mouth. I wish to examine your tongue." The girl obediently opened her mouth, revealing her small tongue. Upon inspection, Xiao Bufan noted that her tongue was somewhat translucent, indicating a deficiency of liver blood. Additionally, the girl's tongue featured a whitish coating with a thin root, suggesting not only a lack of liver blood, but also a cold dampness in the spleen and stomach. This points to amenorrhea caused by weak qi in blood and a deficiency in the spleen and stomach. This form of amenorrhea, resulting from weak qi in blood, is often referred to as blood depletion amenorrhea. Those suffering from blood depletion amenorrhea frequently exhibit symptoms such as blood loss, night sweats, weak spleen and stomach, pale yellow complexion, emaciation, and dry skin. After confirming the girl's condition, Xiao Bufan could not help but smile slightly and said to her mother, "Your daughter's amenorrhea is likely due to weak qi in blood, along with a deficiency in the spleen and stomach, which explains her missed periods." "What? Amenorrhea?" The girl's mother appeared incredulous, muttering, "But my daughter is only 18. This relates to her constitution. She is quite frail. It seems she often consumes cold and damp-inducing foods, such as cold drinks and milk tea, leading to her spleen and stomach deficiency," Xiao Bufan explained with a smile. Hearing this, the girl's mother quickly asked, "Can this condition be treated?" "Rest assured, it is certainly treatable," Xiao Bufan replied cheerfully as he began to write a prescription for her. "I will prescribe some herbs to nourish qi in blood and to warm and invigorate the meridians. After a period of treatment, she will be fine." This condition is not particularly difficult to treat. The challenge lies in accurately diagnosing the underlying cause. As he spoke, Xiao Bufan swiftly penned the prescription. For a patient suffering from blood depletion amenorrhea accompanied by spleen and stomach deficiency, a combination of nourishing liver and blood decoction and warming the meridians decoction would be the ideal treatment. The prescription included ingredients such as Rehmannia, goji berries, cornelian cherry, dodder, yam, angelica, biota seeds, red peony, barley sprout, along with additional herbs like angelica, chuanxiong, cinnamon, and peony. Soon, Xiao Bufan handed the completed prescription and the calculated fee to the girl's mother. "Take this prescription and the fee to the nurse to make the payment. Then proceed to the pharmacy to collect the medicine. The usage and dosage are indicated above. Follow the instructions for preparing the decoction for your daughter. I assure you, you will see results within 3 days." "Oh, all right. Thank you, doctor." The girl's mother smiled and nodded in gratitude. "Yes, go ahead." Xiao Bufan waved his hand with a smile, then signed his name on the prescription. Watching the mother and daughter leave happily, a subtle smile graced Xiao Bufan's face as he felt akin to a revered healer. Had it not been for his recent achievement of mastering the comprehensive gynecology of traditional Chinese medicine, he was certain that his previous self would not have been able to diagnose the girl's condition accurately. However, now with this golden opportunity, he had obtained a mastery of comprehensive gynecology of traditional Chinese medicine, which filled him with confidence about his future in the medical field. Moreover, it seemed that the cool-down period for this system's ability was not long, allowing him to sign in every other day. For Xiao Bufan, this was akin to having the ultimate medical advantage. From this point forward, even without the support of his father and family, he believed he could carve a prosperous path in traditional Chinese medicine. Chapter 4. Another female patient. In truth, Xiao Bufan's background was not particularly poor. Although his mother passed away due to an accident when he was 15, she left him a property. His father, Xiao Yuanyang, is the vice president of the traditional Chinese Medicine College in Shiyuan City, a position he was recently promoted to. Previously, he was merely the director of the college. Without this connection, it would have been improbable for Xiao Bufan to become an attending physician at the 5th hospital before turning 25. Typically, after graduating from medical school, one must undergo 3 years of clinical internship followed by another 3 years as a resident before qualifying for the attending physician title. Therefore, without his father's influence, Xiao Bufan would have needed to wait until his 30s to achieve the same position. However, to return to the previous point, although Xiao Bufan's father, Xiao Yuanyang, has attained the position of vice president at the Traditional Chinese Medicine College, his proficiency in traditional Chinese medicine is rather mediocre, as he did not come from a lineage of practitioners. His rise to the vice presidency also involved an element of fortuity. Fortunately, Xiao Bufan studied at the Provincial Traditional Chinese Medicine College, which is significantly different from the Shiyuan City Traditional Chinese Medicine College. It is worth noting that the latter is merely a vocational college, although the curriculum includes subjects related to traditional Chinese medicine. Finding employment after graduation is not an easy feat, and the skills learned may not necessarily be applicable in clinical settings. Conversely, the Provincial Traditional Chinese Medicine College is an esteemed institution primarily focused on the education of traditional Chinese medicine, fostering a multidisciplinary approach. Graduates from this institution are generally well-positioned to secure roles within hospitals. The disparity between the two colleges is glaringly apparent. Doctor, could you please take a look at me? I have been experiencing severe abdominal pain lately. Just as Xiao Bufan was pondering these matters, a patient entered, holding a registration slip, and took a seat before him to describe her condition. Coincidentally, she was yet another female patient. Severe abdominal pain? Xiao Bufan's brow furrowed slightly as he accepted the registration slip and glanced at it. It read, Name, Fan Jia, Gender, Female, Age, 24. Registration, Traditional Chinese Medicine Outpatient. Additional information, none. Only 24? Xiao Bufan remarked with a smile, glancing at Fan Jia. Aside from the abdominal pain, do you experience any other unusual symptoms? Fan Jia blinked and contemplated before responding. It seems there are no other peculiarities, but if I must mention something, increased vaginal discharge might count. Increased vaginal discharge? Xiao Bufan's brow tightened as he nodded and said, Let me take your pulse to assess the situation. Oh, all right. Fan Jia smiled and extended her delicate wrist, rolling up a bit of her sleeve. Xiao Bufan gently placed his hand on her wrist and began to examine her pulse. Upon doing so, he felt a subtle yet distinct pulse, akin to the tautness of a string, suggesting a stagnation of qi. In that moment, Xiao Bufan raised an eyebrow, realizing that the patient's condition was somewhat unusual. What is happening? How is it that I have only recently mastered the comprehensive text on gynecology of traditional Chinese medicine? Yet I encounter 2 patients in a row with such complex symptoms? Xiao Bufan could not help but sigh, rubbing his nose in exasperation. As the saying goes, fear not the laughter of Western medicine, but dread the low gaze of traditional Chinese medicine. This thought had him not only sighing, but also instinctively touching his nose. At that moment, Fan Jia felt a wave of anxiety wash over her. Doctor, am I going to be all right? She asked with a hint of trepidation in her voice. Xiao Bufan chuckled softly and said, Open your mouth. Let me see your tongue. Fan Jia promptly opened her mouth, sticking out her tongue. Upon examination, Xiao Bufan noted that her tongue was bright red, yet coated with a yellowish hue, accompanied by signs of damp heat and toxin accumulation. After a moment of contemplation, he inquired, This abdominal pain is not during your menstrual period, is it? No. My period has long since passed, Fan Jia replied, a bit dazed. Then aside from the increased discharge, are there any other symptoms? Perhaps occasional bleeding? Ooh, no. At least not at the moment, she responded earnestly, blinking her eyes, considering her pulse, tongue coating, and the results of his inquiry. Xiao Bufan withdrew his hand and looked at Fan Jia. Your pulse is subtle yet taut, and given your abdominal pain and increased discharge, it appears you may be suffering from uterine fibroids. What? Uterine fibroids? Are you even capable of diagnosing me? You simply take my pulse and declare I have uterine fibroids? Fan Jia was taken aback, her face a mixture of shock and agitation as she questioned Xiao Bufan. Xiao Bufan smiled and explained, This is traditional Chinese medicine, not Western medicine. In our practice, diagnosis can be made through observation, inquiry, and pulse taking alone. If I cannot determine your condition through these methods, it would indicate a deficiency in my skills or that your illness is beyond my capacity to treat. Hence, I can confidently inform you that you indeed have uterine fibroids. If you doubt my diagnosis, you are welcome to consult a Western medical practitioner, and I trust their findings will align with mine. Had it been a previous version of Xiao Bufan, he might not have been so certain of the patient's condition. However, as a practitioner who had mastered the comprehensive text on gynecology, he was confident that the patient's ailment was indeed uterine fibroids, albeit in their initial stage. Furthermore, uterine fibroids can be benign or malignant, necessitating further examination for a definitive conclusion. Yet, for a skilled gynecologist in traditional Chinese medicine, the treatment methods for both benign and malignant fibroids are largely similar, with only variations in the herbal prescriptions. Fan Jiejia stood frozen in place, not disbelieving Xiao Bufan's diagnostic skills, but struggling to accept that she could be afflicted with uterine fibroids at such a young age. It is essential to note that she had always been cautious about her health, even when with her boyfriend. So how could this be possible? Chapter 5. Moxibustion Combined Therapy for Young Women. Particularly, there exists an innate fear surrounding gynecological conditions. Thus, upon hearing the term uterine fibroids, Fan Jiejia felt as though her very composure was shattering. Xiao Bufan quickly discerned the pressure weighing on the patient's mind and, with a reassuring smile, gestured for her to calm down. In truth, uterine fibroids are merely one of the most common benign tumors among women, and they are among the most frequently encountered tumors in the human body, also known as fibromyomas or uterine leiomyomas. The treatment for this condition is relatively straightforward, so there is no need for concern. Hearing this, Fan Jiejia hesitated, her expression revealing a hint of worry. But I've heard that uterine fibroids can also be malignant? Indeed, that is a possibility, Xiao Bufan acknowledged with a smile. However, the likelihood of malignant fibroids is quite low. The only way to ascertain malignancy is through a biopsy, but based on my experience, I can assure you that your fibroids are likely benign, making treatment uncomplicated. Really? A glimmer of hope sparkled in Fan Jiejia's eyes as she looked at Xiao Bufan, asking earnestly, "So, Dr. Xiao, you can cure my uterine fibroids, right?" Xiao Bufan nodded with a smile and said, "Certainly, it can be treated. Otherwise, why would I be sharing this with you?" "Well then, I shall trouble you, Dr. Xiao. I will follow your instructions." Fan Jiejia nodded obediently, her demeanor transforming entirely. After all, with an ailment afflicting her, who would dare to disregard a physician's counsel? Ultimately, every human harbors a fear of death. As the saying goes, neglecting a minor illness can lead to a major one, just as a small leak can lead to a dam's collapse. Xiao Bufan glanced at Fan Jiejia and spoke calmly. "In truth, your condition is not particularly difficult to treat. Most Western medical approaches involve the surgical removal of uterine fibroids to ensure the safety of your uterus. However, from the perspective of traditional Chinese medicine, we simply need to fundamentally regulate your body, and naturally, the fibroids will dissipate. I believe that with a combination of moxibustion and herbal medicine, your fibroids will soon be resolved." "All right, I will heed your advice, Dr. Xiao," Fan Jiejia replied earnestly, nodding in agreement. "Please wait here for a moment while I fetch some moxa sticks," Xiao Bufan said, rising to retrieve 2 moxa sticks from the herbal medicine room. Upon returning, he searched for a lighter, gesturing toward the nearby room. "Please lie down in that room and remove your outer clothing. I will perform moxibustion on you." "Okay." Without hesitation, Fan Jiejia entered the adjacent room, shedding her outer layer and lying down on the examination bed. With a flick of the lighter, Xiao Bufan ignited the moxa stick and gently rolled up her thin sleeve to expose her abdomen. Her skin was indeed fair and smooth, suggesting she must take good care of herself, though her youth at 24 certainly contributed. However, Xiao Bufan's focus was not on that. He was here to treat a patient. The moxibustion in traditional Chinese medicine is known for its ability to invigorate blood circulation and unblock meridians. For conditions such as uterine fibroids, moxibustion not only aids in their reduction, but also prevents further progression of the ailment. Thus, in clinical practice, moxibustion is often used as an adjunct treatment for early-stage fibroids or when the fibroids are less than 5 centimeters in size. If the fibroids exceed 5 centimeters, moxibustion may not be suitable as a supplementary treatment. After assessing Fan Jiejia's smooth abdomen, Xiao Bufan promptly cut the moxa stick into small segments and placed them at various acupoints, including the uterus point, Yaoyang point, Senyingio point, Zusamli point, Zhongwan point, Shinkei point, and Chimen point, initiating the moxibustion process. As the moxa burned, a gentle stream of smoke filled the room, creating an ethereal atmosphere. Lying on the examination bed, Fan Jiejie felt a warm sensation enveloping her abdomen, akin to being surrounded by numerous small heating pads, which was quite comforting. Once the last moxa stick was positioned, Xiao Bufan informed her, "This moxibustion will take approximately 20 minutes. You should return for treatment every 2 days, and after about 5 or 6 sessions, you should see significant improvement." "Understood, Dr. Xiao," Fan Jiejie replied, her expression reflecting her comfort. "All right, you may rest here for now. Once the moxibustion is nearing completion, I will return to remove the burnt moxa sticks. I will also prepare a prescription for you, which you can follow at home," he said. "Thank you, doctor," she murmured, her eyes half closed, as she surrendered to the warmth spreading through her body, feeling increasingly drowsy and reluctant to speak, desiring only to lie there in comfort, especially in her abdomen, which felt as if it were immersed in a hot spring. Xiao Bufan observed her for a moment, ensuring she was stable, before returning to his desk to prepare her prescription. With a swift motion, he took pen and paper, quickly drafting the prescription. Due to a power outage at the hospital, he had no choice but to write the prescription by hand, calculating the costs as he went so that the head nurse could process payments. The prescription he prepared for Fan Jiejie included primary herbs such as corydalus, white peony, astragalus, angelica, poria, and prickly ash, adjusting the quantities based on her specific condition. For patients with excess dampness, he might add herbs like philodendron and Job's tears as supplementary treatment. For those with excess liver energy, he could incorporate chrysanthemum, gardenia, and other herbs. In cases accompanied by palpitations and shortness of breath, he might include ingredients like codonopsis, roasted jujube seeds, and licorice. Before long, 20 minutes had passed. Xiao Bufan returned to Fan Jiejie, smiling as he began to remove the nearly burnt moxa sticks from her. Chapter 6. The chaotic outpatient hall. Just as Xiao Bufan was finishing up, Nurse Qin Zhu rushed in, exclaiming, "Dr. Xiao, come quickly. The influx of patients in the Western Medicine Department is overwhelming, and we are struggling to keep up." "What?" Xiao Bufan was taken aback, looking at the nurse in surprise. He had been in the outpatient room for over 2 hours, and only 2 patients had come in. Suddenly, he wondered where this rush of patients had come from. Noting his bewildered expression, Qin Zhu rolled her eyes and pulled him out of the outpatient room, gesturing towards the crowded hall filled with patients. "Look at how many are out there. You're the only one sitting here." Xiao Bufan blinked in astonishment, his jaw dropping at the scene before him. The outpatient hall was teeming with people. Other physicians in the traditional Chinese medicine department had moved their desks outside, and patients clamored, holding their registration slips. "Doctor, please attend to me first. Doctor, could you please check on my son? He is in severe pain." "Hey, do you even know what first come, first serve means? Step back." "Doctor, I'm here for a follow-up. Please see me before anyone else. Watch where you're pushing. Who do you think you are?" "Doctor, my mother has fainted. Please help her." The outpatient hall erupted into chaos, with patients shouting and the medical staff struggling to maintain order. Even the resident doctors were overwhelmed by the crowd. What are the consequences of a power outage in the hospital? Yet, why have so many patients visited the traditional Chinese medicine department? And why has it taken so long for me to attend to just 2 of them? Is it possible that they find my youthful appearance unconvincing? Do they fear my medical skills due to my age? Xiao Bufan, perplexed, rubbed his nose and contemplated, feeling as though these patients harbored a certain animosity towards him. "It is not my fault that I appear youthful. Dr. Xiao, why are you still standing there? Hurry and assist." Qin Zhu gently prodded Xiao Bufan's arm, urging him to act. At that moment, Xiao Bufan snapped back to reality, nodding quickly. "All right, I'll take care of this patient and come to help right away." With that, he returned to his consultation room, presenting the prescription and the bill to Fan Jiejie. "Take this prescription and bill to the nurse for payment. Then go to the herbal pharmacy to collect your medicine. Remember to take your medication on time, 1 dose daily. Split into 2 administrations." Fan Jiejie nodded repeatedly, expressing her gratitude. "Thank you, Dr. Xiao. I truly appreciate your help." Xiao Bufan waved his hand with a smile. "Go on. And remember to come back for moxibustion every 2 days." "Okay, goodbye, Dr. Xiao." Fan Jiejie smiled, as she turned and hurried to the registration desk to pay. After her departure, Xiao Bufan adjusted his white coat and approached Nurse Qin Zuru, inquiring, with so many patients in the hall, "Whom should I assist? Whom should you assist? Have you forgotten that you are also a chief physician?" Qin Zuru shrugged in disbelief, immediately instructing a junior nurse to bring a small table. Placing Xiao Bufan's nameplate on it and gesturing, "You will sit here for consultations. Don't look at me. This is Director Wang's arrangement. Haven't you noticed that other chief physicians are doing the same?" Xiao Bufan stood there, momentarily stunned. However, before he could collect his thoughts, he was swiftly surrounded by a multitude of patients. Despite his youthful appearance, the sheer number of patients in the hall was overwhelming, with at least half of the patients from the Western Medicine Department having come to traditional Chinese medicine due to the power outage affecting the entire northern district of the city. Patients were left with no choice but to seek traditional remedies, especially those whose conditions could not be delayed, such as emergency cases. If they waited a day, who knew what might happen to them? Upon seeing another chief physician present, many patients rushed forward. "Doctor, please help me. My chest hurts terribly. Let me go first." "I arrived before you." "What do you mean you arrived first? Didn't you see that I handed my registration slip to the doctor first?" "Doctor, can you check on my mother? She's in severe pain." "Just because your mother is in pain doesn't mean I won't be in pain too. Do you understand respect for the elderly?" "What? Do you want to fight?" The scene before Xiao Bufan became chaotic as several patients nearly clashed. With a firm slap on the desk, Xiao Bufan raised his voice. "All right, can you all please form a line? If you can't line up, then none of you will be seen. If you continue this ruckus, how can I attend to your ailments? Do you truly wish to be treated?" With his authoritative thump, the crowd of patients exchanged glances, quickly falling into an orderly line. These patients were fearless in the hospital. Their only fear was the prospect of not receiving medical attention. After some time, the man at the front of the line pointed to his registration slip on the desk and spoke softly. "Doctor, that's my mother's registration slip. Could you please help figure out what's wrong with her? She has been complaining of severe abdominal pain since this morning." As he spoke, the man supported his mother to the front of Xiao Bufan. Observing the elderly woman's pale complexion and the beads of sweat on her forehead, it was evident that she was in considerable distress. Xiao Bufan immediately donned a gentle smile, addressing the elderly woman. "Ma'am, let me take your pulse. Just extend your hand." Thank you, doctor," the elderly woman managed through gritted teeth, enduring her pain as she slowly extended her wrist. Chapter 7. Pulse Diagnosis. Internal bleeding at the traditional Chinese medicine department of the 5th Hospital in Shiyuan City. Countless patients crowded the outpatient hall, anxiously awaiting their consultations. As Xiao Bufan examined the elderly woman's pulse, he noted its weakness and the floating quality of the guan pulse, indicating the presence of inflammation. Given her abdominal pain, it was likely that there was an internal inflammation. Typically, for elderly individuals experiencing such inflammation, symptoms would manifest as abdominal pain and an increase in secretions. After contemplation, Xiao Bufan addressed the woman's son. "Your mother may be suffering from inflammation. If we opt for traditional remedies, the treatment duration could be prolonged. Therefore, I recommend that your mother receives immediate treatment with Western medicine to alleviate the inflammation and pain, followed by traditional remedies for recovery." Despite his training in traditional medicine, Xiao Bufan did not harbor disdain for Western medicine. The influence of capital was indeed formidable. Although Western medicine is lauded as a more scientific approach to treatment, its costs are often prohibitively high for the average person. Many minor ailments can be remedied with traditional medicine for a mere fraction of the cost, while Western treatments frequently require hundreds or even thousands of dollars. The Western medical approach, often treating symptoms in isolation, can neglect the patient as a holistic entity, resulting in new issues arising shortly after treatment. This reflects the current state of healthcare. Nonetheless, this does not imply that Western medicine lacks merit. For certain conditions, its efficacy is notably rapid. Therefore, Xiao Bufan personally advocated for patients to first seek relief through Western treatments, followed by traditional methods for holistic recovery, which is a combined approach increasingly pursued in the country. Upon hearing Xiao Bufan's advice, the man eagerly nodded. Yes, doctor, we will follow your guidance. I just want my mother to feel better quickly." "All right," Xiao Bufan replied with a smile, proceeding to prescribe intravenous medications for the elderly woman, as there was no alternative in such circumstances. The elderly gentleman's age is considerable. If traditional Chinese medicine were to be employed for treatment, the process would be quite protracted, and he might not endure such prolonged abdominal pain. Therefore, opting for intravenous therapy to alleviate inflammation and pain, albeit not the optimal treatment plan, is undoubtedly the most suitable approach. Naturally, it is entirely permissible for a traditional Chinese medicine practitioner to prescribe Western medication. The practicing physician law and the prescription management measures in our country do not explicitly prohibit TCM practitioners from issuing prescriptions for Western medicine. In fact, in clinical practice, to achieve better therapeutic outcomes, traditional Chinese medicine occasionally prescribes Western treatments based on clinical diagnosis. Soon, Xiao Bufan prepared the medication for the elderly gentleman and handed it to the man, saying, "Please take this to the head nurse at the front for payment, and a nurse will arrange intravenous therapy for your mother." "Thank you, doctor," the man replied gratefully, nodding repeatedly as he helped his mother to pay. With a sudden clap, just as the man and his mother departed, another patient rushed forward, presenting his registration slip. "Doctor, could you please check what is wrong with me? I feel a tightness in my chest. It's quite distressing." Xiao Bufan paused momentarily, scrutinizing the patient's complexion, which appeared somewhat pale, with notable swelling on his forehead. Furthermore, he observed the patient's prolonged breaths and beads of sweat forming on his brow. This seemed indicative of internal bleeding. Without hesitation, Xiao Bufan took the patient's pulse and inquired, "Have you sustained any significant blows recently, or been struck by something? Perhaps a fall?" The patient appeared taken aback for a moment, then recollected, "Well, not really, but I did fall while ice skating with friends last night. It hurt quite a bit, and I was dazed for a while before I could get up. This morning, I woke feeling a bit short of breath and uneasy, which is why I hurried to the hospital." Upon hearing this, Xiao Bufan raised an eyebrow, feeling the patient's pulse was rapid and strong yet lacked vigor. As noted in Pulse Diagnosis Compendium, a strong pulse often signifies excessive heat in the qi level. If the patient has been ill for a long time or has lost blood, a strong pulse could indicate a critical imbalance between excess and deficiency. Realizing the gravity of the situation, Xiao Bufan urgently called out to Nurse Qin Zuru, "Sister Qin, quickly. There's a patient here I suspect is experiencing internal bleeding. We must take him to the operating room immediately. Otherwise, it could be life-threatening." "What? Internal bleeding?" Nurse Qin Zuru paused, rushing over with a look of concern. "Are you certain this patient has internal bleeding? Could there be a misdiagnosis?" Doubt lingered in her eyes as she was aware of Xiao Bufan's capabilities. After all, diagnosing internal bleeding from merely taking a pulse seemed far-fetched, even for the esteemed Director Wang of their department. Seeing her skepticism, Xiao Bufan felt urgency rising within him. "I assure you, I am not jesting. This patient indeed requires immediate surgical intervention. The hospital is experiencing a power outage, and the Western Medicine Department cannot conduct any examinations. If we delay, it may be too late. Are you certain the patient has internal bleeding?" Nurse Qin Zuru hesitated, sensing the seriousness in Xiao Bufan's demeanor. At that moment, the patient clutched his chest, breathing heavily, and called out, "Doctor, please help me. I can hardly breathe. It's unbearable. Hurry, bring a stretcher." Xiao Bufan's expression shifted, and he yelled to Nurse Qin Zuru, "Quickly bring the stretcher." "Right away," she responded, recognizing the urgency of the patient's condition as she hurried to fetch a transport stretcher. Without delay, Xiao Bufan assisted the patient onto the stretcher and pushed it towards the emergency surgery room. With the entire hospital plunged into darkness, only the emergency department's operating room had a backup power supply. The Chinese medicine department was entirely without power, rendering its surgical facilities inoperative. While there were surgical procedures conducted within Chinese medicine, they were infrequent, leaving the surgical room largely unused and incapable of providing emergency interventions. Chapter 8. The emergency department director's affirmation. In the meantime, other doctors in the lobby observed Xiao Bufan's actions. "What is happening? Why is Dr. Xiao rushing a patient to the emergency department?" Dr. Gu Zhongyi, a TCM pediatrician with nearly 20 years of experience, remarked in surprise. Despite his extensive tenure at the hospital, he had neither ascended to the position of deputy director nor achieved the rank of chief physician, perhaps due to a lack of inherent aptitude in traditional medicine. Nearby, Dr. Lu Zichuan furrowed his brow and replied to Gu Zhongyi, "I overheard Dr. Xiao mention that the patient is experiencing internal bleeding and must be rushed to the emergency department for surgery. However, I am doubtful of his diagnosis. The patient I observed did not appear to be experiencing internal bleeding. If this diagnosis is incorrect, it could lead to a medical malpractice incident. Dr. Liu, the chief physician of TCM Gynecology, expressed his disbelief, stating, "Could Zhao's limited skills really indicate internal bleeding? I find that hard to believe." Gu Zhongyi raised an eyebrow. Reproaching Lu Zichuan, "If you heard Dr. Zhao's diagnosis, why did you not intervene? If he makes an error, it could ruin his medical career." "I can't leave my patients at this moment," Lu Zichuan retorted, gesturing to the crowd surrounding him. Sighing in resignation, Gu Zhongyi muttered, "You cannot simply watch as Dr. Xiao makes a mistake. Young practitioners must encounter trials. Otherwise, they remain unaware of their limitations." Lu Zichuan smiled and waved his hand, then took out his phone to call Director Fong of the emergency department while reassuring Gu Zhongyi, "Rest assured, I will inform Director Fong right away. Everything will be fine." Ring, ring. Soon, the call connected. Lu Zichuan promptly conveyed the situation to Director Fong, urging him to keep an eye on the patient and refrain from proceeding with surgery just yet. Meanwhile, Xiao Bufan was pushing the patient into the emergency department and urgently pulled a doctor aside, exclaiming, "This patient is suffering from severe internal bleeding. He must be taken to the operating room immediately for hemostasis. Please arrange a surgical room for him." The emergency doctor glanced at him with a hint of skepticism and replied, "You are a physician from the traditional Chinese medicine department, aren't you? This young man appears to be just fine. Please don't create unnecessary chaos in our emergency department. Besides, are you not aware that the entire hospital is experiencing a power outage? Without any examinations, how can you assert that he has internal bleeding? How could a practitioner of traditional Chinese medicine possibly diagnose such a condition?" Clearly, the emergency doctor was not convinced by Xiao Bufan's claims. After all, diagnosing internal bleeding is a task that requires experience and instruments, which someone from the traditional Chinese medicine department would not possess. Noticing that the doctor was dismissive of his medical judgment, Xiao Bufan frowned slightly, preparing to engage in a debate. Just then, Director Fong from the emergency department approached with a smile, addressing him, "You must be Dr. Xiao Bufan, correct? Dr. Liu from your department just called me. Are you certain that the patient is indeed experiencing internal bleeding? How confident are you?" Fong Yunpeng, the director, had encountered numerous cases of internal bleeding, and upon seeing the patient lying on the bed, he was inclined to believe that Xiao Bufan's assessment was not far from the truth, contrary to what Dr. Liu had suggested. However, he remained curious about how this young practitioner of traditional Chinese medicine had arrived at such a conclusion. After all, he was aware that the practitioners in that field were not typically renowned for their diagnostic prowess. Moreover, it was a fortunate coincidence that Fong Yunpeng was acquainted with Xiao Bufan's father, Xiao Yuanyang, although he was unaware that Xiao Bufan was his son. Xiao Bufan looked earnestly at Fong Yunpeng and confidently responded, "Yes, I am Xiao Bufan. Based on my diagnostic skills, I am at least 90% certain that this patient is indeed suffering from internal bleeding. If we do not proceed with treatment promptly, the patient may not endure much longer." Upon hearing this, Fong Yunpeng nodded in agreement. "All right, since you are so confident in your assessment, let us prepare for surgery." With that, he turned to have the surgical room readied. "Director Fong, are you really going to trust his judgment?" the nearby emergency doctor asked, momentarily stunned. Fong Yunpeng chuckled and waved his hand dismissively. "Even if I have doubts about his judgment, do I not trust my own eyes? Have you not noticed that the patient lying on the bed is pale and struggling to breathe? Thus, I concur with Dr. Zhao's diagnosis. The patient likely has internal bleeding and must undergo surgery immediately. But the patient hasn't undergone any examinations yet." The emergency doctor seemed hesitant, as the patient appeared merely pale and short of breath without any other symptoms. Fong Yunpeng shot him a stern look, admonishing, "The entire hospital is without power. How can you conduct examinations? We must act decisively and prepare for surgery." Upon receiving Fong Yunpeng's approval, the doctor in charge of the surgical room immediately began making arrangements and even summoned a lead surgeon from the emergency surgery department. After all, when the department head had spoken, the emergency doctors had no reason to disregard his directive. Moreover, Fong Yunpeng had been in the emergency department for many years. His keen eye for diagnosis left no room for doubt among the staff. Chapter 9. An overwhelming number of patients. Before long, the emergency department had prepared a surgical room for the patient. However, since Xiao Bufan was a physician from the traditional Chinese medicine department, he He was not allowed to participate in the surgery. This was done, of course, for the patient's safety and to validate Xiao Bufan's diagnosis while proving the correctness of their own viewpoints. Therefore, Director Fang Yunpeng decided to personally perform the surgery to avoid any potential disputes later on. Moments later, the anesthetist administered the anesthesia to the patient, which soon took effect. Fang Yunpeng picked up the scalpel and began the procedure based on his extensive experience. Indeed, he quickly located the bleeding site within the patient's cranium. The other emergency doctors present were taken aback, exchanging astonished glances. Wow, this patient really does have internal bleeding? Frontal lobe hemorrhage? It seems the patient sustained a severe injury, causing a skull fracture that ruptured small blood vessels in the brain, resulting in this internal bleeding. How did that traditional Chinese medicine doctor, Xiao, manage to identify the internal bleeding? Enough of your speculations. Our director has clearly identified the internal bleeding, so what is so surprising about it? One doctor interjected. But it's not the same. He is a practitioner of traditional Chinese medicine, not an emergency surgeon. How many traditional Chinese medicine doctors have you seen who can diagnose internal bleeding solely by taking a pulse? And this is intracranial bleeding. The esteemed doctors in the emergency department began whispering among themselves. Their curiosity piqued regarding Xiao Bufan's abilities in traditional Chinese medicine, each astonished by the revelation. While Fang Yunpeng continued the surgery, he could not help but chide them. All right, enough chatter. Focus on the procedure. First assistant, second assistant, help drain the intracranial hemorrhage. Nurse, provide me with the hemostatic forceps. Understood. The attending staff quickly regained their focus and diligently followed Fang Yunpeng's instructions. Meanwhile, Xiao Bufan had already returned to the outpatient hall of the traditional Chinese medicine department, continuing to consult with the influx of patients. With the entire northern district experiencing a power outage for the entire day, the traditional Chinese medicine departments of several hospitals had suddenly become highly sought after, with numerous patients crowding in, all eager for medical attention. Upon returning to the outpatient hall of the traditional Chinese medicine department, Xiao Bufan was immediately surrounded by a throng of patients. Doctor, please take a look at me. I feel I can't go on like this. Doctor, my son has been burning with fever. You must help him. Doctor, please attend to my daughter. I was here first. I should be seen first. I've been waiting for quite a while. You cannot cut in line. As Xiao Bufan settled back into his previous position, the patients eagerly thrust their registration slips towards him, clamoring for his attention. It is noteworthy that from the moment he had escorted a patient to the emergency room and returned, barely 20 minutes had elapsed. Consequently, the number of patients in the traditional Chinese medicine outpatient hall had not diminished, but appeared to be on the rise. Observing the anxious faces before him, Xiao Bufan raised his brow slightly and had no choice but to tap his desk gently, admonishing the crowd. All right, if you wish to be treated, please queue up as before. Do not crowd around me. I cannot attend to you in this chaos. As soon as his words fell, the gathered individuals promptly arranged themselves into an orderly line. Once they were all properly queued, Xiao Bufan donned a gentle smile and began his consultations. Meanwhile, not far away, Gu Zhongyi and Lu Zichuan, who were attending to other patients, noticed Xiao Bufan's return. What is the matter? Dr. Xiao seems unperturbed. Did you clearly communicate the situation of that patient to Director Fang in the emergency department? Gu Zhongyi inquired, his brow slightly furrowed. In response, Lu Zichuan appeared momentarily taken aback, replying with a hint of exasperation. I'd already conveyed everything clearly to Director Fang over the phone. Should I call again? Gu Zhongyi nodded. Yes, please do, just to be sure. All right. Lu Zichuan agreed and took out his phone to dial Director Fang again. However, after ringing for a considerable time, no one picked up. It was well known that Director Fang was currently performing surgery on a patient and had no time to answer calls. Listening to the monotonous tone on the line, Lu Zichuan shrugged helplessly and informed Gu Zhongyi, it seems no one is answering the phone. Then let us wait and try again later, Gu Zhongyi replied, momentarily dazed. Before resuming his medical duties with the patient before him, the outpatient department was inundated with patients today, and it seemed unlikely they would have any respite, compelling everyone to put forth their utmost effort in attending to each individual. Xiao Bufan continued to see one patient after another, and with his prior focus on internal medicine and traditional Chinese medicine, coupled with his newfound expertise in gynecology, his speed and accuracy in consultations had significantly improved. Nonetheless, there were still one or two patients whose conditions he could not definitively diagnose. After all, traditional Chinese medicine encompasses a broad spectrum of knowledge. Mastering one specialty does not guarantee proficiency in all ailments. The art of differential diagnosis in traditional Chinese medicine requires a tailored approach, varying from person to person and illness to illness. For those cases he could not accurately assess, Xiao Bufan would simply inform the patients that he was unable to assist and recommend they seek another doctor's opinion. As a physician, patients are not afraid of a doctor not understanding their condition, as they can always consult another knowledgeable practitioner. However, they harbor a deep-seated fear of a doctor feigning expertise and administering misguided treatments. Such ineptitude not only leads to unnecessary expenditures for the patients, but may also exacerbate their conditions, potentially resulting in dire consequences, including death. Naturally, Xiao Bufan was determined not to become a quack. Therefore, he would direct patients with conditions he could not comprehend to seek alternative medical attention, as he felt incapable of providing the necessary care at this moment. Chapter 10. The Silent Father, as the saying goes, a mediocre doctor harms the sick. A good doctor saves lives. Even though Xiao Bufan's current medical skills could only be considered average, he aspired to be a good physician, not a mediocre one. The day passed swiftly. The outpatient department was overwhelmed with patients, and by the time afternoon approached, there were still numerous individuals awaiting treatment. However, this was an unavoidable reality, given the limited number of practitioners in the traditional Chinese medicine department, a reflection of the severe shortcomings within the national healthcare system. It is essential to recognize the vast population of our country, where the doctor-to-patient ratio stands at 1:1950. This statistic implies that, on average, there is only one doctor available for every 1,000 individuals, although the total number of healthcare personnel has reached approximately 13 million. This figure includes many nurses and other medical staff. The actual number of physicians engaged in clinical practice is merely around 4.2 million. Such a significant gap in medical personnel naturally contributes to the difficulties and high costs patients face when seeking care. However, it must be reiterated that doctors are human too. They require rest. Thus, despite the multitude of patients still awaiting consultations, medical professionals must conclude their shifts. Xiao Bufan had attended to nearly 30 patients that day, a workload far exceeding his previous experience, leaving him utterly exhausted. Nurse Qin Zuru, smiling as she tidied up, approached and gently patted Xiao Bufan on the shoulder, saying, "All right, Dr. Xiao, it's time for us to clock out." "Oh, indeed, it's time to go," Xiao Bufan replied, stretching with a yawn. He returned to his office to remove his white coat, preparing to leave for the day. At that moment, Gu Zhongyi, also preparing to leave, turned to Lu Zechun and urged, "Old Lu, should you call Director Feng once more to inquire about that patient sent to the emergency department? We must ensure Dr. Xiao does not inadvertently cause a medical mishap." "Old Gu, you're still hung up on this?" Lu Zechun retorted, rolling his eyes. "If the patient Dr. Xiao sent over truly had any misdiagnosis, I trust Director Feng would have contacted us by now. Since he hasn't called, could it not be possible that Dr. Xiao's assessment was correct? That patient might indeed have suffered internal bleeding." "Internal bleeding?" Gu Zhongyi was momentarily taken aback, struggling to believe it. "That seems unlikely. Even I cannot discern internal bleeding just by taking a pulse. What makes you think Dr. Xiao possesses such extraordinary diagnostic skills?" Lu Zechun chuckled and shrugged. Perhaps it was mere coincidence. After all, if there were indeed a misdiagnosis, Director Feng would certainly have returned the patient. Gu Zhongyi pondered for a moment, then could not help but let out a sigh. "Let's not concern ourselves with it. If there were any issues, as you said, Director Feng would definitely call." With that, Gu Zhongyi removed his white coat and left work alongside Lu Zechun. Meanwhile, Xiao Bufan finished his shift at the hospital and returned to his residence. His current abode, situated on the outskirts of Shiyuan City, resembled a quaint farmhouse, complete with a small yard that spanned over 130 square meters. Additionally, there was a modest piece of land in front where he could cultivate vegetables or use as a parking space. This house had been purchased by Xiao Bufan's mother years ago at a reasonable price, primarily for the land, which she acquired along with the property. Following her passing, the house and the land were bequeathed to Xiao Bufan. As for his father, Xiao Yuanyang, he resided in a home in the city center, closer to the Shiyuan City Traditional Chinese Medicine College. Although Xiao Yuanyang had urged his son multiple times to move in with him, Xiao Bufan had grown accustomed to living alone and preferred not to share a space with another man. Besides, both father and son were usually preoccupied with their respective work, leaving little time for care or companionship. In recent years, with the economic boom, the outskirts had gradually developed. Now, when hunger struck, he could simply order takeout, and laundry could be dispatched to a laundromat. Xiao Bufan commuted in his father's previously discarded Honda Fit, which was both fuel-efficient and reliable, allowing him to enjoy a comfortable life. The only downside was that Xiao Bufan remained single, with no romantic partner in sight. Just as Xiao Bufan returned home, a sudden honking echoed at the gate. Who would it be at this hour? He wondered in surprise as he stepped outside, only to find a brand-new BMW 5 Series parked at his gate. The driver's window slid down, and Xiao Yuanyang poked his head out with a smile. Honking twice before calling out, "Son, come on. Dad's treating you to dinner tonight." "Wow, Director Xiao, you've got a new car," Xiao Bufan exclaimed, walking over to inspect the BMW. He playfully kicked the tire and asked, "Is this high-end or low-end?" "Must have cost quite a bit, huh?" Xiao Yuanyang chuckled. "What high-end or low-end?" "It was just around 600,000. He observed. "Seems like you've been making quite a bit lately. Been picking up side gigs?" Xiao Bufan, sitting in the passenger's seat, dismissed the notion with a smirk. "Is that how you talk to your father? Side gigs? Come on, I'm a legitimate lecturer." All right. Let's south hit the road. "Weren't you the one who insisted on treating me?" Xiao Bufan surveyed the luxurious interior of the car, immediately sensing the elegance that set this vehicle apart. "Let us go. I'm treating you to a feast today," Xiao Yuanyang stated with a grin, starting the BMW and driving towards the city's most opulent hotel. To be honest, Xiao Yuanyang found himself at a loss regarding his son. Initially, he had hoped Xiao Bufan would enroll in a prestigious school and secure a stable position within the system. Yet his son insisted on pursuing clinical traditional Chinese medicine. It seemed Xiao Bufan had forgotten that his father was the deputy dean of the city's traditional Chinese medicine college. Or perhaps, at that time, Xiao Yuanyang was merely a department head. Chapter 11. Flattery for Director Wang. There's an old saying. Encouraging someone to study medicine could invite divine retribution. For anyone wishing to pursue medicine, how many years must one endure before achieving success? Moreover, once one commits to the medical profession, other career options become virtually unattainable. Were it not for some connections, Xiao Bufan would be hard-pressed to attain a position as an attending physician, let alone secure a spot at any hospital. Generally, medical education requires at least 5 years for a bachelor's degree, followed by 3 years of graduate studies, or a combined program lasting a minimum of 7 years. By that calculation, one typically does not enter the workforce until around the age of 30, not accounting for the internship period. Reflecting on these matters, Xiao Yuanyang could not help but let out a sigh, unintentionally pressing the accelerator a bit harder. The BMW 5 Series roared to life as they sped toward the city. Before long, father and son arrived at a luxurious hotel, where they ordered an array of delectable dishes. Originally, Xiao Yuanyang had considered enjoying a drink, but he was dissuaded by Xiao Bufan, who cited the need to drive. Reluctantly, he poured himself a cup of hot tea, munching on the food while addressing his son. "By the time the new year rolls around, you'll be 26. Why haven't you found a girlfriend yet? You don't want the Xiao family line to end, do you?" Xiao Bufan nearly spat out a mouthful of chicken soup, pointing at his father in disbelief. "What are you talking about? I'm only 25. There is no need to worry about the family line. I just haven't found a girlfriend yet. It's not like I'm incapable." Xiao Yuanyang stared at his son, seemingly realizing his mistake, and quickly corrected himself. All right, I misspoke. What has been years since your mother passed? Can't you find someone to settle down with? It would save me from worrying about you constantly, and I'd like to enjoy a few more years of freedom. Let us talk about it after I turn 30. Xiao Bufan shrugged nonchalantly. He then countered, "If you're so eager for grandchildren, why don't you find someone for yourself? It's been ages since Mom left us. Honestly, I wouldn't mind a stepmother. Do you really not mind, or is that just talk?" Xiao Yuanyang interjected. "Actually, someone has been introduced to me recently, but since you didn't give your approval, I didn't pursue it. I'm indifferent. If someone suitable comes along, go meet them," Xiao Bufan said, casually chewing on a piece of beef. "After all, you're still young, and life ahead is long. You wouldn't want to spend your remaining days in solitude, would you? Stop that. Show me some respect. I'm still your father." Xiao Yuanyang felt utterly unable to engage in conversation with his son. However, at least he now understood his son as perspective, knowing he could indeed seek a suitable partner. Once the meal concluded, Xiao Yuanyang drove Xiao Bufan back to the suburbs, choosing to stay overnight in his old house rather than returning to the city. It had been quite rare for the father and son to share the same living space, which is precisely why Xiao Yuanyang decided to remain there for the night. The next morning, Xiao Bufan woke early and was already washed and dressed, while his father, Xiao Yuanyang, remained sound asleep in the room. After all, he had recently become the deputy director, and a later arrival at the academy seemed inconsequential. After all, he was second only to the director in the entire medical college. With a sense of resignation, Xiao Bufan stepped outside to purchase breakfast, then knocked on the door. Calling out to his slumbering father, "Old Xiao, I'm off to work. I've left breakfast on the table for you. Remember to eat when you wake up." Got it," came the groggy response from Xiao Yuanyang, who merely turned over and resumed his slumber. Xiao Bufan lingered outside for a moment, listening to the sounds within, sighed lightly, and then departed for work. With a rumble, he drove his modest Honda Fit towards the 5th hospital in Shiyuan City. Despite living in the suburbs, the area had been well developed, with broad roads now crisscrossing the landscape. The distance to the 5th hospital was not substantial. After about 20 minutes of driving, he arrived at the hospital's entrance. After parking his car, he made his way to the traditional Chinese medicine department. Fortunately, power had been restored to the hospital, and the department was not as busy as usual. As Xiao Bufan leisurely entered the TCM department, he was promptly called over by Nurse Qin Zuru. "Dr. Xiao, why are you so late? You need to head to the director's office. Director Wang is looking for you," Qin Zuru said hurriedly. Taken aback, Xiao Bufan smiled and inquired, "Director Wang is looking for me? Do you know what it's about?" "Qin Jia?" With a look of certainty, Qin Zuru replied, "It's probably about the patient with internal bleeding you examined yesterday. I just saw Director Fong from the emergency department here, and he left with Director Wang." Understanding the implication, Xiao Bufan chuckled and said, "All right, I see. Thank you, Qin Jia. I'll head over to the director's office now." He made his way to Director Wang's office. Upon entering, he noticed a hint of joy on Director Wang's face, indicating a good mood. "Director, you call for me?" Xiao Bufan greeted with a smile. "Ah, Xiao, you're here. Please, have a seat," Director Wang said warmly. "Oh, I want to sit. I have to get back to work soon." Xiao Bufan replied with a grin, nodding. "If you have something to discuss, just let me know. I'll stand and listen." Seeing Xiao Bufan's cheerful demeanor, Director Wang smiled slightly. "Actually, it's nothing serious. I heard you diagnosed a patient with internal bleeding yesterday and sent him to the emergency department?" "Yes, that is correct. Why do you ask, Director Wang?" Xiao Bufan inquired, blinking in surprise. "Well, the emergency department's Director Fong came to see me earlier and mentioned that your diagnosis was spot on. If you hadn't referred that patient for surgery yesterday, he might not have survived," Director Wang explained. Xiao Bufan was taken aback, then asked, "So the surgery was successful? The patient is all right now?" "Yes, he is fine." Director Wang nodded, complimenting Xiao Bufan. "I didn't expect your diagnostic skills to have improved so much, Xiao. It seems we might have a future master of traditional Chinese medicine in our department." In response to Director Wang's praise, Xiao Bufan bashfully touched his nose. "There is no need to exaggerate, Director. It was just one case of internal bleeding. If you keep this up, I want to know how to respond. Honestly, I just wanted to verify the authenticity of this matter," Director Wang said, sipping from his cup of goji berry tea. "If you'd rather not discuss it, feel free to return to your duties. I have nothing else for you here." "All right, I'll get back to work then," Xiao Bufan nodded, glancing at Director Wang's thermos. He couldn't resist teasing, "Director, are you really starting your day off with goji berries? Are you feeling unwell? Should I check your pulse?" "Enough. Do you really think I need you to check?" Director Wang rolled his eyes, waving him off. "Get back to your work. I know how I feel." "Of course. You're fine. I'll be off then." Xiao Bufan laughed, turned to leave the office. With a soft thud, he closed the door behind him. Director Wang chuckled lightly, shaking his head as he murmured, "It seems Xiao has changed. He appears more self-assured than before." After all, Xiao Bufan had been working in the TCM department of the 5th hospital for several years. As the department head, Director Wang was quite familiar with his subordinates. Otherwise, he wouldn't hold his position. Previously, Xiao Bufan would never have dared to joke with him like this, making Director Wang truly surprised by the transformation. Upon returning to his office, Xiao Bufan suddenly remembered that he had yet to sign in for the day. Without hesitation, he called out to the system. "System, let me check in." Beep. "Check-in successful. Congratulations, host, you have obtained advanced listening skills." "Advanced listening skills?" Xiao Bufan hesitated, seemingly dissatisfied with this reward. Typically, listening skills were primarily utilized by Western internal medicine doctors. For a genuine practitioner of traditional Chinese medicine, such a skill seemed somewhat excessive. In fact, within the realm of TCM, listening is merely a subcategory of the four diagnostic methods: observation, listening, inquiry, and palpation. In the past, Western medicine, upon its arrival in China, found it challenging to grasp the dialectical theories of traditional Chinese medicine. However, it did adopt the technique of auscultation from the practice of traditional diagnosis and subsequently invented the stethoscope. Western practitioners utilize the stethoscope to listen to patients, primarily assessing heart rates, murmurs, and lung sounds. Yet, this method does not yield remarkably accurate judgments regarding a patient's condition. In contrast, traditional Chinese medicine's approach to auscultation encompasses not only listening but also olfaction, which distinguishes it significantly from Western practices. The Huangdi Neijing Ling Shu states, "The liver corresponds to wood, its sound is jiao, and its emotion is anger. The heart corresponds to fire, its sound is ji, and its emotion is joy. The spleen corresponds to earth, its sound is gong, and its emotion is contemplation. The lungs correspond to metal, its sound is shang, and its emotion is worry. And the kidneys correspond to water, its sound is yu, and its emotion is fear." Thus, it is said, the five organs manifest their sounds externally. Internal ailments must inevitably reflect outwardly. A skilled physician not only excels in pulse diagnosis, but is also adept at interpreting words and observing expressions. The Shanghan Zabinglin thoroughly describes the sounds associated with various ailments, noting symptoms like snoring from nasal passages and the silence of a voice amidst abdominal thunder. Suddenly, a surge of knowledge and experience regarding auscultation flooded Xiao Bufan's mind, courtesy of the system. Fortunately, this knowledge pertained to traditional Chinese medical practices. As Xiao Bufan assimilated this knowledge, he discerned that his hearing had become notably sharper, allowing him to perceive even the footsteps outside the clinic with remarkable clarity. Moreover, he could identify the footsteps of familiar individuals. Could this be considered a passive reward from the system? Would he no longer need a stethoscope for future patient assessments? Xiao Bufan's initial concerns transformed into elation. He found today's sign-in reward to be quite exceptional. After all, it had not only granted him advanced proficiency in auscultation, but also enhanced his auditory acuity, resulting in a significant gain. A smile emerged on Xiao Bufan's face, lifting his spirits immensely. Just then, a patient knocked on the clinic door and entered, addressing Xiao Bufan. "Hello, doctor. Could you please take a look at me?" As he spoke, he handed over his registration form and medical records. Xiao Bufan cheerfully accepted the documents and glanced at the registration form, which read, "Name, Hikara, age, 45, registration, Traditional Chinese Medicine Clinic, additional information, accompanied medical records." Turning to the medical records, he noted, "Patient, Hikanrue, age, 45, diagnosed by Western medicine as having intermittent insomnia for 2 months. The patient has tried lorazepam, oxazepam, and midazolam, but none achieve the desired therapeutic effect. These medications are all sedatives. However, the records indicated that these drugs had failed to alleviate the patient's insomnia. In a certain sense, Western sedatives merely serve as coercive tranquilizers without directly addressing the body's natural sleep regulation. Once the body develops tolerance to these medications, they become ineffective, losing their ability to induce sleep. This is akin to the anesthetics used in Western surgical procedures, which also carry significant side effects. In the clinic, after reviewing the patient's records, Xiao Bufan smiled and said to the patient, "You are Hikanrue, correct? Let me check your pulse to assess your condition." "Yes, please, doctor," Hikanrue replied, extending his wrist and rolling up his sleeve. Xiao Bufan gently placed 3 fingers on Hikanrue's pulse points, sensing the pulse's rhythm. In traditional Chinese medicine, insomnia is categorized into 2 types: deficiency and excess. Excess symptoms arise from emotional distress, liver dysfunction, dietary irregularities, or phlegm heat disturbances, while deficiency symptoms stem from heart-kidney disharmony, improper water-fire balance, excessive fatigue, or both heart and spleen deficiencies. To diagnose insomnia accurately, one must first assess its severity and then differentiate between deficiency and excess to target the root cause effectively. However, Xiao Bufan's pulse diagnosis skills were still quite rudimentary. Thus, He found it challenging to ascertain the patient's condition solely through pulse examination. Fortunately, with his advanced auscultation skills and heightened hearing, he did not require a stethoscope. As he conducted the pulse examination, he attentively listened to the sounds of the patient's internal organs. He discovered two distinct sounds emanating from within, jiao and gong. In ancient musical theory, sounds are categorized as jiao, ji, gong, shang, and yu, corresponding to the five elements: wood, fire, earth, metal, and water, and to the respective organs: liver, heart, spleen, lungs, and kidneys. The jiao sound corresponds to the liver, while the gong sound corresponds to the spleen. Hence, it could be deduced that both the liver and spleen of the patient were compromised. Observing He Congrue's frail physique, pallid complexion, and lethargic demeanor, one could infer that his condition resulted from spleen dysfunction and liver blood deficiency, leading to the distinctive sounds of his internal organs. Thus, Xiao Bufan promptly discerned the patient's ailment. Given that the patient suffered from spleen dysfunction and liver blood deficiency, treating his insomnia would be relatively straightforward, requiring merely a single herb. With this thought, Xiao Bufan smiled gently and said to He Congruei, "Your insomnia is quite simple to treat. I will provide you with an oral prescription, and you can take it for a week." "What? An oral prescription?" He Congruei paused, his brow furrowed. "Doctor, I'm afraid I won't remember it. Could you please write it down instead?" "Actually, the prescription is quite simple. You will remember it once I tell you." Xiao Bufan replied with a grin. "You just need 3 sour jujubes to be taken morning, noon, and night." "Sour jujubes?" He Congruei was taken aback. He seemed incredulous that a simple remedy could resolve his insomnia. If merely consuming sour jujubes could alleviate his condition, what had been the purpose of his numerous visits to various Western doctors? Was he foolish, or were those physicians merely deceiving him? He Congruei felt a bit dazed, unsure whether to trust the young, traditional Chinese medicine practitioner before him. Xiao Bufan quickly discerned the concern in his eyes and smiled as he explained. "Your condition primarily stems from a deficiency in liver blood storage, leading to insomnia due to insufficient nourishment for the heart. Sour jujube has a cooling nature and is known for its ability to nourish the liver, calm the spirit, and enrich the heart. Therefore, consuming sour jujube is certainly advisable. If you find no improvement after trying it, feel free to return for a complimentary follow-up consultation." Upon hearing Xiao Bufan's explanation, He Congruei nodded hesitantly and said, "All right then. I shall heed your advice, doctor. I will purchase some sour jujube to try." "Thank you." With that, He Congruei stood and departed from the consultation room. After all, sour jujube was readily available everywhere. He did not wait for Xiao Bufan to prescribe anything and hurried out of the hospital. Xiao Bufan blinked in surprise as he watched He Congruei leave his office without a second thought. He shrugged helplessly, pondering, are patients really this difficult nowadays? Do they have so little faith in the hospital that they need to venture out for a mere sour jujube? However, he understood that the sour jujube sold in the hospital was rather expensive. Typically, medicinal sour jujube could cost around 800 to 900 yuan per pound, with some hospitals charging over 1,000. Given He Congruei's condition, he would need at least half a pound, amounting to approximately 250 yuan, which was indeed quite steep. Meanwhile, after leaving the 5th hospital, He Congruei found himself standing in front of a traditional Chinese medicine shop without realizing it. Should I buy some sour jujube to try? He mused, wondering if this remedy could truly alleviate his insomnia. He glanced at the medicine shop and, almost unconsciously, stepped inside. To his astonishment, the sour jujube in this shop was exorbitantly priced at 1,200 yuan per pound. He felt as though he had been fleeced. Holding the purchased pound of sour jujube and staring blankly at the shop's entrance for quite some time. In reality, fresh sour jujube was not particularly expensive, usually costing only a few dozen yuan per pound. However, prices varied based on origin and whether they were cultivated or wild. Wild dried sour jujube could indeed command high prices, aligning with those of the hospital. Goodness, I didn't expect the sour jujube outside to be so costly. Had I known, I might as well have asked Dr. Xiao to prescribe it for me. Perhaps the hospitals would have been cheaper. He Congruei lamented as he trudged home with his pound of dried sour jujube. At that moment, Xiao Bufan sat in his consultation room, having waited for over half an hour without seeing another patient. Clearly, after the hospital resumed power, The patient flow in the traditional Chinese medicine department had returned to its previous level, with few patients seeking out the services of a traditional Chinese medicine practitioner. This was somewhat inevitable, as many patients perceived the traditional Chinese doctors as deceptive. Yet, one could not entirely blame the doctors. Most of them graduated from traditional Chinese medicine schools, where their education was largely theoretical and textbook-based. Those practicing in the hospital were not traditional practitioners who had apprenticed under experienced masters, thus lacking the seasoned skills of their predecessors. Chapter 14. Pediatric Emergency to Speak Candidly. The so-called attending physicians in the hospital's traditional Chinese medicine department were not significantly different from Western doctors. Many of them did not even know how to perform pulse diagnosis. Their consultations began with a series of Western medical examinations, such as blood tests and ultrasounds, regardless of the ailment presented. However, these practitioners did not embody the true essence of traditional Chinese medicine. Most of them could diagnose and treat, yet lacked mastery of the intricate theories of the 5 elements and other traditional philosophies. Xiao Bufan was well aware of this situation and had grown accustomed to the sparse patient flow in the traditional Chinese medicine department. After all, the 5th hospital was merely a secondary-level facility, inferior to the prominent tertiary hospitals. Moreover, the traditional Chinese medicine department itself was small, with limited medical staff. Most importantly, the attending physician skills were quite average, which naturally resulted in fewer patients seeking their care. As Xiao Bufan sat in his consultation room, feeling somewhat bored, he suddenly heard hurried footsteps approaching. The sound drew nearer, and he recognized it as the hurried footsteps of Nurse Qin, for she was the only one in the department whose steps were so brisk. With a creak, the door swung open, and in rushed Nurse Qin Zuru, her face etched with urgency. "Dr. Xiao, quickly, do you know anything about pediatrics?" "Pediatrics?" Xiao Bufan was momentarily taken aback, his gaze fixed on Qin Zuru as he asked, "What is going on? I have some understanding of pediatric traditional Chinese medicine, but I wouldn't say I'm an expert." In truth, he knew little about it, as his expertise lay primarily in traditional internal medicine and gynecology. However, with a comprehensive understanding of gynecological issues, he believed he could still grasp some pediatric symptoms, albeit not with the proficiency of a specialized pediatric practitioner. Qin Zuru, visibly anxious, pulled Xiao Bufan along as she explained, "Dr. Gu has a patient in urgent need of assistance. He and Dr. Lu can't stabilize the condition, so they requested your help." As she spoke, they arrived at Dr. Gu Zhongyi's consultation room. At that moment, in the pediatric traditional Chinese medicine department, Dr. Gu Zhongyi was nearly dumbfounded by the patient before him. He had just begun to perform gua sha therapy to reduce the patient's fever when the child suddenly turned pale, foaming at the mouth, and began convulsing uncontrollably. Moreover, the patient was quite young. This sudden turn of events startled Gu Zhongyi significantly, prompting him to hastily summon Dr. Lu from next door for assistance. However, upon Dr. Lu Zichuan's arrival, he found himself equally at a loss, unable to alleviate the patient's sudden symptoms. What could they do? Both were graduates of medical school, trained in traditional Chinese medicine, and found themselves momentarily dumbfounded by the situation. Their only recourse was to employ various methods to cool the patient down. Yet the results were far from satisfactory. The patient's condition showed no signs of improvement, and their body temperature remained stubbornly high. In a moment of inspiration, Dr. Lu recalled how yesterday, Xiao Bufan had diagnosed a case of internal bleeding merely through pulse examination. He suggested to Gu Zhongyi that they summon Xiao Bufan, as he might possess the solution. After a brief contemplation, Gu Zhongyi agreed to Dr. Lu's proposition, leading to the scene where the head nurse was dispatched to fetch Xiao Bufan. Upon entering the pediatric clinic with Nurse Qin Zuru, Xiao Bufan was met with a chaotic scene. A young patient lay on the bed, convulsing uncontrollably, while Dr. Gu and Dr. Lu stood helplessly by, unsure of how to proceed. The patient's family was in a state of panic, holding their child and weeping, clearly on the verge of emotional collapse. Observing this, Xiao Bufan swiftly approached, inquiring of Dr. Gu, "What is the matter, Dr. Gu? What has occurred?" Seeing Xiao Bufan arrive, Gu Zhongyi quickly briefed him on the patient's condition. This child is merely 8 years old. When brought in by the parents, they stated he had suffered from heat stroke. I began to perform gua sha to relieve the heat, but just as I was halfway through, the patient began to breathe rapidly and convulse. Dr. Lu and I have employed various methods, yet we have been unable to alleviate his condition. If we cannot stabilize him soon, We may have to transfer him to the emergency department. Listening to Gu Zhongyi's account, Xiao Bufan raised an eyebrow and stepped forward to take the patient's pulse. Upon feeling the pulse at the wrist, he noted it was somewhat heavy and weak, yet there was a subtle, slippery quality beneath. This pulse was exceedingly peculiar. In his previous experiences, he had never encountered such a combination. Given Dr. Gu's description, it was clear that the child was indeed suffering from heat stroke. Yet it was still early in the summer. Generally, children are less susceptible to heat stroke during this period. Moreover, if it were truly heat stroke, gua sha should have been effective. Why then did the patient suddenly begin to convulse? Xiao Bufan found himself deep in thought, carefully assessing the pulse while simultaneously attempting to discern the sounds of internal organs through auscultation. As he focused intently on the pulse, the patient continued to convulse. And Gu Zhongyi, filled with urgency, prepared to speak. However, before he could voice his concerns, Xiao Bufan raised a hand and called out sternly, "Shh! Quiet, everyone! Please remain silent. Otherwise, I will be unable to diagnose the patient." Instantaneously, Gu Zhongyi and Dr. Liu exchanged glances, promptly silencing themselves. The pediatric clinic fell into a hush. The only sound emanating from the convulsing patient, who emitted pained whimpers, clearly in distress. Chapter 15. The Resonance of Sound. Joy in the will. Once the atmosphere was completely tranquil, Xiao Bufan continued to sense the patient's pulse while attentively listening to the rhythmic sounds of the organs within. Thump! Thump! A sound reminiscent of a resonant pulse emerged from the patient's heart, resonating loudly. As the saying goes, when the resonance is loud, the end must be absolute. This resonance indicated a state of heat within the heart. Yet the child's emotional state appeared relatively stable. It seemed that prior to this episode, the child had been in high spirits, which is typical for a child at play. With this realization, a light seemed to dawn on Xiao Bufan, and he murmured to himself, could this possibly be a case of shazheng? It is worth noting that shazheng is a collective term for a variety of conditions, not solely limited to heat stroke. In fact, treatment should not solely rely on superficial symptoms, but rather address the root causes. The root cause lies in the excess heat of the hand-tying and foot yangming meridians. By dispelling this excess heat, the various symptoms would naturally subside. Contemporary Western medicine's understanding of shazheng is limited to skin vessel ruptures and poor blood circulation. In contrast, traditional Chinese medicine holds a profound comprehension of the condition. However, with the passage of time and the decline of modern Chinese medicine, much theoretical knowledge concerning the treatment of shazheng has been lost. What remains are primarily gua sha and bloodletting therapies. With these thoughts in mind, Xiao Bufan promptly touched the patient's forehead to ascertain their temperature. As for the examination of the tongue, he bypassed this step altogether. First, shazheng can affect the blood vessels on the tongue, rendering tongue diagnosis ineffective. Second, his skills in tongue diagnosis were not particularly refined. Thus, Xiao Bufan chose to forego this aspect. After confirming the patient's forehead temperature, Xiao Bufan turned to Gu Zhongyi and suggested, perhaps we should try the method of Shixian bloodletting. It should prove effective. In traditional Chinese acupuncture, bloodletting at the 10 diffusion points serves to clear heat, open the orifices, and awaken the spirit. As such, it is beneficial for symptoms such as high fever, unconsciousness, and sore throat. This method not only facilitates the smooth flow of qi and blood, but also expels internal heat toxins, making it particularly useful in emergencies. The Huangdi Neijing states, the four extremities are where yin and yang converge. This is the great conduit of qi, classified as extra meridian points, known as the 10 diffusion points. Additionally, the Qianjin Yaofeng mentions, when the evil disease calls out loudly, the curses flee. Moxibustion at the tips of the 10 fingers resolves all ailments. Bloodletting at the 10 diffusion points? Gu Zhongyi raised an eyebrow and inquired of Xiao Bufan, are you certain this method will be effective? Xiao Bufan nodded earnestly, asserting this acupuncture and bloodletting technique, like gua sha, possesses strong efficacy for shazheng. There will be no issues. Very well, I shall perform bloodletting at the 10 diffusion points. Nurse Qin, please prepare the silver needles. Gu Zhongyi finally acquiesced, turning to Nurse Qin Zuru. Understood. Nurse Qin nodded and immediately set about gathering several silver needles for sterilization. Once the needles were sanitized, Gu Zhongyi did not allow Xiao Bufan to proceed, perhaps doubting his familiarity with the technique. Instead, He took the patient's wrist in one hand and the silver needle in the other, expertly pricking the tips of the patient's 10 fingers. With a swift motion, the needle pierced through the air. With a swift motion, Gu Zhongyi inserted the needle, gently squeezing it to extract a bead of dark purple blood from the patient's subcutaneous tissue. Xiao Bufan stood by, silently observing Gu Zhongyi as he administered the treatment, conscious that his role was merely to consult. Since Dr. Gu did not wish for him to intervene, he refrained from doing so, not wanting to provoke any displeasure. Before long, after Gu Zhongyi had completed 10 finger pricks on the patient, the convulsions ceased and the feverish temperature began to diminish rapidly. The treatment was effective. A wave of relief washed over Gu Zhongyi, akin to a miraculous escape from death. He understood that had this patient suffered a medical mishap due to his diagnosis, he would bear full responsibility as the attending physician. Such a blunder could lead not only to dismissal from the hospital, but also potential legal repercussions. Thankfully, after the bloodletting procedure, the patient's symptoms began to subside. At this moment, Gu Zhongyi felt fortunate for heeding Dr. Lu's advice to summon Xiao Bufan for consultation. Otherwise, he would have been at a loss as to how to proceed. However, just when Gu Zhongyi thought the ordeal was nearing its conclusion, Xiao Bufan suddenly inquired, "Doctor, Gu, are you not going to prescribe for the patient?" "What? Prescribe?" Gu Zhongyi paused, momentarily taken aback, expressing mild astonishment. "Isn't the bloodletting sufficient? The child's symptoms have alleviated. What further prescriptions are necessary?" Xiao Bufan, hearing this, began to doubt how Gu Zhongyi had attained his position as the attending physician in pediatric traditional Chinese medicine. Surely he could not believe that mere bloodletting sufficed? If that were the case, it was no wonder he remained stagnant in his career, unable to ascend to the role of deputy department head. With such medical acumen, not only would the department not promote him, but even if Xiao Bufan were to assume the deputy position, he would not endorse Gu Zhongyi's advancement. With a sigh, Xiao Bufan addressed Gu Zhongyi. "Do you not realize that bloodletting is merely a stopgap measure? Given the patient's young age, a comprehensive treatment plan is essential for a complete recovery. Do you honestly believe he can be discharged in his current condition? What do you suggest I prescribe for the patient then?" Gu Zhongyi asked, a sheepish smile crossing his face. Xiao Bufan glanced at the patient lying in bed and replied with exasperation, "How about Shima Gugan decoction and Xiabai San? 2 doses, taken morning and evening respectively." The Shima Gugan decoction disperses the pathogenic heat of the Yangming meridian, while Xiabai San clears the pathogenic heat of the Tai meridian. Together, they can effectively neutralize the toxins of both meridians, achieving the desired therapeutic effect. Upon hearing this, Gu Zhongyi nodded vigorously. "Understood. I will prescribe the medication immediately." He proceeded to write the prescription and instructed the pharmacy to expedite the order. Xiao Bufan, shaking his head in disbelief, left the pediatric outpatient department and returned to his own duties. Chapter 16. Advanced Pulse Diagnosis. After Xiao Bufan departed, Gu Zhongyi exchanged glances with Lu Zichuan, murmuring, "Did you notice how different Dr. Xiao seems now?" When he spoke of prescribing for the patient, his gaze was remarkably sharp. "Indeed, I sensed it too. Doctor, Xiao seems transformed, almost akin to when Director Wang conducts rounds. It's somewhat intimidating. It seems we are truly aging." Lu Zichuan concurred, nodding in agreement. Gu Zhongyi, who had crossed the threshold of 40, sighed deeply before relaying medical instructions to the patient's family. Meanwhile, upon returning to his consultation room, Xiao Bufan found it still empty, with no new patients having arrived. It became evident that within a secondary hospital, practitioners of traditional Chinese medicine were not particularly favored by patients. Moreover, Xiao Bufan's youthful appearance likely deterred potential patients from seeking his care. As the day passed, Xiao Bufan attended to fewer than 6 patients, spending the majority of his time idly in the consultation room. In the afternoon, as the clock approached 6:30, Xiao Bufan checked the time, removed his white coat, and prepared to leave for the day. The standard working hours at the hospital were 8 to 6, with occasional evening shifts. However, today was not one of those evenings for Xiao Bufan, and he drove his modest vehicle home. Dinner was a simple affair, easily prepared with the meat and vegetables he had harvested from his modest garden, a testament to the ease of living in the suburban outskirts of the city. The night passed without incident. The following day, Wednesday, dawned bright and clear, the weather inviting for an excursion. Yet, Xiao Bufan had to report to the hospital, with any leisure travel postponed until a later holiday. Upon waking and completing his morning routine, Xiao Bufan called out to the system, register my attendance. His anticipation for the traditional Chinese medicine attendance system had grown, as each day's registration felt akin to a lottery, igniting his adrenaline. Beep, attendance successful. Congratulations, host. You have received advanced pulse diagnosis. Advanced pulse diagnosis? Xiao Bufan exclaimed, astonished. He had expected a different reward for today's attendance, not the advanced pulse diagnosis. It was noteworthy that despite his extensive studies in traditional Chinese internal medicine and years of practice, the system had only previously rated his pulse diagnosis at an intermediate level. Now, it had elevated his skill to an advanced tier, saving him a decade of clinical experience. As pulse diagnosis is a crucial component of the 4 diagnostic methods in traditional Chinese medicine, its significance cannot be overstated. The practice of pulse diagnosis has origins as ancient as traditional Chinese medicine itself, with historical texts attributing its foundations to the legendary physician Bien Quebec. However, in reality, the Huangdi Neijing has long documented that the pulse exhibits changes that can indicate the rapid onset of illness. When the 7 perturbations arise, the pulse slows while the illness prevails. Presently, individuals suffering from severe ailments experience erratic energy fluctuations, leading to variations in their condition. The essential discussions within the Huangdi Neijing regarding pulse diagnosis encompass the intricacies of pulse locations and methodologies. Thus, from any perspective, the enhancement of pulse diagnosis is an invaluable asset for a practitioner of traditional Chinese medicine. The elevation of one's pulse diagnosis skills is undeniably comparable to the personal guidance of a master physician. As Xiao Bufan organized the pulse diagnosis knowledge he had acquired, he arrived at the hospital just shy of 8:20, nearly late for work. Typically, the hospital requires staff to clock in by 8:30, and tardiness could result in a deduction from the attendance bonus. Xiao Bufan hurriedly checked in and promptly donned his white coat, ready to commence his duties. Just as he settled into the outpatient room, a gentleman in his 50s entered, holding a registration slip. He greeted Xiao Bufan softly, saying, "Hello, doctor. I'm here for consultation. Please come in." Xiao Bufan replied with a warm smile. "Thank you, doctor. I appreciate your assistance." The gentleman, limping slightly, entered with an awkward gait and displayed noticeable facial edema. Xiao Bufan kindly accepted the registration slip and medical record. Noting the details, name, Dingda, age, 53, registration, traditional Chinese medicine outpatient, other information, accompanied medical record. Dingda? What a distinctive name. Xiao Bufan chuckled, flipping through the medical record. It revealed, patient, Dingda, age 53, Western medical diagnosis indicates rapid heartbeat with pleural effusion, cause yet undetermined. Suspected narrowing of the vessels near the heart, recommended cardiac angiography for further examination. Observing the record, Xiao Bufan inquired with a smile. "The Western doctors suggested you undergo cardiac angiography. Why haven't you proceeded with it? The examination could clarify the specific cause of your ailment." Dingda lowered his head, slightly embarrassed, and replied, "It's too expensive. I can't afford that examination. The doctors in the emergency department told me that the cardiac angiography alone costs over 5,000, and there's no insurance reimbursement. I simply don't have that much to spend on medical care." At this point, Dingda appeared increasingly reserved. Clearly, even 5,000 yuan represented a substantial financial burden for him. Chapter 17. Good medicine is not expensive. It is widely acknowledged that the exorbitant costs associated with Western medicine have yet to find an effective resolution. The power of capital is overwhelming, compelling many to bow to its influence, thus perpetuating the high prices of Western pharmaceuticals and equipment. In plain terms, it all boils down to finances. For ordinary individuals facing complex ailments or serious diseases, the costs can be crippling, often leaving them in financial ruin without assurance of a cure. Dingda's family situation is precarious. He has 2 sons who remain unmarried, and his wife has been bedridden for years. At 53, he still toils at the construction site to support his family. Hence, the 5,000 yuan for the examination is utterly unaffordable for him. Xiao Bufan, understanding the high costs of Western medical care, refrained from further comment, simply saying, "Please extend your hand. Let me take your pulse first." Okay, thank you, doctor." Dingda replied, hesitantly extending his frayed, swollen wrist. Xiao Bufan smiled as he assessed the pulse, quickly noting its weak quality and the presence of a tense, unresolved rhythm. The weak and heavy pulse indicated a deficiency in the vital energy and blood. Raising an eyebrow, he instructed, "Open your mouth. Let me see your tongue." Ding doat kemploid, revealing a bright red tongue with a thin coating and some petechiae at the root. Additionally, Xiao Bufan could distinctly hear a faint sound resonating within the heart pulse. Is there an issue with the heart? Or could it be a cardiovascular concern? Fortunately, Xiao Bufan had reached an advanced level of pulse diagnosis, allowing him to ascertain that Ding De likely faced cardiovascular problems. Despite the visible edema on his face, Xiao Bufan could discern the signs of exhaustion from Ding De's prolonged physical labor. The relentless cycle of manual work day in and day out can easily lead to internal injuries and susceptibility to external pathogens. Coupled with Ding De's age, it is no surprise that his condition has manifested. Thus, the Western medical diagnosis was not incorrect. It was merely that Ding De had not pursued further examinations to confirm his condition. Generally, such cardiovascular issues necessitate surgical intervention, which can be exorbitantly expensive, posing a financial challenge for many patients. Contemplating this, Xiao Bufan advised Ding De, "You must avoid excessive labor. I will prescribe some medication to alleviate the pleural effusion and reduce swelling, followed by a formulation to regulate your heart pulse. You may take it for half a month and see how it goes." As he spoke, Xiao Bufan began typing on the computer keyboard to prescribe the necessary medications. With the advancement of modern technology, most physicians now utilize computers to print prescriptions. The act of handwriting prescriptions is reserved for rare circumstances, such as power outages or exceptional situations. Xiao Bufan first prescribed some diuretics to eliminate the pleural fluid, followed by a formula focusing on heart protection and pulse nourishment. The ingredients included by Zhu, Chaihu, Huangqin, Guoluo Pai, and Fa Banxia. Observing Ding De's complexion, he added a dose of Dan Shun. After completing the prescription, he handed it to Ding De with a reassuring smile, saying, "These herbs should be simmered for an hour and taken 3 times daily. Once the swelling subsides, please return for a follow-up." "Doctor, are these medications expensive?" Ding De asked with a hint of concern as he took the prescription. "If they're too costly, I'll have to forego them." Xiao Bufan waved his hand dismissively, smiling. "These medications are not expensive. Just go and get them. It should not exceed 800 yuan. Due to his consideration for Ding De's financial situation, Xiao Bufan selected relatively inexpensive medicinal herbs. His objective was to effectively combine these ingredients to achieve the goal of healing. What? Is it really that cheap? Upon hearing that the cost would not exceed 800 yuan, Ding De couldn't help but breathe a sigh of relief, repeatedly expressing his gratitude to Xiao Bufan. "Thank you. Doctor, I truly appreciate it." Xiao Bufan waved his hand with a smile, saying, "No need to thank me. Please proceed to the registration desk to settle the payment, and then collect your medicine from the herbal pharmacy." Afterward, Ding De took the prescription and payment slip and exited the consultation room. In contrast to the exorbitant treatment plans often exceeding 10,000 yuan proposed by Western medicine, Ding De felt that the cost of this traditional Chinese medicine was quite reasonable. As long as it did not surpass 1,000 yuan and could effectively cure his ailment, he believed he could manage it. In reality, many of the herbs used in traditional Chinese medicine are not particularly expensive. Rather, it is the prescription and various additional fees from the hospital that inflate the costs. When Ding De completed his payment and received the medicine, he realized that this herbal treatment, costing less than 800 yuan, was indeed a great bargain. With several bags of herbs in hand, it appeared to be in abundance. However, he wondered how long it would take to consume all this medicine. Half a month, perhaps? Glancing down at the doctor's orders written by Xiao Bufan, he left the hospital feeling quite satisfied. Unbeknownst to Xiao Bufan, Ding De was measuring the value of his medical expenses based on the quantity of herbs. If he had been aware of this perspective, he would have been both amused and bewildered. Just then, shortly after bidding farewell to Ding De, a tall young nurse in a white coat approached him, holding a cup of milk tea with a bright smile. "Dr. Xiao, would you like some milk tea?" "Ming de." Xiao Bufan was momentarily taken aback, then looked up and smiled. "Are you sneaking out for milk tea during work hours instead of attending to patients? Aren't you afraid the director will dock your bonus?" The young nurse, Su Xiaoli, was merely 23 years old and worked as a ward nurse in the Department of Traditional Chinese Medicine. Although her appearance may not be classified as stunning, she was certainly attractive, especially in her nurse's uniform, which would resonate with most men. Chapter 18. You wouldn't want that, would you? Inside the consultation room, Su Xiaoli placed the milk tea before Xiao Bufan and took a sip from her own cup, laughing as she said, I merely stepped out to buy some milk tea. What is there to fear? Besides, Dr. Xiao, you know as well as I do that our department has such a low patient flow. The few patients we have are practically withering from boredom. Even if Director Wang sees me idling, he won't have much to say. Su Xiaoli nonchalantly enjoyed her milk tea, seemingly unperturbed by the prospect of being caught slacking off by Director Wang. Xiao Bufan understood that the inpatient department of traditional Chinese medicine indeed had very few patients, as there were not many who sought treatment there in the first place. Consequently, the bonuses for the medical staff were meager, likely just enough for a day or two's worth of meals. Well, if you're not worried about Director Wang, then I have nothing further to say. And thank you for the milk tea. Xiao Bufan chuckled, reaching for the cup on his desk and taking a sip. Ah, original flavor. Quite delightful. After savoring a sip, Xiao Bufan encouraged Su Xiaoli. Even though we have few patients in our ward, you should still adopt a more diligent work ethic. Otherwise, it will be challenging for you to rise to the position of charge nurse, which will be detrimental to your future career. Who says I'm not working hard? I've already wrapped up all the tasks related to the inpatients. Otherwise, I wouldn't have ventured out for milk tea. Su Xiaoli rolled her eyes and pouted, clearly unimpressed. Just then, Nurse Supervisor Qin Ziru came over and called out to Su Xiaoli. Su Xiaoli, why are you still here sipping milk tea? Don't you know that the patient in bed 13 is looking for you to change their dressing? Hurry up. All right, I'm on it. Su Xiaoli pouted slightly, stamped her foot, and dashed off towards the inpatient department upstairs. Watching Su Xiaoli rush off, Xiao Bufan couldn't help but chuckle and shake his head. Turning to Nurse Supervisor Qin Ziru, he inquired, Sister Qin, how is the patient from yesterday that Dr. Gu treated? Have they been discharged? Yes, they've been discharged. Qin Ziru nodded with a smile. The young patient was discharged in the afternoon after taking the prescription you provided. Dr. Gu and the others were all praising your medical skills, saying you surpassed them. They were just joking. My skills are rather ordinary. Xiao Bufan replied humbly with a smile. As long as the patient is well, that's what matters. Now, Sister Qin, please go about your duties. I won't keep you from your work. All right, I'll get back to it. Qin Ziru waved goodbye with a smile and returned to her busy schedule. As a head nurse, Qin Ziru's work was often hectic, as she was responsible for coordinating all tasks related to the nursing staff. Moreover, if patients felt dissatisfied with the nurses, they would often demand to speak with the head nurse for an explanation. This made the role of head nurse both challenging and labor-intensive, prone to causing dissatisfaction. Nevertheless, Qin Ziru had been in this position for 5 or 6 years and had garnered considerable approval for patients. Gulping down a few more sips of his original flavor milk tea, Xiao Bufan sat in his consultation room, waiting for patients to arrive. However, the entire department of traditional Chinese medicine was eerily quiet, and his consultation room was no exception. Although the sign on his consultation room indicated it was for traditional internal medicine, many patients perceived it as inferior to Western internal medicine. Thus, compared to the bustling flow of patients in the Western internal medicine department, the traditional Chinese medicine consultation room was dismally empty. Just as Xiao Bufan was feeling a bit bored, a young man knocked on the door of the consultation room, hesitated for a moment, then steeled himself to enter. Hello, doctor. Could you please take a look at me? The young man nervously greeted Xiao Bufan and took a seat. Seeing a patient had arrived made Xiao Bufan instantly alert, and he smiled, asking, Hello, what seems to be the problem? The young man lowered his head and, after a long pause, stammered, Doctor, actually I don't feel unwell, but I've been experiencing a stinging sensation when I urinate. He spoke the words with evident embarrassment, as if wishing to vanish into the ground. A stinging sensation while urinating? Xiao Bufan was momentarily taken aback before quickly processing the information. After all, men do care about their dignity to some extent, especially concerning certain issues. A man's pride seems to take precedence over his health. This is a source of frustration for many doctors. With this thought in mind, Xiao Bufan could not help but smile at the young man before him and said, Do not be overly anxious. A urinary tract infection is quite a common ailment, and there is no need for embarrassment. Moreover, it is not difficult to treat, as long as you do not shy away from seeking medical help. Upon hearing Xiao Bufan's reassuring words, the young man's mood visibly lightened, and he nodded in response, saying, I understand, doctor. Please help me. Let me take your pulse first. Xiao Bufan replied, gently placing his hand on the young man's wrist. As he assessed the pulse, he inquired, "Do you have a girlfriend? You appear to be only a few years younger than I am." Glancing at the registration slip on his desk, he continued with a smile, 23? Then you should call me brother. Your name is Zhang Ziang, right? That is quite a nice name. Do you have a girlfriend? Not yet, Zhang Ziang admitted, lowering his head in embarrassment. No girlfriend? How do you usually address that aspect of your life? You wouldn't be seeking solutions outside, would you? A knowing smile appeared on Xiao Bufan's face as he continued to question. Zhang Zhang froze momentarily, his face turning crimson with embarrassment as he awkwardly chuckled. No, I haven't done anything like that, doctor. I'm not familiar with what you are implying. Are you certain you haven't? Xiao Bufan pressed, a playful glint in his eyes. You must be honest with me. I am a doctor, not a policeman. Xiao Bufan chuckled, as if he could see right through Zhang Ziang's thoughts, and added, If you do not tell me the truth, I might not be able to treat your condition. Surely, you do not wish for that aspect of your life to be compromised in the future? This remark left Zhang Zhang momentarily stunned, his face paling at the implication. The thought of such a fate was indeed terrifying. Any normal man would find such a statement alarming, wouldn't they? After a long pause, Zhang Ziang sighed and opted for honesty. All right, I confess I did conceal some details from you. About half a month ago, I did go to a nightclub with some friends, but it was just that once. I can't be that unlucky, can I? Did you take any precautions during that time? Xiao Bufan asked, a subtle smile playing on his lips, as if he had anticipated this scenario. Zhang Ziang hung his head in silence. Though it was merely one occasion, it was still his first. What man would think to wear protection during such a moment? After all, one misstep could lead to lifelong regret. Zhang Ziang now regretted his choices, but it was too late. After a long pause, he finally admitted, Dr. Xiao, you are right. I was overly excited, and since it was my first time, I did not take any precautions. Xiao Bufan appeared unfazed by Zhang Ziang's confession. Based on the young man's demeanor and story, it was evident that he had contracted a urinary tract infection. Let me take your pulse now, he said with a smile, placing his hand on Zhang Ziang's wrist once more. Urinary tract infections are among the most common bacterial infections, affecting both men and women. Even everyday life, such ailments are quite prevalent. Some patients with mild infections can recover on their own. In terms of internal medicine, urinary tract infections indeed fall under its purview. While Western medicine often relies on blood and urine tests to diagnose such infections, traditional Chinese medicine can determine the issue simply by examining the pulse and tongue. Xiao Bufan, with his clinical experience, felt the young man's pulse, which was weak and thin, indicating inflammation within. Upon examining his tongue, he noticed a moist surface with slight fissures. This confirmed that Zhang Zhang was indeed suffering from a urinary tract infection, likely due to a deficiency in yang energy combined with bladder heat and toxins. Pondering for a moment, Xiao Bufan inquired, Do you experience any lower back pain or sensitivity to cold? A little, I guess, Zhang Ziang replied uncertainly. Xiao Bufan smiled and nodded. You are experiencing damp heat in the lower body, with a deficiency of yang energy and accompanying bladder heat and toxins. I will prescribe a remedy that should resolve this within a week. As he spoke, he began typing on the computer to generate a prescription. It is worth noting that Western medicine often resorts to heavy doses of antibiotics for urinary tract infections, which can yield significant results in the early stages. However, excessive and repeated use of antibiotics may lead to relapses and diminished effectiveness. From a pharmacological perspective, the bitter and cold nature of these antibiotics can harm the body's yang energy. Thus, for patients with complex urinary tract infections, traditional Chinese medicine can offer effective and more appropriate treatments. Shortly thereafter, Xiao Bufan printed out the prescription. Since the patient was experiencing a deficiency of yang energy and damp heat in the lower body, the treatment should not solely rely on bitter and cold medicines. A balanced approach of supporting the body while expelling toxins is necessary for a complete recovery. The prescription Xiao Bufan provided with a formula of koic seed, aconite, and herba potrinii derived from the essentials of the golden cabinet. The ingredients included 30 g koic seed, 15 g aconite, 30 g herba potrinii, 30 g Hediotis diffusa, and 15 g licorice. This mixture should be boiled in water with a course of 6 doses. If the symptoms are severe, an additional 10 doses may be required until the condition fully resolves. The aconite in the formula helps to bolster yang energy, while herba petrinii offers detoxifying and blood-activating properties. Koix seed aids in clearing heat and dampness. The combination of these three ingredients acts to treat the deficiency of yang while expelling heat and pus. Once Xiao Bufan confirmed that the prescription was correct, he handed it to Zhang Ziang with a smile, advising, "Take this prescription to the pharmacy to pay and collect your medicine. Take 1 dose per day for the first 6 doses and see how you feel. Also, avoid spicy foods. Recently, the weather has begun to warm up, and it is advisable not to wear overly tight clothing and to frequently change and wash garments to avoid oiliness." Zhang Zhang, feeling somewhat embarrassed by Xiao Bufan's admonitions, hurriedly took the prescription and dashed out of the consultation room. With a loud bang, he hurriedly exited, seemingly anxious to avoid being seen by anyone. Observing this, Xiao Bufan couldn't help but chuckle softly and shake his head before continuing to await the next patient. In the morning, there were still a few patients visiting the traditional Chinese medicine department, as some ailments could not be effectively treated by Western medicine. Moreover, there exists a certain group of patients who unwaveringly believe in the efficacy of traditional Chinese therapies. Within the traditional Chinese medicine outpatient clinic, during a lull without patients, Xiao Bufan took the opportunity to tidy up his desk. At that moment, a demure-looking girl resembling a student suddenly appeared at the entrance of his consultation room and timidly inquired, "Doctor, may I ask if you handle gynecological issues here? Are you here for gynecology?" Xiao Bufan was momentarily taken aback, puzzled as to how she had ended up in his consultation room. Had she perhaps registered for the wrong department? It was known that gynecology in the traditional Chinese medicine department was overseen by Dr. Lu Zichuan, the chief physician of Chinese gynecology. However, considering his own competence in gynecology, Xiao Bufan smiled and nodded. "You wish to see a gynecologist, correct? Please, come and take a seat. I will first check your pulse. Kindly hand me your registration slip." "Oh, okay." The young girl nodded shyly and stepped forward to present her registration slip. Name, Chun Yingying. Age, 19. Registration, traditional Chinese medicine outpatient. Additional information, none. Xiao Bufan smiled as he glanced at the slip, realizing she had indeed registered for the wrong department. No wonder she had asked if gynecology was offered here. Smiling, he addressed the girl. "Your name is Chun Yingying, correct? Only 19 years old? You must still be studying?" "Yes, I'm still in school," Chun Yingying replied. Her head lowered as she nervously fiddled with the hem of her clothing. "All right, extend your hand. Let me check your pulse," he instructed, gently placing his hand on her wrist. "Now, tell me, what discomfort are you experiencing?" After a moment of contemplation, Chun Yingying softly replied, "Lately, I have been feeling some abdominal pain, and my period is over half a month late. I'm a bit scared. Doctor, could it be that I'm pregnant?" "Pregnant?" Xiao Bufan raised an eyebrow, perplexed as to why she would come to see a traditional Chinese doctor for a matter that could be confirmed through a pregnancy test. He noted her pulse showed signs of stagnation and a slight slippery quality. Could it be true? A slippery pulse is often indicative of pregnancy. However, the presence of stagnation suggested a deficiency of blood. With a furrowed brow, Xiao Bufan inquired, "Since you suspect you might be pregnant, I assume you have a boyfriend? When was your last intimate encounter?" Blushing, Chun Yingying hesitated before answering, "I can't recall the exact date, as I was drunk that night. Besides the abdominal pain, I occasionally feel a heaviness in my lower abdomen." Heaviness in the lower abdomen? Xiao Bufan felt a sinking sensation in his stomach. Considering her pulse, it was highly likely she was experiencing an ectopic pregnancy, which is indeed a troubling sign. Do young people nowadays not cherish themselves? Xiao Bufan thought with a hint of exasperation as he sighed. "Based on your pulse and symptoms, I suspect you may have an ectopic pregnancy. So I recommend you undergo an ultrasound." "Ectopic pregnancy?" Chun Yingying was taken aback. Terror etched across her face. "Doctor, if it is indeed an ectopic pregnancy, will I need surgery? Is the cost going to be exorbitant?" At that moment, Chun Yingying's concern was not for her health, but rather the potential expenses. As a student, she feared she could not afford treatment, let alone surgery, and she dreaded the thought of confiding in her parents, fearing severe repercussions. Feeling overwhelmed, she bowed her head and began to cry. "Doctor, how could this happen to me? I haven't done anything wrong." Her tears flowed uncontrollably, amplifying her fears. Xiao Bufan, taken aback by her sudden outburst, quickly reassured her, "We haven't confirmed it's an ectopic pregnancy yet. Go for an ultrasound first. What if it isn't? Moreover, even if it is, We can also explore Chinese medicine options to address this condition without surgery. The costs shouldn't be too burdensome. Upon hearing Xiao Bufan's words, Chen Yingying ceased her tears, as if grasping a lifeline, and earnestly asked, "Doctor, is that true? Can traditional Chinese medicine resolve my issue without surgery?" "Certainly. As a physician, I would never deceive you," Xiao Bufan assured her earnestly. While Western medicine primarily advocates for surgical intervention in ectopic pregnancies, traditional Chinese medicine views it as a condition related to blood stasis and pain due to blockage. If one can invigorate the blood and resolve the stasis, it is entirely feasible to manage an ectopic pregnancy without the need for surgery. However, it must be noted that even traditional Chinese medicine cannot transform an ectopic pregnancy into a normal one. Such a feat is beyond the realm of medical science. Nonetheless, it is essential to recognize that for typical practitioners of traditional Chinese gynecology, curing an ectopic pregnancy solely through herbal prescriptions is not a straightforward endeavor. This is not to say that traditional Chinese medicine is ineffective, but rather that most practitioners in gynecology lack extensive clinical experience in differential diagnosis. If a physician cannot conduct a thorough clinical assessment, they naturally cannot identify appropriate treatment methods. Fortunately, Xiao Bufan has already mastered the art of gynecological practice in traditional Chinese medicine. Therefore, once it is confirmed that Chen Yingying is indeed experiencing an ectopic pregnancy, he can prescribe medication for her treatment without the need for surgical intervention. Subsequently, with a smile, Xiao Bufan handed Chen Yingying an ultrasound requisition and said, "Take this for your ultrasound examination. Once the results are out, return to see me." "Okay." Chen Yingying wiped the tears from the corners of her eyes, nodded, and then proceeded to undergo the ultrasound. Thankfully, the examination was not overly expensive, so she did not feel anxious. After settling the fees at the registration desk, she arrived at the ultrasound room for her checkup. The ultrasound process in the traditional Chinese medicine department was swift, as they had independent examination rooms, unlike the crowded facilities in the Western medicine department. Chapter 21, Diagnosis and Prescription. Dingling. Just after Chen Yingying left the outpatient department, Xiao Bufan's phone suddenly rang. It was a call from Director Fong of the emergency department. Glancing at the caller ID, Xiao Bufan quickly pressed the answer button and greeted with a smile. "Good morning. Director Fong, what brings you to call me this time?" "Hello, Dr. Xiao, good morning." Fong Yunpeng's voice resonated through the phone, carrying a cheerful tone. "I called to inform you that the patient you sent to our emergency department 2 days ago is almost ready to be discharged. He mentioned wanting to personally thank you. So I shared your contact details with him. Although it may seem trivial, I thought it necessary to let you know, so you wouldn't be caught off guard when he comes looking for you." Upon hearing this, Xiao Bufan understood the situation and chuckled. "Director Fong, you took the time to call just for this? All right, I appreciate the heads up." Although Fong Yunpeng's reminder concerned a minor matter for Xiao Bufan, who had recently taken on the role of attending physician, it held significant weight. A patient expressing gratitude in person was akin to receiving recognition from the hospital. Such acknowledgement not only reflected the physician's remarkable skills, but also highlighted their commendable ethics, earning them the patient's respect. After a brief conversation with Director Fong, Chen Yingying returned to Xiao Bufan's outpatient room, her face etched with worry, having just completed her ultrasound examination. Noticing her entrance, Xiao Bufan ended the call with a smile and inquired, "So, how did the ultrasound go? Please show me the results." In silence, Chen Yingying handed over the ultrasound report, appearing as if she had already gleaned the findings from the examining physician. In fact, that was indeed the case. Typically, during hospital examinations, the responsible physician provides a preliminary assessment before the patient consults with the attending doctor for further diagnosis. During her ultrasound, Chen Yingying had already learned from the technician that the results pointed to an ectopic pregnancy. Xiao Bufan focused on the report rather than Chen Yingying's expression. The ultrasound findings clearly stated: 1. No gestational sac detected within the uterine cavity, an abnormal hypoechoic area adjacent to the uterus, with embryonic structures and primitive heart motion noted. 2. A pseudo-pregnancy sac formed by desigilization and blood is observed within the uterus. 3. One side of the adnexa shows unclear boundaries, irregular shape, and uneven echogenicity, with gestational structures visible in the fallopian tube, alongside a fluid dark area in the pelvis. The ultrasound indicated a strong suspicion of early ectopic pregnancy. Fortunately, It was detected early, which should facilitate treatment. Xiao Bufan laid the report aside and said to Chen Yingying with a reassuring smile, "Your condition is undoubtedly confirmed as an ectopic pregnancy, but the timely discovery means you need not worry excessively. If you find it challenging to afford surgical costs, I can prescribe a course of traditional herbal medicine for drainage. However, be prepared for a longer recovery period with herbal treatment." Upon hearing this, Chen Yingying, who had been lost in silence, suddenly brightened up and asked, "Dr. Xiao, the cost of this herbal treatment should not be too high, right?" "Indeed. The cost for 2 courses of herbal medicine will likely amount to around 2 or 300 yuan, Xiao Bufan replied with a light chuckle. "However, after the herbal drainage, you will need additional remedies to replenish your health. Otherwise, your body may not withstand it." Altogether, he estimated that the total cost would be around 7 to 800 yuan. Considering the treatment expense would not exceed 800 yuan. A glimmer of joy appeared on Chen Yingying's face as she nodded eagerly. "All right, I will follow Dr. Zhao's guidance. Please prescribe the medication for me." "Very well. I shall prepare the prescription for you," Xiao Bufan replied, while emphasizing, "However, after a couple of days, once the herbal treatment is completed, you will need to return for a follow-up consultation. Understood?" He continued to remind her, "If everything goes well during the follow-up, you can take some tonics to enhance your vitality. It won't be a problem, so there's no need for undue concern." "Yes, I understand. Thank you, Dr. Xiao." Chen Yingying felt as if a tremendous weight had been lifted off her shoulders, her youthful radiance returning to her face. Xiao Bufan smiled without further comment, swiftly typing on the computer keyboard to finalize the prescription. The concoction included Dan Shun, Qi Xiao, Tao Run, San Lung, and Yi Zhu, known for their properties to invigorate blood circulation, eliminate stagnation, and expel the embryo. Additionally, he included some tonics to nourish qi and blood. With a warm smile, Xiao Bufan handed the prescription and registration slip to Chen Yingying, gently instructing, "Now, take this prescription to the registration desk to pay, and then proceed to the herbal pharmacy to collect your medicine." As a young practitioner of traditional Chinese medicine, Xiao Bufan recognized that healing a patient's ailments was not solely about addressing physical symptoms. It also required fostering trust and understanding to heal the patient's psyche. Only then could one truly be considered a good physician. After all, if this young woman were to lose hope, what significance would it hold if he cured her physical condition? If her life were lost, would a successful treatment still bear any value? "Thank you, Dr. Xiao. I am truly grateful." Chen Yingying nodded with delight, then took the prescription and hurried towards the registration desk. Alas, today's young ladies are so easily deceived, often encountering unworthy individuals. Watching Chen Yingying's departing figure, Xiao Bufan couldn't help but shake his head in resignation and sigh, pondering why he remained single. Is it only the young girls who are gullible? Those older girls seem so astute and exceedingly selective. They're quite difficult to please. Chapter 22. Drink less iced milk tea noon. After having lunch in the hospital cafeteria, Xiao Bufan reclined in his consultation room for a brief rest. Fortunately, the hospital's afternoon schedule is rather reasonable, allowing several hours for doctors to dine and repose. Otherwise, the day's work would surely be exhausting. Although Xiao Bufan had seen only a handful of patients that morning, it did not hinder his need for rest. Knock, knock, knock. Just as Xiao Bufan had settled in for his nap, Su Xiaoli unexpectedly knocked on the door of the consultation room, entering with 2 cups of milk tea and a bright smile. "Oh, Dr. Xiao, are you napping? Would you like some milk tea?" Su Xiaoli cheerfully approached him, shaking the cups in her hands. Rubbing his eyes, Xiao Bufan sat up, looking at Su Xiaoli with mild annoyance. "I must ask, why are you out buying milk tea during the afternoon instead of resting? If you want to drink milk tea, why come here? Can't a person enjoy a peaceful nap?" I merely brought you some milk tea. Would you like to have a sip?" Su Xiaoli seemed unfazed by Xiao Bufan's attitude, maintaining her cheerful demeanor as she offered him the drink. "I truly appreciate your gesture." Xiao Bufan, with a resigned expression, accepted the milk tea from Su Xiaoli and stretched, placing it on his desk. He then turned to Su Xiaoli and inquired, "Isn't it too hot for you to be out buying milk tea in this sweltering afternoon? Do take care not to suffer from heat stroke, otherwise your milk tea would be in vain." It was well known that the temperature was rising, nearing the peak of summer, with outdoor temperatures exceeding 30 degrees Celsius. To venture outside for milk tea in such heat seemed rather reckless. Hearing Xiao Bufan's concern, Su Xiaoli's face brightened, and she responded with a grin, "It's not that hot. A calm heart brings coolness. Xiao Bufan shook his head in resignation, took a sip of the milk tea, and raised an eyebrow. Is this iced milk tea again? He turned to Su Xiaoli, questioning her. Su Xiaoli smiled and replied, of course. What better to drink on a hot day than something cold? Is it not to your liking? With a swift motion, Xiao Bufan seized the other cup of iced milk tea from Su Xiaoli, glaring at her. Are you not aware of your own condition today? I'll let you have one this morning, but if you drink another this afternoon, will your body withstand it? Su Xiaoli was momentarily taken aback, looking at him in confusion. What is wrong with my body? I feel perfectly fine. If you doubt me, try testing it. Test what? Do you not know your relatives are coming? Xiao Bufan let out a frustrated huff, giving Su Xiaoli another stern look. If they arrive, you cannot keep consuming iced items. Otherwise, you will regret it when the chill takes hold. Su Xiaoli widened her eyes in disbelief. Really? How can my relatives come at this time? By my calculations, it should be several days from now. Xiao Bufan shook his head, chuckling lightly. That is a question only you can answer. How much iced milk tea have you consumed recently? Are you not aware that consuming too many cold items can affect your menstrual cycle? And you are a nurse nonetheless. It is known that excessive consumption of cold food can disrupt the hypothalamic pituitary ovarian axis in women, leading to menstrual irregularities. Therefore, during 1S period, it is advisable to prioritize warm foods. However, Su Xiaoli felt her cheeks flush at Xiao Bufan's words, stamping her foot in defiance. I don't believe that. I simply enjoy iced milk tea. What's wrong with that? Saying this, she lowered her head and snatched the iced milk tea back from Xiao Bufan, then dashed out. Hey, why won't you heed my advice? If you end up with a stomachache, don't say I didn't warn you. Xiao Bufan called after her with a look of exasperation. Without looking back, Su Xiaoli huffed. Humph. Why should you care? You're not my boyfriend. Xiao Bufan watched as Su Xiaoli disregarded his words, shaking his head in resignation, allowing her to follow her own whims. Gulp, gulp. After returning to the inpatient department upstairs, Su Xiaoli took several large sips of her iced milk tea, savoring the refreshing sensation. Oh, this feels wonderful. On a hot day, nothing beats iced milk tea. However, before she could fully relish her delight, a sudden discomfort in her abdomen made her face change. An acute pain alerted her to an impending calamity. Could it be? Is her period truly arriving early? In that moment, she recalled Xiao Bufan's earlier warning, realizing that her menstrual cycle might indeed be approaching. Without a moment to spare, Su Xiaoli rushed to her office, opened the drawer, and retrieved a pack of sanitary pads, hastily making her way to the restroom. Thankfully, she always kept these on hand. Otherwise, she would have been in dire straits, especially wearing a white nurse's uniform. If her pants were to stain, it would be an utter humiliation. Yet, Su Xiaoli still could not fathom how Xiao Bufan could predict her early period. Surely, he could not discern it merely from her iced milk tea consumption, for she had indulged in it before. What Su Xiaoli did not realize was that Xiao Bufan's medical skills had vastly improved, not to mention his mastery of comprehensive traditional Chinese medicine for gynecology, which enabled him to easily perceive Su Xiaoli's condition. His expertise in auscultation further enhanced his diagnostic abilities. In fact, when he first tasted the iced milk tea, he attentively listened to the sounds of her internal organs and detected issues with her gastrointestinal and renal systems. Coupled with her frequent consumption of iced beverages, the cold in her uterus was particularly pronounced. It was through these observations that Xiao Bufan surmised her menstrual cycle was indeed approaching. He certainly would not have snatched the iced milk tea from Su Xiaoli's hands to prevent her from drinking it. Unfortunately, this girl is quite stubborn. Chapter 23. The Patient Flow Doubling Card. In the afternoon, just before the end of the workday, Xiao Bufan removed his white coat and stepped out of the consultation room, only to encounter Su Xiaoli coming down from the inpatient department. However, upon seeing Xiao Bufan, Su Xiaoli could not help but huff at him, saying, "Humph, you annoying brat. Drink your cold water. I will never buy you milk tea again. If you want some, go buy it yourself." After stomping her foot in frustration, she stormed off home. Did I provoke you in any way? Xiao Bufan shrugged, a look of exasperation on his face. Yet, Su Xiaoli seemed oblivious to his words as she swiftly exited the traditional Chinese medicine department. With that, Xiao Bufan decided not to say anything further and drove his old car home. Before returning home, however, he stopped by a nearby market to purchase some fish and meat. Although there was a market in the suburbs, Xiao Bufan preferred not to make an unnecessary trip, so he opted to buy everything at the market close to the hospital. Later that evening, around 7 o'clock, Xiao Bufan returned home and began bustling about in the kitchen. Clanging and chopping, his culinary skills were decent. He first prepared a fish head dish with vermicelli, followed by stir-fried vegetables with chili and meat, sufficient for his solitary meal. The remaining ingredients were naturally stored in the refrigerator for future use. Before long, Xiao Bufan had prepared 3 dishes and began to enjoy his dinner. Suddenly, just as he was eating, his phone rang. He pulled it out to discover it was his father calling. Pressing the answer button, he asked, "Hello, old man. What brings you to call me so late?" How can you speak to your father like that? Can't I call you if there's nothing going on?" Xiao Yuanyang replied with a hint of displeasure. Xiao Bufan chuckled. "I didn't say you couldn't call, just that I'm currently eating. If you have something to discuss, please be quick. If not, don't interrupt my meal." Xiao Yuanyang waved his hand dismissively, quickly stating, all right. The thing is, your aunt called today and said she wants to introduce me to a woman. She wants me to meet her tomorrow, so I thought I'd ask for your opinion." "Your aunt wants to introduce a woman to you?" Xiao Bufan was momentarily taken aback, but then responded, "If it's your aunt introducing someone, then you should go meet her. I have no objections. After all, it has been many years since Mom passed. You should find someone again." Hearing his son's affirmative response, Xiao Yuanyang's mood brightened, and he smiled. "Great. Since you have no objections, I'll go meet her then. Go ahead. Just don't disrupt my dinner." Xiao Bufan replied with a grin before hanging up. Listening to the busy tone on his phone, Xiao Yuanyang lay in his luxurious apartment, a slight smirk appearing on his face as he murmured, "This kid is becoming increasingly disrespectful. I should teach him a lesson one day, or he might forget who his father is." With that, he proceeded to contact the woman his sister was introducing. Unbeknownst to Xiao Bufan, his father was already quite eager. As for him, he displayed an indifferent demeanor towards the matter. After finishing dinner, Xiao Bufan casually washed up and then retired to his room to sleep. Typically, from Monday to Friday, he would retire early after work, not wanting to stay up late and affect his performance the next day. The next morning, Xiao Bufan rose early, had breakfast, and drove his old car to the hospital for work. Another beautiful day had begun. Could he possibly sign in with the system again? Upon arriving at the hospital and clocking in, a faint smile graced his face. As he stepped into his consultation room, he could not help but call out to the system, "System, let me sign in immediately." Ding. Sign in successful. Congratulations, host. You have received a patient flow doubling card with a validity of 24 hours. A patient flow doubling card? What on earth is this? Xiao Bufan's mouth twitched violently, and his smile vanished instantly. He had anticipated receiving some medical skill reward today, yet the sign-in reward turned out to be a patient flow doubling card. What use do I have for this? Staring blankly at the blue card in his hand, he noticed a line of small text inscribed on it. Upon closer inspection, he read, "By using this card, the host can double the number of patients seeking consultations within 24 hours and also gain an opportunity for an external consultation." What? There's even an opportunity for an external consultation? His expression shifted, and he felt a surge of happiness. An external consultation is equivalent to a cross-hospital consultation, and the fees for such services are quite substantial. Even for a resident physician, the fees for a cross-hospital consultation would typically exceed 6 times that of regular outpatient fees. If one were an expert physician, the fees could range from 500 to 5,000 yuan per hour, easily earning over 10,000 yuan for a single consultation. However, securing an external consultation is not so simple. Generally, if a physician lacks reputation or skill, other departments would not consider inviting them for a consultation, as they could typically handle common ailments themselves. Xiao Bufan scrutinized the blue card in his hand, but did not use it immediately. Fortunately, it did not have a usage deadline. He certainly would not use it at this moment, especially since his current medical title was not high enough. It would be wise to wait until he achieved the status of an expert physician. Chapter 24. Traditional Chinese medicine lacks standards despite Xiao Bufan's gynecological skills being at an advanced level, qualifying him as exceptionally skilled in a particular field. All evaluations and recognitions of titles within a hospital must adhere to the standards set by Western medicine. Presently, the entire traditional Chinese medicine market in the country relies on Western medical standards for its regulations, whether concerning traditional practices or herbal medicine. It is precisely for this reason that, on numerous occasions, even when traditional Chinese medicine prescribes the correct remedy for patients, the efficacy of the treatment remains uncertain. The so-called scientific validation and authentication of herbal medicines by Western medicine inadvertently undermine the therapeutic effects derived from the careful combination of traditional Chinese herbal formulas. The rationale is straightforward. Most traditional Chinese herbs possess toxic properties, and only through the meticulous blending of these herbs can their medicinal benefits be realized. However, should one apply modern technological standards to assess the quality of these herbs, the majority would be stripped of their so-called toxicities, leading to a fabricated standard of scientific qualification that ultimately fails to unleash the inherent medicinal properties of traditional Chinese medicine. Consequently, it is often the case that, while the prescriptions from traditional Chinese medicine are sound and the diagnoses accurate, patients find no tangible relief from their ailments. This holds true not only for herbal remedies, but also for the practice of traditional Chinese medicine as a whole. Thus, even if one possesses exceptional skills in traditional Chinese medicine, without a certificate awarded by Western medical standards, their expertise may go unrecognized by the state. This predicament stands as one of the greatest challenges faced by traditional Chinese medicine in its modern evolution: the absence of a self-contained validation system, necessitating adherence to Western medical criteria. Reflecting on these challenges, Xiao Bufan could not help but exhale a resigned sigh, tucking away the patient flow doubling card in his hand. In the morning, the patient flow in the traditional Chinese medicine department remained consistently sparse. Sitting in his clinic, Xiao Bufan felt as though he might wither away from sheer idleness. Should he simply use the patient flow doubling card now? It would save him from sitting idly in contemplation. With a look of exasperation, he absent-mindedly rubbed his nose, nearly succumbing to the urge to activate the recently acquired patient flow doubling card. Suddenly, a patient knocked on the door of the clinic, entering with a registration slip in hand. The newcomer was a young man, appearing quite youthful and possessing a gentle demeanor, yet he also bore a certain robustness. Xiao Bufan smiled at him, noting that the lad was rather handsome, and inquired, "What seems to be troubling you? Please do share." "Doctor, I am afflicted with gout, and I am uncertain whether this ailment can be treated here," the young man replied calmly, extending his hands forth. His phrasing indicated that he had likely consulted numerous doctors before. "Let me examine you first," Xiao Bufan said with a smile, nodding before focusing on the young man's outstretched hands. He observed that all 10 fingers had become deformed, each bending in an unnatural manner, a classic symptom of gout. Gout is a condition characterized by joint pain and swelling due to hyperuricemia, with severe instances causing excruciating pain that can render one incapacitated. After assessing the young man's severely deformed fingers, Xiao Bufan glanced at the registration slip and remarked, "You are He Rongfei, correct? 25 years old? How long have you been experiencing this gout?" "Approximately 4 to 5 years, I believe. It began around the age of 20. He Rongfei replied with a serene smile. "During this period, I've consulted many doctors, both traditional and Western, but nothing has yielded results." In response, Xiao Bufan nodded knowingly. That is quite typical. Western medicine does not have any specific treatment protocols for gout. It can only manage the condition in the long term to reduce the frequency of flare-ups. At this juncture, Xiao Bufan paused and gestured toward the pulse pillow resting on his desk. "Please place your hand here. I will take your pulse." "All right," He Rongfei responded with a smile. Placing his right hand on the pulse pillow, Xiao Bufan proceeded to assess his pulse. It is important to note that gout can manifest in various forms, and the treatment methods will naturally differ based on its underlying causes. After examining the pulse on his right hand, Xiao Bufan also assessed the left. The left hand as pulse corresponds to the heart, liver, and kidneys, while the right hand reflects the lungs, spleen, and vital essence. Thus, examining both hands ensures a more accurate diagnosis. Soon, Xiao Bufan noted that the young man's pulse was somewhat sluggish, with localized warmth in both wrists and significant swelling in the joints. "Now, please open your mouth. Let me see your tongue," Xiao Bufan instructed. He Rongfei promptly complied. Revealing his tongue, Xiao Bufan observed its pale, swollen quality with a thin, white coating. This clearly indicated that the gout was likely due to a deficiency in the yang energy of the spleen and kidneys. The deficiency in yang energy typically arises from a weakened constitution, allowing external pathogens to invade, leading to prolonged illness and damage to the spleen and kidneys. While Western medicine attributes this condition to elevated levels of uric acid in the blood, resulting in uric acid crystals depositing in the joints, it lacks effective treatments for gout. In contrast, traditional Chinese medicine offers various differential diagnoses in its classical texts. Through auscultation, Xiao Bufan confirmed the fluctuations in the spleen and kidney organs. Turning to He Rongfei and asking, "Do you also experience symptoms such as cold extremities, weakness in the lower back and knees, or abdominal distension and loose stools?" "How did you know, doctor?" He Rongfei responded, somewhat astonished. Xiao Bufan smiled gently and replied, "It is simply the result of my diagnosis. Rest assured, your condition is not overly complex to treat. It merely requires some effort. The underlying cause of your ailment is the deficiency of yang energy in the spleen and kidneys, which can be addressed by tonifying the spleen, enriching the kidneys, and dispelling cold." As he spoke, Xiao Bufan contemplated the appropriate prescription for his treatment. Even within traditional Chinese medicine's classical formulas, there are not many documented remedies for gout. Chapter 25. Recognition from the patient. The Jingui Yaolu states, for pain in the limbs and joints with emaciation, swelling of the feet as if they're about to fall off, dizziness, shortness of breath, and a sensation of warmth accompanied by nausea, the Gui Zhishao Yao Jimu decoction is indicated. The Jingui Yuhan Jing further notes, this condition arises from wind, cold, and dampness obstructing the channels and collaterals, leading to symptoms such as dizziness, shortness of breath, and swelling of the feet, with pain in the limbs and joints. In He Rongfei's case, his symptoms primarily included cold extremities and weakness in the lower back and knees, necessitating warming the yang, dispelling cold, and invigorating the spleen to achieve efficacy. With this in mind, Xiao Bufan ultimately decided to prescribe the Fuzi Lizhong decoction. This remedy not only possesses the properties of warming the yang, dispelling cold, and invigorating the spleen, but it also serves to replenish deficiency and restore yang energy while warming the interior and dispersing cold. However, due to the toxic nature of Fuzi, it must be boiled for approximately 3 hours prior to use to eliminate its toxicity. Thus, it is now quite rare for practitioners of traditional Chinese medicine to dare to prescribe such medications. As the saying goes, ginseng bears no guilt for causing death, while aconite, even if it saves a life, does so without merit. Ginseng is non-toxic, hence anyone may use it without fear. Even if complications arise, no blame would fall upon ginseng. However, aconite is toxic. It contains aconitine, which poses significant dangers. Therefore, despite its potential to save lives, few dare to use it. Consequently, even when aconite saves a life, it is deemed unworthy of praise. With a flurry of keystrokes, Xiao Bufan meticulously prepared the prescription before him and earnestly advised He Rongfei, when decocting this medicine, it is imperative to first eliminate the toxicity of aconite. Boil aconite for no less than 3 hours. Then remove it and combine it with the other herbs for an additional half hour of boiling before consumption. Do you understand? Yes, esteemed doctor, I understand. How long should I take this prescription? He Rongfei nodded vigorously, akin to a chick pecking a grain. Xiao Bufan smiled gently. Let's observe the effects for half a month. Return for follow-up then. Understood. Thank you, doctor. He Rongfei beamed as he accepted the prescription and payment slip, promptly rushing off to settle the payment and collect the medicine, observing the patient depart with a radiant smile. Xiao Bufan felt that this was perhaps the greatest honor a physician could receive, healing a patient and instilling hope for life. Is there a more meaningful pursuit than this? With a smile illuminating his face, Xiao Bufan tidied his desk, awaiting the arrival of the next patient. Yet, regardless of whether another patient would come, it mattered little. After all, working in a hospital entails remaining in one's office during shifts, even in the absence of patients, unless summoned by a fellow physician for consultation. However, given Xiao Bufan's current reputation, it was unlikely that any doctor would seek him out for a consultation. As the clock approached 11 in the morning, Xiao Bufan sat in his office, still waiting for a second patient to arrive. With the morning drawing to a close, he could not help but let out a soft sigh, preparing to remove his white coat and conclude his shift. Just then, a man in his 30s, his head wrapped in a post-operative bandage and supported by a middle-aged woman, appeared before Xiao Bufan, brandishing a ceremonial banner. Stunned, Xiao Bufan scrutinized the man, suddenly struck by a sense of familiarity. Realizing who it was, he inquired, "Are you the patient who suffered from internal bleeding?" "Yes, that's me. My name is Fan Shuani, and I have come specifically to express my gratitude to you, Dr. Xiao." The man smiled warmly, stepping forward to thank Xiao Bufan. Thank you immensely, Dr. Xiao. If it weren't for your timely diagnosis of my internal bleeding and the swift transfer to the emergency department, I fear I would not be here today. As he spoke, Fan Shuani presented the ceremonial banner he had brought. It appeared that patients often resorted to this gesture of gratitude towards their doctors. Xiao Bufan gazed in astonishment at the banner, which bore 8 gilded characters proclaiming, "Noble medical ethics, masterful healing. Is this for me?" He stammered, blinking in disbelief at the unexpected honor. Although he had previously received a call from Director Fong, informing him that this patient wished to express gratitude, the reality of the moment still felt surreal. Could this truly be a recognition of his efforts? It is worth noting that no physician in the traditional Chinese medicine department of the 5th Hospital of Shiyuan City had received such a token of appreciation in many years. Xiao Bufan had only recently become an attending physician and was now receiving thanks from patient. Surely, no one would assume that he had staged this event with an accomplice. As Xiao Bufan pondered these thoughts, coincidentally, Director Wang Tiansheng descended from the upper floors and immediately noticed the unfolding scene. Is someone presenting a ceremonial banner to Dr. Xiao? Is this for real? Wang Tiansheng paused in astonishment and approached Xiao Bufan's office. Upon entering, he surveyed the patient with a smile, questioning, "What is this, Dr. Xiao? A patient has come to present you with a banner?" Director Wang, Xiao Bufan greeted with a smile, gesturing toward the patient. "This is the individual I diagnosed with internal bleeding previously. Today, he has come bearing a banner to express his gratitude. How should I proceed with this?" "Proceed?" Wang Tiansheng chuckled. "If the patient sincerely wishes to present you with a banner, then accept it. Do I need to instruct you on how to handle this? Is that appropriate?" Xiao Bufan asked, appearing somewhat embarrassed. Wang Tiansheng rolled his eyes, slightly exasperated. "Enough. Just accept it. This banner signifies the patient's recognition of your medical skills. Do not dally, as if putting on a performance. Then I shall accept it." Xiao Bufan replied with a nod, finally taking the ceremonial banner from Fan Shuani. As Xiao Bufan accepted the banner, Fan Shuani cheerfully produced a large red envelope. Extending it toward him, "Dr. Xiao, please accept this small token of appreciation from me. After all, one cannot solely offer a banner's thanks. It would seem insincere without a little something extra. What do you mean by this? Are you jesting with me?" Xiao Bufan looked at Fan Shuani with disbelief, firmly stating, "Please take back this envelope. I do not accept such things. It feels like an insult to me. Do you understand? Even if you were allowed to accept such gifts." The presence of the department head made it all the more inappropriate. Xiao Bufan felt utterly at a loss for words. Had the relationship between patients and doctors deteriorated to the point where such gestures were now blatantly offered? Could a healthy and respectful environment for medical professionals still be cultivated? Standing nearby, Director Wang's expression turned serious as he addressed Fan Shuani. "I must insist that our hospital does not accept monetary gifts. Please do not tarnish our profession with such practices. If you insist on pursuing this, I may have to ask Dr. Xiao to return the banner to you." Upon hearing this, Fan Shuani was rendered speechless, caught in a dilemma of whether to keep the envelope or retract it, utterly unsure of how to proceed. Xiao Bufan smiled warmly at the other party, waving his hand as he spoke again. "All right, I shall accept this banner, but you may keep the red envelope for yourself. I do not wish to rely on patients' gifts to augment my income." "Understood." Fan Shuani, feeling somewhat awkward, put away the large red envelope, bowed slightly to Xiao Bufan, and expressed his gratitude once more, saying, "Thank you, I must sincerely thank you, Dr. Xiao. Had it not been for your timely intervention, I fear I would never have seen the light of day again." "Oh, you exaggerate." Xiao Bufan quickly waved his hand and replied, "Even if I had not intervened, there are many capable doctors in our department present. You would have been just fine." At this point, Xiao Bufan glanced at Director Wang, who was standing nearby, and continued speaking to Fan Shuani. "Well then, I see it's getting late. You should head back now, and we too must go for lunch. We have work to attend to this afternoon." "Very well. I shall not interrupt your work any further, Dr. Xiao. Farewell." Fan Shuani nodded repeatedly and, with the support of his family, turned to leave. Once the other party had departed, Director Wang smiled and beckoned to Xiao Bufan, saying, "All right, let us go and have our meal." "Indeed." Xiao Bufan responded with a smile and followed Director Wang to the hospital cafeteria. The food in the hospital cafeteria was quite commendable. While it could not compare to a fine dining establishment, it was certainly far superior to an average fast food outlet. At this moment, in the cafeteria, Wang Tianqing took a few bites of his meal before turning to Xiao Bufan with a serious expression, saying, "Dr. Xiao, you will likely encounter many more patients attempting to offer red envelopes in the future. I hope you can maintain your principles as you did today. Do not compromise your ethics for the sake of profit, lest you become a malignancy within our healthcare system." Hearing Director Wang's words, Xiao Bufan smiled slightly and nodded earnestly, saying, "Rest assured, Director Wang, I will not deviate from my principle for the sake of a mere red envelope. A physician's duty is to safeguard lives. I would never jest with my profession, nor would I gamble with the lives of my patients." Although Xiao Bufan was aware that the practice of doctors accepting red envelopes from patients was all too common in hospitals, and that some doctors would even imply or directly request such gifts, he remained steadfast in his resolve. As a traditional Chinese medicine practitioner equipped with a system's golden finger, he was not lacking in financial resources. Even if he were in dire need of money, Xiao Bufan would never betray the principles of a traditional Chinese medicine doctor for such trivial sums. As Sun Simiao once said, "A great physician must possess sincerity. A true healer must calm their spirit and pursue no desires, harboring a heart of great compassion to alleviate the suffering of all beings." While Xiao Bufan was no saint, he cherished the aspiration to become a great physician. After hearing Xiao Bufan's response, Wang Tianqing nodded in satisfaction, saying, "Excellent. Dr. Xiao, it is wonderful that you hold such convictions, and I believe you will uphold them. I too believe in my ability to adhere to these principles. So do not worry about me, Director Wang," Xiao Bufan replied with a chuckle, continuing to enjoy his meal. Thus, Xiao Bufan and Director Wang engaged in light conversation as they savored their lunch, and before long, their meal was concluded. In the afternoon, after a brief rest in the consultation room, as the time approached for work to resume, a patient entered, holding a registration slip, and with a look of distress, pointed to his back, saying, "Doctor, hello. I have developed a boil on my back, and wonder if you could assist me in removing it." We have a patient." Xiao Bufan, who had been resting, instantly regained his alertness. He smiled gently at the patient and said, "Let me examine the boil first." He stood and moved behind the patient, lifting the garment to inspect the large boil on his back. Upon revealing the sight, Xiao Bufan was taken aback. The boil appeared enormous, with the head already suppurating and a milky white pus occasionally seeping from it. "Goodness, my friend, this boil seems rather severe." Xiao Bufan's brow furrowed slightly as he donned a pair of sterile gloves, pressing gently on the boil. The patient gasped in pain, gritting his teeth and saying, "Doctor, could you be a bit gentler? It hurts terribly inside. I can barely endure it. Even with it being suppurated, you still feel pain?" Xiao Bufan's brow furrowed further as he sighed softly, saying, "It appears we will need to drain the pus before administering treatment. Otherwise, this boil will continue to worsen." Upon hearing this, the patient sighed deeply, replying, "Then I must trouble you to drain the pus, doctor. Otherwise, I won't be able to sleep well tonight. And if I can't rest, I won't be able to work." Chapter 27. The iron-willed Xiao Bufan traditional Chinese medicine posits that boils are generally caused by an accumulation of heat and toxins, necessitating treatment to clear heat and detoxify. However, for boils that have already ruptured and are festering, it is imperative to incise the lesion to remove the pus. Otherwise, the condition cannot be cured. Having assessed the large boil on the patient's back, Xiao Bufan prepared to use the silver needling technique to address the malady. The silver needling technique involves inserting a silver needle along the meridians near the boil, followed by rapid puncturing with a triangular needle to draw out blood and pus, thereby facilitating the removal of toxins. This method is commonly utilized in folk remedies for treating boils, hemorrhoids, and abscesses, particularly in rural areas. Moreover, this technique's advantage lies in its minimal incision size, negating the need for anesthetics or surgical procedures, making it both convenient and efficient. Nevertheless, this method can be somewhat unpleasant for physicians, as puncturing the boil with the triangular needle results in a sudden eruption of pus, akin to a fountain. But let us not dwell on that image. Xiao Bufan retrieved a set of silver needles from his office drawer and began sterilizing them, cheerfully informing the patient, "I will first drain the pus from inside, and then I will prescribe some medication for you to apply to the boil. In a few days, it will heal." The acupuncture silver needles are essential tools for any traditional Chinese medicine practitioner, and thus, Xiao Bufan's consultation room was well equipped with them. However, The silver needles in the consultation room were disposable medical-grade needles, not the reusable ones that traditional Chinese medicine doctors typically carry. Thank you, doctor. I truly appreciate your assistance. With a radiant smile, the patient turned to Xiao Bufan and expressed gratitude. No need for thanks. Healing and saving lives is the duty of a physician, he replied modestly. As he spoke, Xiao Bufan had already sterilized the silver needles. He then placed a sterile gauze over the patient's back to shield against any potential splatter of pus from the abscess. All right, I shall begin the acupuncture. If you experience any discomfort, do let me know, he said calmly, picking up the silver needle and gently inserting it into several acupoints near the patient's abscess. With a series of swift motions, he administered 3 needles to the targeted areas. Although his acupuncture skills were not yet refined, they sufficed for addressing this ordinary case of abscess and pus. Remarkably, the patient felt no discomfort during the procedure. Subsequently, Xiao Bufan switched to a triangular needle, which, due to its conical shape, facilitated easier penetration of the skin and enhanced the process of bloodletting. With a decisive thrust, he pierced the apex of the abscess, eliciting a surprising lack of pain from the patient. As the apex was breached, Xiao Bufan, donning sterile gloves, began to apply gentle pressure on either side of the abscess. In an instant, a torrent of pus erupted forth, an event so graphic it was almost beyond description. The scene was enough to make Xiao Bufan feel queasy. It was his first encounter with such a substantial release of pus. Nevertheless, he reminded himself of his role as a traditional Chinese medicine practitioner, suppressing his nausea to continue applying pressure to the patient's back. With each firm push, thick, milky pus gushed forth from the abscess, significantly reducing its size in a matter of moments. When the fluid transitioned to a crimson hue, Xiao Bufan ceased his efforts and promptly disinfected the area with antiseptic solution. The patient winced as the antiseptic made contact, prompting Xiao Bufan to smile gently and reassure him. This is merely the disinfection process. A bit of pain is entirely normal. So bear with it. I understand, doctor. Thank you so much. The patient gritted his teeth in appreciation. Xiao Bufan smiled in response, continuing to apply antiseptic with a cotton swab until the procedure was complete. Once finished, he discarded his gloves into the medical waste bin and cheerfully informed the patient. The pus has been nearly expelled from the abscess. Remember to apply some ointment afterward. As he spoke, Xiao Bufan prepared a prescription for the patient. He opted for Western medicine, as traditional topical treatments were rarely stocked in hospitals. The external medications for reducing swelling, alleviating pain, and combating infection were predominantly Western. Options included ictamol ointment, mupirocin, and erythromycin ointment, among others. The variety of Western antiseptic and anti-inflammatory medications was abundant and affordable, while traditional Chinese external medicines existed, such as certain plasters or powder-based treatments. They were typically only found in small clinics, as major hospitals seldom carried them. This scarcity stemmed from the complexity of preparation and preservation for these remedies. Nonetheless, traditional external treatments were effective for injuries and wounds, rivaling Western options. But the intricate preparation process hindered their acceptance in modern medical institutions. Upon hearing Xiao Bufan's reassurances, the patient touched the abscess on his back and noted a significant reduction in pain. With a beaming expression, he thanked Xiao Bufan. "Thank you, doctor. I truly feel much better." Indeed, as the pus is expelled, the pain naturally dissipates, Xiao Bufan replied, handing over the prescription and gesturing towards the registration area. "Once you've settled the payment and collected your ointment, remember to apply it 3 times daily, and you should recover in a few days." "Understood. Thank you, doctor." The patient smiled gratefully once more before departing. After the patient left, Xiao Bufan glanced at the unsightly puddle of pus on the floor with a resigned expression, knowing he had to overcome his disgust and clean it up. It was essential to maintain cleanliness. Otherwise, it would be quite unpleasant. Once he tidied up the mess, it was nearly time for lunch. Xiao Bufan washed his hands with antiseptic and made his way to the hospital cafeteria. Upon entering, he unexpectedly encountered Su Xiaoli, who had come for lunch as well. "Ugh, you nuisance. Go drink some cold water." Su Xiaoli huffed, stomping her foot as she passed by him, clearly still irked. Xiao Bufan raised an eyebrow in bemusement, silently questioning why she was still upset. Had she perhaps consumed something disagreeable? Or was it that time of the month? Choosing to avoid provoking Su Xiaoli, he sought a solitary table to enjoy his meal, wary of her unpredictable temperament. Just as he settled in, to his surprise, Su Xiaoli placed her meal directly across from him. Taken aback, Xiao Bufan blinked in disbelief before returning to his food. Su Xiaoli shot him an exasperated glare and snapped. "Xiao doctor, what is your deal? Is it so difficult for you to say sorry? Why should I apologize?" He replied, utterly befuddled. What had he done to warrant an apology? It seemed he had done nothing wrong to her at all. As Su Xiaoli observed Xiao Bufan, seemingly oblivious to his mistake, she pouted and exclaimed, "Shouldn't you apologize for what happened yesterday? If it weren't for you, how could I have had an upset stomach during my period?" Xiao Bufan nearly spat out the mouthful of food he had just taken, utterly perplexed by Su Xiaoli's train of thought. "Isn't your period a result of your own indulgence in iced milk tea? What does that have to do with me?" With a bemused expression, he glanced at her and replied, "It seems that your stomach troubles during your period have little to do with me. Did you not consume that iced milk tea yourself?" Su Xiaoli was momentarily taken aback, realizing that the doctor before her might indeed be a quintessential ironclad man. No wonder her previous kindness had gone unnoticed by him. What was she to do? As a young woman, it seemed unseemly to engage in a battle of wits with such a straightforward individual. Although she recognized that she might appear somewhat naive, she had heard enough about ironclad men, especially since her fellow nurses often discussed them. It was said that such men were notoriously difficult to engage with. In Chapter 28, the narrative reveals that the married female nurses at the hospital were far from naive. They were seasoned veterans. Not even an ironclad man could escape their understanding, as they were well acquainted with all male species. Having worked alongside these married nurses, Su Xiaoli had inevitably absorbed some insights, learning that men of this ironclad ilk often lack comprehension of romantic relationships. This realization left her feeling disheartened. It appeared she had been miscommunicating her feelings all along, operating on entirely different wavelengths. Frustrated, she pondered how to proceed. In the face of Xiao Bufan's bluntness, her earlier attempts at expressing concern felt futile, as he seemed utterly unaware of the need to show compassion toward women during their menstrual cycles. At that moment, Xiao Bufan set down his chopsticks and smiled gently at her, saying, "I've finished eating. You can take your time. I need to return for a nap." He then stood up and left the hospital cafeteria without waiting for her response. Su Xiaoli sat there in disbelief, unable to comprehend that he had simply walked away, not even waiting for her to finish her meal. Pouting in annoyance, she muttered under her breath, "What a pest. Fine, I won't speak to you again." However, before she could finish her thought, she felt a familiar pain in her abdomen. "Oh no, not again," she gasped, clutching her stomach in distress. Without another thought for her lunch, she hurriedly rushed to the restroom. Unbeknownst to Xiao Bufan, upon his departure, Su Xiaoli began to experience her discomfort. He returned to his office, blissfully unaware, and settled in for a peaceful afternoon nap. Later that afternoon, after his rest, Xiao Bufan resumed work in his office. Suddenly, his father, Xiao Yuanyang, called again. Glancing at the caller ID, he answered, "What is it this time? Can it wait until after work?" "Well, I met the woman your aunt introduced me to over lunch today. She is quite lovely, and I think we could explore a relationship." "She agrees too," his father replied, seemingly ignoring his son's irritation and chuckling on the other end. Xiao Bufan was momentarily stunned, taking a moment to process the news. "Oh, really? Congratulations. It seems like spring has arrived for the old man," he quipped. "Enough of that. How can you talk to your father like that?" Xiao Yuanyang chuckled, shaking his head. "We'll arrange a meeting when you have time. You should meet her too. And please, try to behave yourself." Xiao Bufan nodded. "You want me to meet her?" "Sure. That works for me." His father continued, "By the way, I forgot to mention, she has a daughter who is 3 years younger than you and currently in college." "What? Are you telling me you got a 2-for-1 deal?" Xiao Bufan exclaimed, his eyes widening in disbelief. "Did your aunt mention this at all?" "Your aunt told me, but I hadn't shared that with you yet," his father replied with a chuckle. "All right then, if you already knew, there's nothing more to discuss. As long as you're not being deceived." Xiao Bufan shrugged nonchalantly. He then noticed a patient waiting outside his office. "All right, I need to go. A patient is here. If there is nothing else, I'll hang up now," he said, quickly ending the call and putting his phone away. Turning to the patient, he asked, "Hello, are you here to see a doctor? If so, please come in." The patient, a chubby young man, hesitated for a moment before entering. Once seated, Xiao Bufan smiled and asked, "Could you please show me your registration slip?" "Oh, right," the young man replied, snapping back to reality as he handed over the slip. Xiao Bufan examined the registration slip, noting the details. Name, Zhang Xiaowei. Gender, male. Age, 28. Department, General Traditional Chinese Medicine. Additional information, none. You are Zhang Xiaowei, correct? Xiao Bufan inquired with a warm smile. Please tell me what seems to be the problem. Zhang Xiaowei bowed his head in silence for a moment before softly responding. Doctor, I've been feeling a persistent pain in my chest lately. I can't pinpoint why. When I lie down, it seems to disappear, but when I get up, the pain intensifies. Chest pain, you say? Disappearing when lying down? Xiao Bufan furrowed his brow, contemplating the situation. Let me check your pulse first. Okay, Zhang Xiaowei nodded, placing his hand on the pulse pillow on the desk. As Xiao Bufan assessed his pulse, he felt a thin, top pulse that was difficult to suppress. He then examined the patient's tongue, noting its pale, thick coating with slight fissures. This appears to be angina, he concluded. Xiao Bufan felt a twinge of uncertainty, so he quieted his mind and listened closely to the patient's heartbeat. Indeed, he discerned an irregularity in the rhythm. The patient exhibited signs of atrial angina, and given their obesity, it was evident that they were more susceptible to such heart conditions, often accompanied by hypertension, hyperglycemia, and hyperlipidemia. With this in mind, he was almost certain of the patient's ailment. Reflecting on it, Xiao Bufan addressed the patient. You are likely experiencing angina pectoris, commonly referred to as coronary heart disease. This condition is characterized primarily by pain behind the sternum, which may radiate to the anterior chest and the left upper limb. Each episode typically lasts around 35 minutes and can occur several times a day or just a few times a week, with symptoms alleviating upon rest or the use of nitroglycerin. Indeed, doctor, you are absolutely correct. When I lie down to rest, the pain subsides, but as soon as I get up to work, it becomes unbearable. Zhang Xiaowei replied, nodding vigorously. At times, the pain feels so intense that I thought I might not survive it. In response, Xiao Bufan chuckled lightly. Fortunately, your condition is not overly severe. I will prescribe some medication for you to take for a few days, and if you notice improvement, you may continue with it. Will this prescription truly be effective, doctor? Zhang Xiaowei asked skeptically, waving his hand slightly. I do not doubt your medical skills, but I have sought treatment multiple times and taken various medications without any improvement. Well, I suggest you try this prescription. If it proves ineffective, you may return to consult me, Xiao Bufan said with a gentle smile. After a moment of contemplation, Zhang Xiaowei nodded. All right then, I will follow your advice and give this medication a try. With a cheerful demeanor, Xiao Bufan began typing on the computer to finalize the prescription. Danshan, Chuanxiong, Angelica, Peach Kernel, Safflower, Ophiophagon, Schisandra, Nodo Ginseng, Scorpion, and Centipede. Although scorpions and centipedes are toxic, when utilized in this prescription, they can effectively target the ailment. This formula not only invigorates the qi and promotes blood circulation, but also possesses analgesic properties, serving as a foundational remedy for treating angina pectoris with commendable efficacy. Once he printed the prescription, Xiao Bufan handed it to Zhang Xiaowei, saying here, take this prescription along with the payment slip to the front desk to register and pay, then proceed to the pharmacy to collect your medication. You should take it twice daily, 1 dose in the morning and 1 in the evening, and observe its effects over the course of a week. Yes, I understand. Doctor, thank you. Zhang Xiaowei nodded repeatedly, expressing his gratitude as he departed with the payment slip and prescription. Despite his stout appearance, Zhang Xiaowei exhibited surprising speed as he hurried away. Xiao Bufan chuckled to himself. Who would have thought this hefty fellow could run so swiftly? Yet, I wonder why he remains so overweight. He mused, feeling as though he had overlooked something during the diagnosis, yet he dismissed the thought. After the patient left, Xiao Bufan found himself with some spare time. Fortunately, the afternoon did not pass without further patients. Throughout the course of the afternoon, he attended to 4 more individuals. Yet the clinic still felt rather desolate. Nonetheless, Xiao Bufan firmly believed that this situation was merely temporary. He envisioned a future where his clinic would be bustling with patients eager to seek his expertise. After all, he was a traditional Chinese medicine doctor armed with a unique system destined for greatness. One day, he would undoubtedly become a master of national medicine. With these aspirations in mind, Xiao Bufan concluded his day with a smile, shedding his white coat as he finished work. Chapter 29, Medical Experience that evening. After returning home from work, Xiao Bufan prepared a sumptuous dinner for himself. He had cultivated a disciplined routine of working, cooking, and resting after hours. Since becoming a doctor, he felt his social circle had diminished, Apart from interacting with various patients, his only companions were the doctors and nurses within the hospital. Former classmates and friends seemed to have faded into the background, their interactions becoming scarce. Although he had a group chat for classmates on his phone, Xiao Bufan seldom engaged in conversations there, often ignoring the messages. Since graduating, everyone seemed preoccupied with their own lives, leaving little time for casual banter unless one was born into wealth and free from employment concerns. Xiao Bufan himself was somewhat of a marginal wealthy offspring. His father had previously held the position of head of a medical college and was now a deputy director. However, during the time of his mother's passing, he had lived with his grandparents, enduring hardships and gaining insight into life's challenges. Consequently, he had matured far beyond the average youth. After dinner, Xiao Bufan took a brief walk outside before retiring to his room for the night. The next day dawned bright and beautiful, heralding Friday with clear skies and warm sunshine. Before 7 o'clock, the temperature soared to nearly 20 degrees Celsius, a clear indication of the impending heat of summer. After washing up, Xiao Bufan prepared a simple bowl of porridge to satisfy his hunger before driving his old Honda Fit to the hospital. Upon arriving at the hospital, it was still before 8 o'clock, a time that felt late for the physicians on duty, as many patients had already arrived, some even as early as 5 in the morning from rural areas. Xiao Bufan parked his car and observed the long queue at the Western Medicine Clinic, contrasting it with the desolate scene at the traditional Chinese medicine section. He shook his head in resignation and made his way to the entrance of the TCM department. After clocking in, Xiao Bufan donned his white coat and entered his clinic with a smile, promptly instructing the system, I would like to sign in. Ding! Sign in successful. Congratulations to the host for receiving 3 years of medical experience as a former chief physician at the Imperial Medical Institute. Wu Qian. Huh? What is this? Xiao Bufan was momentarily taken aback, astonished by the unexpected sign-in reward. He had not anticipated that the system would bestow such a remarkable gift. Could the experiences of a deceased renowned physician truly be so readily available as a reward? What else could possibly be deemed unworthy? While many might be unfamiliar with the name Wu Qian, Xiao Bufan was well acquainted with this figure, due to the frequent appearances of the individual in traditional Chinese medicine textbooks. In the necessity of reading his work, Medical Classic of the Imperial Dynasty, we find ourselves discussing Wu Qian, whose courtesy name was Wenji. Hailing from Shi County in Anhui during the Qing Dynasty, he once held the esteemed position of chief physician at the Imperial Medical Institute during the reign of Qianlong. Wu Qian's Medical Classic of the Imperial Dynasty is an authoritative and comprehensive medical text from the Qing period, recognized for its thoroughness and succinctness. As someone who could ascend to the role of chief physician, Wu Qian's expertise in traditional Chinese medicine is undoubtedly remarkable. Historical records even note that he treated Qianlong for a cold, which further attests to his medical prowess. It would be implausible for him to gain the favor of the emperor if his skills were subpar. The wealth of experience Wu Qian amassed during his years of practice far exceeds mere 3 years. Even a year's worth of his expertise would be invaluable for someone like Xiao Bufan to learn from. In an instant, Xiao Bufan felt as though his mind was inundated with a plethora of traditional Chinese medical knowledge and experiences, conjuring a multitude of vivid images within his consciousness. The depth of Wu Qian's experience, particularly during his tenure as chief physician, became apparent, despite the limited number of patients he could attend to in the palace. Primarily comprising royal family members and court officials, the vast array of talent and medical literature available at the Imperial Medical Institute was unparalleled. Even without treating the palace's elite, the knowledge gleaned from a multitude of medical texts alone would suffice to elevate him to the status of a renowned physician. As Xiao Bufan organized the flood of clinical experiences and insights regarding pulse diagnosis in his mind, he realized the profound influence of Wu Qian's expertise. Upon regaining his composure, he exhaled deeply, murmuring to himself that studying traditional Chinese medicine indeed requires the guidance of a distinguished master. Relying solely on the knowledge imparted in academic settings would never suffice to become a revered national physician. After absorbing Wu Qian's 3 years of clinical experience, Xiao Bufan felt as though he had undergone 3 years of rigorous training under a master physician, allowing him to develop his own understanding of clinical practice in traditional Chinese medicine. It is worth noting the remarkable capabilities of this system, as Xiao Bufan, having merely received Wu Qian's experience, felt as though he had been transformed. He could distinctly sense a significant enhancement in his abilities, both in pulse diagnosis and clinical reasoning. Just then, in the midst of organizing the medical knowledge he had acquired, Fan Jiejie, donned in a striking red dress and towering heels, entered the consultation room with a radiant smile, greeting Xiao Bufan warmly. "Good morning, Dr. Xiao. You've certainly arrived early. I just started my shift." Xiao Bufan, momentarily distracted, smiled back and inquired, "How have you been since our last session? Have you experienced any abdominal pain after using the medication?" The woman before him was none other than Fan Jiejie, the patient he had previously diagnosed with a uterine fibroid. Today, she had returned for a follow-up consultation, not only for a checkup, but also for the requisite moxibustion treatment. Xiao Bufan had previously advised her that regular moxibustion sessions were essential for effective treatment of her condition. Upon hearing Xiao Bufan's question, Fan Jiejie playfully tossed her hair and replied, "Since taking the medication you prescribed, I haven't felt any pain. However, the discharge has increased, and it feels rather peculiar while walking." "That's good to hear. Just continue with the medication for a while longer," Xiao Bufan said, taking her pulse as he spoke. "Based on your pulse, I can see that the stagnant energy within you is beginning to dissipate, and the damp heat is gradually being expelled. This is a positive development." Xiao Bufan noted an improvement in her pulse compared to their previous encounter, as it no longer felt as dense. Nevertheless, he understood that addressing uterine fibroids required time and a continued regimen of medication and moxibustion. After confirming the changes in her pulse, he continued, "Your menstrual cycle should not be due yet, right? When it arrives, it might help expel some of the fibroids, although the bleeding may be heavier than usual. However, it shouldn't interfere with your daily life." "Yes, I understand. I'll be sure to take precautions." "Thank you for the reminder, Dr. Xiao," Fan Jiejie replied, noting his advice and planning to stock up on supplies. "Just a friendly reminder to prevent any issues," Xiao Bufan chuckled, gesturing toward the adjacent examination room. "Please lie down there. I'll prepare for your moxibustion." "Thank you, Dr. Xiao," she said with a smile, moving effortlessly to the designated room, shedding her outerwear and reclining on the examination bed. Before long, Xiao Bufan entered with the moxa sticks in hand. After igniting one, he expertly cut it into smaller segments and placed them on several acupoints on Fan Jiejie's body, mirroring the acupoints used in their previous session. "You can relax here while I check on you shortly," he said with a smile. "All right," Fan Jiejie replied, her eyes half closed, relishing the tranquility and comfort that the moxibustion provided, choosing to immerse herself in the experience rather than interact with anyone, including the doctor. Xiao Bufan, content, stepped out of the room and returned to his desk, recognizing that he couldn't focus solely on one patient during work hours. Just then, Nurse Qin Ziru rushed over, her voice filled with urgency. "Dr. Xiao, do you have any knowledge of traditional Chinese obstetrics?" "Traditional Chinese obstetrics? I do have some familiarity. Why do you ask?" Xiao Bufan replied, slightly taken aback. "Is there a need for assistance from Dr. Lu?" he inquired, aware that his understanding of obstetrics, while not as extensive as that of a specialist, was still competent enough compared to other physicians in the traditional Chinese medicine department. Xiao Bufan considered himself reasonably competent in the field of obstetrics. At the very least, he believed he could handle general midwifery without any issues. Upon hearing him mention his knowledge of gynecological midwifery, Qinziru hurriedly urged him to follow her, exclaiming, "Dr. Xiao, it's great that you understand midwifery. Come quickly. Dr. Lu is waiting for help." "Wait, isn't Dr. Lu our chief physician in gynecology? Surely he knows about obstetrics?" Xiao Bufan asked, bemusedly glancing at Qinziru. Qinziru could only roll her eyes in exasperation, replying, "You must understand that Dr. Lu is merely the head of our traditional Chinese medicine gynecology department, not the obstetrics division. He is well versed in gynecology, but obstetrics is somewhat beyond his expertise." It wasn't entirely fair to blame Dr. Lu for any lack of specialization. The reality was that the traditional Chinese medicine department rarely encountered patients in labor. The obstetric field had largely been monopolized by Western medicine. And although traditional Chinese medicine also offered obstetrics, most patients sought gynecological care, with very few opting to give birth there. At this moment, Qinziru appeared increasingly impatient. She pulled Xiao Bufan towards the exit, insisting, "Enough with the delays. If you don't hurry, the expectant mother may not last much longer." "But I still have a patient undergoing moxibustion," Xiao Bufan protested, gesturing towards the treatment room. Upon hearing this, Qin Zuru immediately released his arm and said, "Then you should hurry to help Dr. Liu. I'll take care of the patient receiving moxibustion." "All right, I appreciate it, Sister Qin," Xiao Bufan acknowledged, fully aware of the urgency of the situation, and he dashed towards the traditional Chinese medicine obstetrics department. Fortunately, it was on the third floor, and he quickly reached the scene. When Xiao Bufan arrived, he saw chaos outside the obstetrics department. A throng of family members surrounded Dr. Liu Zichuan, preventing him from leaving. The husband of the expectant mother clutched Dr. Liu's white coat, anxiously pressing, "Dr. Liu, do you have any way to assist my wife with a natural birth? If not, please transfer her to the Western Medicine Obstetrics Department immediately. If anything happens to her, I will hold you accountable." "Exactly. If you can't handle this in your department, then transfer her to where they can," shouted another family member, filled with indignation. In the face of such pressure, Dr. Liu could only express his helplessness, repeatedly explaining, "It's not that I wish to avoid transferring the expectant mother. I've already contacted the obstetrics department across the hall. They currently have 3 mothers in labor simultaneously and cannot come to assist your wife. This situation is beyond my control." He knew well that even the Western Obstetrics Department had limited personnel available. They couldn't accommodate every request. At this very moment, there were several mothers awaiting assistance, and they were too overwhelmed to address issues from the traditional Chinese medicine department. Despite being part of the same hospital, competition between departments was fierce, and it wasn't as simple as just asking for a transfer. Thus, faced with this predicament, Dr. Liu found himself at a loss. Otherwise, he wouldn't have considered asking the head nurse to summon more assistance. In truth, the position of traditional Chinese medicine obstetrics was rather awkward. While they certainly had expertise in gynecology, they rarely received patients seeking obstetric care, resulting in a disconnect where practitioners might be proficient in gynecology but lack experience in obstetrics. Like Dr. Liu in this situation. When the family members heard that a transfer was not possible, they erupted in outrage. "What do you mean you can't transfer her? Are you condemning my wife and child to death? Can your hospital take on that responsibility? You're the chief physician, yet you can't even manage this? I'll call the health bureau right now." The husband of the expectant mother was furious, gripping Dr. Liu's collar and launching into a tirade. Dr. Liu sighed in resignation. He was equally at a loss. The Western Obstetrics Department was unable to spare any staff at this critical moment, and the expectant mother's condition had become dire. If assistance was not rendered soon, it could result in a tragic outcome for both mother and child. After contemplating the situation, Dr. Liu addressed the husband. "If there truly is no other option, we may have to consider a cesarean section." Despite his lack of midwifery skills, he was confident in his ability to perform a cesarean section. Otherwise, he would not have attained the position of chief physician in traditional Chinese medicine obstetrics. "No way. I absolutely refuse to consent to a cesarean." The mother-in-law intervened, glaring at Dr. Liu. "If you dare to perform a cesarean on my daughter-in-law, I will ensure your hospital faces the consequences. I demand my grandson be born safely through natural means." Dr. Liu was left speechless. In the face of such unreasonable family members, even if a physician possesses the necessary skills to resolve the issue, they may find themselves powerless to act, as the relatives refuse to heed their counsel, let alone accept any proposed treatment. Just as Dr. Liu was feeling overwhelmed, he noticed Xiao Bufan appearing from across the way. He quickly pushed through the crowd and approached him, urgently asking, "Dr. Xiao, do you have experience with traditional Chinese medicine midwifery?" "Yes, I have some knowledge," Xiao Bufan replied with a nod. "That's fantastic. Here are the patient's medical records. Please take a look." In that instant, Dr. Liu felt as though he had found a lifeline. He led Xiao Bufan towards the delivery room while explaining the patient's condition. The expectant mother is named Tang Xiaohua, 28 years old, and this is her first pregnancy. She has been in labor for over 4 hours. We've administered labor-inducing and pain relief injections, but the baby is yet to be delivered. The mother is only 4 centimeters dilated, and her mother-in-law adamantly refuses to sign the consent for a cesarean. Her condition is extremely perilous. If the baby does not come soon, there's a significant risk of intrauterine death or intracranial hemorrhage. Listening to Dr. Liu's account, Xiao Bufan quickly gained a general understanding of the expectant mother's situation. The difficulties of her first labor stemmed from weak contractions and insufficient dilation, which are common causes of obstructed labor. "Dr. Liu, what is the meaning of this? You brought in such a young male doctor. What exactly do you intend to do for my wife and child?" The husband of the Praetorian could not help but cast a deep glance at Xiao Bufan before turning to Lu Zichuan with a questioning demeanor. Lu Zichuan let out a helpless sigh, smiling as he explained to the family of the Praetorian. This esteemed Dr. Xiao is also a chief physician in our traditional Chinese medicine department. He possesses expertise in obstetrics and is capable of assisting the Praetorian in a smooth delivery. You desire a natural birth for her, do you not? Dr. Xiao has been invited here to facilitate that, so please refrain from further commotion and wait outside. Understood? Upon hearing Lu Zichuan's explanation, the husband exchanged glances with his mother and quickly nodded in agreement, saying, "All right, we understand. We appreciate your assistance, doctors." With a firm action, Lu Zichuan closed the delivery room door without further words. At that moment, Xiao Bufan had just finished reviewing the Praetorian's medical history and turned to Lu Zichuan, stating, "I shall take her pulse to assess the situation. Otherwise, we cannot ascertain the specific condition of both mother and child." Yes, indeed. Lu Zichuan nodded in agreement. Subsequently, Xiao Bufan approached the Praetorian, observing her physical state. At that moment, the Praetorian appeared pale, devoid of any color, her lips having turned white, presenting a notably weak demeanor. Clearly, although Tang Xiaohua had received an analgesic and felt no pain, it did not imply that her body was unresponsive to the current circumstances. It merely indicated that her nerves were numb to the pain. This condition could impede the opening of the pelvic cavity. Hence, it is generally advised against administering analgesics to Praetorians seeking a natural birth. I shall take your pulse now. Rest assured, both you and your child shall be fine. Xiao Bufan said with a warm smile to Tang Xiaohua, and then began to take her pulse. Upon examination, he discerned that the Praetorian's pulse was somewhat weak and slippery, indicating symptoms of both qi and blood deficiency. It is known that the process of childbirth is profoundly depleting to one's vitality. If a Praetorian lacks sufficient qi and blood, various complications may arise, including difficulties in labor. Open your mouth. Let me see your tongue, Xiao Bufan instructed after confirming the pulse condition. Tang Xiaohua made an effort to part her lips and displayed her tongue. Its coating was pale, the shape somewhat thick, with signs of teeth marks along the edges, indicative of spleen deficiency. This suggested that the Praetorian's spleen and stomach were somewhat compromised. Contemplating this, Xiao Bufan turned to Lu Zichuan, stating, "The Praetorian has issues with her spleen and stomach, coupled with qi and blood deficiency. The previous administration of analgesics is extremely detrimental to her delivery. What do you propose we do? The analgesics have already been administered. There is little I can do now." Lu Zichuan replied, his expression one of resigned frustration. Previously, the Praetorian's cervix was not dilating adequately, and she was in constant pain, with her family causing a commotion. I had no choice but to administer the analgesic to alleviate her suffering temporarily. Let's proceed this way. I will prescribe an obstetric formula for the Praetorian. Please have the pharmacy expedite its delivery. A multitude of diagnostic results flashed through Xiao Bufan's mind as he turned to Lu Zichuan, saying, after the Praetorian consumes the medicine, "I shall assist with acupressure, which should facilitate a natural delivery." Fortunately, Xiao Bufan had acquired 3 years of clinical experience from the esteemed physician Wu Qian that morning, coupled with his mastery of the complete text of traditional Chinese obstetrics, which provided him with a swift solution. While analgesics might temporarily numb the Praetorian's pain, the combination of herbal medicine and acupressure could still yield effective results. Without delay, Xiao Bufan retrieved a pen from his pocket and inscribed the prescription on a notepad. The formula: labor-inducing decoction. The ingredients included Atractylodes Ji Ku, Platycodon, Chun Pai, Peony by Ji, Chuan Xiong, Angelica, Cinnamon, Pinellia, powdered grass, ephedra, and ginger. This formulation, known as labor-inducing decoction, is documented in Effective Formulas of the World as Physicians, Volume 14. It is designed to treat cases of impending labor, alleviating pain, and addressing complications such as prolonged labor or maternal fatigue. Upon receiving the prescription, Lu Zichuan quickly handed it to a nearby nurse, urging, "Hurry to the pharmacy, specifically the emergency department, and have them rush the medicine over." "Oh, certainly. I will do that right away," the young nurse responded, nodding eagerly before dashing out. Due to the urgency of the emergency department, the medicine was soon prepared. Since Xiao Bufan had prescribed a decoction that required no prior cooking, it could be quickly dissolved in hot water for immediate use, significantly expediting the administration of the medicine to the parturient. In less than 15 minutes, the obstetrics nurse returned with the prepared herbal concoction. Xiao Bufan promptly instructed the nurse to assist the parturient in consuming the medicine. After waiting for a brief period, he turned to Lu Zichuan, saying, "All right, the effects of the medicine should be manifesting now. I will now assist her delivery with acupressure. Please prepare for the birthing process." Understood. Lu Zichuan nodded, gathering several nurses to prepare for the delivery. Xiao Bufan approached the parturient once more, offering a comforting smile. "Relax. Do not view me as a man. I am merely a physician." "Thank you, Doctor," Tang Xiaohua replied, closing her eyes and falling silent. Ultimately, her and her child's lives relied entirely on the physician, and her ability to deliver naturally was beyond her own control. Thus, regardless of the physician's gender, the paramount concern was the safe birth of her child. The situation had grown critical. Prompt delivery was essential to prevent any imminent danger to the unborn child. Xiao Bufan donned sterile gloves provided by a nurse and began the acupressure to assist Tang Xiaohua in her labor. Indeed, acupressure has long been a method employed in traditional Chinese obstetrics, though it has since been appropriated by Western medicine. Tang Xiaohua remained silent, her eyes closed. As she began to feel her breathing quicken, likely a result of the labor-inducing decoction taking effect, she sensed the fetus within her becoming increasingly active. Yet she felt no pain. Chapter 32. Successful Delivery Assistance. Inside the delivery room, Xiao Bufan's hands pressed upon the parturient's abdomen, following the meridian paths alongside the lumbar and sacral spine, applying acupressure to relevant acupuncture points. This was merely one aspect of the acupressure assistance. As stated in the Great Compendium of Acupuncture, for difficult labor, one may tonify, higu, and disperse san yin jiao to facilitate delivery. In traditional Chinese medicine, tonification and dispersal vary in intensity. Gentle pressure is used for tonification, while firmer pressure is applied for dispersal. Speed also plays a role. Slow strokes for tonification, rapid movements for dispersal. From a technique perspective, pushing in the natural direction is tonification, while pushing against it is dispersal. After massaging the parturient's abdomen, Xiao Bufan pressed upon her higu point, applying pressure with his thumb and performing gentle circular motions. Care was taken to avoid excessive pressure to prevent discomfort at the higu point. Following this, he also stimulated her san yin jiao point with counterclockwise rotations, remaining mindful of the pressure applied. After pressing the acupoints of higu and san yin jiao, Xiao Bufan continued to perform massage on the abdomen of the parturient. With gentle pressure, he assisted in the delivery of the fetus while also aiding the woman in opening her pelvis. Only by widening the pelvis could the cervix fully dilate. Otherwise, if the opening were too small, the child would be unable to emerge. As time slipped away in the midst of Xiao Bufan's steadfast efforts, he remained wholly focused, harboring no other thoughts, solely intent on aiding the mother in the birth of her child. Despite Tang Xiaohua's decent appearance, this was a matter of life and death. A physician ought to embody the essence of their profession. Moreover, Xiao Bufan was merely responsible for the massage, leaving the critical role of delivery to Dr. Lu and several female nurses. The cervix has dilated to 5 centimeters. Now 6 centimeters. Keep going, the baby's head is emerging. The praise for Dr. Zhao's prowess echoed as the child was on the verge of being born. Finally, after what felt like an eternity, the sound of a baby's cry resonated throughout the delivery room. With the collective effort of the medical staff, the child was successfully delivered. It's a healthy boy, weighing 7 pounds and 6 ounces. Quickly, administer oxygen. It seems the baby may have inhaled amniotic fluid. Hurry. Transport the child to the nursery and remember to have the family sign the necessary documents. A flurry of nurses swiftly carried the newborn away, seeking the family for signatures. With the successful delivery, Xiao Bufan exhaled with relief, ceasing his ministrations. He had fulfilled the expectations placed upon him. Dr. Lu Zichuan also stood up, wiping the perspiration from his brow, and turned to the remaining nurse, instructing, "You handle the suturing of the cervix. I need to rest for a moment." Understood. The nurse nodded, crouching down to begin the task. Lu Zichuan sighed in relief, glanced at the mother, and remarked to Xiao Bufan, "Dr. Xiao, I truly owe you one. Without your assistance, I would not have known how to proceed. Thankfully, both mother and child are well. This is indeed a blessing amidst misfortune. In truth, Had it not been for Xiao Bufan's intervention, Lu Zichuan feared he would have faced repercussions from the family, potentially leading to self-recrimination and a deduction in salary. After today's event, Lu Zichuan would no longer underestimate Xiao Bufan's traditional Chinese medicine skills, elevating his regard for him to an equal standing. "Oh, Dr. Lu, you are too kind. We are colleagues in the same department, so such formalities are unnecessary," Xiao Bufan replied with a smile and a wave of his hand. Lu Zichuan sighed lightly, gesturing towards the delivery room's door. "Shall we step outside to converse? The mother needs to be taken back to her ward to rest." "Yes, certainly," Xiao Bufan agreed with a smile, following Lu Zichuan out of the delivery room. However, as they departed, Xiao Bufan did not notice Tang Xiaohua, lying weakly on the bed. Opening her eyes to watch his retreating figure, her lips gently biting as she pondered something unknown. Soon after, Xiao Bufan accompanied Lu Zichuan to his clinic. Lu Zichuan, with a smile, poured Xiao Bufan a cup of hot tea and, with curiosity, asked, "Dr. Xiao, have you been learning a great deal from your father lately? It seems your patient consultations have notably improved." Lu Zichuan was somewhat aware that Xiao Bufan's father was the vice president of the Municipal Chinese Medical College, but he was unsure of the extent of his father's abilities, whether it was his medical expertise or other capabilities that earned him the position. In response to Lu Zichuan's inquiry, Xiao Bufan smiled faintly. "My father? He barely knows any medicine. His knowledge of traditional Chinese medicine is likely less than mine." "No way. Your father is the vice president of the medical college," Lu Zichuan exclaimed, eyes wide in disbelief. Xiao Bufan chuckled, refraining from further comment, instead glancing at his watch and saying, "All right, Dr. Lu, it seems time is slipping away. I have patients waiting in my clinic, so I must return to my duties." "Understood, Dr. Xiao. If you have matters to attend to, please go ahead. I have no further issues here," Lu Zichuan nodded with a smile, escorting Xiao Bufan out of his office. After leaving the Chinese gynecology and obstetrics clinic, Xiao Bufan returned to his own office, only to find that Fan Jejia had already departed, leaving only Nurse Qin sitting there. "Has the patient already left?" Xiao Bufan blinked in surprise at Nurse Qin. "Yes. She has completed her moxibustion treatment and returned home. I also provided her with post-treatment care instructions," Qin replied, standing up. "How did things go with Dr. Lu? Was the baby born?" Xiao Bufan smiled. "Yes, the baby has been born, and both mother and child are safe and sound." Upon hearing this, Qin clutched her chest and murmured, "As long as mother and child are safe, that's all that matters." With that, Qin turned to Xiao Bufan. "Since everything is fine with Dr. Lu, and you have returned, I shall attend to my own tasks. You can oversee the clinic." "All right, Nurse Qin. Please go ahead with your work." Xiao Bufan nodded, settling down at his desk. "I must get busy. If I don't, the end of the workday will soon be upon us," Qin said with a smile before departing. As the head nurse of the traditional Chinese medicine department, Qin was not only the overseer of the entire department, but also the leader of the younger nurses, meaning her responsibilities far surpassed those of Xiao Bufan. Typically, he only needed to wait in his office for patients to arrive, while Qin's duties kept her occupied throughout the day. Once Qin left, Xiao Bufan reflected on the earlier experience of assisting Tang Xiaohua in her delivery, and a realization dawned upon him. Perhaps the true master of traditional Chinese medicine ought to be a versatile physician, capable of addressing any ailment with precision, including methods such as massage and obstetrics. Chapter 33. Refusing a dinner invitation from a female patient in the afternoon. After having lunch and a brief rest, Xiao Bufan resumed his work in the clinic. Unfortunately, throughout the entire afternoon, he only attended to 2 patients, both of whom were returning for follow-up consultations. Before Xiao Bufan had fully activated his system's capabilities, his medical skills could only be considered average. Nevertheless, he was a licensed physician specializing in traditional Chinese medicine, which meant he had a handful of patients, albeit not many. Thus, it was not surprising when another patient walked into his clinic shortly after he had completed a consultation with a previous one. With a rhythmic tap of her high heels, a woman in her early 30s entered the room, dressed in a fitted blouse. Holding her registration slip, she took a seat and immediately expressed her dissatisfaction. "Dr. Xiao, could you please take another look at me? Ever since I took the medicine you prescribed during my last visit, my menstrual cramps have intensified. Surely, you didn't prescribe the wrong medication, did you? Is that so?" "That seems rather unlikely," Xiao Bufan replied, momentarily taken aback, before awkwardly smiling and adding, "Please extend your hand. I shall take your pulse once more." He recognized this patient. If memory served him correctly, her name was Zhu Limei, and she had just turned 31. During her previous visit, he had prescribed Siwu decoction, a classic remedy in traditional Chinese medicine known for nourishing blood and regulating menstruation, which should alleviate menstrual pain. Yet, she claimed it had exacerbated her discomfort. How could that be? With a furrowed brow, Xiao Bufan began to assess her pulse. Soon, he discerned a notable discrepancy from his last examination. Her pulse was thin and wiry, indicative of internal issues, while the fine pulse pointed to dampness. Clearly, he had misdiagnosed her previously, confusing her wiry pulse with a soft one, an error that could easily occur without substantial clinical experience. Fortunately, Xiao Bufan's skills in gynecology had significantly improved, and he was quite adept at recognizing such subtle differences now. This, perhaps, illustrated the greatest distinction between theoretical knowledge and clinical practice. In theory, one could memorize the principles of traditional Chinese medicine, but accurate diagnosis and practice required a blend of personal experience and theoretical understanding. After a brief contemplation, Xiao Bufan smiled as he retracted his hand and instructed, "Now, please open your mouth so I can examine your tongue." Zhu Limei obediently complied, revealing a pale red tongue with a thin white coating. Upon closer inspection, Xiao Bufan could not help but smirk ruefully. It appeared he had indeed misdiagnosed her condition. He had initially presumed her discomfort stemmed solely from a deficiency, hence the Siwu decoction. However, it seemed evident now that she was also experiencing symptoms of coldness within her body, which rendered the previous remedy ineffective. Feeling somewhat embarrassed, he addressed Zhu Limei with a gentle smile. "I must apologize, Miss Zhu. It appears the last prescription may not have been appropriate. If you permit, I'd like to offer a different formula this time." Truthfully, Xiao Bufan felt quite helpless about his previous error. It was a consequence of his earlier limitations in gynecology. Ultimately, the responsibility lay with him, not with the patient. Upon hearing his words, Zhu Limei furrowed her brow and inquired, "What do you mean, Dr. Xiao? Are you admitting that the last prescription was incorrect?" "Indeed, I acknowledge that I made an error in my previous prescription. That is undoubtedly my responsibility," he replied sincerely, refraining from deflecting blame as many doctors might. "I apologize, Miss Zhu, and I will prepare a new formula for you. If this prescription does not yield results, I will cover the cost of the medication and compensate you for any inconvenience caused." How does that sound? Seeing the earnestness in Xiao Bufan's expression, Zhu Limei sighed. "Very well, Dr. Xiao. I suppose I will trust you once more, especially since you are quite the handsome doctor." "Thank you for your trust, Miss Zhu." Xiao Bufan responded with a smile, then proceeded to type a new prescription into the computer. This time, he opted for Xiao Jianzhong decoction, a warming remedy known for its ability to nourish and harmonize the internal organs, addressing a variety of symptoms associated with coldness and disharmony within the body. The ingredients included maltose, cinnamon twig, peony root, licorice, jujube, and ginger. Swiftly, he printed the prescription and handed it to Zhu Limei with a beaming smile. "Here, Miss Zhu, please take this to the front desk to pay and collect your medicine. I assure you that this time, you will find relief from your discomfort. Should this remedy prove ineffective, feel free to return, and I will ensure you are compensated for your losses. Since you have such confidence, I will trust you once again." Zhu Limei replied, casting a lingering glance at Xiao Bufan. She then hesitated, brushing a lock of hair behind her ear, and asked, "Dr. Xiao, are you free after work? I would like to invite you to dinner, if you would be so gracious." Xiao Bufan was momentarily taken aback, unsure of how to respond. Was this truly happening? A female patient inviting him to dinner? He had merely been trying to help her with her ailments, and now it seemed she was seeking something more. He sighed internally, finding it rather amusing yet perplexing. Should he accept her invitation? It was merely a meal after all, and he discerned that she was indeed quite attractive and elegantly dressed, albeit already married. Ultimately, he chose to decline her invitation, politely stating that he was unavailable. "Very well, if you are busy, then I shall take my leave," Zhu Limei said, a hint of disappointment in her voice as she stood to exit the clinic. Watching her depart, Xiao Bufan chuckled softly and shook his head, glancing at the time as he prepared to conclude his day. Tomorrow was Saturday, a day of rest, while Sunday would see him back on duty for the evening shift. Although the traditional Chinese medicine department had few patients at night, the hospital required a doctor to be on duty around the clock. As an institution dedicated to saving lives, the hospital operated on a rotating schedule. Consequently, even on weekends, every department needed to have a doctor on call. Otherwise, if a patient experienced an emergency and could not receive timely treatment, it could lead to fatal consequences, and the hospital would inevitably face public condemnation. Chapter 34. Signing in for century-old wild ginseng in the evening, Xiao Bufan returned home after work. As was his routine, he began preparing his dinner upon arrival. After all, dining was of paramount importance in life. Living was, after all, for the sake of sustenance. Soon enough, he had prepared 2 dishes and a soup. Relishing his meal, just as he finished his dinner, the phone rang. It was his father, Xiao Yuanyang. "Hello, what's the matter?" Xiao Bufan asked while clearing the table. On the other end, Xiao Yuanyang chuckled. "Tomorrow is your day off, right? I've arranged for you to meet the lady I introduced you to. We'll meet around 10 in the morning so that you can get to know each other." 10 in the morning, is it? Xiao Bufan did not oppose his father's arrangement and nodded in agreement. "All right, I'll be there on time." After all, this was his father's matchmaking endeavor, not his own, and he had no reason to hinder his father's pursuit of happiness in his later years. After a brief chat, an unintended remark from Xiao Bufan made his father hang up in irritation. Listening to the beeping tone, Xiao Bufan scratched his nose and muttered, "When did he become so easily irritable? Has he been overindulging in sea cucumbers lately?" Since becoming the vice president of the Shiyuan City Traditional Chinese Medicine College, many had bestowed gifts upon Xiao Yuanyang, including the prized sea cucumber, which had become a popular offering. Sea cucumbers, renowned for their nutritional value and medicinal properties, could nourish the kidneys, enhance vitality, and stop bleeding. However, excessive consumption could lead to heatiness. It seemed he needed to find a way to alleviate his father's stress. He couldn't let him suffer the consequences of overindulging alone. Xiao Bufan smiled to himself, devising a perfect excuse to retrieve some sea cucumbers from his father's residence after their meeting. The next day, Xiao Bufan slept until 9 o'clock in the morning. Realizing the time, he hastily got dressed, skipped breakfast, and drove his old car towards the city. After all, he had promised his father to arrive by 10 for the meeting, or he risked incurring his father's wrath. Zooming down the road, he arrived in the city in just a few minutes, only to find himself caught in traffic at a red light. Observing the long queue of cars, he realized it would take at least half an hour to clear. Resigned, he decided to use this time to check in with the system. Initiate sign in. As he sat in the car, he felt that it was a perfect opportunity to check in. Beep, sign in successful. Congratulations, host. You have received 2 century-old wild ginseng. Century-old wild ginseng? Xiao Bufan blinked in astonishment, momentarily taken aback. He had never anticipated receiving such a reward from the system. Previously, he had been granted skills in traditional Chinese medicine and clinical experience from esteemed practitioners. Now, he had received precious herbal materials. It seemed that anything related to traditional Chinese medicine could be obtained through the system. Pondering this, he took out the 2 prized wild ginseng roots. They appeared immaculate, each root intact, truly the finest quality. This was an invaluable resource, potentially life-saving in critical moments. A faint smile crept across Xiao Bufan's face. It was known that cultivated ginseng was sold by weight, but wild ginseng commanded astronomical prices, especially this premium variety. At a recent auction, a 25-year-old wild ginseng had fetched over 3 million. Thus, these 2 century-old wild ginseng roots could easily be worth 700,000 or more. Of course, Xiao Bufan had no intention of selling them for such a sum. After all, century-old wild ginseng possessed remarkable healing properties, rejuvenating vital energy and regulating the central nervous system. In modern scientific terms, ginseng not only revitalized, but also contained unique compounds beneficial to various biological functions. Selling such a life-saving resource was out of the question. One never knew when it might be needed. After some time, he smiled and stowed away the 2 prized roots. Half an hour later, Xiao Bufan finally arrived at the hotel his father had mentioned. Fortunately, it was just before 10, so he was not late, but rather a few minutes early. Upon entering, he immediately spotted his father, Xiao Yuanyang, dressed impeccably in a black suit and holding a bouquet of roses. Wow, Dad sure knows how to impress, Xiao Bufan thought, smirking as he approached and took a seat across from him. What is the occasion? Did we not agree to meet at 10 o'clock? Why hasn't the other party arrived yet? Coughing lightly, Xiao Yuanyang remarked, I suppose they must be on their way, caught in traffic. He seemed somewhat bashful, holding a bouquet of roses in front of his son. Come on, at your age, still feeling shy? Xiao Bufan teased, his eyes sparkling with mirth. It's just a bunch of roses, not for me, so there's no need for you to be so awkward. How dare you speak to your father like that? Xiao Yuanyang's expression turned serious, casting a disapproving glance at his son. I had already instructed you to maintain decorum in such situations. Otherwise, others might think I failed to educate you properly. All right, since this is your first formal meeting with them, I shall give you some face today. Xiao Bufan replied with a grin, straightening himself in his seat, refraining from further jesting. After all, the lady was about to arrive. Any further jokes could lead to embarrassment later on. At that moment, the hotel door swung open, and a middle-aged woman dressed in a pristine white gown entered, her demeanor exuding a certain sternness. Following her was a lovely young lady, her natural beauty evident even without makeup. The striking resemblance between the two made it clear they were mother and daughter. Xiao Bufan turned to his father, whispering, "So, is it them? Enough, they have arrived." "Behave yourself," Xiao Yuanyang admonished, casting a warning glance his way. Xiao Bufan chuckled, gesturing to indicate he understood, and settled into a more composed posture, ceasing his playful banter. The middle-aged woman and her daughter approached, smiling warmly. "Apologies for the delay. We encountered some traffic. We're not late, are we?" "Not all, just on time," Xiao Yuanyang replied, rising to greet them. He glanced at Xiao Bufan, saying, "This is your Aunt Fong. Are you not going to greet her? Is this your son? He resembles you quite a bit." Fong Xiaoyun exclaimed, smiling as she assessed Xiao Bufan. "Hello, I'm Fong Xiaoyun, and this is my daughter, Fong Wenjing." "Hello, Aunt Fong. I'm Xiao Bufan," he replied, shaking her hand, only to notice her palms were calloused. His curiosity piqued about her background, despite being nearly 50. She did not appear to be a typical village woman engaged in manual labor. Xiao Yuanyang smiled slightly, then complimented Fong Wenjing. "Is this your daughter? She is indeed as beautiful as you. I heard she is preparing for her postgraduate exams. Quite impressive. Please, old Xiao, don't flatter my daughter too much. She is wonderful in many ways, but she is rather shy and struggles to interact with others. She will face challenges in society." Fong Qiuyun chuckled lightly, shaking her head before turning to praise Xiao Bufan. "Unlike your son, who is already a physician in the hospital, I hear Xiao Bufan has become an attending physician. He's merely a specialist in traditional Chinese medicine. There's nothing particularly remarkable about it. He still has a long way to go," Xiao Yuanyang retorted, though his tone betrayed a hint of pride. As Xiao Bufan listened to his father and Aunt Fong exchanging compliments about their children, he couldn't help but smirk. He discreetly observed the lovely Fong Wenjing across the table. If his father and Aunt Fong were to develop a relationship, Fong Wenjing would become his sister. Fong Wenjing seemed to sense his gaze, meeting his eyes with a subtle smile, appearing not as shy as her mother described. In truth, she was also curiously studying Xiao Bufan, finding him quite appealing. While not conventionally handsome, he possessed a charm that grew more alluring with each glance. If not, he would not have been asked out by female patients previously. Moreover, Fong Wenjing noted that her mother appeared to have a favorable impression of Uncle Xiao, suggesting that they might indeed grow closer. In contrast to Xiao Bufan, who lost his mother at 15 and grew up in a single-parent household, Fong Wenjing had never known her father, leaving her with a profound yearning for paternal affection. Unfortunately, her mother's demanding job had caused her to overlook this need, leading to the perception that Fong Wenjing was introverted. Xiao Yuanyang glanced at the time, realizing it was nearly 11 o'clock. He cheerfully called out to Fong Qiuyun and her daughter, "It seems time is slipping away. What do you prefer to eat? Shall we order now and chat while we dine?" "We are not picky eaters," Fong Qiuyun replied with a smile. "Then I shall order freely. If you don't enjoy the dishes, please let me know, and we can change them," Xiao Yuanyang said, summoning the waiter to place their order. "We'll have a 3-kilogram lobster, black pepper beef, stone pot tofu, poached chicken, and some red crab with yellow sauce, along with oyster sauce lettuce." "Certainly, please hold on. Your order will be ready shortly," the waiter responded cheerfully before retreating to the kitchen. The restaurant service was impressively swift. In no time, several dishes were served. Xiao Yuanyang eagerly invited everyone to begin, serving Fong Qiuyun with care. "I see you work hard at the prison. You must eat well. I'll prepare some chicken soup for you later." "Thank you." Fong Qiuyun graciously accepted, appearing unfazed by his attentiveness in front of their children. "Wait, you work at the prison?" Xiao Bufan interjected, momentarily taken aback. "Aunt Fong, are you a female officer there? No wonder you carry yourself with such poise." If she indeed worked as a police officer, it would explain the calluses on her hands. Fang Qiuyun smiled without uttering a word, but it was the elder, Xiao Yuanyang, who hastily began to explain. Your Aunt Fang is the warden of the women's prison in Shiyuan City. Impressive, isn't it? What? Aunt Fang is the warden of a women's prison? Xiao Bufan couldn't help but widen his eyes, disbelief etched across his face. He had some knowledge of the women's prison in Shiyuan City, as there were only 2 such facilities in the entire Jianglin province, one on the outskirts of the provincial capital and the other right here in Shiyuan City. It was said that the women's prison in Shiyuan held nearly 4,000 female inmates, aged between 18 and 35, with some even younger. Fortunately, domestic women's prisons differed from their foreign counterparts, which often employed male guards, leading to various unsavory incidents. In contrast, domestic facilities were managed solely by female guards, alleviating many potential issues. Despite this, managing a women's prison was still a strenuous task. After all, women tended to be more complicated than male offenders. Nevertheless, the allure of a women's prison for men was undeniable, rivaling that of an all-girls school. Indeed, I'm the warden of the women's prison. Are you particularly interested in our facility, Xiao? Fang Qiuyun inquired playfully, a mischievous smile gracing her lips. Having served as a warden for decades, she was well acquainted with the typical thoughts that crossed a man's mind upon hearing about a women's prison, and she quickly deduced what Xiao Bufan was contemplating. No, I have absolutely no interest in the women's prison. I'm merely a tad curious. Xiao Bufan hastily waved his hands in denial, not daring to admit his fleeting thoughts of visiting the prison. After all, such thoughts were permissible in imagination, but taking action was another matter entirely. Unexpectedly, Fang Qiuyun chuckled. Actually, if you're interested in our women's prison, it wouldn't be impossible for you to take a look. After all, you're a doctor, aren't you? With so many female inmates living in a repressive environment, they are prone to various gynecological issues, and we are unable to assist them adequately. Doesn't your prison have a dedicated medical staff? Xiao Bufan blinked, momentarily taken aback. Fang Qiuyun smiled and replied, We do have doctors, but how many of them are willing to work in a prison? Those who are willing typically possess only average medical skills. While they can treat common ailments, they struggle with more complex conditions. This, unfortunately, is a stark reality. With the current economic climate, everyone is chasing after financial gain. The salary for a prison doctor is hardly enticing. Who would want to take on such a role? Consequently, gynecological infections frequently arise among the inmates, which has become a persistent headache for me. Listening to Fang Qiuyun's account, Xiao Bufan began to comprehend the situation. He waved his hand with a smile. Aunt Fang, you may have misunderstood. I am merely a physician specializing in traditional Chinese medicine, not Western medicine. While Western medicine may offer quicker solutions for gynecological conditions, traditional medicine often entails a more intricate and prolonged treatment process. So, I'm afraid I can't be of much help. However, if you truly require assistance, I could introduce you to a couple of Western gynecological specialists. They might be more suited to assist the inmates. Chapter 36. Old Xiao takes action to be honest. Xiao Bufan never anticipated that his aunt would introduce him to the warden of a women's prison. It was rather bewildering. A vice dean of a medical school becoming acquainted with the warden of a women's prison? It felt quite peculiar. Fang Qiuyun regarded Xiao Bufan with a serious expression and nodded. You make a valid point. Let's not dwell on this. If the need arises, I will reach out to you. All right, Aunt Fang. Should you require assistance, feel free to contact me. I may not have connections elsewhere, but I do possess a few in the medical field, Xiao Bufan replied with a smile, casting a knowing glance at his father, Xiao Yuanyang. Xiao Yuanyang found himself at a loss for words. It seemed his son was trying to leverage his connections for favors. This was his own endeavor to win over Aunt Fang, and here was his son meddling. Xiao Yuanyang shot a glare back at Xiao Bufan, as if wishing to send him back to the suburbs. Xiao Bufan chuckled to himself, continuing to enjoy his meal. Soon enough, lunch concluded, and both Xiao Yuanyang and Fang Qiuyun felt quite satisfied with the gathering. After all, their children had met, alleviating any concerns for future interactions. Once lunch was over, Xiao Yuanyang suggested they stroll through the market to purchase some items and strengthen their bonds. Fang Qiuyun readily agreed. Xiao Bufan exchanged glances with Fang Wenjing, and they reluctantly followed the elders. What surprised Xiao Bufan was how his father seemed to have experienced a revival of youth while accompanying Aunt Fong, energetically shopping for an entire afternoon without showing any signs of fatigue. It was nothing short of miraculous. Xiao Yuanyang had not engaged in much physical activity in recent years, and his diet had become increasingly indulgent, leading to significant weight gain. If he were to walk this much under normal circumstances, he would have been lamenting his fate long ago, rather than appearing so sprightly. Could this be the magic of love? Observing his father's lively demeanor, Xiao Bufan couldn't help but feel a twinge of reflection. He then turned to Fong Wenjing, who was following closely behind, and asked, "So, after an entire afternoon of shopping, are you feeling tired?" "I'm all right, just a bit thirsty," Fong Wenjing replied, wiping the sweat from her brow. Her face slightly flushed from the heat. "Let me get something for you," Xiao Bufan offered, pointing to a store across the street. "What would you like? A beverage or mineral water?" "I do prefer mineral water. I don't usually drink soft drinks," Fong Wenjing replied with a smile. "All right." Xiao Bufan nodded enthusiastically before darting across to purchase several bottles of mineral water. "Thank you." Fong Wenjing smiled gratefully as she accepted a bottle from Xiao Bufan, eagerly opening it to quench her thirst. Xiao Bufan mirrored her actions, taking a few sips before continuing. "I heard my father mention you are preparing for graduate school. Uncertain about your chosen field of study? I have opted for a major in educational studies, with aspirations to pursue a doctorate and eventually become a university professor." Fong Wenjing smiled warmly at Xiao Bufan, seemingly regarding him as an elder brother, despite the fact that he was 3 to 4 years her senior. "So, you wish to become a university teacher? Teaching is quite admirable. At least you have winter and summer vacations, unlike us doctors who enjoy no breaks." Xiao Bufan replied with a nod, expressing his approval of Fong Wenjing's choice. After all, being an educator and nurturing future generations is a noble pursuit. However, just as their conversation flourished, chaos erupted nearby, where Xiao Yuanyang and Fong Qiuyun were shopping for clothes. A young woman, cradling a small child, shouted frantically, "Inin, please don't scare me. Quickly, spit it out. What did you eat? Hurry." It appeared that the little one had choked on something. Xiao Yuanyang's expression shifted to one of concern as he approached the distressed mother, announcing, "I am the dean of the medical school. Hand the child to me." Without hesitation, the mother passed the child into his arms. Xiao Yuanyang laid the child across his lap and applied the Heimlich maneuver, pressing his thumb against her navel and exerting inward pressure. This method is commonly used in Western medicine for emergencies involving choking or airway obstructions and is notably effective. "What is happening? Why is that old man holding the child?" Xiao Bufan, noticing the commotion from a distance, rushed over with Fong Wenjing. Upon closer inspection, he realized that the elder was administering the Heimlich maneuver to a little girl who was clearly in distress due to choking. With unwavering determination, Xiao Yuanyang continued his efforts, his thumb pressing firmly against the girl's abdomen, relentlessly repeating the procedure until, with a sudden cough, the child expelled a dark object from her mouth. Following this release, she inhaled several deep breaths of fresh air before bursting into tears, crying, "Mommy, mommy, I want my mommy." Xiao Yuanyang smiled as he returned the child to her grateful mother, advising, "The child is fine now, but it would be prudent to take her to the hospital for a checkup, just in case." The mother expressed her immense gratitude, thanking him profusely for saving her child. "No need for thanks. The important thing is that the child is safe," he replied humbly, waving off her gratitude with a calm demeanor. Applause erupted from Fong Qiuyun and her daughter, who had witnessed the entire rescue. "Well done, Xiao. It seems your role as vice dean of the medical school is well-deserved. Your execution of the Heimlich maneuver was commendable," Fong Qiuyun praised, increasingly favoring him. As the warden of a women's prison, she too possessed knowledge of the Heimlich maneuver. Yet her first instinct had been to question the mother's intentions, momentarily delaying her response. Standing nearby, Fong Wenjing clapped enthusiastically, exclaiming, "Yes, Uncle Xiao saved a life. You are truly amazing." The flattery from the two women made Xiao Yuanyang blush, and he humbly dismissed their praise, saying, "This is merely what we, as healthcare professionals, ought to do. No need for accolades. Please do not make me the center of attention. All right, no more praise for my father. If you keep this up, he might not sleep tonight from all the compliments." Xiao Bufan interjected playfully, glancing at the time and suggesting, "We've been shopping all afternoon. Perhaps it's time for dinner? Otherwise, we might find no tables available later, especially on a Saturday when families flock to restaurants. Upon hearing his son's remark, Xiao Yuanyang nodded in agreement. Yes, it's getting late. Let us find a place to eat. Agreed. We'll follow your lead, Fang Xuyin responded, granting Xiao Yuanyang a moment of pride. The four of them, laden with bags, soon settled into a restaurant. To maintain an air of generosity, Xiao Yuanyang ordered a variety of dishes, but Xiao Bufan, needing to return to the suburbs, opted for a simple meal, choosing to sip tea while waiting for the others to finish. An hour later, as dinner concluded, Xiao Bufan bid farewell to Fang Xuyin and her daughter, exchanged goodbyes with his father, and left in his modest car, the Honda Fit. That boy, always so carefree. I wonder when he'll find more serious path, Xiao Yuanyang remarked, shaking his head with a smile as he watched his son depart. Fang Xuyin, however, chuckled and said, I think Xiao is a wonderful young man. If he becomes an elder brother, I'm sure he will take good care of Wenjing. Mom, you and Uncle Xiao aren't even together yet. Isn't it a bit early to say such things? Fang Wenjing blushed at her mother's words, quickly interjecting. All right, let us drop it, Fang Xuyin agreed. Then turned to Xiao Yuanyang. I think we've eaten enough. We should head back now. Shall we conclude our day here? Yes, I'll drive you home, Xiao Yuanyang replied, rising to fetch his BMW 5 Series, escorting Fang Xuyin and her daughter back. Meanwhile, upon returning to his suburban home, Xiao Bufan suddenly recalled a task he had neglected. All right, I forgot to bring some sea cucumbers from my father's new house. Oh well, I can always fetch them next time. They 1T run away. Chapter 37. Acupuncture the following day, Sunday. Xiao Bufan had an early start today as he was scheduled for duty at the hospital. Rising with the dawn, he quickly freshened up and set off in his dilapidated Honda Fit towards his workplace. Upon arriving at the hospital, the clock had just struck 7:40. He parked his battered vehicle in the hospital lot, turned, and headed straight to the traditional Chinese medicine department to clock in before entering his consultation room. System, please sign me in. Upon stepping into the consultation room and donning his white coat, Xiao Bufan promptly initiated the check-in process. Ding! Check-in successful. Congratulations, host. You have acquired complete text on traditional Chinese medicine acupuncture, mastery level. Another mastery level skill in traditional Chinese medicine? A grin spread across Xiao Bufan's face, a glimmer of satisfaction lighting his expression. Acupuncture, as an indispensable method within the realm of traditional Chinese medicine, undoubtedly holds significant importance. The art of acupuncture consists of needles and moxibustion, encompassing not only theoretical knowledge, but also acupoints, techniques, and relevant instruments. The ancient text Huang Di Neijing states, cold hidden in the body leads to ailments, treatable through acupuncture. The benefits of acupuncture extend beyond merely unblocking meridians and harmonizing yin and yang. It also aids in reinforcing the vital energies and dispelling pathogenic factors. Currently, there are 354 acupoints within traditional Chinese medicine that have been verified through study. As the saying goes, external marks of meridians and acupoints, internal organs and systems. Each acupoint's therapeutic effect varies significantly depending on its combination with others. In the next moment, a wave of memories surged into Xiao Bufan's mind as he sat in his consultation room. The knowledge contained within complete text on traditional Chinese medicine acupuncture rivaled that of complete text on traditional Chinese medicine gynecology, indicating that digesting this wealth of information would take some time. Once Xiao Bufan fully assimilated this knowledge, his understanding of traditional Chinese medical principles would undergo a profound transformation and elevation. This advancement was both comprehensive and expansive, as the theories of acupuncture also encompass dialectical thinking and acupoint selection principles. Such an extensive repository of acupuncture knowledge and clinical experience was certainly unattainable within the confines of a medical school. Traditional Chinese medicine has evolved into numerous schools of thought, yet truly effective practices often reside within these very traditions rather than in the standardized textbooks of medical institutions. Reveling in the immense depth of complete text on traditional Chinese medicine acupuncture, Xiao Bufan's expression radiated with exhilaration. Perhaps this was the true power of possessing a system that bestowed knowledge effortlessly. He need not shadow esteemed practitioners or engage in extensive clinical research, for the system provided him with essential traditional Chinese medicine knowledge directly. If only more such wisdom could be imparted, he mused, he could swiftly ascend to the status of a revered master of traditional Chinese medicine. Morning passed, and around 9 o'clock, the first patient of the day arrived at Xiao Bufan's consultation room. A woman in her 40s entered, her frail appearance suggesting severe malnutrition. Accompanying her was her husband, a rugged-looking middle-aged man, whose calloused hands spoke of a life spent laboring in the fields. He entered with a simple, earnest smile, nodding in greeting to Xiao Bufan. "Doctor, hello. I brought my wife in for consultation. Please have her take a seat and hand me the registration slip," Xiao Bufan replied warmly. Gesturing for the couple to settle in, the man assisted his wife into a chair before rummaging through his pockets, ultimately producing a substantial stack of medical records and the registration form. "Is there really this much?" Xiao Bufan was momentarily taken aback, intrigued by the sheer volume of documents presented. It was his first encounter with a patient who came bearing such an extensive collection of medical history. As he began to sift through the papers, his brow furrowed deeper with each glance. The earliest record dated back 3 years, indicating that the patient had been suffering for over 3 years without any sign of improvement. The records from various hospitals revealed a pattern of consultations at numerous prominent institutions, yet none had succeeded in curing her condition. It appeared the ailment was a perplexing enigma that no physician could unravel. The array of examinations included traditional Chinese medicine evaluations, Western medical tests, and a multitude of diagnostic results. As he scrutinized these findings, Xiao Bufan's expression turned serious. It was evident that the patient's condition was not straightforward. Finally, he examined the records from the First People's Hospital of the provincial capital, which detailed: patient, Qiao, 46 years old. Traditional Chinese medicine diagnosis: pale tongue with thin coating, weak and thin pulse, accompanied by prolonged bleeding. Western diagnosis: uterine prolapse, cervix positioned below the level of the ischial spines, with the entire uterus protruding outside the body, compounded by rectal prolapse and continuous hemorrhaging. Such a severe case of uterine prolapse? Xiao Bufan was momentarily stunned, realizing the gravity of the patient's condition was far worse than he had anticipated. Generally, uterine prolapse occurs only after a certain age, making it rare for someone under 50 to present such symptoms. Furthermore, the patient, Qiao, also exhibited persistent bleeding, which was a significant factor in why numerous hospitals have been unable to provide a cure. Typically, the treatment for such conditions in Western medicine involves the complete removal of the uterus, followed by hormone therapy to regulate menstruation and control bleeding. However, hormonal treatments often lead to recurrence and difficulty in achieving a full recovery. After reviewing the medical history and various diagnostic results, Xiao Bufan smiled gently at the woman before him. "Let me check your pulse first, and then we can determine how best to proceed with your treatment." "Thank you, doctor," Qiao replied with a warm smile, extending her delicate, slender arm towards him. As his fingers gently rested on her wrist, he began to assess her pulse. Xiao Bufan sensed a profound discord in the patient's pulse, feeling it weak and feeble, almost delicate and lifeless, attributes uncharacteristic of a middle-aged woman. In the clinic, with a serious demeanor, he took the woman's pulse and instructed, "Please open your mouth. Let me examine your tongue." Qiao promptly complied, extending her tongue. When patients face a doctor, they typically regard the physician's words as gospel, obediently following every directive during the consultation. Xiao Bufan inspected her tongue, noting its pale, thin coating and a somewhat white hue. This indicated a deficiency in the spleen and a lack of yang energy, causing the body to fail in processing moisture. As the saying goes, a weak spleen leads to insufficient qi, which in turn may result in a descent of energy, causing uterine prolapse and a sensation of heaviness in the lower abdomen. Moreover, the patient's condition had persisted for an extended period, with considerable blood loss. Besides the spleen's deficiency, her vital energy had significantly diminished, leaving her blood insufficient to support her recovery. This complexity suggested that merely prescribing a few remedies would not suffice. It was evident that the patient had visited numerous hospitals and attempted various treatments, yet the results had been minimal at best. Fortunately, Xiao Bufan was well-versed not only in the entirety of traditional Chinese gynecology, but also in acupuncture. Thus, he swiftly formulated an initial diagnosis. Acupuncture could be employed to halt the bleeding, followed by herbal prescriptions to replenish her qi and blood, ultimately addressing her spleen deficiency. This balanced approach of acupuncture and herbal medicine might yield remarkable results. With this in mind, Xiao Bufan turned to the middle-aged man beside her and smiled gently, saying, "You should proceed to arrange for your wife's hospitalization. Must she really be hospitalized?" The man appeared momentarily taken aback, seeming puzzled by Xiao Bufan's recommendation. He had originally brought his wife here merely for reassurance, doubting that a practitioner in a small clinic could remedy her ailment, especially after their experiences at larger hospitals that had failed to provide a solution. Xiao Bufan, perceiving the family's apprehension, waved reassuringly. "It's fine. Go ahead and complete the admission procedures. Her condition can be treated." "Really? My wife's condition can be cured?" The man's face lit up with disbelief and excitement as he gazed at Xiao Bufan. Xiao Bufan nodded with a smile. "Rest assured, it can be treated. Otherwise, I wouldn't advise hospitalization. However, her condition is somewhat intricate and may require time for complete recovery, so hospitalization is the safest option." Hearing Xiao Bufan's firm assurance, the man's expression brightened, and he eagerly nodded. "All right, I will take care of the admission process." "Thank you, doctor. I truly appreciate your help." He hurried off to the registration desk to facilitate his wife's hospitalization. "Doctor, can my condition truly be treated?" Xiao Ziyun's face mirrored the man's astonishment, her eyes gleaming with a flicker of hope as she implored Xiao Bufan. In that moment, both the middle-aged man and Xiao Ziyun appeared as if they had grasped a lifeline, filled with excitement. They had visited many hospitals where each had either declared her illness untreatable or insisted on surgery with uncertain outcomes. Thus, they had nearly resigned themselves to the belief that her ailment was beyond remedy until they encountered a doctor here who claimed he could heal her, despite his youthful appearance. Their willingness to trust Xiao Bufan's words stemmed from the despair they had endured over the past 3 years, desperately seeking hope. Without it, they feared that their next visit to another hospital might lead them to abandon treatment altogether. Xiao Bufan smiled kindly at Xiao Ziyun. "Do not worry. Your condition can indeed be treated, though it will require some time." Thank you so much, doctor," she exclaimed, her eyes shimmering with newfound hope as if she had glimpsed the dawn of a new day. Xiao Bufan merely nodded in response, his demeanor encouraging. Before long, the middle-aged man returned with the completed admission paperwork. After glancing at the documents, Xiao Bufan said to Xiao Ziyun, "You both should head to the inpatient department upstairs. Once you're settled, I will come up to administer acupuncture." "Thank you, Dr. Xiao." Xiao Ziyun and her husband expressed their gratitude profusely as they helped each other out of the clinic. Once they departed, tranquility enveloped Xiao Bufan's clinic once more. However, he was not idle. He needed to prepare a set of medical silver needles for disinfection before proceeding with Xiao Ziyun's acupuncture treatment. Given the nature of her condition, disposable needles would not suffice, prompting him to search for a suitable set in the medical supplies area. Just as he located an appropriate set of silver needles and turned back to his clinic, Su Xiaoli stormed in, visibly upset, brandishing an admission form. With a loud thud, she slammed the form onto his desk, her tone laced with indignation. "Is this patient named Xiao Ziyun under your care?" "Yes, I admitted her. Is there a problem?" Xiao Bufan blinked, maintaining a cheerful demeanor. Su Xiaoli's expression turned to one of exasperation as she pointed at him. "Do you even know the situation with Xiao Ziyun? How could you recklessly admit her? If any disputes arise, are you prepared to face the consequences?" Having encountered Xiao Ziyun at various hospitals, Su Xiaoli had quickly unearthed her extensive medical history, learning that she had consulted no fewer than 10 different doctors, all of whom had failed to resolve her condition. Naturally, she found it hard to believe that Xiao Bufan could succeed where so many others had not. If the illness was indeed untreatable, why was he proceeding with her admission? Isn't this clearly inviting trouble for oneself? Moreover, what if the patient encounters an unforeseen incident during the treatment process? From the perspective of Xiao Bufan, a chief physician, he certainly would not be able to bear the consequences, which could ultimately jeopardize his medical career. Su Xiaoli is utterly flustered by her concern, which is why she expresses such intense anger towards Xiao Bufan, feeling an overwhelming sense of worry. Observing Su Xiaoli's furious demeanor, Xiao Bufan quickly realized the situation and smiled, gesturing for her to calm down. "All right, there's no need for you to fret unnecessarily. Since I am able to admit the patient, I certainly have a method to treat her condition. Furthermore, this is my first time admitting a patient, even if I am unable to cure her as a nurse. Shouldn't you fully cooperate with me?" Su Xiaoli was momentarily rendered speechless by Xiao Bufan's words. It is well known that healing the sick is a physician's sacred duty. If a doctor hesitates even to admit a patient, he is not a competent physician, but merely a machine trained to extract money from patients. Such doctors are not uncommon in hospitals these days. After casting a deep glance at Xiao Bufan, Su Xiaoli sighed softly. All right, I understand your point. I will assist you in admitting this patient, but you must ensure that no issues arise. Rest assured, if I lack confidence, I would not have admitted her. Xiao Bufan replied with a reassuring smile, alleviating Su Xiaoli's concerns. Subsequently, Su Xiaoli returned to the inpatient department upstairs and promptly arranged a room for Xiaozian. Ding-ling-ling. Shortly after Su Xiaoli left, Xiao Bufan's phone suddenly rang. He hurriedly pulled out his phone and discovered it was Director Wang calling. He quickly pressed the answer button. Hello, Director Wang. What can I do for you? I heard you just admitted a patient. Are you certain you can treat her? If you lack confidence, it's better not to admit her. Wang Tianqing's voice resonated through the phone, tinged with uncertainty. Xiao Bufan was momentarily taken aback. He never expected Director Wang would specifically call to inquire about this matter. He had only just admitted the patient, and already they were following up? Clearly, Su Xiaoli must have reported to him before leaving. Xiao Bufan sighed inwardly and explained to Director Wang, Rest assured, Director Wang, I am confident I can cure this patient. Otherwise, I would not have admitted her. Upon hearing this, Wang Tianqing pondered for a moment before finally nodding, affirming, All right, since you believe you can treat this patient, I won't say more. Just handle it as you see fit. With that, Wang Tianqing hung up, seemingly without further comment. Xiao Bufan shrugged in exasperation, pocketed his phone, and began disinfecting the silver needles he had found earlier. The disinfection process for the silver needles is quite straightforward, whether using fire or alcohol. Chapter 39. Acupuncture treatment upstairs in the inpatient department. After Su Xiaoli returned from the outpatient clinic downstairs, she immediately arranged a room for the patient, Xiaozian. Fortunately, there were not many patients in the traditional Chinese medicine ward, making it quite easy to assign a room. In the inpatient department, each room accommodates 2 beds, and most of the rooms were unoccupied. Not only could Xiaozian be assigned a room, but her husband, Zhang Funian, could also rest on the other empty bed. Of course, this would not incur any medical fees. After settling Xiaozian and her husband in room 19, Su Xiaoli turned her attention back to her other tasks. Despite Su Xiaoli's dedication to the patient Xiao Bufan had admitted, she could not neglect her other responsibilities. In the morning, around 10 o'clock, after seeing another patient, Xiao Bufan took the disinfected silver needles and made his way to the inpatient department upstairs. Knock, knock, knock. He rapped on the door of room 19 before pushing it open. With a creak, upon seeing Xiao Bufan enter, Zhang Funian, a middle-aged man tidying up, promptly stood up, beaming as he greeted, Hello, Dr. Xiao. Would you like some water? I can pour you a cup. As he spoke, Zhang Funian picked up a thermos at the foot of the bed, preparing to pour Xiao Bufan a cup of freshly brewed tea. This, perhaps, was the best way he could think to show his hospitality. Seeing this, Xiao Bufan smiled and waved his hand. Thank you, but I won't have any water. I should first check on your wife. That would be a great help, Dr. Xiao, Zhang Funian replied, nodding gratefully. As a patient-s family member from a rural background, he did not know how to adequately express his gratitude to a doctor, so he could only show a sincere smile. Xiao Bufan chuckled and waved his hand again. No need to be so formal every time you see me. Since I have admitted your wife, let us focus on her treatment and not burden yourselves with too much anxiety. As he spoke, Xiao Bufan approached the patient Xiaozun and smiled gently. Come, let me take your hand for a re-examination. Oh, all right. Thank you, Dr. Xiao. Xiaozun nodded and extended her wrist from under the blanket. Xiao Bufan placed his hand on her wrist, once again feeling her irregular pulse. Although he had already diagnosed her previously, conducting a second examination before treatment is essential, especially for complex ailments. However, this time, Xiao Bufan did not rely solely on pulse diagnosis. He also employed his advanced auscultation skills, carefully listening to the sounds of her internal organs and abdominal condition. As he felt Xiaozun's chaotic pulse, he attentively listened to the various sounds within her body. Through auscultation, Xiao Bufan discerned a tremor in her abdomen, evidently caused by a descending uterus leading to gastrointestinal discomfort. Additionally, he detected a faint, rhythmic sound resembling uterine pulsations emanating from her spleen. According to the saying, the sound of the spleen relates to the uterus, and in intention, it reflects thought. This thought could manifest as longing, reflection, or worry. Clearly, Xiaoxian's current condition was compounded not only by her ailment, but also by her anxiety about it, exacerbating her health issues. After identifying the internal and external causes of the patient's condition, Xiao Bufan felt more confident in treating Xiaoxian's ailment. He then retrieved the previously sterilized silver needles and addressed Xiaoxian. I will first perform acupuncture on you a few times, followed by prescription for treatment. Your condition requires both acupuncture and herbal medicine to be effective. With that, Xiao Bufan commenced the acupuncture procedure. The patient was weak with qi deficiency, necessitating a focus on replenishing vitality. Although this vital energy is intangible, it is the fundamental essence of life. Moreover, it is crucial to rectify the qi of the spleen and stomach, ensuring the patient maintains a joyful disposition. Therefore, acupuncture points such as San Yin Jiao, Qi Hai, Guan Yuan, and the foot Xiao Yin kidney meridian were prioritized, supplemented by points like Zhong Wan, Zhu San Li, and Tian Shu. With swift precision, the silver needles pierced Xiaoxian's San Yin Jiao, Qi Hai, and Guan Yuan points. Fortunately, his acupuncture skills were commendable. The technique emphasizes speed and accuracy, avoiding excessive force and depth. If inserted too deeply, not only would it cause the patient discomfort, but it would also negate the therapeutic effects of acupuncture. Additionally, various acupuncture techniques exist, including lifting and thrusting, twisting, rubbing, retaining needles, and heat supplementation. Given the complexity of Xiaoxian's condition, the lifting and thrusting technique was deemed most suitable. Each insertion was executed with rapid succession, and the entire acupuncture process lasted less than 10 minutes. Upon concluding the session, Xiao Bufan smiled as he collected the needles and informed Xiaoxian, "This acupuncture should be done twice a day. I will return to perform another session before you leave today. In the evening, please monitor whether your bleeding decreases. If it does, we will continue with acupuncture for a few more days before transitioning to herbal treatment." Acupuncture is not a miraculous remedy. It cannot resolve your condition in a single session. Even with medication, there is a necessary process. Upon hearing this, Xiaoxian nodded gratefully, saying, "Thank you, Dr. Xiao. I will keep an eye on my condition." Although she had yet to feel the immediate benefits of the acupuncture, after the session, she began to sense a warmth within her body, akin to an electric current coursing through her, particularly in the area of her uterus, a sensation she had not experienced in a long time. Xiao Bufan nodded encouragingly and added, "If you experience any discomfort this evening, feel free to have the nurses contact me. I will be on duty at the hospital today." It was a Sunday, and Xiao Bufan was scheduled to work a night shift, meaning he would remain at the hospital rather than return home. "Understood. I will remember that. Thank you, Dr. Xiao." Xiaoxian replied earnestly, expressing her gratitude once more. With that, Xiao Bufan turned to leave the ward. However, instead of heading directly to his office, he sought out Su Xiaoli to request her assistance in monitoring his patients. Though still somewhat miffed at Xiao Bufan, Su Xiaoli did not outright refuse, but nodded in agreement. After all, in a hospital setting, personal emotions must not interfere with professional responsibilities, as any negative impact on patient care would not be easily excused. In the afternoon, Xiao Bufan's clinic welcomed several patients. The first to enter was a robust young man, seemingly in good health, wearing a short-sleeved shirt that exposed much of his arms. Xiao Bufan greeted him with a smile and inquired, "Hello, what seems to be the trouble?" The previously confident young man suddenly appeared bashful upon hearing the question. "Is there something you find difficult to express?" Xiao Bufan asked, amused by his demeanor. After a moment's hesitation, the young man, Chenanjia, shyly presented his registration form and murmured, "Actually, I don't have any major issues, but I suddenly feel something is off." Xiao Bufan raised an eyebrow, momentarily taken aback. "What exactly feels off?" he asked, glancing at the form that listed, name, Chenanjia, gender, male, age, 26, appointment, traditional Chinese medicine general outpatient. Additional information, none. "You're Chenanjia, correct? What did you mean by feeling unwell?" He probed further. Chenanjia's face flushed as he stammered, "I mean, something just feels wrong." "All right, I understand now." Xiao Bufan finally grasped the situation and chuckled. "Please extend your wrist. I'll check your pulse." Chenanjia complied without further delay. As Xiao Bufan examined his pulse, he noted its rapid and thin quality, accompanied by a peculiar sound from the kidneys. It was evident that the patient had underlying kidney issues, indicative of typical kidney deficiency and insufficient kidney qi. Without needing to inspect his tongue, Xiao Bufan could ascertain the root of the problem. Curious, he asked, "What is your profession? Do you interact with many women?" "Pretty much," Chen Nanjie replied, a hint of pride in his voice. "I work as a fitness trainer at a gym, so I often interact with women." "A fitness trainer, you say?" Xiao Bufan chuckled. While he knew fitness trainers frequently had relationships, he found it amusing to encounter someone so visibly fit, yet evidently suffering from significant kidney deficiency. It was likely that this patient had been quite active socially within the gym, leading to his current state of debilitation. Upon reflecting on this, Xiao Bufan could not help but let out a deep sigh and said to Chen Nanjie, "Your ailment is entirely of your own making. It seems you indulge in certain activities rather frequently, do you not? While such pursuits may indeed be pleasurable, a man must practice moderation. Otherwise, excessive indulgence will lead to kidney deficiency and fatigue, and ultimately, you risk succumbing to impotence." At this juncture, Xiao Bufan cast a penetrating glance at Chen Nanjie before continuing. "How about this? I shall prescribe you a remedy to nourish your liver and kidneys, fortifying your energy and soothing your liver. You should take care to replenish your vitality." As he spoke, Xiao Bufan promptly wrote out a prescription containing various herbs such as angelica, romania, ephoteligastrum, eclipta, schisandra, North American ginseng, ophiopagon, dipsacus, and dried tangerine peel. This formulation serves to invigorate the liver and kidneys and enhance one's energy. However, given the patient's excessive physical exertion, it would be challenging to replenish the substantial yang energy he had depleted. Thus, Xiao Bufan added a few more ingredients, including earthworm and salvia, before handing the printed prescription and payment slip to Chen Nanjie, saying, "All right, take these to the registration desk and pay the fee. Then proceed to the herbal pharmacy to collect your medicine." Additionally, heed my advice. Young people must learn to exercise restraint. Otherwise, no matter how much medicine you take, it will not suffice to restore your health. In time, your affliction will only worsen, and even the most skilled physician would be powerless to assist. Xiao Bufan's words caused Chen Nanjie to flush with embarrassment, wishing he could vanish into the ground. Yes, I understand, doctor. I shall certainly practice moderation from now on," he replied, nodding vigorously. He was eager to leave the hospital, hoping not to encounter any acquaintances. Immediately after receiving the prescription and payment slip from Xiao Bufan, Chen Nanjie hurriedly exited the consultation room, wishing to vacate the premises without delay. Observing Chen Nanjie's hasty departure, Xiao Bufan shook his head in resignation, reflecting on the irony of the world. Those who are parched perish, and those who are inundated drown. Even a fitness instructor could suffer from kidney deficiency due to excessive indulgence. One could only imagine the lives of wealthy capitalists. Yet, how many single souls remain, confined to their homes, surviving solely on the fleeting pleasures of indulgence? Perhaps only they and heaven itself know the answer. Not long after Chen Nanjie left, a second patient entered Xiao Bufan's consultation room. This new patient presented with a relatively straightforward condition. After a brief examination, Xiao Bufan performed a couple of acupuncture sessions and resolved the issue. Following this, he enjoyed a lull of over an hour before welcoming the third patient of the afternoon. This patient was an older woman, attired in a powdery brown dress, her face heavily coated with foundation, appearing somewhat pale. Upon her entrance, Xiao Bufan immediately noticed numerous acne lesions adorning her face, commonly referred to as acne vulgaris. Perhaps this was the reason for the thick layer of foundation she wore. Acne is a chronic inflammatory skin condition affecting the pilosebaceous unit, primarily prevalent during adolescence. Encountering a patient of such advanced age suffering from acne was a first for Xiao Bufan. Furthermore, it was evident that the extent of her acne severely impacted her appearance. As soon as she entered, the woman handed her registration slip and medical history to Xiao Bufan. Her eyes filled with hope as she asked, "Doctor, could you please help me? Can traditional Chinese medicine treat my acne? I must first examine your condition before I can provide an answer." After all, traditional Chinese medicine is not a form of sorcery. It cannot be diagnosed with a mere glance. Xiao Bufan responded with a smile, accepting the registration slip and medical history. He observed the details. Name, Yang Chunhua. Gender, female. Age, 45. Registration, traditional Chinese medicine, general outpatient. Xiao Bufan scrutinized her medical history, which indicated, patient, Yang Chunhua, 45 years old, diagnosed by Western medicine with severe chronic inflammation of the sebaceous glands, overproduction of androgen, and excessive sebum secretion. Previous treatments included tetracycline and retinoid combinations, but results were unsatisfactory and prone to recurrence. Gazing at the patient's medical history, Xiao Bufan raised an eyebrow, immediately realizing that Yang Chunhua had likely consulted numerous Western physicians prior. Yet, despite these consultations, her acne remained unresolved. This led him to deduce that her condition might be classified as a difficult case of acne. To be candid, Xiao Bufan was not particularly well-versed in dermatological conditions. However, traditional Chinese medicine encompasses a broad spectrum of knowledge. Thus, while he was not an expert, he was not entirely ignorant either. In traditional Chinese medicine, acne is generally categorized into 3 diagnostic types: wind heat type, damp heat accumulation type, and phlegm dampness type. Typically, in such cases, pulse diagnosis is unnecessary. Most conclusions can be drawn from observation and inquiry. Nevertheless, given his moderate proficiency in these diagnostic techniques, he ultimately opted for pulse diagnosis. After some contemplation, Xiao Bufan set down the medical history and addressed Yang Chunhua. "Please extend your hand. I shall take your pulse to assess your condition." "Ah, yes, of course," Yang Chunhua responded, somewhat dazed, as she extended her wrist. Xiao Bufan gently took her pulse, sensing signs of qi stagnation transforming into fire, accompanied by audible disturbances in the lung organs. This clearly indicated qi stagnation and internal heat due to emotional distress, leading to the accumulation of heat and toxins, culminating in her condition, commonly known as rosacea. Rosacea is a complex form of acne, challenging to treat and often requiring extensive time for resolution. After discerning the underlying cause through pulse and auscultation, Xiao Bufan inquired, "Do you particularly enjoy drinking alcohol and consuming seafood?" It is well known that individuals suffering from emotional distress often seek solace in alcohol, yet this very indulgence exacerbates symptoms of heat and toxin accumulation, leading to conditions such as rosacea. Of course, it is essential to note that while alcohol and seafood may aggravate the condition, they are not the sole causes. Upon hearing Xiao Bufan's question, Yang Chunhua's expression momentarily darkened, and she lowered her gaze, softly responding, "Yes, doctor, you are correct. Over the years, I have developed quite the fondness for wine, and I find it necessary to consume at least a bottle of red wine each night to sleep." Upon hearing this, Xiao Bufan, while diligently inscribing his diagnosis onto the patient's medical record, gently advised Yang Chunhua, "It would be wise to limit your alcohol consumption. Otherwise, your acne will remain unresolved. Life presents no insurmountable obstacles. Some matters, once past, should remain in the past, lest you continue to burden yourself with worry. Otherwise, with your long-standing emotional distress compounded by excessive drinking, even a deity would struggle to remedy your facial issues." At this juncture, Xiao Bufan paused momentarily, contemplating before he continued. "Your acne can certainly be treated, but it may require considerable time. As for the Western medications, I advise against their use. During the treatment, you must avoid greasy, spicy foods and absolutely refrain from alcohol. Do you understand?" "Doctor, is it really impossible to have just a little?" Yang Chunhua inquired desaillie. "If I don't drink at all, I won't be able to sleep at night." Xiao Bufan halted his pen, gazing at her incredulously. "If you cannot refrain from alcohol, I cannot prescribe you treatment. Even if you take the medication, it would be futile." Yang Chunhua was taken aback. "Then how long must I abstain from drinking?" "I cannot specify a duration, but you must avoid alcohol for at least the entirety of your treatment. Otherwise, all efforts would be in vain." Xiao Bufan shrugged, his tone tinged with resignation. "If you wish for my assistance, you must adhere to my advice. Otherwise, I cannot help you." "Very well then. I will heed your guidance and refrain from drinking." After some reflection, Yang Chunhua ultimately resolved to quit drinking. After all, for a woman, her appearance holds paramount importance, far surpassing any other concern. If abstaining from alcohol could banish her acne and restore her former beauty, she would not hesitate to do whatever it takes, even if it meant consuming something as unpalatable as human excrement. In traditional Chinese medicine, such a substance, known as ren zhong huang, can be ingested in pill form or brewed as a decoction, possessing the virtues of cooling blood and detoxifying. Observing Yang Chunhua's earnest demeanor, Xiao Bufan discerned that she had taken his words to heart. With a smile, he nodded and declared, as long as you can abstain from alcohol. Your acne can be entirely cured. Allow me to prescribe a remedy for you to try." He promptly entered the details into the computer, preparing a formula known as Xian Fong Huamingyin. This traditional Chinese herbal remedy comprises ingredients such as Baiji, Beimu, Fong Fong, Qi Xiao Yao, Dangui Wei, Gan Chao Jia, Zao Jiao Ci, Chuan Shan Jia, Tian Hua Fun, Ru Xiang, Mo Yao, Jining Hua, and Chen Pai, among others. This formula is renowned for its ability to clear heat, detoxify, reduce swelling, and alleviate pain, commonly employed to treat initial stages of abscesses, inflamed tissues, and various purulent infections. Naturally, the treatment of acne falls within its purview. With a smile, Xiao Bufan finalized the prescription and reiterated to Yang Chunhua, "Remember, during the course of your treatment, you must not consume alcohol or seafood. This is imperative." "Understood, doctor. I will be diligent." Yang Chunhua assented earnestly, clutching the prescription and payment slip as she rose to complete her registration. Though she truly enjoyed drinking, she believed in her capacity to overcome her addiction for the sake of reclaiming her beauty. Once Yang Chunhua departed from his office, Xiao Bufan glanced at the time, deeming it appropriate to ascend once more to the inpatient department to continue acupuncture treatment for Qiao Ziyan. Before long, the afternoon had elapsed. As it was Sunday, Xiao Bufan was required to remain on duty at the hospital throughout the day, including the evening shift. Thus, after finishing his shift, he opted not to drive home, but instead dined at the hospital canteen, satisfying his hunger before returning to his practice. As the evening unfolded, there were few patients seeking consultations in the traditional Chinese medicine department. Consequently, Xiao Bufan found himself somewhat idle. So he took the opportunity to delve into a book on traditional Chinese medicine that he had previously acquired. Around 9 o'clock that evening, while engrossed in Jin Kuei Yao Lu, a revered ancient text of traditional Chinese medicine that serves as the foundation of herbal prescriptions, Xiao Bufan felt he had gained considerable insight. His understanding deepened with each reading, especially as his theoretical knowledge progressed. He pondered whether the system would reward him with proficiency in this text during the next sign-in. With a smile, Xiao Bufan set aside Jin Kuei Yao Lu and resolved to venture out for a late-night snack, feeling it inappropriate not to procure something to eat at such an hour. Given the lack of patience, he removed his white coat, secured the door to his office, and strolled outside. The fifth hospital of Shiyuan City is situated in a relatively vibrant area, surrounded by numerous residential complexes, shopping centers, and pedestrian streets, ensuring a bustling atmosphere not dissimilar to the city center. After exiting the hospital, he ambled leisurely to a nearby barbecue stall, ordering a selection of grilled delicacies. Naturally, he refrained from ordering any alcoholic beverages, adhering to the prohibition during his shift. After spending a brief 15 minutes indulging in his late-night meal, he wiped his mouth with a napkin and turned to head back to the hospital for a rest. Yet, just as he pivoted, a vehicle careened into view from down the street, disregarding the traffic light and hurtling towards him. Alarmed, Xiao Bufan halted in his tracks. In an instant, the vehicle veered sharply, crashing into the barbecue stall across the street with a thunderous crash, toppling tables and scattering grilling equipment. The vehicle finally came to a halt after colliding with a large tree behind the stall, its front crumpled beyond recognition, the hood lost in the chaos. In an instant, the once tranquil night market erupted into chaos. Countless bystanders and onlookers were startled into screams. At this moment, the fate of the driver inside the vehicle remained uncertain. Even more horrifying was the sight of several patrons enjoying barbecue who had been knocked to the ground. The scalding barbecue stand toppled onto some of them, resulting in severe burns, and in some cases, they were pierced by skewers from the barbecued food. It hurts. Help. Mommy, I want my mommy. Call the police. Call an ambulance. Someone please help. Is anyone coming to assist? My leg. It feels trapped. Someone help me. Is there anyone to save me? I don't want to die. The cries of agony rose and fell, quickly drowned out by the panicked screams surrounding the scene. What happened? A car accident? Xiao Bufan was momentarily stunned before snapping back to reality, sprinting towards the nearby barbecue stand. The area where Xiao Bufan was situated was lined with barbecue stalls, bustling with patrons, and given the proximity to a hospital, the foot traffic was particularly heavy. As he hurried towards the barbecue stand, he fished out his phone and dialed emergency services, stating urgently, "Hello, is this the police? I need to report a serious car accident." The location is near the barbecue stalls on the pedestrian street opposite the 5th hospital. Please send help immediately. The operator quickly grasped the situation and confirmed. So, the barbecue stalls across from the 5th hospital, right? We will dispatch help right away, but you might want to contact the emergency department there as well. Of course. The 5th hospital is right across the street. Why am I even calling the police? Xiao Bufan thought, hastily dialing the emergency department of the hospital. Quickly, there's been an accident at the barbecue stalls on the pedestrian street across from the hospital. Send someone for immediate assistance. After hanging up, Xiao Bufan rushed to the scene of the accident. The nurse who answered the call at the emergency department was momentarily taken aback, seemingly unable to comprehend Xiao Bufan's words. Fortunately, others in the emergency department had already noticed the accident occurring across the street and promptly reported the situation to Director Fong. Meanwhile, Xiao Bufan arrived at the scene and was struck dumb by what lay before him. The vehicle was completely mangled, and the driver's head was crushed, evidently lifeless. It was a tragic sight. Despite the vehicle's reputed safety features, it lacked airbags. A quick assessment revealed at least 3 individuals had suffered severe burns, and several others had minor injuries, with 2 being impaled by skewers from the barbecue. This was clearly the aftermath of a catastrophic accident. What on earth was the driver thinking? This is madness. Yet, the driver could no longer respond, and no amount of cursing would change the grim reality. The disaster had already occurred, rendering any complaints utterly futile. With a heavy heart, Xiao Bufan shook off his anger and began to assist the injured. The driver was beyond help. There was no point in attending to someone who was evidently deceased. Instead, he approached an injured bystander, crouching down to assess the extent of their injuries. Though merely a traditional Chinese medicine practitioner, he was capable of making initial evaluations of injuries that often surpassed those made by Western doctors. The injured individual appeared to be in their 20s. Their body covered in burns from the flying embers of the barbecue, their face swollen with massive blisters. It seemed they had no time to evade the disaster when it struck, resulting in them being thrown to the ground, with several skewers embedded in their body. The sight was utterly harrowing. Realizing the delicate nature of the situation, Xiao Bufan understood he could not physically examine the injured person without inflicting unbearable pain. Help, please. I don't want to die. Zhang Ziao lay on the ground, trembling in agony, his teeth chattering. Despite the excruciating pain, he was terrified that if he closed his eyes, he might never open them again. Thus, through gritted teeth, he continued to cry out for help, striving to maintain consciousness. Xiao Bufan never anticipated that a simple night out for a snack would lead him to the scene of such a horrific accident. Observing the wounded, he realized he had to act swiftly to provide aid. In situations involving burns, there exists a crucial 2-minute window for treatment. Failure to act within this time frame could lead to scarring, even if healing occurs later. A wealth of traditional medical knowledge flooded Xiao Bufan's mind as he quickly surveyed the surroundings. Soon, he noticed bottles of rice vinegar at nearby barbecue stalls and shouted to the crowd, "Quickly, bring me the rice vinegar from those stalls. Hurry, rice vinegar can treat burns." Rice vinegar possesses properties that alleviate bruising, control bleeding, and detoxify, a time-honored remedy established by traditional Chinese medicine over millennia. In addition to rice vinegar, other natural substances, such as tung oil, egg yolks, and hibiscus leaves, could also provide effective treatment for burns. Upon hearing his call, several young men sprang into action, rushing to retrieve bottles of rice vinegar from the nearby stalls. This illustrated the willingness of many to lend a helping hand during times of crisis. Soon, Xiao Bufan took the rice vinegar handed over by several individuals, unscrewed the cap, and poured it onto Zhang Ziao's wound. "Ah, it hurts. It hurts so much." Zhang Ziao suddenly cried out in agony, rolling on the ground. "Quick, hold his hands and feet to prevent him from moving. Otherwise, the dirt on the ground could easily lead to infection." Xiao Bufan shouted to the young men nearby. After glancing at the writhing Zhang Ziao, the young men promptly restrained his limbs to prevent further movement. Xiao Bufan then continued to pour the rice vinegar onto the burn area of Zhang Ziao's body. It hurts. Let me go. You have to let me go. It's unbearable." In an instant, Zhang Ziao was in excruciating pain, yet he struggled in vain against the hold of several individuals. "Won't you stay here to watch over him? We will proceed to assist the next injured person." After applying rice vinegar to Zhang Ziao's burns, Xiao Bufan instructed the young men and turned to rush towards the next injured passerby. The The young men exchanged glances, leaving one to monitor Zhang Ziao while the others followed Xiao Bufan to the next injured individual. Fortunately, there were only 3 severely burned victims at the scene, allowing for a relatively swift treatment. As for the other injured pedestrians, their injuries appear to be minor and likely not serious. With the 5th hospital just across the street, Xiao Bufan believed the emergency medical team would arrive swiftly, so he prioritized emergency treatment for the severely burned patients first. As Xiao Bufan tended to the last patient with severe burns, a group of doctors and nurses from the 5th hospital's emergency department finally arrived with a stretcher. "Quick! Assist the injured patients. We must act swiftly." The head of the emergency department, Director Fong Yunpeng, clad in a white coat, appeared at the scene. "Yes, Director, we understand." The emergency staff responded in unison, swiftly beginning their tasks. At that moment, a female nurse from the emergency department approached Xiao Bufan, pointing at him and questioning, "Hey, what are you doing? Who allowed you to apply things on the injured? Do you realize that this could lead to severe infections?" As she spoke, she attempted to intervene and stop Xiao Bufan's actions. Xiao Bufan looked up and noticed he did not recognize the nurse. Although he was also a doctor at the 5th hospital, he worked in the traditional Chinese medicine department, making it understandable that he did not know the emergency nurse. However, before the nurse could reach him, Director Fong Yunpeng's voice rang out. "Oh, Dr. Xiao, what are you doing here?" "Huh, Director Fong?" Xiao Bufan was taken aback for a moment, then smiled and replied, "If I said it was a coincidence, would you believe me?" "Yes, I believe." Fong Yunpeng smiled slightly and turned to the nurse beside him, saying, "All right, Xiao Li, you need not interfere with Dr. Xiao. He is our attending physician in traditional Chinese medicine, so he should be fine." "Oh, okay," the nurse nodded, no longer attempting to halt Xiao Bufan's actions. Fong Yunpeng glanced at the rice vinegar in Xiao Bufan's hand, curiosity evident in his tone. "Dr. Xiao, what are you doing? Why are you pouring rice vinegar on the injured?" Hearing this, Xiao Bufan smiled slightly and explained, "Rice vinegar has properties that disperse blood stasis, stop bleeding, detoxify, and kill parasites. It is quite effective for alleviating redness, swelling, and pain caused by burns." There was simply nothing else available at the scene. Considering the crucial 2 minutes for treating burns, I chose to apply rice vinegar to these severely burned patients to prevent their skin from rupturing. Does rice vinegar really have such a healing effect for burns? Fong Yunpeng appeared momentarily stunned, then realized, "Well, it seems I have been a bit uninformed." "Dr. Xiao, you know that we in Western medicine are not familiar with your practices, but based on the conditions of these patients, it appears their burns have indeed been effectively addressed." At this point, Fong Yunpeng paused, surveying the patients before continuing. "Fortunately, these 3 severely burned individuals have not shown any adverse reactions. We will need to wait until we return to the hospital for further examinations." It was important to note that by the time they arrived at the scene with the stretcher, over 4 minutes had passed since the accident occurred. If Xiao Bufan's treatment had been ineffective, the patients would have already been experiencing rapid heartbeats and excruciating pain. Yet, the 3 severely burned individuals remained calm, allowing the medical personnel to lift them onto the stretcher without protest. Clearly, Xiao Bufan's urgent care had made a difference. Fong Yunpeng believed that this young attending physician from traditional Chinese medicine would not recklessly treat patients. After all, he had previously diagnosed an internal hemorrhage merely by taking a pulse. Reflecting on this, Fong Yunpeng smiled and asked Xiao Bufan, "Dr. Xiao, would you be interested in working in our emergency department?" "Huh? Work in your emergency department?" Xiao Bufan was momentarily stunned, seemingly unable to believe his ears. The director of the emergency department was actually asking him if he wanted to join their team. "But I am a practitioner of traditional Chinese medicine." Chapter 44. My future in traditional Chinese medicine. "You want me, a TCM doctor, to work in the emergency department? Are you serious?" Xiao Bufan looked at Fong Yunpeng in disbelief, feeling somewhat speechless. "Director Fong, are you joking with me? I am a physician in traditional Chinese medicine, and you want me to work in the emergency department? Do you think that is realistic? The methods of treatment in your emergency department and in traditional Chinese medicine are entirely different systems." "No, I am not joking," Fong Yunpeng replied with a slight smile, looking seriously at Xiao Bufan. "Although you practice traditional Chinese medicine, who says TCM cannot be applied in emergencies? While I may not be familiar with your treatment methods, I know that some TCM techniques can indeed be utilized for emergency care. There is no rule preventing TCM practitioners from entering the emergency department." As the director of the emergency department, although Fong Yunpeng did not fully understand TCM, He had witnessed TCM doctors using their methods for emergency treatment and found it quite enlightening. Thus, despite his lack of knowledge about TCM, he still held a respectful attitude towards practitioners. However, he firmly believed that traditional Chinese medicine could be employed for emergency treatment. Upon hearing Fang Yunpeng's assertion, Xiao Bufan was momentarily taken aback, as if profoundly touched by the words. Indeed, who says that traditional Chinese doctors cannot work in emergency departments? Who claims that traditional Chinese medicine cannot be used in emergencies? In contemporary society, people have become accustomed to relying solely on modern medicine for resuscitating patients. Yet they often overlook the existence of traditional Chinese medicine. It must be acknowledged that traditional Chinese medicine is a complete medical system. It is not merely an isolated discipline nor a method solely for nurturing the body. It is a time-honored practice utilized by our ancestors for thousands of years to heal ailments. Even during the millennia before the advent of Western medicine, traditional Chinese medicine illuminated the vast lands of China with its brilliance. Over the centuries, it has undoubtedly saved countless lives. Thus, traditional Chinese medicine is far from being a worthless practice. Rather, it is a legitimate and effective form of medicine capable of preserving life. Nevertheless, Xiao Bufan, while possessing unwavering confidence in the potential of traditional Chinese medicine for emergency treatment, was acutely aware that his current medical skills had yet to reach that level. After some contemplation, he politely declined Director Fang's kind invitation, saying, "Thank you, Director Fang, for your offer. But I believe it is more suitable for me to remain in the traditional Chinese medicine department. I think the emergency department may not be the right fit for me." Despite the fact that emergency department physicians enjoyed the highest salaries in the hospital and that Director Fang had extended an invitation, Xiao Bufan steadfastly believed that he was fundamentally a practitioner of traditional Chinese medicine. Therefore, staying in that department was the most fitting choice for him. Moreover, he envisioned his future path within the realm of traditional Chinese medicine, rather than in emergency care. Seeing Xiao Bufan decline his invitation, Fang Yunpeng appeared to have anticipated this outcome. With a smile, he replied, "Very well, since you prefer not to join our emergency department, we will respect your decision. However, the doors of our emergency department will always remain open to you. You are welcome to come anytime. Thank you for your kindness, Director Fang. If the need arises, I will certainly consider it." Xiao Bufan expressed his gratitude with a smile. Subsequently, he joined his colleagues in transporting the injured individuals back to the hospital, where the emergency department prepared to provide further treatment. At that moment, the sound of sirens from the police arrived, echoing from afar. Soon, 3 police cars came to a halt, and a contingent of officers disembarked, immediately commencing their investigation of the accident scene. Aside from the deceased driver, who had not yet been transported to the hospital, all other injured parties had already been taken to the emergency department of the 5th hospital. Consequently, upon their arrival, the police had relatively few tasks to perform. Their responsibilities were limited to retrieving the deceased driver, assessing the cause and circumstances of the accident, and determining liability. As for compensation for the injured, that would fall under the jurisdiction of the courts. After conducting a thorough examination of the scene, the officers soon discerned that the driver of the vehicle involved in the accident reeked of alcohol. This revelation eliminated the need for further investigation. It was evident that the deceased driver had been drinking. Alas, yet another traffic accident caused by driving under the influence. Why do people refuse to heed the warnings? "Do not drink and drive," lamented an older officer who diligently recorded the findings of the accident. At that moment, a more authoritative officer addressed his colleagues, stating, "All right, the results of the scene are quite clear. The accident was caused by the driver operating the vehicle under the influence. You 3 stayed behind to photograph the scene. The rest of you, accompany me to the hospital to take statements from the injured and the doctors. After all, the injured have already been transported to the hospital." "Understood. Team Leader Chin." The officers acknowledged, quickly dividing into 2 groups to set their plans into motion. Before long, Team Leader Chin, accompanied by several officers, arrived at the 5th hospital's emergency department to interview the injured pedestrians. As the first doctor on the scene, Xiao Bufan was naturally called in to provide his statement as well. After completing the interviews, the hour approached 11 at night. At this point, aside from the emergency and inpatient departments, the rest of the hospital had dimmed its lights for the night. Thus, after finishing his statement, Xiao Bufan returned to the outpatient room of the traditional Chinese medicine department and laid down in the nearby lounge, quickly drifting into slumber. Of course, The inpatient department remained lit, and nurses were still on duty in the outpatient room. However, given the late hour, it was unlikely that any patients would arrive at the traditional Chinese medicine department seeking treatment. Consequently, the medical staff on duty had mostly retired for the night, with no one foolishly lingering about. Xiao Bufan was no exception. Yet, if any patients were to arrive during this late hour, the nurses at the station would promptly awaken Xiao Bufan, so sleeping during night shifts was not a concern. After all, he was not the sole staff member on duty in the department. In the stillness of the night, while Xiao Bufan was sound asleep, Xiao Ziyun, lying in room 19 of the inpatient department, suddenly awakened and decided to use the restroom. Upon entering the bathroom, she glanced down at the blood flow and was taken aback, her eyes widening in disbelief. The bleeding has truly diminished. In that instant, tears of joy streamed down her face, overwhelmed with excitement. It was astonishing that after just 2 acupuncture treatments earlier in the day, the relentless bleeding she had endured had significantly reduced. This transformation filled her with unprecedented shock. It was the exhilaration within her that prevailed. The bleeding has genuinely lessened. After using the restroom, Xiao Ziyun excitedly roused her husband, Zhang Fenian, her voice a mix of joy and disbelief. What has lessened? Zhang Fenian rubbed his bleary eyes, still appearing somewhat groggy from sleep. My bleeding has decreased, Xiao Ziyun exclaimed, grasping Zhang Fenian's arm, her face radiant with excitement as she repeated her news. You mean your bleeding has lessened? Zhang Fenian's expression shifted, first to one of astonishment and disbelief, followed by sheer joy as he embraced his wife, Xiao Ziyun. Really? Does this not imply that your ailment has hope for a cure? Such delightful news brought tears of joy to Zhang Fenian and his wife, Xiao Ziyun, as they embraced, their pent-up emotions finally pouring forth after years of restraint. However, they soon composed themselves, aware of the late hour and the need to maintain the tranquility of their hospital surroundings. After exchanging exhilarated glances, the couple found themselves unable to quell their excitement, resulting in a night of complete insomnia. The following morning, as dawn barely broke and the clock struck 6, Xiao Bufan awoke from his slumber. He gathered his toiletries from the outpatient room and proceeded to freshen up. After washing up, he stepped outside the hospital to purchase a few buns to satiate his hunger before returning to his outpatient room to instruct the system. System, sign me in. Ding. Sign in successful. Congratulations to the host for acquiring the complete compendium of traditional Chinese massage. Advanced. Traditional Chinese massage? This reward appeared to be quite commendable. Xiao Bufan's eyes brightened, a subtle smile gracing his face. Although it was merely an advanced version of the complete compendium of traditional Chinese massage, it represented a significant reward for him. Traditional Chinese massage, rooted in the theories of organ systems and meridian studies, employs manual techniques for therapeutic purposes alongside pathological diagnosis. As the saying goes, massage is akin to medicine. The hands serve as the remedy. Traditional Chinese massage encompasses pediatric massage, health maintenance massage, and gynecological massage, among other therapeutic techniques. In the realm of traditional Chinese medicine, some patients may require no medication, as a few sessions of massage could completely resolve their ailments. This approach boasts minimal side effects and extensive applicability, rendering it a vital component of the traditional Chinese medicine framework. Within this context, the significance of massage is on par with acupuncture, both being equally essential. As an unfamiliar memory surged into his consciousness, Xiao Bufan swiftly assimilated the knowledge from the system's reward, integrating the complete compendium of traditional Chinese massage into his broader understanding of traditional Chinese medicine. One cannot deny the impressive efficacy of this system. With each passing day, the knowledge and clinical experience he garnered through the system's sign-ins enriched his medical skills far beyond the traditional learning from a cadre of esteemed practitioners. Just as he finished processing the system's reward, Nurse Qin Zuru, in her high heels, approached and called out, "Dr. Xiao, it's time for the morning meeting. Hurry up." Yes, I understand," Xiao Bufan replied, snapping back to reality before rising to accompany Nurse Qin to the conference room. It was Monday, the time for their weekly departmental meeting. Upon arriving, he noted that the rest of the staff had already gathered. Director Wang Tianqing glanced at the tardy Xiao Bufan, but refrained from commenting, simply surveying the attendees. "Are we all present?" "Yes, everyone is here," Nurse Qin Zero affirmed. "Good. Since we are all here, let us proceed with a brief morning meeting. We have 2 matters to discuss today. First, concerning our department's performance. Colleagues, we must exert ourselves. If we continue on this path, we may not even secure the basic attendance bonus next month. Are you not aware of the need to promote our traditional Chinese medicine department actively? Attracting patients is essential for our achievements and bonuses. Ultimately, we rely on this for our livelihoods. If you remain so unambitious, you may find yourselves seeking alternative means for your salaries. At this point, Director Wong paused, surveying the group before continuing. The second matter pertains to the one-on-one training program. In a few days, our hospital will welcome a new cohort of intern doctors, and some interns will be assigned to our department. Each of you attending physicians will need to mentor one intern. Understood? Director, do I need to mentor as well? Xiao Bufan asked, slightly taken aback. Wang Tiansheng frowned slightly and replied, "You are also one of our attending physicians. Of course, you are required to mentor. Otherwise, how will we arrange the interns? This training demands one-on-one mentorship. Each attending physician must guide one intern, and only one. Do you understand?" "Yes, Director, we understand." The group of doctors and nurses responded in unison. The reason for the collective response was the possibility of intern nurses being included in the program. After all, each batch of interns consists not solely of outpatient doctors. Xiao Bufan nodded along with the others. After a thorough look around the room, Wang Tianqing nodded satisfactorily and waved his hand. "All right, that concludes today's morning meeting. Everyone, return to your duties." "Thank you, Director." The group politely expressed their gratitude before dispersing to resume their tasks. Xiao Bufan blinked and turned to head back to his outpatient room. Suddenly, Director Wong called out to him, "Dr. Xiao, wait a moment. There will be a consultation at the orthopedic department shortly. Come with me to gain some clinical experience." "Huh? Director Wong, you're taking me to the orthopedic consultation?" Xiao Bufan was momentarily stunned, finding it hard to believe. Why was Director Wong suddenly being so generous? With a smile, Wang Tianqing nodded. "Yes, Dr. Xiao, I believe your recent performance has been commendable, hence my decision to bring you along." He then gave Xiao Bufan a gentle pat on the shoulder and exited the conference room. As Xiao Bufan observed the departing figure of Director Wong, he stood in a daze for a moment before finally returning to his outpatient room. Chapter 46. The Consultation. Director Zhou. The temperature outside remained uncomfortably high, the summer sun stretching the hours interminably. Sitting in his outpatient room, Xiao Bufan occasionally peered into the traditional Chinese medicine department as waiting area, reflecting on the disheartening scarcity of patients seeking treatment. As the morning wore on, Xiao Bufan sat in the outpatient room, yet he had not seen a single patient, which left him feeling rather bored. It was no wonder that Director Wong had expressed his sentiments during the morning meeting. However, to consider it from another perspective, if hospitals across the world were devoid of patients, it would indeed be a positive sign, indicating a universal absence of illness. Yet, this was far from reality. Each day, patients afflicted with ailments continued to arrive in droves. The only difference was that fewer chose traditional Chinese medicine, opting instead for Western medicine in pursuit of immediate results and swift recovery. With the evolution of the times and advancements in technology, traditional Chinese medicine faced unprecedented challenges. Were it not for certain conditions that only traditional Chinese medicine could effectively treat, it is conceivable that its practice might be relegated to obscurity. Knock, knock, knock. Just as Xiao Bufan pondered these thoughts, Wang Tianqing strolled in leisurely and rapped on the door of Xiao Bufan's outpatient room, announcing, "Dr. Xiao, it's time to go for the consultation." "Oh, right," Xiao Bufan replied with a smile, rising to accompany Director Wong towards the orthopedic department. The two exchanged no further words during their walk. Soon, they arrived at the orthopedic outpatient clinic, where Director Yang Xuezheng looked up upon their arrival and greeted them with a smile. "Director Wong is here. Let me brief you on the patient's condition." The patient is Zhou Haitao, nearly 53 years old, a leader in our city's health bureau. His condition primarily stems from a herniated disc, resulting in sciatica, and he exhibits significant muscle weakness in his lower back, along with slight atrophy in the anterior tibial muscle, while everything else appears normal. We have been treating Director Zhou for nearly half a year now, but his sciatica keeps recurring, and we have been unable to achieve a cure. Initially, we considered surgical intervention, but he is unwilling to undergo surgery. Recently, he has been irritable, which prompted us to seek your expertise in traditional Chinese medicine to explore potential treatment options. As he spoke, Yang Xuezheng led Wang Tianqing and Xiao Bufan to the doorway of the orthopedic ward. However, he paused before entering, turning to Wang Tianqing. I am aware that traditional Chinese orthopedic techniques can be remarkably effective for such ailments. Though I have dabbled in it myself, my knowledge is insufficient, and I can only request you take a look. As the head of the orthopedic department, Yang Xuejing had indeed studied some traditional Chinese orthopedic techniques. However, he lacked the proficiency and the differential diagnostic perspective inherent to traditional Chinese medicine, having primarily focused on Western medical practices. Thus, even with his limited knowledge, he could only apply it to simple fractures or dislocations. Upon hearing Yang Xuejing's words, Wang Tianqing nodded in agreement. I must first assess Director Zhou's condition to make an accurate diagnosis. Otherwise, merely listening to your account will not suffice. I understand, but I must caution you, Director Wang. While this consultation is crucial, please do not provoke Director Zhou's temper. Otherwise, we may all face dire consequences, Yang Xuejing advised, exuding a sense of resignation. Despite the seemingly modest rank of the Health Bureau chief, his authority over the management of hospitals was substantial. If the treatment were successful, all would be well. However, failure would likely lead to severe repercussions for the entire orthopedic department. Yang Xuejing's earnest expression made it clear he was concerned about the implications of their visit. Wang Tianqing, understanding his worries, smiled reassuringly. I comprehend your concerns, yet we must first examine Director Zhou's specific condition. Absolutely. With that, Yang Xuejing pushed open the ward door and entered first. Wang Tianqing exchanged a knowing glance with Xiao Bufan before stepping into the room alongside him. Upon entering, Yang Xuejing greeted the patient in the bed with a warm smile. Director Zhou, I have summoned Director Wang from the traditional Chinese medicine department to examine you. Perhaps they can offer some solutions for your condition. He gestured towards Wang Tianqing, introducing him. This is Director Wang Tianqing from our Chinese medicine department, whose expertise is well regarded throughout the city. I am confident that his skills will be of benefit to you. Yang Xuejing refrained from making definitive claims, merely suggesting that there might be some assistance for Director Zhou's condition, leaving the final diagnosis open-ended. Wang Tianqing approached the bed with a smile, addressing the patient, Hello, Director Zhou, I am Wang Tianqing from the traditional Chinese medicine department. Zhou Haitao, lying in bed, struggled to sit up, but found the pain in his back so intense that he could not manage it. Oh, the pain is unbearable, he exclaimed in distress, before surrendering to the bed, looking at Wang Tianqing. Director, I apologize. I am in such agony that I cannot even rise to greet you. Not all, Director Zhou. No need for apologies. You are a patient. We understand, Wang Tianqing responded, moving closer to the bedside. Perhaps I should examine you first. Otherwise, it will be challenging for me to ascertain the nature of your ailment. What is there to ascertain? I have undergone countless examinations. It is merely a herniated disc pressing on the nerve. Zhou Haitao lamented, wincing as he placed a hand on his lower back to alleviate the pain. By the way, I have heard that your traditional orthopedic techniques can alleviate herniated discs. Why not just give me a massage? Wang Tianqing paused momentarily, then smiled as he explained. You are correct, Director Zhou. Our traditional orthopedic techniques can indeed alleviate certain skeletal and meridian issues. However, an examination is essential first. Otherwise, we cannot determine the appropriate technique for your treatment. Moreover, it is important to note that the location of pain varies, necessitating different acupressure points. Thus, I must first identify the specific area of your discomfort before proceeding with any treatment, for a blind massage could not only be ineffective but might exacerbate your condition. Upon hearing Wang Tianqing's explanation, Zhou Haitao couldn't help but nod and said, All right then, please proceed with the examination. With that, Zhou Haitao reclined on the hospital bed, allowing Wang Tianqing to commence his assessment. Chapter 47. Shall I have a go? In the orthopedic ward, Wang Tianqing began to evaluate Zhou Haitao's physical condition. The sciatica caused by a herniated disc is particularly unique. This ailment cannot be diagnosed through pulse examination but must be assessed via palpation. Palpation, also known as pressure diagnosis, involves touching and pressing specific areas of the patient's body to garner diagnostic impressions. Wang Tianqing lifted the medical blanket covering Zhou Haitao and began pressing around his lower back while inquiring, Does this hurt? Oh, that hurts. Zhou Haitao instantly felt a sharp pain in his lower back, unable to suppress a gasp, and exclaimed, Could you please be gentler, Director Wang? It's excruciating. And how about here? Wang Tianqing shifted to a different spot and pressed again. This isn't too painful, just a little numb. What about this area? That doesn't hurt. All right. I understand. Wang Tianqing withdrew his right hand, nodding slightly. Director Zhou, the protrusion between your lumbar vertebrae 4 and 5 is quite severe, completely compressing your nervous system, which explains the intense pain in your sciatic nerve. Zhou Haitao furrowed his brow and asked, "Can this be treated with traditional Chinese medicine manipulation?" Wang Tianqing pondered for a moment and replied, "Indeed, traditional Chinese manipulation can remedy your condition, but it largely depends on the practitioner's skill level." He continued, "To alleviate the symptoms of a herniated disc through external force, the practitioner must possess exceptional technique, ideally reaching a level known as Hua Jin to effectively treat such a serious condition." Huh? What do you mean by that? Zhou Haitao looked bewildered, sensing an ominous undertone in Wang Tianqing's words. With a smile, Wang Tianqing shrugged and said, "To put it plainly, while I do have some understanding of traditional manipulation, my skills have not yet attained that level. Therefore, for your herniated disc-induced sciatica, I would personally recommend considering surgical treatment." Zhou Haitao was rendered speechless upon hearing this. If he had wanted surgical intervention, why would he have waited until now? He grimaced, feeling an inner turmoil akin to a stampede of 1,000 wild horses. At this moment, Wang Tianqing too felt somewhat helpless regarding Zhou Haitao's sciatica. It is well known that traditional Chinese manipulation can indeed cure sciatica caused by a herniated disc, but the effectiveness hinges on the severity of the condition and the practitioner's skill. Moreover, it is crucial to note whether the manipulation doctor has reached that exceptional level. Should an unqualified practitioner attempt to perform the manipulation, the treatment might not only prove ineffective, but could exacerbate the condition. Of course, traditional Chinese medicine offers more than just manipulation techniques for treating herniated discs. Some family tradition practitioners possess proprietary formulas for plasters that treat injuries and herniated discs. Though these recipes are closely guarded secrets, the efficacy of such remedies can also be limited. Thus, finding suitable plasters for treating herniated discs often depends on sheer luck in encountering the right practitioner. Traditional manipulation and some family recipes for plasters can indeed address issues like sciatica. Standing by, Xiao Bufan observed the scene for a while, his expression reflecting an inner conflict. Should he speak up? It's merely a matter of Hua Jin manipulation. Director Wang doesn't he know how, but I do. Earlier that morning, he had signed in and fortuitously received an advanced text on the complete treatise on traditional Chinese manipulation, which included clinical experiences regarding Hua Jin manipulation. However, it is essential to clarify that the concept of Hua Jin in traditional Chinese manipulation differs significantly from the martial arts portrayal of the term, which emphasizes penetrating force for combat. In traditional manipulation, Hua Jin focuses on a sticky and flowing energy, serving as a means to treat the patient as soft tissues and bones through external force. This principle arises from the belief in traditional Chinese medicine that if external force can cause harm, it can similarly be employed to heal. As Xiao Bufan hesitated, Zhou Haitao, lying on a hospital bed, noticed his expression and immediately pointed at him, asking, "Is this young man also a doctor in your traditional medicine department?" He seems to have something to say. As the head of the health bureau, Zhou Haitao possessed considerable acumen in reading people, a skill crucial for his position. He immediately discerned that Xiao Bufan had something to express. Hearing Zhou Haitao's inquiry, Wang Tianqing turned to Xiao Bufan with a smile and introduced him. "This is Dr. Xiao Bufan, our attending physician in the traditional medicine department." At this juncture, Wang Tianqing paused, then looked at Xiao Bufan earnestly and asked, "So, Xiao, do you have something to share?" After pondering for a moment, Xiao Bufan decided to speak candidly. "I merely wish to say that if Director Zhou's herniated disc requires Hua Jin manipulation, perhaps I could give it a try." "You? Hua Jin manipulation?" Wang Tianqing was momentarily taken aback, his expression one of disbelief. "Are you implying that you can perform Hua Jin manipulation?" "Dr. Xiao, this is no joking matter. Are you certain you possess this skill?" It wasn't that Wang Tianqing was unwilling to accept Xiao Bufan's claim. Rather, the concept of Hua Jin manipulation was so advanced that even his mentor couldn't accomplish it. How could he believe that this young man could? Although Wang Tianqing's mentor was not a nationally renowned master, he was certainly esteemed within the realm of traditional manipulation. If even his mentor could not master Hua Jin manipulation, how could Xiao Bufan possibly do so? Nevertheless, Xiao Bufan looked at Wang Tianqing earnestly and nodded. "Director Wang, I assure you, I am not jesting. Shall I give it a try? Wang Tianqing was momentarily stunned, questioning whether he had misheard. Chapter 48. The herniated disc is healed you? Hua Ji manipulation? Surely you jest. A glimmer of astonishment crossed Wang Tianqing's face, his disbelief palpable. Xiao Bufan nodded seriously. I am not joking. I truly can perform Hua Ji manipulation. Gazing at Xiao Bufan's earnest demeanor, Wang Tianqing remained skeptical, for this proposition was entirely beyond his expectations. At this moment, Director Zhou, lying on the hospital bed, couldn't help but gesture towards Xiao Bufan, asking, why not let you give it a try? Are you certain you can cure my ailment? Zhou was in considerable discomfort, his lower back aching intolerably. Thus, upon hearing Xiao Bufan mention his expertise in energy manipulation massage, Zhou felt as though he had grasped a lifeline, experiencing a desperate hope akin to a patient frantically seeking a remedy. Indeed, I am skilled in energy manipulation massage, but I must first conduct an examination, Director Zhou. Xiao Bufan replied with a smile, his demeanor earnest. Although Director Wang had already assessed Zhou, Xiao Bufan had yet to perform his own examination. This step was essential. Without it, he could not ascertain the specifics of Zhou's condition, let alone proceed with treatment. In traditional Chinese medicine, every patient is treated uniquely, and even the same patient may receive different diagnoses from various practitioners. Upon hearing Xiao Bufan's words, Zhou Haitao turned to glance at Wang Tianqing, standing beside him, and nodded. Very well, then I shall trouble you, Dr. Xiao, to examine me. While Zhou had no way of confirming Xiao Bufan's claims of expertise, the intensity of his pain left him little choice. Even a glimmer of hope for alleviation was worth pursuing, as long as it did not involve surgery. Xiao Bufan approached, loosening his wrists as he prepared to assess Zhou's lower back. Wang, initially inclined to object, ultimately refrained from speaking out. After all, he had intended to bring Xiao Bufan for a consultation, and to interject now would be to undermine his own intentions, especially since it was Zhou himself requesting Xiao Bufan's assistance. With a gentle touch, Xiao Bufan placed his right hand on Zhou's lower back, commencing his examination. His technique was remarkably gentle, causing Zhou to feel no discomfort at all. Zhou quickly recognized that Wang's massage methods paled in comparison to Xiao Bufan's. Doubts that lingered in Zhou's mind about Xiao Bufan's claims began to dissipate, replaced by a burgeoning belief in his abilities. As Xiao Bufan's hands glided over Zhou's lower back, he adeptly gauged the severity of the condition through the pressure he sensed. For a skilled practitioner of traditional Chinese massage, the hands serve as the most accurate diagnostic tools. Xiao Bufan's tactile examination provided insights akin to a modern medical scan, allowing him to discern the extent of Zhou's musculoskeletal injuries. He soon confirmed that Zhou's condition aligned closely with Wang's earlier assessment, noting significant protrusion between the fourth and fifth lumbar vertebrae. With a smile, Xiao Bufan addressed Zhou, Director. While your herniated disc is somewhat severe, the intervertebral spacing is relatively narrow. This suggests that with a few sessions of massage, you should recover fully. Really? Zhou's face lit up with surprise and hope. Is that true? Xiao Bufan nodded confidently. Trust me, Director Zhou, your condition is not as dire as it may seem. As Dr. Wang mentioned, with energy manipulation massage, complete recovery is achievable. Zhou expressed his gratitude and urged Xiao Bufan to begin the treatment without delay. After flexing his wrists once more, Xiao Bufan commenced the massage with dedication. As he began, Xiao Bufan's hands moved like fluttering butterflies, deftly tapping various acupoints on Zhou's back before transitioning to kneading and pressing. In an instant, Zhou felt an immense wave of comfort wash over him, as if the pain had evaporated entirely. He questioned whether he had merely been dreaming of his earlier discomfort. This feels wonderful. Zhou couldn't help but moan in satisfaction, his expression one of utter enjoyment. The scene left Wang Tianqing and Yang Xuezheng, who were waiting nearby, utterly astonished. Could it be? Is Xiao truly capable of energy manipulation massage? Though Wang did not fully comprehend the intricacies of Xiao Bufan's technique, he was profoundly impressed by Zhou's evident relief. While he was aware of energy manipulation massage, he had never witnessed it firsthand, especially since even his mentor lacked this skill. Xiao Bufan's hands alternated between pressing, kneading, and applying elbow pressure along Zhou's back. After approximately half an hour, he suddenly applied force between the fourth and fifth lumbar vertebrae, deftly repositioning the protruding vertebrae back into place. With a satisfying click, Zhou exclaimed in surprise, instantly feeling as though his back had been restored to its former state. Free from pain. Is it really gone? Have I truly healed? Zhou sat up, astonished to discover that he could do so without discomfort. The experience was nothing short of miraculous. Am I really all right? Zhou asked, his eyes wide with disbelief as he turned to Xiao Bufan. Xiao Bufan assured him with a nod. You should be just fine now. You can stand and walk to see for yourself. It should be no problem. Under the watchful eyes of those present, Zhou cautiously stepped down from the bed and took a few tentative steps. To his amazement, he discovered that his previously painful back felt completely normal. He walked a couple more steps, realizing that the stiffness and discomfort had vanished entirely. In the orthopedic ward, Zhou ambled about cautiously, reveling in his newfound mobility, his face radiating joy. It doesn't hurt anymore. This is incredible. I never imagined that your energy manipulation massage could be so effective, Dr. Xiao. It seems I had underestimated the power of traditional Chinese massage all along. Director Zhou returned to the bedside with a beaming smile, giving Xiao Bufan a thumbs up. Dr. Xiao, I feel much better in my lower back now. I truly appreciate your help. Director Zhou, you are too kind. Healing and saving lives is the duty of a physician. There's no need for thanks. Xiao Bufan replied humbly, waving his hand with a gentle smile. Director Zhou chuckled and inquired, Dr. Xiao, do you think I should take some medication for my sciatica? I can't shake this uneasy feeling. Despite the alleviation of pain following Xiao Bufan's treatment, Zhou Haitao was apprehensive that the discomfort might return. In response, Xiao Bufan smiled reassuringly. Director Zhou, you are overthinking it. Traditional Chinese massage serves as a form of treatment equivalent to medication. During the massage, I realigned your displaced lumbar discs, so there's no need for further medication. However, if you wish, you may consider some herbal remedies to invigorate your qi and promote circulation. That would aid your recovery. Really? Zhou Haitao appeared surprised. Are you saying I can manage without medication? Should I continue with the massages? Xiao Bufan nodded affirmatively. Absolutely. Continued massage is essential. Our traditional methods not only heal, but also strengthen the body. Given your condition, 2 to 3 sessions a week should suffice. Based on your current state, I predict a complete recovery within a month. Just a little care afterward should prevent any major issues. Upon hearing this, Zhou Haitao's face lit up with joy, and he smiled. Excellent. I will entrust all my future treatments to you, Dr. Xiao. Shall we exchange contact information? Of course. Xiao Bufan agreed with a smile, and they exchanged details. Nearby, Wang Tianxing and Yang Shuezhing exchanged glances, both unable to hide their envy. After all, Zhou Haitao held a significant position in the city's health bureau. While his authority might seem limited, he wielded considerable influence over all hospitals in Shiyuan City, as the health bureau oversaw various medical regulations and practices. Xiao Bufan's ability to alleviate Director Zhou's back pain undoubtedly established a connection with him. It was easy to imagine that, through the upcoming massage sessions, Xiao Bufan could cultivate a friendship with the director. Wang Tianxing couldn't help but feel a twinge of envy. After all, Zhou Haitao was a key figure. Unfortunately, his own massage skills did not reach such heights. When Xiao Bufan turned to Wang Director, he sensed a flicker of admiration in the latter's eyes. What could that mean? Why was Wang Director envious of him? Confused, Xiao Bufan refrained from questioning it. After bidding farewell to Zhou Haitao, the two turned to leave the orthopedic ward, as their consultation had concluded and it was time to return to the traditional Chinese medicine department. After sending Xiao Bufan and Wang Tianxing off, Yang Shuezhing found himself deep in thought, numerous ideas swirling in his mind. In Western orthopedic medicine, there remain many ailments that modern techniques could not treat or alleviate, particularly degenerative diseases and soft tissue injuries, where the results were often mediocre. Traditional Chinese medicine seemed to possess unique methods and efficacy in these areas. If Western orthopedics could collaborate with traditional Chinese medicine, the healing rates might improve significantly. After all, if traditional massage could resolve sciatica caused by a herniated disc, what orthopedic conditions could it not treat? Considering this, Yang Shuezhing resolved to find time to discuss potential collaboration with Xiao Bufan. His insight as the head of Western orthopedics was evident. It was no wonder Zhou Haitao chose the Fifth Hospital's Western orthopedics over others for his treatment. Subsequently, Yang Xuejing began documenting the treatment process that Xiao Bufan had conducted on Zhou Haitao, intending to present it as a case study for an upcoming orthopedic competition. Meanwhile, Xiao Bufan and Wang Tiancheng returned to the traditional Chinese medicine outpatient department. Throughout their walk, Wang Tiancheng remained contemplative, lost in thought. Upon entering the department, he finally voiced his curiosity. Dr. Xiao, if I recall correctly, you didn't practice traditional massage before. How did you become so proficient so quickly? Director Wang, are you inquiring how I mastered this technique? Xiao Bufan smiled, shrugging lightly. If I claimed I just learned it recently, would you believe me? Recently? Are you joking? Wang Tiancheng was taken aback, unable to accept Xiao Bufan's claim. Traditional massage, especially at such an advanced level, was not easily acquired, and even his own mentor had not mastered it. How could a young physician? Realizing this, Wang Tiancheng shook his head. Well, if you prefer to keep that private, I respect your decision. However, I hope you can apply your skills to bring honor to our department. Xiao Bufan smiled, but did not respond, as he felt Wang Tiancheng's words were too grand for someone of his modest position as an attending physician. As the morning approached 11 o'clock, Xiao Bufan, armed with sterilized silver needles, ascended to the inpatient department. Upon opening the door to room 19, he was greeted by the sight of Zhang Fenian and his wife, engaged in cheerful conversation, seemingly in high spirits. Dr. Xiao, you're here, Zhang Fenian exclaimed, rising to greet him with a warm smile. I have come to provide acupuncture for your wife. With a smile, Xiao Bufan pointed at Xiaozhen, who was seated on the treatment bed, and approached her to inquire. How has it been? Was the bleeding last night more or less than before? You aren't feeling any discomfort, are you? Less, Xiaozhen replied joyfully, giving Xiao Bufan a thumbs up. Your medical skills are truly remarkable, Dr. Xiao. They surpass even those of chief physicians at major hospitals. I've consulted many doctors about my condition, and they all insisted that surgery was the only solution. I believe my ailment is not beyond treatment. Rather, it's their lack of skill. Had I encountered you earlier, I might have been cured long ago. Hearing such praise from his patient, Xiao Bufan felt a slight blush rise to his cheeks, almost overwhelmed by her compliments. Truth be told, had she met him sooner, he could not guarantee he would have been able to resolve her condition, especially since his system had not yet fully activated at that time. All right, Aunt Xiao, please refrain from flattering me any further. I might become bashful, Xiao Bufan chuckled, waving his hand dismissively before retrieving the sterilized silver needles. Let's proceed with your acupuncture treatment. Since your bleeding has reduced, it indicates that my treatment plan is indeed effective. After this session, we can start medication tomorrow. Thank you, Dr. Xiao, Xiaozhen replied, nodding appreciatively. Xiao Bufan smiled, gesturing for her to remove her outer garment to facilitate the acupuncture process. Once she complied, he wasted no time in inserting the silver needles into several acupoints, just as he had done the previous day. Senyanjio, Qihai, Guanyuan, and others. Before long, the acupuncture session concluded. Xiao Bufan methodically collected the needles and said to Xiaozhen, now, allow me to check your pulse. As he placed his hand on her wrist, he noticed that her pulse was no longer as chaotic as it had been the previous day. It seemed to have regained some vitality, and the vibrations in her abdomen had significantly weakened. With a light chuckle, he nodded and remarked, excellent. The bleeding within you appears to have stopped for now. I will prescribe medication tomorrow, and, with a period of treatment, you should recover to normalcy. Thank you so much, Dr. Xiao. I am truly grateful, Xiaozhen said, her eyes brimming with appreciation as she nodded repeatedly. Xiao Bufan waved his hand. All right, now that the acupuncture is finished, please rest well. I will return this afternoon for another session, and by tomorrow, we can commence your medication. With that, he rose and exited the ward. As Xiaozhen watched Xiao Bufan's departing figure, she exchanged a glance with her husband, Zhang Fuyan, and murmured, Dr. Xiao is truly a wonderful person. How remarkable that he possesses such advanced medical skills at such a young age. I believe he will undoubtedly become an exceptional traditional Chinese medicine doctor in the future. Does he need to wait for the future? He is already quite impressive. Zhang Fuyan replied with a chuckle, countering his wife's remarks. In the afternoon, after lunch and a brief rest, Xiao Bufan sat in his consultation room awaiting patients. However, over the course of half an hour, no patient arrived, leaving the traditional Chinese medicine clinic eerily quiet, save for a few nurses bustling about. Finally, as the day neared its end, a patient, A beautiful young lady, entered the consultation room. Yet, at first glance, Xiao Bufan sensed something peculiar about her. She appeared to have already become a mother. After receiving her registration form, he smiled and inquired, "Hello, what seems to be the problem?" I don't have any discomfort, just a feeling of bloating," the young lady stammered, her bashfulness evident as she struggled to articulate her condition. "I've heard that traditional Chinese medical massage can alleviate this symptom. I wonder if you could assist me, doctor." "Bloating?" Xiao Bufan was momentarily taken aback, his expression a mix of surprise and concern. "You should probably consult a gynecologist for this. What brings you here?" Lowering her head, she mumbled, "I've already been to the gynecology department, but they only have instruments available, and I've tried them. Nothing seemed to work." "So, the instruments were ineffective?" Xiao Bufan raised an eyebrow and nodded. "Very well. Traditional Chinese massage can indeed help with your situation. However, as a male doctor, it would be inappropriate for me to perform the procedure. Would you like me to summon a female nurse to assist you?" That would be fine. I appreciate your help, doctor," Su Xiaodai replied, her head bowed, unsure of how to face him. The truth was, had her discomfort not been so unbearable, she wouldn't have sought medical attention for such a matter. Furthermore, she occasionally experienced fevers that would arise weekly, and being in the nursing phase, she was hesitant to take any medications that might affect her baby's health. Normally, with such bloating, she could simply ask someone at home for assistance. There would be no need to come to a hospital. In a consultation room, Xiao Bufan glanced at Su Xiaodai before dialing for Su Xiaoli from the inpatient department upstairs. He had no choice among the nurses in the traditional Chinese medicine department. He was only slightly familiar with Su Xiaoli, as nurse in charge Qin Zuru was currently occupied with her duties. Soon, Su Xiaoli hurried downstairs after receiving the call. "Dr. Xiao, you called for me? What is it?" "Yes, this patient is experiencing some bloating. Could you assist her?" Xiao Bufan indicated Su Xiaodai, who was seated across from him. Bloating?" Su Xiaoli's eyes widened in surprise as she turned to look at the female patient, momentarily stunned. "Xiaoli, what are you doing here? Do you work at this hospital?" Su Xiaodai exclaimed, astonished as she stood to face Su Xiaoli. Xiaodi, what brings you here?" Su Xiaoli exclaimed in delight, taking hold of Su Xiaodia's hand. Xiaodai's face flushed slightly as she lowered her head and murmured, I have a bit of discomfort, so I came to see." Xiaoli was momentarily taken aback, then turned to Xiao Bufan and asked, "Dr. Xiao, is my cousin's condition very serious?" What did you say? She's your cousin?" Xiao Bufan was also momentarily stunned, a look of surprise crossing his face. Xiaodi? They're actually cousins? How could he not have realized it earlier? However, it was not entirely his fault, as the differences in their appearances were indeed quite stark. Xiao Dai was not only more beautiful than Xiao Li, but more importantly, she was already married, and her figure was simply beyond imagination. "Yes, she is my cousin, the daughter of my uncle," Xiao Li explained to Xiao Bufan with a smile before pressing on, "Dr. Xiao, what exactly is wrong with my cousin?" Xiao Bufan awkwardly scratched his nose and explained, "Your cousin's discomfort is a type of nodular sialadenitis, which requires massage techniques to alleviate. Otherwise, it can easily become blocked. Additionally, this condition may come with a bit of inflammation, which can lead to fever, but she cannot take antipyretic medication." Upon hearing this explanation, Xiao Li was momentarily speechless, exclaiming, "But I don't know how to perform the massage. Actually, the technique is quite simple. I can teach you." Xiao Bufan chuckled, pointing to Xiao Dai across the room, and said to Xiao Li, "Otherwise, you wouldn't want me to personally administer the massage to your cousin, would you?" "All right, I'll give it a try." Xiao Li was naturally reluctant to let Xiao Bufan take action, considering it was her cousin. Subsequently, she led her cousin Xiao Dai to the adjacent room. Xiao Bufan stood outside, instructing Xiao Li on the massage techniques. "First, spread your fingers, then pull inward from the outside. Be gentle. Do not apply too much force. Additionally, while massaging, you can gently rub a few times to expand the head's meridians, allowing the internal glandular structures to be relieved." "Okay, I understand," Xiao Li nodded, continuously following Xiao Bufan's instructions as she massaged her cousin Xiao Dai. Xiao Li, don't apply so much pressure." Xiao Dai appeared to be enjoying herself, occasionally reminding Xiao Li to adjust her strength. "You know, the prices for external massage therapists are quite exorbitant nowadays. If you don't wish to come to the hospital for this issue, hiring a massage therapist for home service would be unaffordable for an ordinary family. Moreover, Some husbands cannot accept the presence of a massage therapist. After a considerable time, Xiao Dai's discomfort was finally alleviated, and she felt a wave of relaxation wash over her. When the two cousins emerged from the room, Xiao Bufan smiled and asked, "How is it? Has it been alleviated?" "Yes, it has." Xiaoli nodded in response. "That's good. You should massage her daily from now on. After about 10 days, it should be much better," Xiao Bufan said with a smile. Glancing at Xiao Dai and then waving his hand lightly, "All right, your issue has been resolved. If you need further relief, just ask Xiaoli directly to avoid the hassle of registration." Thank you, Dr. Xiao." Xiao Dai expressed her gratitude, then lowered her head and took her cousin Xiao Li out of the room. Watching the two cousins dash away, Xiao Bufan couldn't help but chuckle and shrug. Glancing at the time and realizing it was nearly time to leave work, he then picked up the silver needles from his desk and headed upstairs to provide acupuncture treatment for Xiao Ziyan. After completing the acupuncture session with Xiao Ziyan, Xiao Bufan returned to his clinic, removed his white coat, and prepared to head home. As he drove his old car down the road, he suddenly remembered that his father had plenty of sea cucumbers, so he quickly turned around and headed towards the upscale neighborhood where his father lived. Xiao Yuanyang had purchased a spacious flat in the city, which was not only large but also elegantly decorated. When Xiao Bufan arrived at the flat his father had bought, he unlocked the door and stepped inside, only to find that his father seemed to be out. The vast house was eerily quiet. Could it be that his father had gone out again to meet Aunt Fong? Xiao Bufan pondered, then began to search through the spacious flat. After a short while, he indeed found several boxes of sea cucumbers and some unopened bottles of red wine. His father certainly knew how to enjoy life. Such fine wine left untouched would now benefit him. Xiao Bufan chuckled to himself and loaded everything in his old car. After closing the door, he drove home, laden with his spoils. When Xiao Yuanyang returned home, he initially thought he had been robbed, seeing the disarray in the house. He looked around and discovered that the cash was still there, but the boxes of sea cucumbers and wine had vanished. Well, it must have been that little rascal who came to stock up. Xiao Yuanyang was furious, fuming as he pulled out his phone to call Xiao Bufan. Ding ding ding. Meanwhile, Xiao Bufan had just returned to the suburbs and was busy moving the sea cucumbers and wine into his room when his phone suddenly rang. He smiled as he brought the 2 boxes of sea cucumbers and several bottles of wine back into his room, knowing it was his father calling. Ding ding ding. The phone continued to ring incessantly. After setting down the wine, Xiao Bufan leisurely took out his phone and answered the call. In the next moment, his father's furious voice erupted from the phone. "You little rascal, tell me, did you take all my sea cucumbers and wine?" Xiao Bufan couldn't help but chuckle. Hee Dad. Didn't you already guess? Why ask? Upon hearing his son's admission, Xiao Yuanyang was infuriated, launching into a tirade. "You just took my sea cucumbers and wine without even a word. Anyone would think we were robbed. I was almost ready to call the police." All right, regardless, I am still your son. Do you really need to call the police, just for a few items?" Xiao Bufan chuckled nonchalantly, then casually opened a bottle of red wine to inhale its aroma. Addressing the old man on the other end of the line, he remarked, "This red wine appears quite delightful. What do you say, old fellow? Care to join me for a glass?" Xiao Yuanyang nearly erupted in frustration once more. However, considering that this son was indeed his flesh and blood, he quickly reassured himself. No need to get upset. After all, he was his own son, and it was not worth it to let anger consume him. With a helpless sigh, Xiao Yuanyang conceded, All right, who else do I have but you? I must admit defeat." He continued, "By the way, the next time you come to my place for something, please refrain from leaving the house in such disarray. Otherwise, I'll have to spend money hiring someone to clean it up." With that, he angrily hung up the phone, wishing to end the conversation with his son immediately. Listening to the busy signal echoing in his phone, Xiao Bufan smiled as he put the device away and turned to the kitchen to prepare dinner. After a flurry of activity, he crafted a delectable meal of 3 dishes and a soup, savoring it alongside the red wine. Once he had eaten his fill and refreshed himself with a cool shower, he retired for the night, and thus the evening passed without incident. The following day, before the sun had fully risen, Xiao Bufan arose to wash and prepare himself, then set off in his old Honda Fit towards the hospital. Today, he was to administer treatment to Xiao Ziyun, and he felt a twinge of excitement. After all, Xiao Ziyun's condition was a complex medical puzzle that many hospitals have been unable to resolve. If he could successfully treat her ailment, It might enhance his reputation within the medical community of Shiyuan City, potentially attracting more patients seeking his expertise. Contemplating these thoughts, a smile crept onto Xiao Bufan's face as he stepped into the traditional Chinese medicine outpatient department. Upon arriving at his consultation room and donning his white coat, he couldn't resist immediately instructing the system. System, initiate check-in. Beep, check-in successful. Congratulations, host, you have acquired traditional Chinese medicine dietary therapy, proficient level. Proficient level dietary therapy? How could this be? Xiao Bufan was momentarily taken aback. While dietary therapy was indeed a branch of traditional Chinese medicine, it had become largely forgotten in contemporary practice. However, as a wealth of knowledge about dietary therapy flooded his mind, he realized he had underestimated its significance. It is essential to note that dietary therapy is a pivotal aspect of traditional Chinese medicine, built upon millennia of culinary wisdom. The Shinong Binchao Jing contains numerous secret recipes for medicinal dishes, and the Qianjin Fong states, for treatment, one must first employ dietary therapy. Only if dietary therapy fails should medicine be used. This highlights that dietary therapy is fundamentally superior to medicinal treatment. Dietary therapy serves as the foundational discipline of medicinal cuisine, relying on principles of traditional Chinese medicine, including yin and yang, the five elements, organ theory, and the properties and combinations of herbs. Traditional Chinese medicine emphasizes the connection between flavors and organs: sour for the liver, bitter for the heart, sweet for the spleen, pungent for the lungs, and salty for the kidneys. Only by discerning symptoms can one appropriately prescribe dietary remedies tailored to individuals. Crafting a dietary prescription is akin to formulating a medicinal prescription and must be approached with utmost precision. After absorbing the information on dietary therapy, Xiao Bufan had to admit he had indeed underestimated its therapeutic effectiveness. Traditional Chinese medicine values the subtle signs of illness, asserting that ailments evolve daily rather than remaining static. Especially after 2 days of acupuncture treatment, Xiaoziyan's condition was bound to have changed, and he needed to confirm her status before formally prescribing treatment. After some contemplation, Xiao Bufan made his way to the inpatient department, mindful that he needed to assess Xiaoziyan's pulse to observe any changes in her condition. Upon arriving at her hospital room, he was greeted warmly by Zhang Funian, who cheerfully asked, "Dr. Xiao, have you had breakfast yet? We have some boiled noodles. Would you like to try some?" Xiao Bufan glanced at the electric pot cooking noodles in the room and smiled, politely declining, "I've already had breakfast, thank you." Although hospital regulations prohibited the use of electrical appliances in patient rooms, aside from phone chargers, he chose to overlook this minor infraction, aware of the couple's financial struggles over the years due to medical expenses. Approaching Xiaoziyan's bedside, he smiled gently. "All right, Auntie Xiao, let me check your pulse to assess your condition." Gratefully, she extended her wrist, and he began to feel her pulse carefully. To his surprise, he discerned a notable improvement in Xiaoziyan's pulse compared to the previous day. Although still somewhat weak, it had regained considerable strength. For the patient, this was undoubtedly excellent news. Moreover, Xiao Bufan also noticed that Xiaoziyan's complexion appeared to have improved slightly compared to yesterday, which served as evidence that his treatment plan was indeed correct and entirely feasible. Subsequently, with a smile, Xiao Bufan retracted his right hand and said, "Well, you are recovering quite well. Aunt Xiao, your pulse looks quite good. We should be able to proceed with medication." At this point, Xiao Bufan turned to Zhang Funian beside him and remarked, "Uncle Zhang, please accompany me downstairs. After I prescribe the medication for Aunt Xiao, you can take the prescription directly to the payment counter and then wait in the Chinese medicine room for the decoction." "Okay, got it," Zhang Funian replied with a smile, and followed Xiao Bufan downstairs to the outpatient clinic on the first floor. Upon returning to his clinic, Xiao Bufan immediately began to prepare a prescription for Xiaoziyan. Considering that her uterine prolapse was due to qi deficiency, he decided to adopt a principle of tonifying qi and elevating it. He prescribed a decoction designed to tonify qi and support the intestines. This decoction, a traditional Chinese medicine formula from Fu Qingzhu's gynecology, is effective for treating postpartum qi deficiency, inability to retract the intestines, and rectal prolapse. The ingredients such as ginseng, astragalus, and white atractylodes are used to tonify qi, while angelica and ligusticum can replenish blood and prevent stasis. Additionally, the herb shengma is included to elevate the sinking qi. The combination of these herbs harmonizes to achieve the desired effect of tonifying qi and elevating. As the saying goes in Fu's writings, this formula is purely for tonifying qi, and it does not focus on elevating the intestines. Even if only a small amount of sheng ma is used, it merely guides the qi upwards. Thus, one must understand that the application of sheng ma is to promote qi with lesser amounts and to invigorate blood when used in larger amounts. Before long, Xiao Bufan completed the prescription on the computer and handed the printed prescription to Zhang Funian, saying, "Take this prescription to the registration desk for payment, and then proceed to the Chinese medicine pharmacy to wait for the decoction." Given that this was a traditional Chinese medicine department, the inpatients would naturally have their herbal medicine prepared for them. "Thank you, Dr. Xiao." Zhang Funian expressed his gratitude, bowing slightly. Xiao Bufan waved his hand with a smile. "All right, hurry along to pay for the medicine. Remember, this medicine should be taken twice daily, once in the morning and once in the evening. The pharmacy will prepare it for you, and if you prefer not to go, you can ask a nurse to bring it to you." "Understood. Thank you so much, Dr. Xiao." Zhang Funian reiterated his thanks before turning to head to the registration desk. Watching Zhang Funian's departing figure, Xiao Bufan felt assured that his wife would soon recover fully after taking the medicine. Once Zhang Funian had left, Xiao Bufan stretched lazily and glanced at the time, realizing it was already nearing 9 o'clock in the morning. Is it already past 9? Why is there still not a single new patient? Xiao Bufan sighed in mild exasperation, just as he was about to rise to use the restroom. Suddenly, the outpatient room door creaked open and a pale, emaciated man walked in, holding a registration slip, looking rather listless. As soon as this patient entered, Xiao Bufan caught a faint, unpleasant odor. Instantly, he furrowed his brow and inquired, "Hello? May I ask where you're feeling unwell?" "Doctor, I've been feeling dizzy for the past few days, and I've experienced some difficulty breathing. However, after a thorough examination at the Western Medicine Department, nothing was found. My blood pressure, which has always been normal, has suddenly dropped significantly these past 2 days, and now I can barely tell directions when I walk." The patient handed over his registration slip while sitting down to explain his condition. Xiao Bufan glanced at the registration slip, which read, "Name, Zhang Guangpu. Gender, male. Age, 43. Registration, traditional Chinese medicine general outpatient. Other information, none." After reviewing the slip, Xiao Bufan smiled and said, "Your name is Zhang Guangpu, correct? Let me check your pulse first. Otherwise, I want to be able to ascertain your condition based solely on your words." "Ah, okay. Then I'll trouble you," Zhang Guangpu replied, nodding blankly as he extended his wrist. Xiao Bufan placed his hand on Zhang Guangpu's wrist to feel his pulse. Upon contact, he noted that the pulse was somewhat superficial and soft, yet there was a hollow sensation in the middle, while both sides exhibited a solid pulse. This clearly indicated a deficiency of blood. Then, Xiao Bufan examined Zhang Guangpu's tongue coating and confirmed that it was indeed a case of blood deficiency. However, he was puzzled about the underlying cause of this deficiency, especially since nothing had been detected during the examination at the Western Medicine Department. This was quite strange. After a moment of silence, Xiao Bufan asked Zhang Guangpu, "When you walked in, I noticed a foul odor emanating from you. Is there a part of your body that is rotting? Could you show me your wound?" "Oh, you mean that?" Zhang Guangpu immediately lifted his pant leg, pointing to a large swollen area on his thigh. "This wound on my leg was caused by a leech. A while back, when I was in the field harvesting rice, I accidentally got stung by a leech in the paddy. You know how powerful leeches can be. I had to pull for quite a while to get that leech off my thigh." As he spoke, Zhang Guangpu scratched the area where the leech had bitten and continued, "This wound on my leg hasn't healed for some reason, and sometimes it feels a bit tingly and itchy." "You were bitten by a leech on your thigh?" Xiao Bufan was taken aback, looking closely at the small, completely suppurated wound on Zhang Guangpu's thigh. He frowned and crouched down to examine it carefully. Although the wound appeared small, the surrounding area was inflamed and purulent, and it seemed as if something was writhing inside the wound. It looked extremely repulsive. Immediately, Xiao Bufan donned sterile gloves and poked at the wound on Zhang Guangpu's thigh, asking, "Are you certain this wound was caused by a leech? Does it feel painful aside from the tingling and itchiness?" "It doesn't hurt at all, not one bit." Zhang Guangpu shook his head repeatedly. Chapter 54. Terrifying indeed. The area around the wound was completely suppurated, yet he felt no pain whatsoever. This was highly unusual. Xiao Bufan's brow furrowed slightly, sensing that something was amiss. Typically, if one were bitten by a leech, the wound would heal quickly once the leech was removed. A leech is simply a water leech. The common leech, once it has satiated itself with sufficient blood, will detach itself naturally, even if one does not forcibly remove it. Ideally, after a patient has eliminated the leeches, their wound should not exhibit signs of suppuration or swelling. After all, the saliva of these leeches contains anticoagulant factors, which are unlikely to lead to bacterial infections in the wound. Currently, it is known that there are over 500 species of leeches worldwide, the majority of which feed on small aquatic invertebrates. Only a small fraction subsists on the blood of humans and mammals. Xiao Bufan furrowed his brow as he glanced at the suppurating wound on the patient's thigh, countless similar cases flashing through his mind. What could be the cause? Suddenly, a spark of insight illuminated his thoughts, as if he had grasped a vital clue. He promptly stood up and instructed Zhang Guangpu, "Please wait here. I will gather some supplies." With that, Xiao Bufan fetched a plastic basin and prepared a solution of hypertonic saline with a concentration exceeding 85%. Upon returning to his clinic with the basin, he turned to Zhang Guangpu with a serious expression and said, "I suspect that you have leeches inside your body. The leech that bit you is likely not the only one. It is possible that the one you removed has deposited some eggs into your thigh's blood vessels, which has resulted in your current condition." "Doctor, surely you jest," Zhang Guangpu exclaimed, startled by Xiao Bufan's words, trembling as he looked at his thigh in disbelief. "How could a leech enter my body? That is utterly terrifying. It can't be true." Indeed, the very notion of leeches was unsettling enough. The idea of them burrowing into one's body was even more horrifying, especially when a doctor voiced such a claim. It was enough to send chills down anyone's spine. Seeing Zhang Guangpu's frightened expression, Xiao Bufan quickly reassured him, "Do not be afraid. Leeches are not venomous. Even if they have entered your body, they will merely draw a bit of blood. As long as these leeches have not invaded your vital organs, there is generally no immediate life-threatening concern." "Could you please refrain from saying such things? Your words only increase my fear," Zhang Guangpu stammered, visibly shaken. Noticing this, Xiao Bufan waved his hand dismissively and continued to comfort him. "Fear not. I will extract these leeches for you shortly, and then you may return home." Zhang Guangpu's heart raced. He regretted seeking treatment from this young physician. What if he left not only untreated, but also terrified beyond measure? Ignoring Zhang Guangpu's apprehensions, Xiao Bufan donned a fresh pair of medical gloves and took a small surgical blade to begin the disinfection process. As he sterilized the blade, he explained to Zhang Guangpu, "I will first make an incision at the wound to drain the pus, and then I will remove the leeches. Afterward, you could take some blood-replenishing medication." Upon seeing the gleaming surgical blade in Xiao Bufan's hand, Zhang Guangpu shuddered and asked, "Doctor, will this hurt? Perhaps you should administer some anesthetic first?" "You need not worry about anesthetic. You won't feel pain from my actions. This indicates that the tissue around your wound has mostly necrotized," Xiao Bufan replied with a reassuring smile. "Moreover, anesthetics are quite costly. If you wish to use one, it would likely cost several hundred yuan." "What? Is anesthetic that expensive?" Zhang Guangpu grimaced at the thought of the additional cost. "Then forget it. Just proceed, doctor." With that, he closed his eyes, steeling himself as if awaiting slaughter. Xiao Bufan chuckled and shook his head, then moved the surgical blade towards the wound on Zhang Guangpu's thigh. With a swift motion, he made an incision of approximately 3 centimeters, and a torrent of pus flowed forth from the wound. Xiao Bufan's brow furrowed slightly as he observed the changes in the wound's condition. A copious amount of toxic pus continued to pour out, revealing the underlying flesh and blood vessels. In that moment, Xiao Bufan discerned small black worms wriggling within the blood vessels of Zhang Guangpu's thigh. The sheer number of these tiny creatures was alarming. Indeed, these worms must be the hatched offspring of the leeches. Xiao Bufan was convinced that his earlier hypothesis was correct. Without hesitation, he plunged Zhang Guangpu's injured thigh into the basin of hypertonic saline. This saline would cause the leeches to dehydrate, loosening their grip, allowing them to detach from the patient's body. Doctor, what are you doing? This hurts terribly." Zhang Guangpu gasped as his entire thigh was suddenly immersed in the saline solution, the stinging sensation causing him to gasp in pain. Yet, Xiao Bufan's grip on Zhang Guangpu's thigh was firm, rendering him immobile. "It hurts. It hurts," Zhang Guangpu cried out, but Xiao Bufan appeared oblivious to his cries, focusing solely on the task at hand. Time passed, and suddenly, with a plop, a dark leech crawled out from Zhang Guangpu's wound, landing in the basin of hypertonic saline. Thrashing about. A leech! Zhang Guangpu exclaimed in shock, nearly toppling the basin in his fright. Fortunately, Xiao Bufan's grip was strong enough to prevent any mishap. Following the first leech's emergence, more and more leech offspring began to drop into the basin. Xiao Bufan began to count the leeches as they fell from Zhang Guangpu's thigh. 1, 2, 3, 4, 5, 6. In total, he counted 17 leeches that had crawled out from the wound. Thankfully, these leeches were not particularly large. Otherwise, Zhang Guangpu might have succumbed to severe blood loss by now. However, despite the leech's removal, Xiao Bufan remained uncertain whether additional leeches remained within Zhang Guangpu's blood vessels. Thus, it would be prudent to conduct further imaging to confirm the situation, as leech eggs can sometimes elude detection even during a thorough examination. Unless the leeches grow larger and severely impact the health of the individual, they cannot be surgically removed. Zhang Guangpu gazed at the writhing leech larvae in the basin beneath him, nearly overwhelmed by nausea at the grotesque sight. It was truly horrifying. Once Xiao Bufan confirmed that no leech larvae were emerging from Zhang Guangpu's wound, he stood up and smiled slightly, saying, "All right, the leech larvae in your thigh should be mostly cleared out, but we still need to conduct an examination just to be safe." With that, Xiao Bufan returned to his desk and, upon pressing the keyboard, generated a request for a leg vascular examination for Zhang Guangpu. Chapter 55, The Hard-of-Hearing Elder Inside the Consultation Room. Zhang Guangpu looked down at the wriggling leech larvae in the basin, shivering in fright as he repeatedly nodded, Yes, I will follow your advice, doctor. I will go for the examination immediately." As he spoke, he took the examination request from Xiao Bufan's hands and turned to head towards the examination department. After Zhang Guangpu left the consultation room, Xiao Bufan couldn't help but let out a resigned sigh. He bent down to pick up the basin containing the repulsive creatures, intending to dispose of it. It was simply too unappetizing to leave in the consultation room. Before long, the morning passed, and by the time lunch break arrived, Zhang Guangpu had yet to return from his examination. Xiao Bufan deduced that the examination department must be quite busy, likely requiring Zhang Guangpu to wait until the afternoon to complete his tests. Therefore, Xiao Bufan decided not to linger for the results, and after finishing work for the morning, he headed directly to the hospital cafeteria for lunch. As the saying goes, man is iron, rice is steel. One meal missed brings unease. Xiao Bufan had no intention of working on an empty stomach. If a person lacks enthusiasm for meals, it is hard to imagine what else could inspire them. In the afternoon, after lunch and a brief rest, Xiao Bufan returned to his consultation room. Yet regrettably, no patients came seeking his counsel. As the clock approached 3:30, Zhang Guangpu finally returned, holding the leg x-ray and looking anxious as he handed it to Xiao Bufan. With a smile, Xiao Bufan received the film and examined it closely. Finding no dark spots, this indicated that Zhang Guangpu's leg veins were devoid of any leech larvae. After reviewing the results, Xiao Bufan beamed at Zhang Guangpu, saying, "Well, it appears your leg veins are essentially clear. You can rest assured. I will prescribe some supplements for blood replenishment for you to take. Is that so?" Upon hearing that the leech larvae were no longer in his thigh, Zhang Guangpu immediately expressed his gratitude. "Thank you, doctor. I'm truly grateful. Had it not been for your timely intervention, I cannot imagine what might have happened." The thought of the leech larvae remaining in his body sent a shiver down Zhang Guangpu's spine. Had he not visited the hospital today, and had he seen another doctor instead of Xiao Bufan, he could hardly fathom what the outcome might have been. Perhaps it would have been akin to a tale he once heard, where one's blood was entirely drained by leeches, leading to their demise. The mere thought filled him with dread, and for a considerable time thereafter, he resolved never to venture into the fields to harvest rice again until he ensured that all water had been drained and no leeches were present. Otherwise, he would be too terrified to return to the fields, embodying the adage of once bitten, twice shy. Xiao Bufan, having prepared the prescription for blood replenishment, handed it along with the payment slip to Zhang Guangpu, saying, "Here, take this prescription and payment slip to the registration desk to settle the fee. Then proceed to the pharmacy to collect your medication and follow the doctor's orders." "All right, I understand. Thank you, doctor." Zhang Guangpu, filled with gratitude, thanked Xiao Bufan once more before turning to leave with the prescription and payment slip in hand. Not long after Zhang Guangpu departed from Xiao Bufan's consultation room, an elderly gentleman with a head of silver hair entered, leaning on a cane. He directly addressed Xiao Bufan. "Doctor, hello. I am suffering from severe tooth pain. Do you treat dental issues here?" The elder's voice was somewhat breathy, his front teeth long gone, with only a few remaining at the back. "You are here for dental issues?" Xiao Bufan was momentarily taken aback, then smiled and inquired, "You should visit the dental department for that. Why have you come to the traditional medicine department? Did you perhaps take a wrong turn looking for the dental clinic?" The elder seemed a bit hard of hearing, cupping one hand over his ear and responding, "What did you say about getting lost?" "I'm here for my toothache." It was clear that this elder not only spoke with a breathy voice, but also had difficulty hearing. Xiao Bufan, without any intention of turning the elder away or requiring him to re-register, simply smiled and said, "Very well, sir. Please open your mouth. I shall examine your teeth and tongue." "Huh? You want to look at my teeth?" The elder shot him a glare, muttering, all right. Who am I to refuse a doctor? Go ahead and take a look." As he spoke, the elder opened his mouth wide, revealing his teeth and tongue. Xiao Bufan, wearing a mask, scrutinized the elder's oral cavity and discovered extensive ulceration, with a foul odor emanating from within. "Goodness, your mouth is in such a state of decay. It's a wonder your teeth aren't hurting." Xiao Bufan shook his head in disbelief, then proceeded to take the elder's pulse. Upon doing so, he noted that while the elder's pulse was strong, the tongue coating was quite thick and yellow, coupled with symptoms of halitosis and gum bleeding. It became evident that the elder was likely suffering from purulent apical periodontitis due to stomach fire-induced toothache. Traditional Chinese medicine posits that teeth are extensions of bone, with the kidneys governing bones and the stomach meridian connecting to the gums, thus establishing a close relationship between teeth and kidneys, as well as gums and stomach. From the holistic perspective of traditional Chinese medicine, toothache is often associated with the invasion of external pathogens, inflammation, dysfunction of the liver and kidneys, and a lack of self-care. Generally speaking, acute toothaches and swollen gums tend to be treated through the stomach, while chronic toothaches, loosened teeth, and mild discomfort with less swelling are better addressed by focusing on the kidneys. The symptoms presented by the elderly gentleman before me suggest that a treatment aimed at clearing stomach heat and cooling the blood to alleviate pain would be remarkably effective. A modified version of the Qingwei powder could be employed for this purpose. Reflecting on this, Xiao Bufan couldn't help but smile gently at the elderly man and said, "I believe your toothache is caused by an excess of stomach heat. Allow me to prescribe a remedy that should resolve the issue within a couple of days." As he spoke, Xiao Bufan began typing on the computer keyboard, directly prescribing several doses of Qingwei powder for the gentleman. This herbal formula is known for its efficacy in clearing heat from the internal organs, cooling the stomach, and alleviating blood heat. It is primarily used to treat toothaches associated with stomach heat, facial warmth, a preference for cold over hot foods, as well as bleeding gums and other related symptoms. The prescription comprised the following ingredients: 10 g of Huanglian, 15 g of Shengdi, 10 g of Dampi, 6 g of Shengma, 12 g of Huanqin, 30 g of Shirgao, 15 g of Lianxiao, 10 g of Baiji, 3 g of Xixin, and 12 g of Dahuang. Before long, Xiao Bufan had prepared the prescription and cheerfully handed the printed medical order and payment slip to the elderly gentleman. "Here you go, sir. Please take this prescription and payment slip to the registration desk to pay and collect your medicine." "What prescription? What do I pay?" The elderly man appeared somewhat confused, staring blankly at Xiao Bufan. It seemed that Xiao Bufan would have to personally escort the gentleman to the payment and collection point. With a resigned expression, he stood up and smiled at the elderly man, saying, "Let me accompany you to the payment desk, just to ensure you don't get lost along the way." With that, he gently assisted the elderly gentleman and led him towards the registration and payment area. "Oh, thank you, young man. You're a doctor, aren't you? There aren't many doctors like you around these days." The elderly gentleman praised Xiao Bufan with a beaming smile, appearing quite delighted. Chapter 56. Symptoms of Water Retention. Hearing the elderly man inquire whether he was a doctor, Xiao Bufan instantly concluded that the gentleman's memory might not be very reliable, which could pose a bit of a dilemma. After all, the prescription he had provided needed to be taken at specific intervals. If the gentleman were to forget how to take the medicine, it could lead to complications. With this in mind, Xiao Bufan helplessly asked the elderly man, "Mr. Wang, Did you come to the hospital alone for your dental issue? Is there no family member accompanying you? What family? No. My children have all gone to work. There's no one at home. The elderly man waved his hand with a cheerful grin, asserting, I'm just here for a toothache, and I'm still fit as a fiddle. I don't need anyone to accompany me. This Mr. Wong appeared to possess an inexplicable confidence in his health, firmly believing he did not require anyone as company for his medical visit. Xiao Bufan sighed in exasperation and remarked, Indeed, you may not need anyone with you. But considering you seem to misidentify even the outpatient department, and given that you struggle to hear and walk with a cane, I worry that even if I let you take the medicine home, you might not remember how to take it. Mr. Wong opened his mouth as if to retort, but ultimately said nothing, merely expressing his discontent with a grunt. Deep down, he was somewhat aware of his forgetful nature. After Xiao Bufan had assisted Mr. Wong with the payment at the registration desk, fearing he might forget how to take the medication, he took out a piece of paper to write down the medical instructions, including the method and dosage of the herbal remedy, and reiterated the advice to Mr. Wong before escorting him out of the traditional Chinese medicine outpatient department. Once he had seen Mr. Wong off, Xiao Bufan turned around to return his consultation room, only to be greeted by the second patient of the afternoon. This new patient appeared to be blind, as he entered the room with a cane, carefully feeling his way until he found a chair to sit down. Xiao Bufan blinked, studying the patient with a smile, and inquired, Hello, what seems to be troubling you? I feel a tightness in my chest. This morning, I woke up feeling short of breath and dizzy, and I'm unsure of the cause, the blind patient responded, slowly stowing his cane and handing over his registration slip, while explaining, This sensation has intensified throughout the afternoon, and now I even find it difficult to breathe. I'm feeling quite lightheaded. Upon hearing this, Xiao Bufan chuckled as he accepted the registration slip from the patient. Let me check your pulse and see what is going on. He then placed his hand on the patient's wrist while glancing at the information on the slip. It read, Name, Wu Shirley. Gender, male. Age, 38. Registration, Western Medicine Ophthalmology. Other information, none. Wu Shirley. The name seemed rather casual. Could it be that he was named so because he'd been blind since birth? Xiao Bufan paused for a moment, then realized that Wu Shirley had also mistakenly entered the wrong department, having registered for Western Medicine Ophthalmology rather than traditional Chinese medicine. However, he refrained from making any comments, as it was quite normal for a blind patient to inadvertently enter the wrong outpatient department. After a brief moment, Xiao Bufan returned to focus, seriously checking the patient's pulse. He noted that the pulse was somewhat deep and tense, with a slippery quality. Additionally, there were significant sounds emanating from the patient's stomach, almost resembling water. Furthermore, even the kidneys seemed to produce a slight, unusual noise. What could be causing this condition? Xiao Bufan's brow furrowed slightly as he addressed Wu Shirley. Please open your mouth so I can examine your tongue. Wu Shirley obliged, opening his mouth wide and extending his tongue. Observing closely, Xiao Bufan noted that the tongue was a pale red, with a thin white coating, and the patient's complexion appeared somewhat swollen. Based on these observations, it seemed that Wu Shirley was experiencing shortness of breath due to excessive water intake. As stated in the Jing Kui Yao Lu, if the pulse is deep, it indicates the presence of water. If there is water retention, the face and body swell, the pulse is deep, and urination is impeded, leading to fluid retention. If there is fluid in the chest, the person experiences shortness of breath and thirst, with pain in the limbs and joints, and the pulse is deep, indicating fluid retention. Fluid retention refers to water that remains stagnant in the body, which is often the result of excessive drinking. While hydration is beneficial, overconsumption can lead to issues. If excess water cannot be expelled promptly, it may cause bodily swelling and increase the burden on various organs, particularly the kidneys. Therefore, the abnormal sounds from the kidneys and stomach further validate the diagnosis of fluid retention. Upon clarifying these circumstances, Xiao Bufan could not help but inquire of Wu Shirley. Do you drink water regularly? Is it true that once you start, you find it hard to stop? Doctor, how did you know? Wu Shirley's expression momentarily froze, revealing a hint of surprise. Isn't it commonly said that drinking more plain water is beneficial for one's health? Therefore, I have developed the habit of consuming several large bottles daily. Xiao Bufan chuckled and continued. Do you often find yourself visiting the restroom? Is there a sense of difficulty when you urinate? And, at times, do your limbs ache? Upon hearing Xiao Bufan's inquiries, Wu Shirley pondered for a moment and replied, Well, I must admit, I do experience those issues, but I've never paid much attention to them. You see, as a blind person, my understanding of my ailments is rather limited. Sometimes, when I feel pain in that area, I assume I must have accidentally bumped into something. I rarely consider the possibility of illness. It is important to understand that for a blind individual, life is inherently more challenging, even in good health. Consequently, when they do experience discomfort, they likely attribute it to minor accidents rather than illness. Thus, doctors must exhibit additional patience and compassion towards blind patients. Reflecting on this, Xiao Bufan smiled and said to Wu Shirley, "Your condition appears to stem from excessive water consumption over time, resulting in a condition known as water retention, which causes fluids to accumulate beneath the skin, obstructing the flow of vital energy and leading to symptoms such as chest tightness, shortness of breath, and dizziness." "Huh? Doctor, what does that mean?" Wu Shirley asked, bewildered, as he struggled to comprehend Xiao Bufan's explanation. With a swift motion, Xiao Bufan typed on his computer, printing out a prescription while elucidating. "In simpler terms, you are drinking too much water, causing an excess to accumulate in your skin and bloodstream, which hinders its proper expulsion, resulting in these symptoms. Is it truly possible to become ill from drinking too much water? Aren't we often told that hydration is beneficial?" Wu Shirley seemed incredulous, his face a canvas of disbelief. Xiao Bufan chuckled and clarified, "Indeed, while hydration is essential, your intake has exceeded a healthy limit, leading to an adverse effect. Moderation is key. Overindulgence will undoubtedly burden your body." As he spoke, Xiao Bufan had already printed out the prescription. As the saying goes, water and phlegm share the same origin. When excess water cannot be expelled, it naturally leads to an increase in humidity within the body. An accumulation of moisture can give rise to numerous ailments, making one susceptible to various illnesses. Water-related ailments can be categorized into three types: water retention, water accumulation, and edema. In your case, Wu Shirley, it appears to be water retention, for which a prescription of Lingue Zhugan decoction will suffice. This decoction consists of 4 ingredients: poria, cinnamon twig, white atractylodes, and licorice. Poria facilitates the expulsion of excess moisture, addressing the symptoms. White atractylodes and licorice bolster the spleen, mitigating the source of moisture. Cinnamon twig warms the heart, dispersing cold and aiding in the regulation of moisture. The combination of cinnamon twig and licorice harmonizes and supports yang energy, while also alleviating counterflow, thus controlling the excess moisture. Chapter 57. Another obstetric consultation? Although Wu Shirley found Xiao Bufan's explanation somewhat perplexing, he was nonetheless taken aback. Could it truly be that excessive water intake could lead to such complications? A look of realization dawned on his face as he nodded. "Understood, doctor. I shall refrain from indiscriminately drinking so much water in the future." "Good, as long as you understand. Now, let us proceed to settle the payment and collect your medication." Xiao Bufan smiled as he handed Wu Shirley the printed prescription and payment slip, then assisted him to the registration desk. For blind patients, doctors must exercise extra patience and care. Thus, Xiao Bufan personally guided Wu Shirley through the payment process and to the herbal pharmacy for his medication. Throughout this time, he diligently attended to Wu Shirley until he finally escorted him to the door of the traditional Chinese medicine department before returning to his office. Before long, the afternoon slipped away. As the end of the workday approached, Xiao Bufan went upstairs to the inpatient department to inquire about Xiaoxian's reaction to her medication. Upon confirming that she experienced no discomfort and was beginning to regain her strength, he shed his white coat in preparation to leave for the day. However, just as he was about to clock out, a call came in from Lu Zichuan of the obstetrics and gynecology department, urgently requesting his assistance. Since Xiao Bufan had successfully aided a patient in labor previously, Lu Zichuan's perception of his medical skills had greatly improved. Consequently, whenever a challenging situation arose in the obstetrics department, Lu Zichuan would immediately think to call upon Xiao Bufan for help. Without delay, Xiao Bufan hurried to the obstetrics and gynecology department, where he found Lu Zichuan looking somewhat exasperated. "What seems to be the issue, Dr. Lu? Why such haste in summoning me? Is another patient experiencing complications?" Lu Zichuan sighed in resignation. "Indeed, you guessed correctly, Dr. Xiao. We have another patient in labor who is encountering difficulties. This woman is over 50 years old and has a history of heart disease, diabetes, and hypertension, conditions that pose significant risks. As he spoke, Lu Zichuan shook his head, perplexed by the decision of a woman of such advanced age to conceive. I simply cannot fathom why she would choose to have a child at this age. Lu Zichuan continued, currently, the patient is experiencing transverse fetal presentation. But given her multiple high-risk conditions, a cesarean section is not an option. As a result, the obstetrics department has declined to admit her. Listening to Lu Zichuan's account, Xiao Bufan's brow furrowed slightly, realizing the complexity of the situation. A woman in her 50s with existing heart disease, diabetes, and hypertension? This was indeed a precarious situation. However, if her case were not so complicated and a cesarean section were feasible, she would likely not have been directed to the traditional Chinese medicine department for assistance. After all, every patient in labor represents a potential success for the department and an opportunity to enhance their overall performance. After reviewing the patient's medical history provided by Lu Zichuan, Xiao Bufan contemplated for a moment before stating, "The patient's condition is complex. I must assess her personally to make an accurate diagnosis." In the delivery room of the obstetrics and gynecology department, Lu Zichuan nodded and led Xiao Bufan to the distressed patient. "Ah, it hurts so much, doctor, please help me," cried the elderly mother, lying on the bed, her face contorted in agony and terror. The pain of childbirth is indeed formidable, comparable to the sensation of 12 ribs fracturing simultaneously. Enduring such prolonged suffering exerts immense psychological pressure on the mother. Most individuals could scarcely withstand such intensity of pain, save for the remarkable mothers. Upon Lu Zichuan's arrival, a nurse promptly reported, "Director Lu, the patient is already 7 centimeters dilated, and the baby's bottom is at the birth canal. What should we do now?" "What? The baby's bottom is at the birth canal?" Lu Zichuan was taken aback, breaking into a cold sweat, nearly leaping up in alarm. Typically, in a natural delivery, the head of the baby enters the pelvis first, resulting in the best and most favorable outcome for a smooth delivery. However, if the baby presents buttocks first, it poses significant risks, rendering the likelihood of a natural birth nearly non-existent. In such cases of transverse presentation, a cesarean section is usually performed. Yet, the dilemma lies in the fact that this elderly mother is not a suitable candidate for surgery due to her numerous health conditions, which could exacerbate her other ailments if a cesarean were attempted. Thus, a natural birth became her sole option, should she be unable to deliver naturally. The possibility of losing the child would loom large. In a moment of urgency, Lu Zichuan turned to Xiao Bufan, asking, "Dr. Xiao, the patient is already 7 centimeters dilated, and the baby's bottom is at the birth canal. Is there anything you can do? I need to assess the patient's condition first." Xiao Bufan replied with a grave expression before moving to the mother, placing his hand on her wrist. "At this critical juncture, you are still taking her pulse?" Lu Zichuan thought, exasperated. The baby's bottom was already at the birth canal. Continuing this way could jeopardize the mother's life. What use was a pulse check at this moment? Yet, seemingly oblivious to Lu Zichuan's concerns, Xiao Bufan proceeded to check the mother's pulse and then instructed, "Now, open your mouth. I need to examine your tongue." The mother, overwhelmed with pain, was momentarily taken aback, feeling as though the young doctor was jesting with her. "I am in excruciating pain, and you want me to open my mouth for a tongue examination?" Seeing her hesitation, Xiao Bufan's expression turned stern, laced with urgency. "Hurry, open your mouth. Do you want to deliver naturally or not?" Startled, the mother complied, opening her mouth and sticking out her tongue, her heart racing with anxiety. After examining her tongue, Xiao Bufan quickly assessed that her condition was merely due to the baby's transverse position, and thankfully, her cardiac issues had not yet manifested. With this realization, Xiao Bufan donned a pair of sterile gloves and informed Lu Zichuan, "The mother's condition is stable for now. As long as we can promptly correct the baby's position, she should be able to deliver naturally." As he spoke, he moved to the delivery position. Upon inspection, he noted that the amniotic sac had already ruptured, and the baby's bottom was nearly at the birth canal. However, given the improper presentation, no amount of maneuvering would suffice. The baby's body was larger than its head, making a natural delivery impossible unless the position was corrected. In traditional Chinese medicine, the fetus must be repositioned back into the womb to facilitate a natural birth. Executing such a maneuver demands a physician's skillful technique, as pushing the baby back into the uterus carries the risk of uterine rupture if not performed with utmost care. Without hesitation, Xiao Bufan placed his hands on the mother's abdomen and began to apply gentle upward pressure, striving to reposition the baby. Fortunately, the baby remained still, allowing for a successful adjustment back into the womb within 3 minutes. Next, he commenced a clockwise massage on the mother's belly to correct the baby's posture, an intricate and time-consuming process, given that the mother was already 7 centimeters dilated. This procedure could not be prolonged, as any delay risked significant hemorrhaging. At that moment, it seemed the fetus sensed the manipulation and began to adjust its position in response to Xiao Bufan's efforts. In no time, the baby had rotated a full 180 degrees. Remarkably, Xiao Bufan corrected the fetal position in under 10 minutes, leaving Lu Zichuan and the nurses in sheer disbelief, gazing in astonishment at the now properly positioned fetus. Dr. Zhao's technique is astonishing. Is this truly the Xiao Bufan I know? How could he restore the baby's position so effortlessly? This is nothing short of miraculous. Amidst their astonishment, Xiao Bufan remained focused, continuing to assist the mother in the delivery. Though the baby's position had been corrected, the infant had yet to be born. A single misstep could still lead to dire consequences. Xiao Bufan, with a serious expression, continued to assist the parturient with gentle massages, his hands deftly controlling the pressure with utmost care. After more than half an hour, the sound of the baby's cry pierced the air. A chubby baby boy had finally arrived. Instantly, the medical staff in the delivery room erupted in jubilant cheers. It's a boy. The baby is truly here. Incredible, Dr. Xiao. A natural birth. It has really happened. A wave of excitement swept through the room as the nurses hurriedly clamped the umbilical cord, ensuring the newborn's airways were clear by suctioning out any mucus. Shortly after, a nurse disinfected and tied off the umbilical cord, then weighed the newborn. This little one weighs a hefty 9 pounds and 4 ounces, exclaimed the nurse in charge of weighing the baby, her face beaming with joy. The atmosphere was filled with elation, especially considering the advanced age of the mother and the successful outcome. Suddenly, Lu Zichuan led the applause, and soon everyone joined in, directing admiring glances at Xiao Bufan. Few doctors possess the skill to correct a transverse fetal position and facilitate a smooth delivery as he had done. Not to mention, his technique of uterine massage was truly commendable. As the applause resonated, Xiao Bufan chuckled and waved his hands, saying, "All right, no need to look at me like that. The mother has just given birth and is quite exhausted. You should help her back to rest." Right. Xiao Wang, you and the others. Quickly assist the mother with suturing, then help her back to recover. Lu Zichuan instructed the nurses behind him, a broad smile on his face. He then stepped forward, gently patting Xiao Bufan on the shoulder, expressing his gratitude. "Dr. Xiao, I cannot thank you enough for your assistance. Without your intervention, we might not have been able to help this mother at all." Xiao Bufan smiled and waved his hand dismissively. "Dr. Lu, you are too kind. It's simply my duty." "Your words are too humble, Dr. Xiao. I truly must thank you," Lu Zichuan insisted, then glanced at the clock. "It's nearly time to clock out. How about I treat you to a meal? Surely, you want to decline?" "Sure, I'd be delighted to join you for dinner," Xiao Bufan replied with a grin, appreciating Lu Zichuan's generosity. After bidding farewell to their obstetrics and gynecology colleagues, the two men made their way to a small restaurant across from the hospital. Lu Zichuan, in a generous spirit, ordered a feast of 5 dishes and a soup, disregarding whether the two of them could finish it all. Soon the dishes arrived, and with a welcoming smile, Lu Zichuan urged, "Come on, Dr. Xiao, don't be shy. Eat up." "Thank you." Xiao Bufan nodded appreciatively, picking up his chopsticks without hesitation and diving into the meal. As they ate, they chatted about various trivial matters in their department. After chewing on a piece of beef, Lu Zichuan sighed and remarked, "Our traditional Chinese medicine obstetrics is becoming increasingly challenging. Patients are being lured away by Western medicine, and our experience with deliveries has significantly diminished." Xiao Bufan paused, taken aback by the sudden turn of conversation. He understood the scarcity of patients in traditional Chinese medicine, but he felt powerless to address the situation. Not to mention, the entire field of traditional Chinese medicine was facing a decline in patient flow, not just their department. With a resigned shrug, Xiao Bufan said, "The decline in patient numbers is unavoidable. The convenience and speed of Western medicine have inevitably attracted more patients. It's a trend beyond our control." "Indeed, it's a prevailing trend," Lu Zichuan sighed. "Had I known the field of traditional Chinese medicine obstetrics would be this desolate, I would have chosen differently," sparing myself from this predicament. Observing Lu Zichuan's despondent demeanor, Xiao Bufan felt at a loss for how to console him. After all, who wouldn't he wish for a larger patient base? A greater number of patients would naturally translate to increased income, and doctors, too, need to provide for themselves. Despite the noble image of doctors, the earnings of most practitioners in traditional Chinese medicine barely suffice for a modest living, especially when compared to their Western counterparts. As Lu Zichuan lamented, Xiao Bufan recognized the pressures of modern society. Even as the head of the obstetrics department, Lu Zichuan felt that his salary was insufficient. This struggle was reflected in the increasing number of traditional Chinese medicine graduates who sought alternative careers upon leaving school. It is worth noting that, according to incomplete statistics, over 200,000 students graduate from higher Chinese medicine institutions each year, yet less than 1/6 pursue careers in traditional Chinese medicine. In other words, out of the annual cohort, only around 40,000 enter hospital practice, while others either switch fields or pursue further academic qualifications. This ratio is not exclusive to traditional Chinese medicine. It reflects the entire medical industry. Seeing Lu Zichuan's troubled expression, Xiao Bufan felt uncertain about how to provide comfort. Recognizing that the fundamental remuneration for healthcare workers in the country was inadequate, a reality that could not be altered by individual effort, except for those exceptional physicians who, through their expertise, could earn far beyond their salaries with a single successful procedure. The consultation fee for a traditional Chinese medicine doctor visiting a patient at home is unlikely to be less than that earned by a Western medicine doctor performing surgery. However, one must possess the requisite medical expertise. Otherwise, who would seek your services? Lu Zichuan is acutely aware of the current state of basic remuneration for medical professionals in the country, so his complaints are merely expressions of frustration. He certainly lacks the courage to resign, as he has a large family to support. Unfortunately, with work scheduled for the following day, neither of them could indulge in alcohol. Thus, their dinner was rather conventional. Xiao Bufan hardly ate, spending most of the time listening to Lu Zichuan's grievances about his salary. Later that evening, around 9 o'clock, after finishing their meal, the two parted ways to return home. Upon reaching his suburban residence, Xiao Bufan found himself with nothing to do. So he took a shower and prepared for bed. Suddenly, his phone rang. What? It's so late. Who could be calling? Xiao Bufan paused for a moment, then pulled out his phone to discover an unfamiliar number. After a brief consideration, he pressed the answer button and greeted, "Hello, may I ask who is calling?" "Ah, Xiao. It's me, your Aunt Fong." The voice of Fong Qiuyun emanated from the phone, imbued with a hint of languor, as if she had just finished work. "Huh, Aunt Fong?" Xiao Bufan was momentarily taken aback, then realized, "Ah, it's you, Aunt Fong. I didn't expect a call from you at this hour. Is there something you need? Didn't you mention you could introduce me to a couple of specialists in Western gynecology?" Fong Qiuyun replied with a smile from the other end of the line. "I happen to require your assistance right now. Could you help me find a doctor proficient in Western gynecology? Do you need one right now?" Xiao Bufan was momentarily stunned, struggling to comprehend. "Yes, I need one immediately. It would be best if they could come to our women's prison for a consultation tomorrow. Otherwise, the situation here is rather dire." "All right, let me see if I can arrange that for you," Xiao Bufan replied, still a bit dazed. Truth be told, when Xiao Bufan initially suggested he could introduce a couple of specialists, it was merely a polite offer. He had not anticipated that less than 3 days later, she would indeed reach out for his help. Fortunately, despite his background in traditional Chinese medicine, he knows some acquaintances in Western gynecology. After hanging up with Fong Qiuyun, he promptly contacted his Western medicine friends. Ringing, the first call went to Dr. Wang Tianhao, a gynecologist at the First People's Hospital. Approaching 40, he is the chief physician in gynecology there and is quite skilled. Xiao Bufan had met him at a hospital annual event. Although they were not particularly close, they were familiar enough. Before long, the call connected. With a smile, Xiao Bufan greeted, "Hello, Dr. Wang, this is Xiao Bufan from the 5th Hospital. I hope I'm not disturbing your rest with this late call." "Oh, you're Dr. Xiao from the 5th Hospital? Hello." Dr. Wang, who was on night duty, immediately recognized Xiao Bufan and replied cheerfully, "I'm on duty at the hospital, so there's no way you could disturb my rest. What is on your mind?" Xiao Bufan chuckled and said, "Actually, it's a small matter. The women's prison in our city is looking for a Western gynecologist to assist with some gynecological issues. I was wondering if you might be available to help tomorrow." "You said where? The women's prison?" Dr. Wang paused, visibly taken aback. and quickly waved his hand in refusal. I'm afraid that's quite out of the question. If it were any other place, I might consider it. But a women's prison? I truly can't manage that. With that, Dr. Wang hung up, not allowing Xiao Bufan a chance to continue. Go into a women's prison to treat gynecological issues? Unless he had lost his senses. After all, Wang Tianhao was the chief physician of gynecology at the First People's Hospital. No matter how lowly the task seemed, he would never stoop to visiting a women's prison to treat female inmates. Listening to the busy tone on the line, Xiao Bufan sighed helplessly and dialed another number. Hello, is this Dr. Chun from the Maternal and Child Health Hospital? This is Xiao Bufan from the 5th Hospital. Oh, Dr. Xiao, what can I do for you? Well, the women's prison in our city is seeking a Western gynecologist to assist with some issues. Would you be available to help tomorrow? What? The women's prison? Yes, the women's prison. I'm sorry, Dr. Xiao, but I can't take on that case. Perhaps you might check with the women's hospital. They might have someone willing to go. With a click, the call ended abruptly. Xiao Bufan, witnessing yet another rejection from Dr. Chun at the Maternal and Child Health Hospital, had no choice but to reach out to another gynecologist from a different hospital. However, predictably, almost all the gynecologists he called refused as soon as they heard women's prison. Eventually, he even called the gynecologist from his own hospital, only to receive yet another refusal. It became evident that no gynecologist was willing to venture into a women's prison for consultations. After all, the very notion of a women's prison is too sensitive, often conjuring negative associations. Chapter 60. It seems I must take matters into my own hands at home. Faced with a string of refusals, Xiao Bufan sighed in resignation, realizing he had underestimated the complexity of the situation. Initially, he thought that merely going to the women's prison to treat female inmates for gynecological issues would attract several willing doctors. However, it was clear that no one was eager to go to a women's prison for consultations. Yet, he had already made the offer. What was he to do if no one wanted to attend to the needs of the female inmates? One cannot afford to lose credibility in front of Aunt Fong. Can they? If the word gets out and he fails to deliver, it would not only tarnish his own reputation, but could also lead to repercussions for his family, potentially causing his elder to sever ties with Aunt Fong. Contemplating this, Xiao Bufan couldn't help but let out a sigh. If no one else was willing to visit the women's prison to attend to the female patients, it seemed that he would have to take matters into his own hands. Though he was not particularly keen on consulting in a women's prison, he understood the importance of fulfilling a promise. Failing to do so would compromise his integrity. The following day, bright and early, Xiao Bufan rose, refreshed himself, and drove his old Honda Fit to the hospital for his shift. Just as he parked his vehicle in the hospital garage, the attending physician of the pediatric department, Gu Zhongyi, emerged from a nearby Volkswagen, smiling as he glanced at Xiao Bufan's car. He teased, "Dr. Xiao, your old Honda Fit must be at least a decade old, right? The paint is chipping off the doors. Why haven't you replaced it with a new one yet?" Xiao Bufan chuckled and replied, "Well, changing cars requires money, doesn't it? Without funds, how could one afford a new vehicle?" Gu Zhongyi smirked slightly and said, "Nowadays, buying a new car isn't as costly as it used to be. I heard that over 40 automotive manufacturers in the country are slashing prices. Even Mercedes has reduced prices by 110,000. With that, Gu Zhongyi approached and patted Xiao Bufan on the shoulder, speaking earnestly, "Dr. Xiao, if you don't change your car now, when will you? A new vehicle might just help you in your current single status." "Ah, Dr. Gu, you might have a point there. Perhaps it is time for me to consider a new car?" Xiao Bufan mused, resting his chin in his hand. If car manufacturers were indeed lowering prices, he could afford a decent vehicle, especially since he had been working for several years and had accumulated some savings from his father's allowances. The thought of purchasing a newer model previously valued at over 200,000 for a mere 100,000 was quite tempting. He decided to visit a dealership on his day off on Saturday. With that, Xiao Bufan and Gu Zhongyi continued their light-hearted banter as they made their way to the traditional Chinese medicine outpatient department. "Dr. Xiao, I must get back to work now. I suggest you act quickly on the car situation. Otherwise, you might miss your chance," Gu Zhongyi said with a wave before heading to his pediatric consultation room. "All right, I'll consider getting a new car," Xiao Bufan replied with a smile as he entered his own consultation room. Upon entering, Xiao Bufan immediately called out to the system. "System, please sign me in." Beep. Sign in successful. "Congratulations, host, you have acquired mastery-level tongue diagnosis. Mastery-level tongue diagnosis? Xiao Bufan's expression brightened, a smile spreading across his face. Although tongue diagnosis may seem basic, its significance is paramount in traditional Chinese medicine. Within the four diagnostic methods of TCM, observation, listening, inquiry, and palpation, tongue diagnosis is the most critical aspect of observation. As the saying goes, all internal and external ailments manifest their forms and characteristics on the tongue. A true expert in TCM can often discern a patient's condition merely by examining their tongue, sometimes without the need for pulse diagnosis. In an instant, a wealth of information regarding tongue diagnosis flooded Xiao Bufan's mind. After assimilating this new knowledge, his diagnostic skills underwent a remarkable transformation. Previously, his observational skills were at a novice level. Now, they had advanced to an intermediate level, aligning perfectly with his role as an attending physician in the TCM department. While his inquiry skills still required enhancement, his proficiency in the other core diagnostic methods far surpassed his current position. Just as Xiao Bufan finished absorbing the knowledge he had gained, his phone rang abruptly. He quickly pulled it out to find that it was a call from Fang Xiuyan. Really? She's calling so early? Xiao Bufan's expression shifted to one of surprise. He rubbed his nose and answered, "Good morning, Aunt Fang. Have you had breakfast yet? Is it still early? I hope you're not still in bed." Fang Xiuyan's cheerful laughter resonated through the phone. Xiao Bufan hastily shook his head, denying, "Oh no. Aunt Fang, I'm already at the hospital, ready for work." "Oh, is that so? You've already started your shift?" Fang Xiuyan smiled slightly before asking, "How'd it go with the specialists? Did any gynecologists agree to visit the women's prison for consultations?" Well, Xiao Bufan stammered. "I'm afraid my friends all declined when they heard it was for the women's prison." "All declined?" Fang Xiuyan's face fell, anxiety creeping into her tone. "What are we to do? Last night, several female inmates contracted infections, and if we don't treat them promptly, it won't TB long before the entire prison is affected." "Really? Is it that serious?" Xiao Bufan was taken aback. In his medical career, he had never heard of a gynecological ailment that could spread so rapidly. Moreover, there were no men in the women's prison, eliminating the possibility of transmission through sexual contact. How could infections spread so quickly among women? Fang Qiuyan sighed, a hint of frustration in her voice. "Yes, the rapid transmission and sudden outbreak have left our prison doctors unable to manage or treat the situation. If it weren't for the severity of this illness, I wouldn't have called you so late. Indeed, had it not been for this urgent health crisis." Fang Qiuyan and Wu Ti have reached out to Xiao Bufan, considering she knew many doctors. Although she wasn't a high-ranking official, she managed a prison housing over 4,000 female inmates. Anyone aware of her position would surely extend her some courtesy, given the significance of those inmates, some of whom came from influential families and had merely stumbled down the wrong path. The female inmates, with a mere touch of influence, would undoubtedly consider the demeanor of Warden Fang Qiuyan, unless they wished to endure a less than favorable existence within those walls. It is essential to understand that our society is steeped in interpersonal relationships. Often, matters cannot simply be disregarded. Fang Qiuyan's decision to contact Xiao Bufan for assistance stemmed from two motivations. Firstly, to ascertain whether he could indeed resolve the pressing issue, and secondly, to bestow a modicum of merit upon him. Should Xiao Bufan succeed in addressing the sudden outbreak of illness within the women's prison, it would undoubtedly shine a favorable light on his future endeavors. Upon hearing Fang Qiuyan's words, Xiao Bufan finally grasped the gravity of the situation. The ailment plaguing the prison was far more serious than the routine gynecological issue described by Aunt Fang the previous night. After some contemplation, Xiao Bufan suggested, "If the situation is as dire as you say, perhaps I should come over and assess it myself. Of course, this is contingent upon your belief in my medical skills and character. Otherwise, my presence would be of no consequence." Fang Qiuyan pondered for a moment before responding. "If you believe you possess the ability to handle this condition, I am more than willing to place my trust in you. However, the situation is urgent. If you truly wish to assist, it would be best to arrive promptly. Otherwise, I will have no choice but to escalate the matter to the city authorities and request specialized medical personnel to conduct an evaluation." To be candid, prior to receiving the early morning call from the prison, Fang Qiuyan had assumed the outbreak was merely a common gynecological issue. However, the alarming report made her realize it was, in fact, a highly contagious disease. should Xiao Bufan be unable to confirm that he could provide assistance. She would have to report the situation immediately. After all, if the illness were to spread uncontrollably, her position as warden would be untenable, leaving her with no option but to return home to tend to the fields. Understood. I shall request leave and head over immediately, Xiao Bufan replied, recognizing that the situation had escalated beyond Aunt Fong's control. He nodded affirmatively before hanging up and seeking permission from Director Wang. Naturally, Wang Tianqing readily approved Xiao Bufan's request for the morning off. As the clock approached 9 o'clock, Xiao Bufan navigated his dilapidated vehicle through the streets, finally arriving at the women's prison after a journey of over 40 minutes. The facility is situated on a low mountain, approximately 12 kilometers from the city outskirts, covering an area exceeding 3,000 square meters, surrounded by guards and high walls. Though referred to as a low mountain, it is officially named Wanggui Mountain, with an elevation exceeding 400 meters. Thus, the women's prison in Shiyuan City is also known as Wanggui Prison, a name symbolizing the hope for those who have dared to return and amend their ways. The prison has indeed lived up to this meaning, with numerous female inmates rehabilitating and departing to commence new chapters in their lives each year. Upon arriving at the prison, Xiao Bufan was halted at the entrance by a guard. "Halt! What is your purpose here? This is a women's prison, and unauthorized individuals are not permitted entry," a stern female officer commanded, blocking his path. Xiao Bufan promptly rolled down his window and replied, "Hello, I was summoned by the warden to assist with the consultation. I am a medical professional from the 5th hospital in our city." Summoned by the warden? The officer remained unmoved, her expression serious as she responded, "Please present your invitation or relevant identification." I'm afraid I do not have an invitation. Perhaps I should call the warden directly?" Xiao Bufan searched his pockets, realizing he had forgotten even his medical credentials. "Then please make the call," the officer said, maintaining her serious demeanor and stepping aside in silence. Reluctantly, Xiao Bufan took out his phone and dialed Fong Xiuyan. Ringing. Soon, the call connected. "Aunt Fong, I've arrived at the prison entrance. But I'm being denied entry," he explained. "You're at the prison gate?" Fong Xiuyan paused, then nodded. "I understand. I'll have someone let you in." With that, she hung up and called the guard at the checkpoint. Before long, the officer seemed to receive the directive and informed Xiao Bufan, "You may proceed." "Thank you," he replied gratefully, driving through the gate. Once the warden's order was relayed, the guard allowed him entry. As Xiao Bufan maneuvered through several checkpoints and arrived at the main entrance of the women's prison, he found Fong Xiuyan waiting for him. Today, she was clad in a crisp uniform, presenting a professional appearance, quite unlike her demeanor during her previous meeting with Xiao Yuanyang. As he stepped out of the car, he greeted her with a smile. "Apologies for any delay, Aunt Fong. Timeliness is not the issue. The crucial question is whether you are equipped to resolve the ailment afflicting our prison," Fong Xiuyan stated with a serious expression, her gaze piercing through to the heart of the matter. "If you cannot address this issue, perhaps I should seek a more specialized physician." Taken aback, Xiao Bufan was momentarily speechless. He had not anticipated that upon arriving at the women's prison, Aunt Fong would question his medical expertise. Did she truly hold such a low opinion of him? He had significantly improved his skills over time and was no longer the novice he once was. If he were unable to handle such a straightforward infectious disease, it would certainly be a blow to his pride. Reflecting on the rewards he had accrued recently, Xiao Bufan felt confident in his ability to manage basic infectious diseases. After all, in contrast to Western medicine, traditional Chinese medicine is considered the progenitor of infectious disease treatment. Historically, all infectious diseases fall under the category of epidemics in Chinese medical thought. Over the centuries, traditional Chinese medicine has accumulated a wealth of experience in preventing and treating epidemics, successfully curbing countless outbreaks throughout history. Each epidemic has claimed numerous lives, and in response, traditional Chinese medicine has developed a deeper understanding of these diseases and proposed effective prevention and treatment strategies. As stated in the Huangdi Neijing Suan, all epidemics are easily transmitted, regardless of severity, and as long as the body's righteous qi remains intact, the evil cannot invade. In the discourse on epidemics, it is noted that pathogens enter through the mouth and nose, and the nature of the ailments they cause can either be influenced by the heavens or transmitted from one to another. Despite the varying symptoms, the underlying illness remains the same. In light of these traditional Chinese medical concepts, Xiao Bufan has elevated his understanding to a commendable level, although he cannot yet compare himself to the esteemed masters of traditional medicine. He is confident that his skills surpass those of the attending physicians and even the chief physicians within the entirety of Shiyuan City's traditional Chinese medical institutions. With this in mind, Xiao Bufan earnestly assured Fong Xiuyun, "Rest assured, Aunt Fong, as long as it is not an exceptionally complex case, I am confident in my ability to provide effective treatment." "Very well. If you possess such confidence, then let us proceed," Fong Xiuyun replied, leading Xiao Bufan into the depths of the women's prison. The facility in Shiyuan City is notably expansive, with a security presence of female guards stationed every few meters, making entry a challenge for the average individual. After a lengthy and winding journey through numerous iron gates, they finally arrived at the section of the prison where inmates are held. With advancements in modern technology and architecture, contemporary prisons are far removed from the chaotic and squalid conditions of the past. The internal structure of Shiyuan City's women's prison is meticulously organized, featuring around-the-clock surveillance and regular patrols by female guards. Several iron gates are equipped with both key and password locks for added security. The notion of an ordinary person escaping from such a facility is akin to a fantasy. Inmates typically engage in manual labor and partake in daily exercises, residing in rooms shared by 6 individuals. With nearly 4,000 female prisoners, the demand for accommodations necessitates over 600 cells, not accounting for the housing requirements of the guards. Consequently, the total number of sleeping quarters exceeds 800, alongside areas designated for recreation, dining, and work. As Fong Qiuyun guided Xiao Bufan through the women's prison, she elaborated, "The recent outbreak of infectious disease is predominantly concentrated within the prison sector, which houses approximately 1,000 inmates. Initially, we assumed it was merely a case of gynecological infections due to the frequent mix-up of personal hygiene items among the inmates." Upon entering the prison area, Fong Qiuyun instructed for Xiao Bufan's phone to be confiscated. "This is a women's prison. No electronic devices, including mobile phones, are permitted," she stated with a smile. Xiao Bufan nodded in understanding. They soon reached the living quarters of the female inmates, which are situated within a singular building, resembling dormitories found in schools, albeit with iron doors that are securely locked. Upon arrival, Xiao Bufan noticed that the building was cordoned off by police tape, with several medical personnel in protective gear attending to the situation, seemingly isolating the structure while a contingent of female guards maintained vigilance. The severity of the situation appeared to exceed Xiao Bufan's expectations. At that moment, a guard in protective clothing approached Fong Qiuyun, reporting, "Warden, after thorough examination, we suspect that the ailment afflicting this section may not be a simple gynecological infection, but rather a Class B infectious disease. We have seen an increase of 3 additional cases, and if the situation is not stabilized promptly, the entire area may succumb." "Class B infectious disease?" Fong Qiuyun's brows furrowed, and she looked at the guard with concern. "Are you certain? What preliminary diagnosis do you have?" Although not a physician, her role as warden necessitated some familiarity with the classifications of infectious diseases. In China, infectious diseases are categorized into 3 classes: Class A, Class B, and Class C. Class A diseases, such as plague and cholera, are subject to stringent management and must be reported within 6 hours upon detection. Class B diseases require notification within 12 hours, while Class C encompasses diseases like influenza and rubella, managed through testing protocols. Upon hearing Fong Qiuyun's inquiry, the guard promptly presented several test results, his expression betraying concern. "We suspect it may be anthrax." "Anthrax?" Fong Qiuyun paused, seemingly unfamiliar with the term. "Are you certain?" Xiao Bufan, equally taken aback, seized the test results from Fong Qiuyun's hands. The findings indicated patient's white blood cell count elevated, patient's neutrophil count elevated, presence of large positive bacillus anthracis in the patient's samples. Good heavens, could this truly be anthrax? Xiao Bufan's expression shifted, tension mounting within him. It is well known that anthrax is a formidable infectious disease with a nearly 100% fatality rate. Compounding the alarm is the disease's potential incubation period. Fortunately, based on the test results, it appeared that this instance of anthrax was likely cutaneous anthrax, which does not manifest rapidly. Should it have been inhalational anthrax, even the most skilled traditional medicine masters would be powerless, as patients can succumb to respiratory failure within 48 hours. Differentiating cutaneous anthrax from other conditions is relatively straightforward. Initial symptoms often present as papules on the face, arms, or neck, progressing to vesicles filled with pale yellow fluid. If the entire body subsequently erupts in small vesicles, it is indicative of cutaneous anthrax. Realizing this, Xiao Bufan's expression grew serious as he urgently inquired of the medical staff, "Do you have any protective gear available? Please provide a set for Aunt Fong, quickly." "Yes, of course," the guard replied promptly, hastily retrieving an unused set of medical protective clothing. "Why aren't you wearing protective gear?" Fong Shuyun asked, momentarily taken aback as she turned to Xiao Bufan. Xiao Bufan smiled and raised his hands, stating, "I am a traditional Chinese medicine practitioner, relying on the techniques of observation, listening, inquiry, and pulse-taking to diagnose my patients. If I were to don protective clothing, how could I possibly take a pulse? Thus, I see no need for such attire." He acknowledged the highly infectious nature of anthrax, but noted its non-airborne transmission. As long as one is cautious not to suffer skin abrasions or be splattered by the saliva or blood of an infected individual, the risk of contagion remains minimal. Donning protective gear would hinder his ability to conduct pulse examinations, prompting him to outright reject the idea. The prison doctor, momentarily taken aback, looked at Xiao Bufan in disbelief, asking, "Are you certain you do not require protective clothing?" Xiao Bufan nodded earnestly, affirming, "Indeed, I do not need it." The prison doctor turned to the warden, who showed no objection, thus refraining from further persuasion. Fong Xun scrutinized Xiao Bufan with newfound respect, her admiration for him soaring by 100%. She perceived his mindset as remarkably noble, embodying the qualities a physician should possess. "Very well, if you are resolute in your decision, we shall proceed without protective gear. Let us enter and assess the situation," she said, nodding at him. However, she reminded him, "You have only 12 hours to diagnose and treat. If the condition cannot be stabilized within this time frame, I will have no choice but to report to the City Health Organization and request their intervention." With that, she stepped into the prison cell, and Xiao Bufan followed closely, nodding seriously. "Understood, Aunt Fong. I am well aware of the severity of Class B infectious diseases." As they entered one of the cells, they found 6 female prisoners, the earliest victims of the outbreak. Upon entering, Xiao Bufan immediately approached one of the afflicted women. To him, these women were not criminals, but rather patients suffering from a grave illness. He focused on the nearest patient, taking her wrist to assess her pulse. In the realm of traditional Chinese medicine, both Class A and B infectious diseases fall under the category of plagues. The Danchi Heart method states, "Plague, the common affliction of many, also known as the celestial epidemic. The onset of plague is sudden and perilous, with symptoms such as aversion to cold and intense heat, followed swiftly by fever without chills, headaches, body aches, a white-coated tongue, a red tongue body, and a rapid pulse." Upon touching the patient's wrist, Xiao Bufan immediately sensed a weak and formless pulse, an ominous sign of impending death. This was the manifestation of a scattered pulse. The term scattered pulse flashed through his mind. It was his first encounter with such a pulse type. A scattered pulse indicates a deficiency of vital energy and blood, lacking substance and exhibiting a disordered quality. The human body relies on a vital force to maintain life. The circulation of qi and blood must remain intact. Normally, a healthy pulse is strong, rhythmic, and well-defined. A scattered pulse signifies a person nearing death, indicating a dispersion of vital energy and an impending cessation of life. After assessing the pulse, Xiao Bufan examined the patient's tongue and pondered the most effective prescription for treatment. The woman's face was covered in chickenpox, with some areas already scabbed over with black anthrax lesions, a sight both horrific and alarming. The first step in preserving her life was to restore some of her vital energy before proceeding with further treatment. If normal pulse patterns could not be reinstated, her chances of survival would be negligible. Xiao Bufan's mind raced with various traditional Chinese emergency remedies. It was essential to stabilize the patient's condition swiftly, otherwise, she might succumb before any treatment could commence. Fortunately, traditional Chinese medicine offers several emergency prescriptions capable of saving lives from the brink of death, such as Tianshan snow lotus, century-old ginseng, thousand-year-old ganoderma, and ironclad dendrobium. Each of these medicinal herbs, if genuine, possesses the potential to restore life. as he contemplated the most appropriate combination of herbs. A prison doctor entered, carrying pre-prepared intravenous medication. "Excuse me, I need to administer intravenous fluids to the patient," he said. Xiao Bufan stood momentarily stunned, still grappling with the right remedy for emergency treatment. Every choice he made would weigh heavily on the patient's life, a matter far too serious to take lightly. The doctor quickly inserted the four, but within a minute, the patient began to tremble violently, her breathing becoming erratic, as if she were enduring unspeakable torment. "Stop the intravenous administration immediately," Xiao Bufan shouted, his expression shifting dramatically. The doctor, startled, hastily removed the four, his mind racing with panic. If the patient were to die due to the intravenous treatment, both he and the warden would bear the consequences. Observing the stricken woman, the doctor murmured anxiously, "What is happening?" Administering hydrocortisone and penicillin to a patient with anthrax should not provoke such a severe reaction. He felt utterly at a loss, questioning his medical knowledge and the appropriateness of his prescribed treatment. Meanwhile, Xiao Bufan furrowed his brow, formulating a resolution in his mind. The patient's extreme reaction to hydrocortisone and penicillin indicated a hypersensitivity to glucocorticoids. In this scenario, the use of Shenfu decoction would likely yield significant benefits, as it is known for its potent ability to replenish yang energy. In cases of severe illness leading to extreme weakness, or when there are long-standing ulcers, significant blood loss, or loss of vital energy, this remedy can be employed for treatment. It is often said that to replenish postnatal energy, nothing is better than ginseng. To restore prenatal energy, nothing surpasses aconite. This is the foundation of the ginseng and aconite decoction. Ginseng and aconite are two complementary herbs, and when used appropriately, they can swiftly transform energy from the void and promptly revive the yang within the life gate. This formula is remarkably effective. The ginseng and aconite decoction can treat severe depletion of vital energy, sudden loss of yang, cold extremities, weak respiration, and faint pulse, making it highly pertinent to the situation. Pondering this, Xiao Bufan eagerly inquired of the prison doctor nearby, "Are there any Chinese herbs available in the prison? I need to prescribe a treatment for the patient immediately." "Well, we do have some, but the herbs might not be complete. There are some that we Haven tea prepared here," the prison doctor responded, momentarily taken aback. With a hint of surprise in his gaze as he asked, "What prescription are you planning to write? Chinese medicine seems to take effect slowly, doesn't it? Surely we have ginseng and aconite?" With a serious expression, Xiao Bufan replied, "I prescribe 15 grams of ginseng and 30 grams of peeled aconite. Prepare a decoction without the need for boiling. We must act swiftly." Indeed, there are numerous combinations for this decoction. Yet, Xiao Bufan's specific prescription of 15 grams of ginseng and 30 grams of peeled aconite is particularly effective for reviving yang and replenishing qi. The priority is to restore the patient's yang energy before proceeding with further treatment. Ginseng and aconite decoction? The prison doctor was momentarily stunned, then turned to the prison warden. After a deep glance at Xiao Bufan, Fang Qiu nodded and said, "Let us try the prescription Xiao has provided. Should anything go awry, I will take full responsibility." "Understood, Warden," the prison doctor replied, nodding before hastily preparing the prescription. Once the doctor departed, Fang Qiuyun turned to Xiao Bufan and asked, "Are you certain this prescription will be effective? This is a Class B infectious disease. Can Chinese medicine truly help?" Xiao Bufan, brimming with confidence, nodded affirmatively and assured her, "Rest assured, Aunt Fang, this prescription will undoubtedly work." "Let us hope so," Fang Qiuyun replied lightly, then quietly awaited the return of the prison doctor with the medicine. Before long, the prison doctor returned with the prepared ginseng and aconite decoction. Naturally, he was not alone, as there were 6 female inmates in the cell. Necessitating enough medicine for all of them, it would be unreasonable to treat only one patient. "Quickly, administer the medicine to the patients," Xiao Bufan instructed as soon as he saw the doctor returning with the medicine. "Right away." The prison doctor nodded, acting like a mere instrument as he took a spoonful of the decoction to feed the female inmate. The others followed suit, distributing the medicine to the remaining inmates. Once all the female inmates had taken the medicine, the next step was to await the effects. Xiao Bufan, along with Fang Qiuyun and others, stood by in silence, anticipating the medicine's efficacy. The ginseng and aconite decoction is known for its swift action, designed for emergency use, and should not be underestimated. The other prison doctors also awaited anxiously, their expressions filled with apprehension and unease. After all, they bore the responsibility as the prison's medical staff. Should this infectious disease spiral out of control, they would surely bear the brunt of the consequences. Suddenly, one of the female inmates began to cough. In no time, the complexions of several female inmates visibly brightened, transforming dramatically before the observer's eyes. Quick, bring the monitoring device to check their blood pressure and heart rates. The prison doctor's face lit up with joy as he shouted to a fellow doctor nearby. When the monitoring device was placed on the patient, the readings began to rise steadily, seemingly signaling the restoration of her vital energy. Glancing at the displayed data, the prison doctor exclaimed, "Wonderful! The patient's blood pressure and heart rate are rising. The heart rate has reached 66 beats per minute, and blood pressure is at 92/70 millimeters of mercury." Though the female inmate had shown little response except for her earlier cough, her complexion was noticeably better than before, akin to a flicker of life returning. Leaving everyone present in awe, Fang Qiuyun turned to Xiao Bufan, her eyes betraying a hint of astonishment at his remarkable medical skills. How could such a swift effect be achieved with a single dose of Chinese medicine, especially for a Class B infectious disease? Unaware of Fang Qiuyun's astonished expression, Xiao Bufan stepped forward to grasp the female inmate's wrist, taking her pulse once more. Upon feeling the pulse, he detected a significant change in her vitality. A vigorous energy was progressively revitalizing her internal qi. It is crucial to note that the body's qi is in constant flux. Any instrument can only provide a standard result and cannot capture the dynamic changes within the patient's energy. Such shifts can only be discerned by a seasoned traditional Chinese physician through pulse diagnosis. At this moment, Xiao Bufan could distinctly sense that the patient's pulse had become stronger than before. The pulse was deep and heavy, indicating internal stagnation of evil energy. The patient's yang was suppressed, unable to surface. This indicated that while some vitality had been restored, it was merely a temporary measure. The anthrax virus continued to wreak havoc on the patient's energy, blood, and internal organs, threatening her very life. Feeling the pulse under his fingers, Xiao Bufan's brow furrowed slightly as a diagnostic approach began to form in his mind. As the saying goes, specific prescriptions for specific diseases, combined prescriptions for complex ailments. While the patient was afflicted with anthrax, it also fell under the category of a plague. From the perspective of traditional Chinese medicine, plagues arise not only from the invasion of malevolent qi, but also from four primary causes: dampness, heat, toxin, and stagnation within the body. Anthrax clearly belongs to the category of toxicity. Hence, the immediate priority is to detoxify before addressing the root cause. Perhaps the Qingwen Baidu decoction could be a viable solution? After careful consideration, Xiao Bufan deemed this prescription feasible. The Qingwen Baidu decoction is derived from the work Yizhen Ida by the Qing dynasty scholar Yulin, which he formulated based on the experiences of his predecessors in treating epidemics. This decoction is effective against all symptoms of heat, both internally and externally, including coughing up blood, nosebleeds, and severe fever. It possesses the ability to clear heat and toxins from the qi in blood, alleviate excessive fire in the 12 meridians, and has antiplatelet aggregation, reduces blood viscosity, and exhibits anti-inflammatory, analgesic, antibacterial, and antiviral properties. With this in mind, Xiao Bufan turned to the prison doctor and instructed, "Prepare a prescription for the Qingwen Baidu decoction." "Huh? Another prescription?" The prison physician momentarily froze, then, looking utterly perplexed, inquired, "How is the Qingwen Baidu decoction prepared? I'm not familiar with this formula." It should be noted that he had previously studied Western medicine, and these prison doctors were entirely ignorant of traditional Chinese medicine. Xiao Bufan sighed softly and stated earnestly, the previous Shinfu decoction was merely intended to assist the patients in regaining their vital energy. The subsequent formula is meant to treat the ailments. With that, Xiao Bufan proceeded to write out the prescription for the Qingwen Baidu decoction. Shengdi 18, Huang Lian 25. Huang Qin Mui Jin, Zan Bi Hai Mui Lam, Si Gao Ba Mui, Zi Hai Mui Du, Gan Gao Mui Shao. The prison physician promptly noted down the prescription before turning to prepare the medicinal herbs. However, Xiao Bufan stopped him and cautioned, "Remember, you must first boil the Shi Gao before adding the other herbs. It is imperative not to brew them together." "Oh, understood. I will remember." The The physician nodded vigorously in agreement, and then went off with a few others to prepare the Chinese medicine. Once the physicians had departed, Fang Qiuyun, donned in medical protective gear, could not help but ask Xiao Bufan, Xiao, "Are you certain this prescription will work? There won't be any issues, will there?" "Rest assured, Aunt Fang, this prescription is absolutely reliable," Xiao Bufan replied with confidence. "If these patients show improvement after taking the Qingwen Baidu decoction, I believe the other infected individuals can also try this formula with minimal risk." "Very well. Since you are so confident, I shall certainly support you. Regardless of the outcome, I will remember your kindness," Fang Qiuyun said with a smile, gently patting Xiao Bufan's shoulder. He smiled back and waved his hand dismissively, saying, "Aunt Fang, you are too kind. Healing is our duty as physicians. Every patient deserves our care, regardless of their origin." With that, Xiao Bufan turned to attend to the next patient, continuing his diagnoses. Despite the clarity that these female inmates had been infected with anthrax, each individual's constitution differed, necessitating a thorough examination of each before making any nuanced adjustments to the prescriptions. Such adjustments typically involve minor modifications to the dosages of certain herbs to achieve optimal therapeutic effects. After Xiao Bufan had completed his examinations of all the infected patients, the prison physicians returned with the prepared medicine. He immediately instructed them to administer it to the initial 6 patients and subsequently wrote out prescriptions for the remaining infected inmates. The prison physicians, clad in protective gear, busily ran about preparing the herbal remedies, perspiring profusely, yet unable to avoid their duties. It is worth noting that there were no male guards in the female prison, let alone male physicians, making the current group of prison guards all young ladies. However, due to their protective gear, Xiao Bufan could not discern their appearances and thus had no idea of their beauty. After all the infected patients had consumed their medicine, approximately 2 hours had elapsed, leaving less than 10 hours remaining. Should these patients fail to show improvement within the next 10 hours, Fang Qiuyun would have no choice but to report the outbreak of infectious disease to the municipal health organization or even the provincial health organization. Fortunately, after taking the medicine, the heart rates and blood pressures of the anthrax-infected patients stabilized. Subsequently, Xiao Bufan checked their pulses every half hour to monitor the progression of their conditions. Chapter 65. Traditional Chinese Surgical Methods. Soon, the morning passed swiftly. Xiao Bufan had to borrow a phone from Aunt Fang to call Director Wang of the Traditional Chinese Medicine Department, informing him that he would need to take the afternoon off and would not be able to work at the hospital that day. "What did you say? You can't come to work this afternoon?" Wang Tianqing was taken aback, confused as to why Xiao Bufan was requesting an entire day off when he had previously only mentioned needing the morning off. Xiao Bufan merely smiled, offering no further explanation before hanging up the phone. Listening to the busy tone, Wang Tianqing momentarily paused, muttering in frustration, "Am I the director, or is he? This young man is increasingly disregarding my authority." Nevertheless, despite his complaints, he held a fondness for Xiao Bufan, particularly given the latter's remarkable performance in the department recently, which was nearly rivaling his own role as department head. Meanwhile, Xiao Bufan was unaware of Wang's thoughts as he diligently attended to the patients in the women's prison for their 4th round of consultations. After having lunch in the prison cafeteria, he checked each female inmate's pulse, a smile of satisfaction spreading across his face. Through this examination, he observed that their pulses were stronger than before, and their complexions had noticeably improved. Clearly, the prescription he had provided was yielding positive results. The fevers among all the anthrax-infected inmates were subsiding, indicating that Xiao Bufan's diagnostic reasoning had been sound. After Xiao Bufan finished examining all the female inmates, Fang Qiuyun, who had been waiting, asked, "So, Xiao, how are the inmates faring? Is the infectious disease under control?" "There are no significant issues. Their conditions are generally stable," Xiao Bufan replied, turning to Fang Qiuyun with a confident smile. "Their ailments are largely under control, and we need only administer one more dose of medicine. Thereafter, it is a matter of recuperation. Additionally, regarding the source of the anthrax infection, your prison must promptly investigate and conduct a thorough disinfection to prevent any secondary transmission, ensuring the safety of the other inmates." Upon hearing this, Fang Qiuyun felt a wave of relief wash over her and nodded, saying, "As long as it is stable." "That is good. I will immediately arrange for the disinfection. You need not worry about that." "All right, Aunt Fang, I understand," Xiao Bufan replied with a smile and a nod. For the next few hours, he remained vigilant regarding the patient's conditions. As the afternoon approached dusk, all the anthrax-infected patients had completely recovered from their fevers and regained their senses, no longer appearing dazed as before. The prison physicians, having assessed the situation in the prison, also breathed sighs of relief. This dreadful infectious disease had finally been brought under control. All that remained was to identify the source of the infection and conduct a thorough disinfection of the prison. As for the female inmates infected with anthrax, following that, they merely needed to continue their medication and rest for a few days to recover fully. After confirming the effectiveness of Xiao Bufan's treatment, Fang Shiyun refrained from immediately reporting the infectious disease to the Municipal Health Organization. After all, if they could resolve this Category B infectious disease within the prison, reporting it later would indeed be a significant achievement, potentially garnering her a considerable bonus and subsidy. If it were not for this incentive, Fang Qian would not have thought of seeking Xiao Bufan's assistance first rather than promptly notifying the Municipal Health Organization. Frankly, she was quite astonished that Xiao Bufan managed to control this Category B infectious disease with just 2 doses of traditional Chinese medicine. Typically, even health organization personnel would require considerable effort to manage such a disease, let alone an ordinary physician. The prison doctors were equally taken aback by Xiao Bufan's medical prowess. They had never encountered such a formidable and youthful traditional Chinese medicine doctor before. One of the prison doctors gazed at Xiao Bufan with starry eyes and even boldly requested his contact information, expressing a desire to discuss medical matters with him. It is worth noting that these prison doctors, who had long worked in the prison, found it quite challenging to find boyfriends, leaving them all single to this day. In truth, not only these prison doctors, but most of the female guards in the women's prison were also single, with some being particularly beautiful. Xiao Bufan naturally did not decline the prison doctor's kind offer and added her as a friend on WeChat, learning her name in the process, Gao Qilan. A lovely name indeed. Later that night, Fang Qun treated Xiao Bufan to a sumptuous meal in the prison cafeteria before cheerfully escorting him to the prison gate. All the female inmates infected with anthrax had begun to recover, and there was no need to trouble Xiao Bufan further. Fang Qiyun, the prison warden, could manage the remaining matters herself. All right, Xiao, I'll see you off here. Fang Qiyun smiled as she brought Xiao Bufan to the gate, pointing to the road leading down the mountain. Drive slowly on your way back. I cannot thank you enough for your help this time. Once I have some free time, I'll invite your father out for a meal, my treat. Haha, sure. I'll let my dad know, Aunt Fang, Xiao Bufan replied with a smile and a nod. Well then, it's settled. If anything else arises, I will call you, Fang Shiyun said, waving goodbye to Xiao Bufan with a beaming smile. It's getting late. You should head home and rest. All right, goodbye, Aunt Fang. Xiao Bufan waved back and drove his dilapidated car down the mountain. Once Xiao Bufan departed, Fang Shiyun turned back into the women's prison to begin organizing other matters. The entire prison required a thorough disinfection, and the sudden outbreak of the virus needed to be reported to higher authorities. However, while reporting, she could not neglect to take credit for the incident, especially since Xiao Bufan's assistance warranted a request for a reward. Otherwise, it would seem as though she had done nothing as the warden. Though Fang Shiyun had not yet confirmed her relationship with Xiao Yuanyang, she had already developed a fondness for this young man. And even if she did not end up with Xiao Yuanyang, she wished to adopt Xiao Bufan as her godson. Fortunately, Xiao Bufan remained oblivious to Fang Shiyun's thoughts. Otherwise, he might have found himself embroiled in an internal conflict. After all, being a godson does not differ much from being a stepson, and he might as well consider uniting Aunt Fang with his own father instead, which would not be significantly different. Boom, boom, boom. Shortly thereafter, Xiao Bufan returned to his suburban courtyard in his battered car. After parking, he opened the gate and entered the living room. He quickly showered with cold water and prepared for rest, to prevent bringing anthrax virus home from the women's prison. Xiao Bufan meticulously disinfected the clothes he had worn and even thoroughly sanitized his car before settling into a peaceful sleep. Thus, the night passed without incident. The next day, the weather outside was bright and sunny, with not a cloud in sight. After rising early and washing up, Xiao Bufan performed another round of disinfection before driving his old car to the hospital for work. It was Thursday, and fortunately, he did not have to work the night shift. Consequently, when he arrived at the hospital, his spirits were high. Creak. Upon entering the traditional Chinese medicine outpatient department, Xiao Bufan cheerfully pushed open the door to his consultation room, changing into his white coat as he instructed the system. System, please sign me in immediately. Beep, sign in successful. Congratulations, host, you have obtained advanced traditional Chinese surgical techniques. Traditional Chinese surgical techniques? Advanced? Xiao Bufan's eyes widened in astonishment, his face reflecting shock. It is well known that traditional Chinese surgery is an extraordinary medical practice, comparable even to Western surgical methods. In fact, during the Three Kingdoms period, the renowned physician Hua Tuo performed an appendectomy using traditional Chinese surgical techniques and even conducted surgeries on Guan Yu to treat his injuries. Hua Tuo once offered to open Qiao Qiao's head to remove a tumor, but Qiao Qiao, plagued by suspicion, imprisoned Hua, ultimately leading to his demise. The only remnants of Hua Tuo's medical text, the Qing Nong medical book, were the first 3 volumes, as the rest perished in flames. Of course, these tales are merely folklore, their veracity long lost to time. Nonetheless, one fact remains. Nearly 2 millennia ago, the forefathers of traditional Chinese medicine were already capable of performing surgical procedures. The Book of the Later Han records, if a disease manifests as a lump internally, which needles and medicines cannot reach, one should first use wine to consume the ma fei powder, rendering the patient unconscious and allowing for incision and extraction of the mass. This ma fei powder is an anesthetic developed by Hua Tuo, rumored to be a purely herbal concoction with no side effects. Compared to modern Western anesthetics, it would undoubtedly be the best anesthetic available, especially due to its absence of side effects, making it suitable for any surgical operation. Unfortunately, the formula for ma fei powder has been lost to history, existing only in written records. Author's expression, Chapter 66, Paying for the Patient. With a sudden hum, Xiao Bufan felt an overwhelming influx of knowledge regarding traditional Chinese surgical techniques flood his mind. The overwhelming sensation of having an abundance of knowledge suddenly inundate his mind nearly caused him to faint. After all, such an influx of information could overwhelm the human cortex. Fortunately, it seemed the system was aware of Xiao Bufan's limits, and soon this feeling dissipated from his consciousness. Once Xiao Bufan assimilated the knowledge of traditional Chinese medicine, TCM, surgical techniques, he realized that not only Western medicine could perform surgeries. TCM also possessed its own methods of surgical treatment. In fact, TCM encompasses 3 primary surgical approaches. The first approach is the pharmacological treatment method, which is self-explanatory. It involves tailoring medications to the specific location and progression of the disease, thereby ensuring that the medicinal properties reach the affected area directly. The second method parallels that of Western medicine, surgical intervention. However, TCM surgical techniques are diverse, including incision methods, cauterization, gua sha, needling, ligation, and more. The third category consists of what are termed alternative therapies, which encompass drainage techniques, cotton padding, acupuncture, fumigation, as well as hot compress and cryotherapy, among others. Even within surgical treatment, TCM views the patient holistically. The distinctive characteristic of TCM surgery lies in its emphasis on differentiating disease from syndrome. This involves diagnosing the disease first, then the syndrome, followed by integrating local and systemic syndromic differentiation with a primary focus on localized differentiation and a stress on the stages of diagnosis, thereby leading to various therapeutic methods. After all, every ailment undergoes a process of occurrence, development, and transformation. Throughout this progression, the syndromic differentiation at each stage varies, necessitating different treatment methods accordingly. From the TCM perspective, the treatment of any ailment must be determined by the actual condition of the patient, rather than categorizing most ailments under a single classification as often done in Western medicine, which hinders precise differentiation. Take, for instance, the common cold. In Western medicine, symptoms such as fever, headache, cough, and runny nose are collectively labeled as a cold. Conversely, TCM distinguishes between wind cold, heat cold, warm cold, and damp cold variations. Although these conditions may manifest similarly as cold and cough, their pathogenic factors and stages differ significantly. If treated uniformly with Western methods, considerable individual variation arises, resulting in disparate treatment outcomes. This explains why, despite using the same Western medication for a cold, some individuals experience relief while others may worsen. Having fully digested and comprehended the TCM surgical methods, Xiao Bufan's understanding and appreciation of traditional Chinese medicine deepened significantly. He now possessed a formidable confidence in his medical capabilities, feeling assured that he could measure up to the science of esteemed TCM families. However, it must be noted that with the advancement of technology, the divide between TCM and Western medicine has become increasingly pronounced. Nowadays, it is rare to find TCM practitioners performing surgical procedures, as if surgery has become the exclusive domain of Western medicine. If Xiao Bufan aspired to achieve significant results in TCM surgery, he might need to wait until he attained the position of chief physician in TCM before such ambitions could be realized. After all, many doctors in Western medicine have yet to step into the operating room, let alone their TCM counterparts. Nonetheless, aside from surgical procedures, Xiao Bufan felt capable of engaging with other TCM surgical therapies. With this thought, he sighed softly and proceeded upstairs to check on the condition of the hospitalized patient. Xiao Ziyun. Upon arriving at the ward, he pushed open the door to find Zhang Fenian sitting beside the bed, feeding Xiao Ziyun boiled noodles, both appearing quite content. Dr. Xiao has arrived, exclaimed Zhang Fenian, immediately putting down the noodles to greet him. Xiao Bufan smiled and waved his hand, saying, "Uncle Zhang, there's no need for such formality. I'm here to check on Aunt Xiao's health. How has she been feeling after taking the medicine these past few days?" "Much better. Thank you, Dr. Xiao," replied Xiao Ziyun with a beaming smile. "After taking the medicine you prescribed, I feel significantly improved. My menstruation has completely stopped, and I feel as though I am fully recovered and brimming with energy." "Oh, is that so? Let me check your pulse," Xiao Bufan said with a smile, stepping forward to examine her wrist carefully. After a considerable moment, he withdrew his hand, genuinely pleased, and remarked, "Indeed, your recovery is quite remarkable. Your complexion has improved significantly. I estimate that after a couple more days of medication, you will be ready for discharge." "Really? After just 2 more days of medicine, I can be discharged?" Joy illuminated Xiao Ziyun's face, clearly elated. Xiao Bufan chuckled. "Yes, just a couple more days, and you can come down to me for the discharge procedures. However, once you're home, you must bolster your nutrition. Living on boiled noodles alone is insufficient. You need to consume more protein-rich foods. Otherwise, your body will not withstand it." Upon hearing this, Zhang Fenian nodded vigorously, responding, "Yes, I understand, Dr. Xiao. I will find a way to get her some nutritional supplements. I won't let her continue on this meager diet." Xiao Bufan paused for a moment, but then realized that it was not that Zhang Fenian did not wish to provide better for his wife. Rather, their financial situation was constrained. The medical expenses alone were a significant burden. With this thought, he sighed softly, momentarily at a loss for words. Eventually, he stood up and smiled at Zhang Fenian, saying, "Once you are discharged, make sure to replenish her nutrition. Aunt Xiao's health will surely improve further." With that, Xiao Bufan turned and exited the ward. However, after leaving, he made his way to the registration desk and inquired with the nurse, "Has Xiao Ziyun in bed 19 settled her fees? How much is left in her prepaid account?" "Patient in bed 19? Let me check," the nurse replied with a smile, nodding at Xiao Bufan before typing on the computer. "Yes, I found it. The patient named Xiao Ziyun has exhausted her prepaid account. Not only is there no money left, but she also owes over 400 medical fees." Upon hearing the nurse's words, Xiao Bufan understood why Zhang Fenian and his wife were subsisting on boiled noodles. It is not that the two of them do not desire better food. Rather, they're simply out of funds. After a moment of contemplation, Xiao Bufan promptly retrieved his phone and addressed the nurse at the registration desk. "Could you please bring me the payment QR code? I will cover 2,000 yuan for Xiao Ziyun." "What? Dr. Xiao, you intend to pay the medical fees for the patient?" The nurse was momentarily taken aback. Her eyes wide in disbelief as she looked at Xiao Bufan. "Is that really appropriate? What if the patient doesn't reimburse you later? That would mean you've paid for nothing." "Well, if they don't pay me back, then so be it. It's no trouble," Xiao Bufan replied with a smile, proceeding to scan the code for payment. The nurse, still in a state of shock, printed the payment receipt and handed it to him. "Dr. Xiao, you really needn't go out of your way for this. Your salary for the month isn't that substantial." It's no problem. After all, I'm still single and don't have much need for excessive spending." Xiao Bufan waved his hand dismissively and returned to his consultation room with the receipt in hand. The 2,000 yuan advance payment, after deducting the over 400 yuan owed by Xiao Ziyun, should suffice for her stay in the hospital until her discharge the day after tomorrow. To be honest, Xiao Bufan did not consider himself a saint, but he could not bear to see patients suffer, especially the elderly, the weak, and those truly in need. even though his own salary and bonuses were not substantial. 2,000 yuan was merely half a month's income for him. For Qiu Ziyun and her husband, however, that amount posed a significant obstacle to their discharge from hospital. Thus, he decided to cover the cost on their behalf, viewing it as a minor loss on his part. Chapter 67. You want me to be a feature doctor? In the morning, as the clock approached 9, Xiao Bufan sat quietly in his consultation room, awaiting new patients. The flow of patients in the traditional Chinese medicine department remained consistent, just enough to sustain the entire medical staff, while many others opted for Western medicine instead. He wondered when the patients in the traditional Chinese medicine department might rival those in Western medicine, or if he should consider transferring to a different top-tier hospital's traditional Chinese medicine department. Hello, doctor. I am here for a consultation. As Xiao Bufan pondered these thoughts, a middle-aged man in his 30s walked in, smiling as he took a seat before him. May I see your registration slip? Xiao Bufan snapped back to reality, taking the slip from the man's hand. The slip read, Name, Fan Tianmei. Gender, male. Age, 34. Registration, Traditional Chinese Medicine Department. Other information, none. Fan Tianming, right? What seems to be troubling you? Xiao Bufan inquired after examining the registration slip. Actually, I don't feel unwell per se. I just want to know if there are any remedies in your department to bolster vitality, Fan Tianming replied, his demeanor somewhat peculiar as he spoke without a hint of embarrassment. Well, recently I have been experiencing some weakness in my lower back and knees, and I feel a bit drained. Whenever my wife asks for my contribution in the evening, I find myself feeling a tad apprehensive. Fan Tianming rambled about his concerns. Xiao Bufan couldn't quite discern the source of his apprehension and chuckled, shrugging his shoulders. Your symptoms suggest kidney deficiency, but there are various types of kidney deficiency. Let me take your pulse first. Really? You need to take my pulse? Fan Tianming's face showed a flicker of surprise as he extended his right hand. All right then, please do. Chuckling softly, Xiao Bufan proceeded to take his pulse. Upon examination, he noted a sluggish pulse, particularly heavy in the radial region, unresponsive to gentle pressure, but yielding to firm pressure. The situation regarding his kidney deficiency seemed rather severe. Xiao Bufan raised an eyebrow, withdrawing his hand. Your kidney deficiency appears quite serious. Do you also experience cold extremities, irritability, night sweats, or frequent urination? Is that something you can determine from the pulse? Fan Tianming exclaimed. Astonished, Xiao Bufan smiled. You are exhibiting classic signs of excessive kidney yang deficiency. Consume some Yugui pills, or Jinkui Shunqi pills. They should be beneficial. Yugui pills? Are they effective? Fan Tianming's eyes widened with skepticism. Isn't it said that Lu Wei Di Huang Wan is the remedy for kidney deficiency? Why are you recommending Yugui pills instead? Lu Wei Di Huang Wan is intended for kidney deficiency, while Yugui pills are more suited for your condition, Xiao Bufan explained. Alternatively, I can prescribe a few dietary remedies for kidney health. This way, you can avoid medication, and after a month or so of consistent consumption, you should see some improvement. Dietary remedies for kidney health? I'm interested, Fan Tianming said enthusiastically, excitement etched on his face. Doctor, please wait a moment while I note down these remedies. As he spoke, Fan Tianming pulled out his phone and activated the recording function. With a casual smile, Xiao Bufan began to list the remedies. The first remedy involves walnuts, ligustrum lucidum, goji berries, fried red dates, and fried lotus seeds, which should be soaked in a small amount of white wine for half a month, then sweetened with honey. This combination is excellent for nourishing the brain and kidneys. Additionally, you can take a sheep kidney, wash it thoroughly in clean water, soak it for half a day, then cut it into small pieces and cook it in boiling water with cauliflower. After filtering, stir-fry it with black fungus, ginger, garlic, and other ingredients before consuming. This remedy also supports kidney health. Excellent. I've noted all these remedies. I'll give them a try. Thank you, doctor. Joy sparkled in Fan Tianming's eyes as he nodded vigorously. As a physician well-versed in traditional Chinese dietary therapy, Xiao Bufan found these remedies to be quite commonplace. Observing Fan Tianming's excitement, he couldn't help but chuckle and shake his head, unsure of what to say. After all, what man wouldn't he wish for robust health? However, the rapid pace of modern life has led many individuals to experience various forms of kidney deficiency, particularly those who frequently work late nights and have irregular eating habits. Their kidney issues have become increasingly common. Just then, after sending off the kidney-deficient patient, the door swung open once more. Nurse Qin Ziru suddenly entered, lightly tapping on his desk to remind him, Dr. Xiao, Director Wang is calling for you. He wants you to come to his office urgently. Director Wang is calling for me? What could it be about? Xiao Bufan paused, looking at Qin Ziru with surprise. Sister Qin, do you have any idea why the director is looking for me? Well, I'm not too sure. It might be regarding the promotion of our traditional Chinese medicine department. Qin Ziru replied with a smile. I heard that the hospital allocated some funds for us to handle our own publicity. The promotion department has visited our office several times already. Xiao Bufan listened, still puzzled. Why would Director Wang call him regarding the promotional department? After all, he was particularly adept at publicity. Nevertheless, he felt compelled to go when summoned. Eventually, he rose and made his way to Director Wang's office. Greeting him with a smile, Director, you called for me? Oh, yes, I wanted to discuss something with you. Please have a seat. Wang Tianqing said with a welcoming smile. Xiao Bufan felt somewhat bewildered, unsure why Director Wang appeared so amiable today. He quickly inquired, Director, if you need to discuss something, please feel free to be straightforward. There is no need for such formality. Wang Tianqing took a sip of the goji berry tea in his hand and leisurely began. You're likely aware of the situation in our traditional Chinese medicine department. Our patient flow has been exceedingly low, which has severely impacted our department's revenue. After careful consideration, the hospital has decided to create a Douyin public account to promote our department and hopefully increase our patient flow. Why did you call me for this? I'm not knowledgeable about publicity. Xiao Bufan questioned, a hint of confusion in his gaze. Wang Tianqing chuckled. You need not concern yourself with the promotional aspects. I called you here to be our department's on-camera physician. On-camera physician? What do you mean? Xiao Bufan scratched his head in confusion, but soon comprehended what Director Wang meant. Although he was a doctor, he was familiar with modern digital trends like Douyin and Kuaishou. He occasionally watched them and understood that this promotion involved creating a public account to film short medical-related videos for the department. Naturally, this required a physician to appear on camera. Realizing this, he remarked with a wry smile, Director, you don't mean to have the promotional team film me, do you? That seems a bit inappropriate. We have Dr. Gu and others in our department. Why must it be me? Chapter 68. The Beauty of the Promotion Department? In the director's office, Wang Tianqing looked at Xiao Bufan with a smile, responding as if it were obvious. Why would that be inappropriate? The reason I want you as our on-camera physician is simple. You are the youngest attending physician in our department. No one else is more suitable than you. The others are too old for this role. Do you think young people would be interested if it were them? Xiao Bufan was momentarily speechless. So, it was merely because of his youth that he was selected? He had initially thought it was due to his medical skills. At this point, he found himself at a loss for words. However, reflecting upon the situation, he realized that among the attending physicians in their department, he truly was the youngest, with the others all being over 35. Wang Tianqing took another sip of his goji berry tea and seemed to read Xiao Bufan's thoughts. He continued with a smile. Dr. Xiao, you need not worry. We will not have you working for free. There will be a stipend for the on-camera physician role. A stipend? How much will it be? Hearing about the stipend piqued Xiao Bufan's interest, instantly dispelling any fatigue he had. Wang Tianqing replied with a grin. Well, it's not a large amount, about 2,000 yuan a month. If the promotional videos prove effective, we can consider increasing it, with the prospect of a 2,000 yuan stipend. Xiao Bufan thought this might not be such a bad gig after all. After a moment of consideration, he addressed Wang Tianqing. All right, Director, I'll take this on. Wang Tianqing nodded approvingly. Wonderful. I'll call the promotion department to inform them, and they will send someone over to film you. Thus, Xiao Bufan became the spokesperson for the traditional Chinese medicine department of Shiyuan City 5th Hospital. Yet, referring to him as a spokesperson seemed inaccurate. He was more aptly described as a promotional physician. With a smile, Xiao Bufan looked at Director Wang and asked, All right, Director, do you have any other matters to discuss? If not, I shall return to my work. No, nothing else. You may return to your duties. Wang Tianqing waved him off with a smile. Just cooperate with the promotional team when they contact you for the short video. You need not worry about anything else. Understood. Xiao Bufan nodded and left the director's office. Before long, the morning slipped away, and as lunchtime approached, Xiao Bufan had seen only a few patients. When he arrived at the hospital cafeteria, he encountered Su Xiaoli from the inpatient department. She seemed to be still upset with him, as she hadn't spoken to him in several days. Xiao Bufan sat down in front of Su Xiaoli with his meal and cheerfully greeted her. So, had your cousin's bloating improved over the past few days? I haven't seen you out buying milk tea lately. Upon hearing Xiao Bufan's question, Su Xiaoli's expression shifted, and she instantly appeared unhappy. Why ask about my cousin? You could have just greeted me. Su Xiaoli glared at him, slightly annoyed. My cousin's situation is none of your concern. I can handle him myself. Her demeanor suggested she was quite displeased, as though she resented Xiao Bufan for inquiring about her cousin. After all, her cousin was a married woman. Xiao Bufan, taken aback by Su Xiaoli's attitude, could only feel speechless. Merely inquiring about a patient's condition should not raise any objections. In light of this, Xiao Bufan shrugged and remarked, "All right, if you prefer I not inquire about your cousin, I shall refrain. By the way, why haven't you ventured out to indulge in milk tea these past few days? Have you given it up?" I isn't it, because I've been listening to your advice to consume less milk tea." Su Xiaoli huffed lightly, her irritation evident as she pushed around the food on her plate. "Fine, I want tea asked further. It seems your mood hasn't been particularly bright lately. Perhaps Aunt Flo hasn't departed entirely?" Xiao Bufan teased while eating. "Can't we have a conversation without resorting to trivialities?" Su Xiaoli sighed in exasperation, quickly finishing her meal in silence. Without a glance at Xiao Bufan, she angrily exited the hospital cafeteria. Xiao Bufan. In the afternoon, after lunch and a brief respite, Xiao Bufan resumed his duties in his consultation room. The weather outside was sweltering, with the scorching sun baking the earth, making it uninviting for anyone to step outside. Consequently, patients seeking treatment at this hour were scarce, particularly in the traditional Chinese medicine department, which was nearly deserted. Glancing at the empty waiting area, Xiao Bufan couldn't help but let out a resigned sigh. At that moment, a tall, sweet-looking young lady entered, carrying a set of live-streaming equipment. "Hello, you must be Dr. Xiao Bufan. I am Su Yahui from the publicity department, here to film a promotional video for you." She greeted him with a smile, extending her delicate hand. Hello, I am Xiao Bufan," he replied, somewhat taken aback by her striking beauty. When had the hospital's publicity department recruited someone so lovely? Why hadn't he noticed her sooner? Su Yahui stood at about 170 centimeters tall, and in her white coat and high heels, she appeared nothing short of exquisite. Of course, Xiao Bufan was merely surprised by her appearance and was not rendered speechless. Withdrawing her hand, Su Yahui said, "Dr. Xiao, let me explain the process for our promotional shoot, which will facilitate our collaboration." "Oh, all right. Please go ahead," Xiao Bufan nodded. Eager to listen, Su Yahui found a suitable spot to set up the live streaming equipment and began to explain. "The promotional video will be filmed as follows. Every day while you consult with patients, I will record the sessions and edit them into short clips for release on Douyin. The hospital places significant emphasis on promoting our traditional Chinese medicine department. Hence, a dedicated Douyin account has been created for us, which we will jointly manage. I will handle the filming and editing, while you will respond to various questions from netizens. This will not only enhance your reputation, but also elevate the standing of our department among online users. Do you understand?" Upon hearing her explanation, Xiao Bufan quickly grasped the purpose of the promotional Douyin account and nodded. "I understand what you mean." "Great. Since you comprehend, I'll adjust the equipment now, and we can start filming today as promotional video shortly." Su Yahui replied with a smile, handing him a clip-on microphone. "Please wear this, so we can clearly capture your voice during the shoot." All right." Xiao Bufan accepted the microphone, attaching it to the collar of his coat, and curiously asked, "But I currently have no patients. How will we film? Surely, it cannot just be me on camera?" "Su Yahui checked. No worries, Dr. Xiao. I can first film the consultation area, then capture some footage of you in your consultation room. We can later add text to introduce your background." "Well, okay." Xiao Bufan, unfamiliar with video shooting, decided to leave everything to Su Yahui. He merely needed to cooperate with her, as the rest did not concern him. As a newcomer in the publicity department, Su Yahui might not be well-versed in traditional Chinese medicine, but she was certainly knowledgeable about filming and promotion, which was why she had been assigned to document Xiao Bufan. After adjusting her equipment, Su Yahui exited the consultation room, evidently heading to film the entrance in the waiting area. Not long after, she returned, her camera still adjusting angles, capturing the interior of the consultation room and taking several shots of Xiao Bufan. Xiao Bufan felt as though he had transformed into a model. following Su Yahui's directions for poses as she directed the shoot. He had no choice but to cooperate, given her expertise in promotional filming. Suddenly, a plump young man knocked on the door and entered the consultation room. "Oh, a patient has arrived?" Su Yahui immediately halted her filming, positioning the camera to focus on Xiao Bufan. "Dr. Xiao, please attend to the patient. I can film a segment of your consultation for editing later." All right." Xiao Bufan nodded, welcoming the young man to take a seat. The young man, with squinty eyes, appeared oblivious to the filming equipment as he approached Xiao Bufan, presenting his registration slip. "Well, doctor, I'm not actually here for treatment. I just wanted to ask if traditional Chinese medicine has any methods for weight loss." Upon noticing the man's considerable weight, Xiao Bufan was momentarily speechless. Just this morning, another individual had inquired about how to bulk up, and now an afternoon visitor was asking about weight loss. How absurd. This was a traditional Chinese medicine consultation, not a marketplace. Xiao Bufan could not help but sigh lightly as he glanced at the registration slip handed to him. With a smile, he said, "Traditional Chinese medicine indeed offers some methods for weight loss, but it must be tailored to the individual. Let me take your pulse first, and then we shall proceed." "All right. I appreciate your help, doctor," replied the plump young man, nodding with a smile as he extended his robust wrist. Upon contact, Xiao Bufan sensed a certain stagnation in the young man's pulse, slow yet strong, indicating an excess of coldness within, an invasion of cold evils into the body. As the saying goes, coldness condenses, and when it condenses, it clogs. When it clogs, it obstructs. The internal chill was a significant contributor to the patient's obesity and blocked meridians. After a considerable pause, Xiao Bufan retracted his right hand with a smile and addressed the young man. "You are Zhou Haisheng, correct? Your pulse indicates an excessive presence of coldness within you, alongside notable issues with your liver that require careful nurturing. Doctor, I came to see if traditional Chinese medicine could assist me in losing weight." "I did not come here for a medical consultation," Zhou Haisheng replied with a slightly sulky expression. "I merely wish to shed some pounds. Lately, it feels as if even drinking water makes me gain weight. In less than 2 months, I've gained 4 or 5 pounds. Xiao Bufan was momentarily taken aback, then smiled and explained, "Given your current physique, weight loss is indeed crucial, but it must be preceded by proper nurturing of your body. Otherwise, any attempts at losing weight will be ineffective. Your propensity for gaining weight is largely due to the heavy coldness within you, leading to blocked meridians. Such blockages can result in various issues, and obesity is merely one manifestation. Therefore, nurturing your body is imperative. Otherwise, you won't be able to resolve your high blood pressure and cholesterol issues." Upon hearing Xiao Bufan's explanation, Zhou Haisheng nodded, seemingly understanding, and said, "All right, you are the doctor. I will follow your guidance as long as it helps me lose weight." Xiao Bufan looked at Zhou Haisheng and sighed softly. "Let me prescribe you a remedy to protect your liver and dispel the cold." "Is that just for liver protection? What about my weight loss?" Zhou Haisheng inquired. Narrowing his small eyes, Xiao Bufan chuckled. "The liver protection and cold dispelling will help nurture your body. As for weight loss, traditional Chinese medicine indeed has numerous methods, such as acupuncture, threading, massage, cupping, and gua sha, all of which can assist in weight reduction. However, considering your current physical condition, I believe it is best to nurture your body first before embarking on a weight loss journey. Otherwise, your body may struggle to cope. Of course, if you insist on starting your weight loss journey now, I can share a little tip with you. Would you like to try it? A little tip? What sort of tip can assist with weight loss?" Zhou Haisheng's small eyes sparkled with interest, and he sat up straight, eager to learn more. Xiao Bufan pointed to a specific area on the ear, just below the prominent portion near the face, and said, "Press this hunger point on your ear for about 5 times half an hour before meals each day. This can effectively reduce your appetite, thereby achieving some weight loss." "Hunger point? Does that really work?" Zhou Haisheng blinked, somewhat skeptical, as he pressed the acupoint on his ear. Xiao Bufan explained, "This acupoint is related to the sensation of hunger. When the stomach signals the hypothalamus to indicate hunger, pressing this point can provide a degree of counteraction. However, the specific efficacy will vary from person to person. It is not a miracle solution for instant weight loss." Hearing this, Zhou Haisheng smiled and nodded. "All right. I'll try it as you suggest, doctor. If it proves effective, I shall certainly bring you a banner of gratitude." Xiao Bufan chuckled, but remained silent, for he cared little for banners. His focus was solely on healing his patients. He then handed Zhou Haisheng the printed prescription and pointed towards the registration area, saying, "Take this prescription and payment slip to the registration desk, pay the fee, and then proceed to the herbal pharmacy to collect your medicine." "Okay, thank you, doctor," Zhou Haisheng replied cheerfully, taking the prescription and payment slip before heading towards the registration desk. Just as Zhou Haisheng stepped out of the consultation room, Suya Hui, who had been filming across the room, suddenly rushed over to Xiao Bufan, her large eyes wide with curiosity. "Dr. Xiao, is the hunger point you mentioned for weight loss really effective?" Xiao Bufan was startled by Suya Hui's sudden approach, taking a moment to respond with a nod. "There is certainly some effect, though results will vary among individuals." At this juncture, Xiao Bufan found himself unconsciously appraising Suya Hui, inadvertently noticing her striking features, which made him feel a tad flustered. "Truth be told, given your figure, you hardly need to lose weight," he stammered, swallowing hard. Suya Hui seemed oblivious to Xiao Bufan's reaction as she tossed her hair and replied, "What woman would ever be dissatisfied with being slender? I believe I should weigh below 100 pounds to look appealing." Xiao Bufan couldn't help but glance at her figure, momentarily at a loss for words. "If you continue to lose weight, what will become of your proportions?" He pondered inwardly. "Dr. Xiao, is the pressing of the hunger point truly effective for weight loss?" Suya Hui pressed on with enthusiasm, clearly invested in the matter. Xiao Bufan, now slightly exasperated, replied, "The method does have its merits. However, the extent of its effectiveness will depend on the individual." "Well, as long as it works," Suya Hui remarked, not overly concerned with the specifics of the effectiveness. While packing up her filming equipment, she continued, "Dr. Xiao, I think we can conclude today's shoot here. The footage is sufficient for me to edit the promotional video." Xiao Bufan nodded with a smile. "All right, you are free to make that decision. Let's add each other as WeChat friends. Later, once I publish the promotional video, Dr. Xiao, please keep an eye out for any comments from netizens. If anyone raises professional questions, and you have the time, it would be great if you could respond." Suya Hui said with a smile, pulling out her phone to add Xiao Bufan as a friend after packing her filming equipment. Naturally, Xiao Bufan had no objections. He quickly added Suya Hui on WeChat and then watched her leave his clinic. After her departure, Xiao Bufan glanced at the time and realized it was nearly closing time. Time certainly flies. He sighed softly, shook his head, and removed his white coat in preparation for leaving. As he stepped out of the traditional Chinese medicine clinic, he unexpectedly ran into Gu Zhongyi, the pediatrician. "Oh, Dr. Xiao, you're off work too? Shall we walk together?" Gu Zhongyi greeted him with a broad smile as they strolled side by side towards the parking lot. Upon reaching the parking area, Gu Zhongyi glanced at Xiao Bufan's vehicle and chuckled. "I thought you were going to buy a new car after I suggested it yesterday. Still driving this one?" "Well, I haven't had the time to visit the dealership. I'll check it out when I have a break," Xiao Bufan replied with a smile. Gu Zhongyi laughed and refrained from pursuing the topic of the car. Suddenly, as if recalling something significant, he asked, "Oh, by the way, Dr. Xiao, I heard from Dr. Liu that you used TCM massage during a gynecological consultation. Do you happen to know pediatric massage as well?" "Pediatric massage?" Xiao Bufan paused, looking at Gu Zhongyi. "I have some knowledge about it." "Why do you ask, Dr. Gu?" "Well, there's a patient of mine whose condition isn't improving, and I was wondering if pediatric massage might help." Gu Zhongyi explained, then hesitated before asking, "Since you know pediatric massage, would you be available for a consultation tomorrow?" "Consultation, you say?" "Absolutely. I will be happy to help." Xiao Bufan agreed without hesitation. After all, this was an opportunity to assist a patient. Moreover, it wouldn't be polite to decline since Gu Zhongyi had personally asked him. Seeing Xiao Bufan's enthusiastic acceptance, Gu Zhongyi beamed and said, "Great. If you're available tomorrow, I'll have the patient's family bring her over early, and I'll call you then." "Sound good. It's settled then," Xiao Bufan replied with a smile before he climbed into the driver's seat and drove home. After more than 20 minutes, Xiao Bufan finally returned to his suburban home. Once there, he busied himself preparing a sumptuous dinner, relishing the meal. However, just as he finished eating, a sudden and violent explosion resonated from afar, causing the entire yard to tremble. A massive fireball illuminated the night sky over the suburbs of Shiyuan City. "What is happening?" Xiao Bufan was momentarily taken aback and hurriedly approached the window to peer outside. He noticed a distant location engulfed in thick smoke, as if it were on fire, drifting in the wind. "This is bad. There must have been an explosion at the nearby chemical plant." Xiao Bufan quickly pieced it together. A large chemical factory was situated in that direction, known for producing chemical products. Given his residence in the suburbs, he was quite familiar with the facility. He recalled that the plant covered over 1,000 square meters and housed 2 production workshops, a central laboratory, a solid raw materials warehouse, and 2 finished goods warehouses, as well as a miscellaneous storage area. With over 400 employees, it was considered one of the larger enterprises in Xiao City. In light of such a sudden explosion, he could only imagine how many lives might have been lost. The magnitude of the blast would undoubtedly lead to numerous injuries. Despite being located in the suburbs, many employees worked there, and the area was not entirely devoid of residents. In an instant, Xiao Bufan envisioned the chaos unfolding at the site. I must go and see for myself. His resolve ignited. He set aside his dishes and drove towards the chemical plant, compelled by his duty as a doctor. Though he was not obligated to respond, given the severity of the explosion, the city's emergency center might not notify the 5th hospital for assistance, as it was not a top-tier facility. Typically, in emergencies, the first responders would be the fire department and police, followed by the major hospitals. However, since Xiao Bufan lived closest to the explosion site, he hurriedly made his way there without a second thought. Simultaneously, the Xiao City Emergency Center received the news and promptly dispatched relevant rescue teams. Firefighters, police, and paramedics from the First People's Hospital were mobilized almost simultaneously, racing towards the chemical plant. The citizens of Xiao City were startled by the explosion, with countless individuals standing on rooftops, gazing towards the chemical plant's direction, filled with concern. Many had relatives working there, which naturally heightened their anxiety. This sudden explosion had awakened the entire populace and emergency personnel of Xiao City. Even the mayor rushed to the scene without delay. Chapter 71, Urgent Rescue. The blaring sirens of countless ambulances, fire trucks, and police cars surged through the main thoroughfares of the city. In this moment, the vibrant metropolis appeared particularly cacophonous, as all eyes turned towards the direction of the suburban chemical plant engulfed in flames. With a deafening roar, another explosion reverberated through the air as Xiao Bufan arrived at the scene, nearly causing him to mistake the accelerator for the brake in his shock. Fortunately, he quickly regained his composure and brought the car to a halt less than 100 meters from the chemical plant. Without hesitation, he exited the vehicle and rushed towards the site. Upon entering the chemical plant, he was met with billowing smoke and towering flames, the intense heat causing several empty oil barrels nearby to topple over. Run. Another explosion is imminent. Help. Call for emergency assistance. Is the finished product warehouse safe? Quickly, send someone to check on the finished product warehouse. We cannot afford for it to catch fire, or we will truly be doomed. Manager Huang, it's terrible. Over a dozen employees from production line 1 haven't escaped. What should we do? What? The employees from production line 1 are still inside? Hurry, we must save them. We can't. The flames are too fierce. We cannot enter. Then we must wait for the firefighters to arrive. A chaotic scene unfolded as the workers of the chemical plant scrambled to escape, the majority pushing frantically towards the exits in a desperate bid for survival. Although the plant's managers wished to assist, they found themselves powerless in the face of such overwhelming destruction. The tumultuous sounds surrounding them rendered it impossible for Xiao Bufan to discern their words. Yet, even if he could, he held no authority to offer opinions, as he was merely a humble doctor, not a figure of authority. In his capacity as a physician, Xiao Bufan's first instinct upon entering the chemical plant was to render aid. However, he was not reckless enough to jeopardize his own safety in the process. Thus, he refrained from plunging into the inferno and instead swiftly scanned the area before dashing towards an injured worker. The employee lay on the ground, writhing in agony, blood mingling with dust as it pooled beneath him. Xiao Bufan knelt beside him, tearing away the fabric of the man's clothing to examine his wounds. With a swift rip, he exposed the injury, and by the light of the flames, he discerned the severity of the damage. A shard of metal, the size of a palm, had penetrated the employee's abdomen, blood oozing forth relentlessly. He noted the grievous burns surrounding the wound, evidence that the metal had been searing hot when it struck. It became clear that this individual was not only suffering from the puncture, but also likely had internal injuries due to the intense heat. In a flurry of motion, Xiao Bufan withdrew a few silver needles from his pocket and prepared to administer treatment. Given the dire circumstances, he could not remove the metal shard embedded within the man. but he could staunch the excessive bleeding. As a skilled practitioner of acupuncture, he understood how to employ his craft for urgent care. Acupuncture could not only promote circulation, but also serve as a means to control hemorrhage, provided the acupoints selected could regulate blood flow. Fortunately, with his unique capabilities, such challenges were trivial for him. With precision, the silver needles were swiftly inserted into the relevant acupoints, such as Qihai, Wanyuan, Zisangli, and Gushu. Each of these points held blood-stanching properties. Soon, the blood flow from the injury began to diminish visibly, and the relentless bleeding came to a halt. With a reassuring pat on the injured man's shoulder, Xiao Bufan offered encouragement. "Stay still. The rescue team will arrive shortly. You will be all right." "Thank you." The injured worker, though unaware of Xiao Bufan's identity, expressed his gratitude, astonished by the rapid cessation of his bleeding. Xiao Bufan offered a gentle pat on the man's arm before rising to assist the next injured worker. Beyond those trapped in the inferno, many others had suffered injuries in the vicinity. The explosion had caught everyone off guard, leaving countless individuals wounded, with some even trampled in the ensuing chaos. With another ominous rumble, another minor explosion echoed in the distance. Under the glow of the flames, thick smoke billowed ominously, the fire seemingly intensifying. It was crucial to remember that this was a large chemical plant. The smoke contained hazardous toxins that could inflict severe harm if inhaled or if it contacted the eyes. Xiao Bufan glanced at the swirling smoke and quickly donned a mask from his pocket before continuing his race towards another injured worker. He soon arrived at yet another victim, who was clearly suffering from smoke inhalation, clutching his eyes and wailing in distress. "My eyes, they hurt so much. Someone help me. I can't see. Please, someone." The employee at the chemical plant covered his eyes with his hands, wailing in agony. The pain from both eyes being simultaneously scorched by toxic gas was unbearable for an ordinary person. In Chapter 72, the miraculous acupuncture hemostasis at the explosion site, Xiao Bufan, without a moment's hesitation, shouted to a nearby employee, "Hey, is there a clean water source around here? Quickly bring me some clean water." The employee, momentarily stunned by the call, nodded vigorously and hurriedly fetched a bucket of clean tap water. Upon receiving the bucket, Xiao Bufan diligently washed the injured man's eyes with copious amounts of water, reassuring him, "Do not worry. The exposure of your eyes was brief. Once you reach the hospital, you'll be fine." As he spoke, Xiao Bufan had thoroughly rinsed the man's eyes and then found a piece of cloth to bandage them, effectively preventing further irritation from the surrounding smoke. After ensuring the well-being of this injured individual, he entrusted him to the care of the previously mentioned employee and continued to rush toward the next injured worker. At that moment, a cacophony of sirens erupted outside the chemical plant. A convoy of ambulances, fire trucks, and police vehicles arrived at the explosion site. Soon, a battalion of firefighters and emergency medical personnel disembarked, resolutely charging into the chemical plant. Quickly, one team, bring the dry powder foam truck to extinguish the largest flames. The second team, don your fireproof suits for rescue. The third team, bring over the water truck and connect it to the fire hydrant to combat the nearby flames. The fire chief immediately began directing the rescue operation upon exiting the vehicle. Countless firefighters, moving in unison, transformed into unyielding warriors against adversity, fearlessly advancing toward the inferno. Likewise, the medical personnel dispatched for this rescue mission joined the fray. Soon, Yang Tianming, the head of the emergency department at the First People's Hospital of Shiyuan City, noticed a patient whose abdomen had been pierced by a metal shard. "What happened? Why are there several silver needles embedded in the patient's body?" Yang Tianming asked, intrigued, as he observed the injured man being carried on a stretcher. The doctor responsible for the stretcher paused, uncertain. This patient was impaled by a piece of metal. According to his account, his wound was bleeding profusely until someone applied these needles, after which the bleeding ceased. "Are you suggesting that someone used acupuncture to stop the bleeding?" Yang Tianming found it hard to believe. He had never witnessed acupuncture employed in such a manner. Yet, the evidence was undeniable. After a moment of contemplation, he inquired, "Do you know where this person is?" The injured party mentioned that the individual had gone to assist others and was likely still on site. "Still here, you say? All right, I understand." Yang Tianming nodded slightly and waved to the doctor. "Quickly, get the patient onto the ambulance and transport him to the hospital for surgery." "Yes, Director Yang." The doctor responded, nodding in agreement, before helping to lift the patient onto the ambulance. After watching them depart, Yang Tianming began to search for Xiao Bufan's figure among the chaos. Truth be told, Yang Tianming had never encountered the remarkable technique of acupuncture for hemostasis in as many years as the head of the emergency department. Thus, even he, a seasoned medical professional, was filled with curiosity. Meanwhile, Xiao Bufan was busy administering acupuncture to the fourth injured employee. This particular worker had a steel bar transfixing his chest, blood gushing forth in alarming quantities. At that moment, the injured man appeared pale, a clear sign of significant blood loss. If he did not receive prompt assistance to staunch the bleeding, even a trip to the hospital for emergency care might not save him from irreversible consequences. Without hesitation, Xiao Bufan produced a silver needle and swiftly inserted it into the Qingmen acupoint, known for its calming and hemostatic properties. As the needle pierced the skin, the flow of blood from the wound diminished by more than half. Although it did not completely halt the bleeding, it represented a significant improvement, sufficient to stabilize the patient until he could reach the operating table, preventing severe repercussions from excessive blood loss. Yang Tianming happened to witness this scene unfold. Stunned, he stared at Xiao Bufan, asking, "Young man, are you a traditional Chinese medicine doctor? Which hospital do you represent?" What a remarkable technique for acupuncture hemostasis. Xiao Bufan, rising to meet the gaze of the man clad in a white coat, recognized him as a doctor involved in the rescue efforts. However, he pondered whether the man was there to aid the injured or merely to observe. Despite his curiosity, he refrained from commenting on the situation, instead responding, "I am the attending physician of the traditional Chinese medicine department at the 5th hospital. My name is Xiao Bufan. May I ask who you are?" "Hello. I am Yang Tianming, the head of the emergency department at the First People's Hospital," he replied with a smile, shaking Xiao Bufan's hand. With a hint of curiosity, he continued, "By the way, Dr. Xiao, did you come specifically for the rescue? It seems this operation wasn't assigned to your hospital." No." Xiao Bufan hesitated briefly before responding honestly. "Our hospital did not receive any rescue assignments. I live nearby, so when I heard about the explosion, I came to see if I could be of assistance. After all, I am a doctor, and it is our duty to save lives. I could not stand idly by." Upon hearing Xiao Bufan's words, Yang Tianming's expression conveyed admiration. He then patted Xiao Bufan's shoulder, saying, "Very well, then you may join the rescue efforts. If you encounter any issues, feel free to come to me." It is important to note that the medical personnel from the First People's Hospital were indeed the qualified doctors authorized to provide treatment to the injured during this rescue operation. If the doctor in charge of the rescue had not obtained the consent of Yang Tianming, the emergency department director, any unforeseen incidents during the emergency response involving the injured would have held him accountable. Thus, Yang Tianming's approval was of great significance to Xiao Bufan, though he appeared indifferent to it. It is important to recognize the harsh realities of today's society, where even those who act heroically might face backlash, let alone those engaged in emergency medical services. After witnessing Xiao Bufan's acupuncture and hemostasis technique, Yang Tianming immediately took a liking to this young practitioner of traditional Chinese medicine, which led him to nod in agreement for Xiao Bufan to continue his participation in the rescue operation. Otherwise, he would have had to find someone to remove Xiao Bufan from the scene, as he bore the primary responsibility for the medical rescue efforts. Who would allow an unfamiliar doctor to partake in such a critical mission, should there be any casualties due to the medical rescue process? The director of the emergency department at the First People's Hospital would certainly face disciplinary actions. Nevertheless, Yang Tianming consented to Xiao Bufan's involvement, indicating the profound impact Xiao Bufan's acupuncture had on him. At that moment, another emergency doctor beside him could not help but express concern, saying, "Director Yang, are you truly allowing Dr. Xiao to join our rescue efforts? We are not acquainted with him at all." Yang Tianming chuckled lightly, waving his hand dismissively. "What is there to be unfamiliar with? Did you not hear him say he is the attending physician in the traditional Chinese medicine department at the 5th hospital? That establishment is a reputable hospital here in Shiyuan City, and you witnessed his remarkable acupuncture technique. He is indeed a capable doctor. Rest assured, if anything were to occur, I will take full responsibility. You need not worry." "All right then, we will heed your words, Director Yang." With the director's assurance, the attending doctor had no further objections. Meanwhile, Xiao Bufan cast a deep glance at Yang Tianming's departing figure before turning back to the rescue efforts. Suddenly, a deafening explosion erupted. The chemical plant before them experienced a secondary explosion, unleashing a torrent of flames and scorching heat that engulfed several nearby firefighters. "This is bad. Xiao Wu, quick! Save the people!" The captain of the fire brigade, Gan Tianlei, shouted urgently as he dashed forward without a second thought. The sudden secondary explosion consumed the closest firefighters. The immense blast sending flames soaring into the sky, leaving no time for a response. A team of firefighters battling the blaze was instantly thrown to the ground by the force of the explosion, with several suffering injuries from flying debris. Tragically, one firefighter was struck by a shard of metal that penetrated his skull, entering the region of his brain. In an instant, this firefighter collapsed as if shot by a bullet. Gan Tianlei rushed forward, cradling the injured firefighter and calling out urgently, "Xiao Zhang, what happened? Hurry, we need a doctor." With a rush, several emergency doctors arrived on the scene, while another group of firefighters took over the position to continue battling the flames. Xiao Bufan was startled by the explosion, having been relatively close to the site. He quickly regained his composure and sprinted to the side of the most severely injured firefighter. Without hesitation, Xiao Bufan extracted his silver needles and swiftly targeted several acupuncture points on the injured firefighter. In such scenarios, immediate intervention is crucial to prevent further damage to the head and to mitigate excessive blood loss that could lead to cerebral hypoxia. After performing the acupuncture, Xiao Bufan alleviated some of the bleeding in the firefighter's brain, but it was merely a temporary measure. It could not completely halt the significant hemorrhage caused by the penetrating injury. While acupuncture can provide urgent hemostatic effects, its efficacy depends on the specific circumstances and location of the bleeding. Given that this firefighter had suffered a severe skull injury, even acupuncture could not fully control the bleeding. Meanwhile, several emergency doctors nearby were busy tending to the injured firefighters. Fortunately, aside from one severely hurt individual, the others only sustained minor injuries, such as superficial cuts from small metal shards or facial burns from the blast heat. Immediate cooling and wound cleaning are required for this firefighter's facial burns. This firefighter's right leg has been lacerated by debris. We need to stop the bleeding, disinfect, and bandage the wound. Thankfully, the number of injured personnel was not large, and the severity of their injuries was manageable. Medical staff from the First People's Hospital promptly attended to the injured firefighters, following medical protocols with practiced efficiency. At that moment, Yang Tianming, director of the emergency department, arrived on the scene. After surveying the situation, he inquired of a nearby emergency doctor, "What is going on here? How many firefighters are injured? Are their injuries serious?" Fortunately, there are not many injured firefighters. However, this one seems to be in critical condition and requires immediate transport to the hospital for surgery. The emergency doctor pointed to the severely injured firefighter lying next to Xiao Bufan, anxiety evident on his face. Upon hearing this, Yang Tianming's brow furrowed, and he turned to Xiao Bufan, asking, "Dr. Xiao, what is the status?" "The firefighter's skull has been penetrated by a metal piece, and he likely has significant brain injury. I recommend immediate transfer to the hospital for examination and surgery to remove the metal fragment from his cranial cavity," Xiao Bufan replied, standing and nodding at Yang Tianming as he outlined the situation. "Understood," Yang Tianming acknowledged, quickly instructing the doctors to lift the severely injured firefighter onto the ambulance. At that moment, Captain Gan Tianlei grasped Yang Tianming's arm urgently, saying, "Director Yang, I implore you to save Xiao Zhang. He is only 21 years old, just 21. Rest assured, Captain Gan, we will do our utmost to treat him." Yang Tianming nodded solemnly as he assured Gan Tianlei. It was evident that Yang Tianming and Gan Tianlei were acquainted, for in the vast expanse of Shiyuan City, it was not uncommon for emergencies to arise, leading to a network of familiarity among the emergency medical personnel and firefighters. Meanwhile, two doctors from the First People's Hospital's emergency department carefully lifted the injured firefighter into the ambulance. However, the rescue efforts on-site were far from over. Gan Tianlei continued to lead a group of firefighters in extinguishing the flames while rescuing trapped employees from the chemical plant. Fortunately, their collective efforts bore fruit, as the fire was effectively contained and did not spread further. Alas, 3 employees from the first production line, previously trapped in the inferno, could not be rescued, signifying that this sudden explosion had resulted in at least 3 fatalities. The number of injuries was even greater. More than 10 firefighters sustained injuries during this rescue operation. Fortunately, There were no reported fatalities, as even the firefighter struck by a metal shard had only temporarily lost consciousness. As the raging flames were brought under control, Xiao Bufan turned to bid farewell to Yang Tianming before preparing to rest. However, Yang Tianming smiled slightly and stopped him, saying, "Dr. Xiao, shall we exchange contact information? I am quite interested in your acupuncture techniques for stopping bleeding and alleviating pain. Perhaps we could have future discussions?" "Very well." Xiao Bufan blinked in surprise for a moment before mutually adding Yang Tianming as a friend on WeChat. He then turned to leave. At that moment, within the emergency department of the First People's Hospital in Shiyuan City, the doctors on duty watched in bewilderment as injured patients were wheeled in, several adorned with acupuncture needles. What was happening here? Why did the severely injured individuals arrive covered in silver needles? There had been no mention of any traditional Chinese medicine practitioners being involved in this rescue operation. They exchanged puzzled glances, each wearing a look of confusion. Nonetheless, this did not impede their efforts to conduct further examinations and treatments for the injured. Although the Western medicine doctors were initially perplexed by the needles, they noted that upon their removal, the patient's bleeding increased significantly, prompting them to regard the silver needles with newfound respect. In the early morning, just before 6:30, the sky began to lighten and the sun gradually rose in the east. Exhausted firefighters, having battled the flames all night, sat at the now extinguished site, munching on steamed buns and sipping porridge to satiate their hunger, bathed in a halo of sunlight that made them appear almost ethereal. Despite the multiple explosions that occurred during the firefighting efforts, resulting in some injuries, not a single firefighter expressed fear. They selflessly rushed to quell the flames. It was precisely due to their unwavering dedication that the inferno was extinguished so swiftly. Chapter 74. This surgery is beyond our capability. In the morning, around 7 o'clock. Xiao Bufan returned home, freshened up, and changed his clothes before heading to the hospital for work. As for the ongoing rescue efforts at the chemical plant, there was no need for a mere traditional Chinese medicine doctor, like him, to concern himself with such matters. Upon arriving at the hospital, the clock had just struck 8. After clocking in at the outpatient department of the TCM section, Xiao Bufan immediately instructed the system. "System, please sign me in." Ding. Sign in successful. Congratulations, host, on receiving the advanced TCM Ba Duan Gene Health Method. What is this? The Ba Duan Gene Health Method? Xiao Bufan was momentarily taken aback, pleasantly surprised by this reward. As a TCM doctor, he was well aware of what the Ba Duan gene entailed, having seen in practice. This method, originating from the Northern Song dynasty, is a comprehensive fitness regimen that, with long-term practice, not only strengthens the body and wards off ailments, but also helps the underweight gain strength and the overweight lose weight. In fact, Ba Duan gene is considered one of the oldest forms of Qigong in China, which later gave rise to variations like the 12 and 16 Duan gene. However, the modern iteration of Ba Duan gene lacks these profound benefits. Xiao Bufan could not ascertain whether the system's reward was based on the ancient or the modern practice. Suddenly, a surge of white light flashed through his mind, entering his Shun Ting acupoint, and a wealth of unfamiliar memories flooded in. Moments later, he fully absorbed this newfound knowledge, realizing that the Ba Duan gene he had received was the ancient seeded version, not the contemporary one. This version was said to cultivate qi, known as the one Ba Duan gene. It is a seeded, dynamic exercise and an internal cultivation method, revered by many medical practitioners and health enthusiasts during the Ming and Qing dynasties. If this truly allows for the cultivation of qi, then I have struck gold. With this thought, Xiao Bufan's heart skipped a beat, feeling as though he had won a grand prize. After all, authentic ancient health methods are exceedingly rare today. Even if one were to find such methods, many have been altered beyond recognition by later generations, rendering them ineffective. Subsequently, Xiao Bufan organized the knowledge acquired in his mind and sat down with a smile, awaiting patients for consultations. During this idle time, he decided to practice the seated Ba Duan gene according to his memory. After stretching his arms, he closed his eyes, focusing his mind. This was the first posture of the seated Ba Duan gene. Close your eyes and still your thoughts. Hold firm and cultivate your spirit. Bite your teeth 36 times. And embrace the Kunlun with both hands. In an instant, Xiao Bufan felt a profound sense of inner peace, his mind devoid of distractions, and his breathing transitioned from hurried to calm, akin to a tortoise's breath. Soon, he became immersed in the practice of the Ba Duan gene health method. Meanwhile, at the First People's Hospital's emergency department, Director Yang Tianming and his colleagues, upon returning from the chemical plant, discovered that the firefighter whose skull had been pierced by a metal shard had yet to be scheduled for surgery. What's going on here? Dr. Wang, why has this patient not been arranged for surgery? Yang Tianming was immediately filled with anger and sought out Dr. Wang Minghua, who was responsible for the matter, to voice his concerns. Dr. Wang Minghua was the attending surgeon in the emergency department of the First People's Hospital, well-versed in surgical procedures. With a heavy sigh, Dr. Wang replied to Yang Tianming, Director, it is not that I am unwilling to operate on this patient, but the metal fragment has penetrated too deeply, perilously close to the pituitary gland. Moreover, the surrounding neural structures are densely packed, making me hesitant to proceed with the surgery. If something were to go awry during the operation, and the patient were to perish on the operating table, I cannot bear that responsibility. Upon hearing Dr. Wang's words, Yang Tianming raised his eyebrows slightly and shot him a glare, demanding, show me the examination results of the patient and the imaging as well. Here they are, Director. All the examination results are right here. Dr. Wang promptly responded, handing over the various test reports and the brain scans of the patient. Yang Tianming first examined the brain scans, then glanced at the test results, stating, gather the other surgeons. We need to convene an emergency meeting. Understood, Director. I will do that right away. Dr. Wang nodded and hurried off to summon the others. Soon, all the surgeons from the emergency department arrived. Yang Tianming presented the examination results to them and inquired, what are your thoughts on this patient's condition? How do you propose we approach the surgery? One of the surgeons stood up, exhaling deeply, and said, Director, I believe we cannot perform this surgery. It would be best to transfer the patient to the provincial hospital, where they have the capability to handle such a complex case. Hearing this, Yang Tianming shot him an exasperated look and retorted, this patient is one we rescued, a hero in our operation. Are you suggesting we send him to the provincial hospital for treatment? Isn't that a slap in our own faces? However, if we do not remove the metal fragment, the patient may end up in a persistent vegetative state, or should he awaken, he could very well be left with severe cognitive impairments, Dr. Wang interjected. But given the current state of the patient, it may already be too late to perform the surgery even at the provincial hospital, added Dr. Wang, rising from his seat. With a decisive slap on the desk, Yang Tianming addressed the group, you must understand that this patient is our hero, someone who has borne the weight for us. As doctors, we cannot shy away from this challenging surgery. We must exert every effort to save his life, ensuring he can return to a normal existence. Seeing Yang Tianming's fervor, the attending surgeons nodded in agreement, reigniting their discussion about the patient's condition. The metal piece was lodged perilously close to the pituitary gland, and unless they could meticulously navigate the surgery to avoid harming it, the procedure would be exceedingly difficult. I believe the skill of the lead surgeon is paramount. If we cannot stabilize the surgical instrument with complete precision, it could easily injure the pituitary gland, one surgeon observed. Moreover, the fragment entered through the lateral ventricle at an angle, complicating the surgical approach further. The situation does not look promising. None of us here seem equipped to handle such a delicate operation. What then should we do? We cannot simply allow this patient to miss the optimal window for surgery. Another surgeon lamented. After an extended discussion, the surgeons failed to propose any viable plans. Yang Tianming, the head of the emergency department, felt a cold sweat forming. He had promised the fire brigade's captain, Gan Tianlei, that he would ensure the firefighters' recovery. If he failed, not only would the fire brigade be displeased, but the entire citizenry of Shiyuan City would be disheartened as well, for this was indeed a heroic figure. Had the provincial hospital not been so far away, Yang Tianming would have considered transferring the patient there to secure a glimmer of hope. However, given the circumstances, that option seemed impractical. The distance to the provincial capital was significant, and several hours had already passed since the patient was brought back to the hospital. Any further delay would jeopardize the chance for surgery. After a moment of contemplation, Yang Tianming spoke firmly, Dr. Wang, contact other hospitals in the city immediately and see if any surgeons are available for a consultation. We must act swiftly. Yes, I'm on it, Dr. Wang replied, promptly rising to reach out to other hospitals. As Yang Tianming watched Dr. Wang leave, he drummed his fingers on the desk, his mind racing with possible solutions. Chapter 75, Cross-Hospital Consultation. In the emergency department of the First People's Hospital, After a period of contemplation, Yang Tianming suddenly turned to another attending surgeon and asked, Dr. Chun, do you think a physician from the traditional Chinese medicine department could perform surgical procedures? What? A TCM physician performing surgery? Dr. Chun was momentarily taken aback, staring incredulously at Yang Tianming. Director, you must be joking. I have never heard of a TCM physician performing surgery. At this moment, another attending surgeon interjected. Actually, traditional Chinese medicine does have surgical practitioners, and their skills are quite respectable. However, it is rare for TCM doctors to undertake surgical operations in our country. Dr. Liang, do you think if we could enlist a highly skilled TCM physician for the surgery, the chances of success might increase? Yang Tianming inquired, turning to Dr. Liang. Doctor, Liang nodded with a smile. If Director Yang can indeed find such a proficient TCM physician, I believe there is a possibility for success, as some techniques in TCM surgery are indeed quite unique. They may have methods that could help. However, where can we find such a skilled TCM physician on such short notice? It seems we don't have any of that caliber in Shiyuan City, Dr. Liang added. Leave that to me. I will take care of it, Yang Tianming replied with a smile, his thoughts immediately turning to Xiao Bufan, who had utilized acupuncture to control the patient's bleeding and pain at the rescue site the previous night. His recollection of Xiao Bufan was not solely due to his exceptional acupuncture skills, but also because he had been the one to provide urgent care to the severely injured firefighter who still had the silver needles inserted at that moment. After some reflection, Yang Tianming pulled out his phone and contacted Xiao Bufan directly. Ring, ring, in the traditional Chinese medicine outpatient department of the 5th hospital. Xiao Bufan had just finished consulting a patient when he noticed his phone ringing. Who could be calling me at this hour? He paused for a moment, then took out his phone to discover it was Director Yang from the emergency department, whom he had added the night before, attempting a voice call via WeChat. What could Director Yang want? Xiao Bufan blinked, rubbed his nose, and then pressed the answer button, greeting him with a smile. Hello, Director Yang. It seems we just parted ways not long ago. Is there something you wanted to discuss? Indeed, there is something I wish to inquire about. Yang Guangming replied with a nod, immediately diving into the matter at hand. Do you remember the firefighter who suffered a cranial injury from a metal fragment? We have conducted a comprehensive examination, and it turns out that the fragment is alarmingly close to the pituitary gland. Given our surgical expertise, we are unable to perform the necessary operation. Therefore, I would like to ask if you, Dr. Xiao, have any methods in traditional Chinese medicine that could address this situation. If you have any solutions, could you possibly come for consultation? Upon hearing Yang Guangming's words, Xiao Bufan quickly grasped the situation. Although he had only provided emergency treatment for the firefighter's intracranial hemorrhage and pain relief earlier, he was somewhat aware of the severity of the injuries. After a moment of contemplation, Xiao Bufan responded, So, you would like me to come for consultation? Very well, I will head over immediately. After all, the injured firefighter was a hero, and Xiao Bufan felt no justification in neglecting to assist him. Wonderful. I will await your arrival, hoping we can save this brave firefighter. Yang Guangming nodded with a smile before ending the WeChat voice call. Xiao Bufan then approached the nursing station to greet head nurse Qin Zuru before making his way to the door, where he hopped into his modest car and set off for the First People's Hospital. The distance between the First People's Hospital and the Fifth People's Hospital was not too great, and by car, it would only take about 10 minutes. Before long, Xiao Bufan arrived at the First People's Hospital, where Yang Guangming was personally waiting at the entrance of the emergency department, clearly showing his regard for Xiao Bufan's expertise. As for Dr. Wang Minghua, who had contacted other hospitals, he had already called 4 or 5 places without a single emergency physician daring to take on the surgery, leaving the matter unresolved. Dr. Xiao, welcome. It is a pleasure to have you at our emergency department. Yang Guangming exclaimed with enthusiasm upon seeing Xiao Bufan. Xiao Bufan smiled and shook Yang Guangming's hand, saying, Thank you, Director Yang. Shall we proceed to examine the patient? Time is of the essence. Ah, yes, indeed. We must see the patient without delay. Yang Guangming nodded and led Xiao Bufan into the emergency department while arranging for the patient's examination results to be brought over. As Xiao Bufan reviewed the examination results and the images of the patient's brain, his brow furrowed slightly, and he remarked, The lethality of this metal fragment is astonishing. It has penetrated the brain, coming within 2 centimeters of the pituitary gland. That is indeed perilously close. A conventional surgery would likely endanger the patient's pituitary gland. It is crucial to note that the pituitary gland is located ventrally beneath the thalamus, primarily regulating the body's endocrine system. Any damage during surgery could lead to unforeseen complications, especially considering the dense network of nerves surrounding the area. After carefully examining the patient's results, Xiao Bufan pondered various traditional Chinese surgical techniques. Perhaps the hanging suture method could be of use? Traditional Chinese surgical methods are divided into internal and external treatments. The internal treatment approaches are largely akin to Western internal medicine. However, traditional Chinese medicine also encompasses unique methods such as drainage and specific herbal formulas, distinguishing it from Western practices. Among the external treatment techniques, Chinese medicine includes drainage, cotton padding, and hanging sutures, all of which are unique to its surgical practices. Thus, traditional Chinese surgery can sometimes achieve remarkable results with external treatments alone or rely on internal methods for recovery. There is no single approach. After some thought, Xiao Bufan turned to Yang Guangming and stated, "This surgery is indeed challenging, but it is not without potential solutions." "Huh, so you do have a method?" Yang Guangming asked, momentarily taken aback and gazing at Xiao Bufan in surprise. Xiao Bufan smiled gently, replying, "I believe we can utilize the traditional Chinese hanging suture technique to extract the metal fragment from the patient's brain. This approach should avoid contact with the pituitary gland while minimizing damage to other areas of the brain." "Is that feasible?" Yang Guangming expressed his astonishment. "I have seen the hanging suture method used for treating ulcers and infections, but for removing a metal fragment from the brain? Are you certain you aren't jesting?" Xiao Bufan explained, "The hanging suture method I refer to differs from what you have seen. If you trust me, Director Yang, I would like to perform the surgery on this patient." "Very well." Yang Guangming pondered for a moment before nodding emphatically. "I have faith in your medical skills, Dr. Xiao, and I trust you would never gamble with a patient's life. If you're confident in your ability, then proceed. I, Yang Guangming, support you." Xiao Bufan was momentarily taken aback, unable to believe the level of trust Yang Guangming was placing in him, especially considering they had only met the day before. How could he have such faith in his traditional medical skills? Yang Guangming seemed to sense Xiao Bufan's doubts and patted his shoulder reassuringly. "I trust my judgment and intuition will not lead me astray. Moreover, your expertise in acupuncture for hemostasis and pain alleviation has already demonstrated the prowess of traditional Chinese medicine. Therefore, I have every confidence in your capabilities." "All right, since you have such faith in me, let us begin." Xiao Bufan nodded silently, understanding that time was of the essence. If it did not remove the metal fragment from the patient's brain swiftly, it could be too late. Yes. I will arrange for the operating room to be prepared immediately." Yang Guangming responded with a smile, promptly instructing the staff to ready the surgical suite. Given the efficiency of the First People's Hospital's emergency department, the operating room was prepared in a timely manner. Xiao Bufan did not have to wait long before everything was set up, and the patient was wheeled into the operating room. Thus, Xiao Bufan was about to embark on his first inter-hospital consultation. He donned surgical scrubs alongside several attending physicians from the First People's Hospital's emergency department and then entered the operating room where the injured firefighter had already been brought in. The anesthesiologist administered anesthesia to the patient. Yang Guangming glanced at the injured individual and turned to Xiao Bufan for confirmation. "Dr. Xiao, the surgery is about to commence. Is there anything else we need to prepare? Please prepare some sterilized silver sutures, along with a hollow tube that is 3 times the diameter of the iron shard, and a few small rubber bands. Ensure everything is sterilized," Xiao Bufan replied after examining the wound on the patient's head. Fortunately, the iron fragment that penetrated the firefighter did not appear to be large, with a diameter not exceeding 1 inch. Otherwise, even the hanging suture method would have proven ineffective for its removal. "Understood. I will make the arrangements immediately." Yang Guangming nodded and promptly instructed the nurse to gather the necessary items. This novel merely serves as a work of fiction. The medical knowledge presented is not accurate. Please do not take it seriously. Chapter 76. The surgery is a success. In the operating room, the nurse swiftly prepared all the required items for Xiao Bufan. After confirming that everything was in order, Xiao Bufan turned to Yang Guangming and said, "We are ready. Let us begin the surgery. Director Yang, you will be responsible for making the incision while I will extract the iron shard from the patient's brain. This will expedite the process." "What about the incision? Do you have any specifications?" Yang Guangming asked, momentarily taken aback. Xiao Bufan pondered briefly and replied, "The cranial incision should be 2 fingers wide, and the dura mater should be 1.5 fingers. You need not worry about the rest. I will handle it." "Very well," young Guangming nodded, picking up the surgical knife to begin the incision along the patient's wound. Although the 2-finger-wide incision was not particularly large, it represented a significant opening in the human skull. At this moment, the patient was connected to various monitoring devices, and the effects of the anesthesia were already taking hold. With a precise cut, Yang Guangming opened the wound and received the electric drill from the assistant, drilling into the skull along the trajectory of the iron shard. The sharp drill swiftly penetrated the patient's skull, causing blood to spurt forth. Through the monitoring equipment, Yang Guangming halted the drill just shy of 1 inch from the iron fragment. He then withdrew the drill and called out to the nearby nurse. "Pass me the milling cutter." Without hesitation, the nurse handed it over. Yang Guangming took the cutter and continued to work on the opening in the skull. Observing this, Xiao Bufan realized that Yang Guangming's craniotomy was nearing completion. Xiao Bufan quickly took the sterilized silver suture, fashioned a loop knot, and inserted it into the prepared hollow tube until the knotted end protruded. Next, he secured a small rubber band at the other end of the tube and said to Yang Guangming, "Director Yang, I will take it from here." "Very well." Yang Guangming nodded, pausing his actions and allowing Xiao Bufan to take his place. With the hollow tube containing the silver suture, Xiao Bufan approached the operating table and, peering through the surgical monitor, slowly inserted the tube into the incision. In that moment, all the other doctors and nurses held their breath, attentively watching Xiao Bufan's delicate maneuvering. When Xiao Bufan prepared for the task, the attending physicians had already surmised how he intended to extract the iron shard from the patient's brain. Yet, knowing the plan and executing were 2 entirely different matters. For a surgical procedure, practical execution always prevails over theoretical knowledge, allowing no room for error. Yang Guangming widened his eyes, fearful of missing any detail. After all, such a technique was unprecedented, even for the director of the emergency department. With utmost caution, Xiao Bufan guided the hollow tube deeper into the patient's brain until he reached the location of the iron shard. He then gently released the rubber band at the tube's end, manipulating the elasticity to rotate the silver suture within the tube. The attending medical staff could clearly see through the surgical monitor that the silver suture was gradually maneuvering along the edge of the iron shard. Xiao Bufan focused intently on the monitor, stabilizing the hollow tube with one hand while controlling the rotation of the silver suture with the other. Suddenly, with a swift motion, the knotted end of the silver suture ensnared the farthest end of the iron shard without touching the patient's pituitary gland. This astonishing feat left all present in awe. Each physician and nurse in the room was a top-tier professional in emergency surgery, fully aware of the remarkable skill required for such precision. Even more astonishing was the proximity of the iron shard to the patient's pituitary gland, yet the fine silver suture managed to avoid contact entirely. Xiao Bufan paid no heed to the astonished expressions of the medical staff. With a slight tug, he pulled the entire iron shard out along the hollow tube. Finally, the iron piece was extracted, and an immediate surge of blood erupted, splattering Xiao Bufan's face. "Quick, apply pressure to stop the bleeding and prepare to suture the wound," he urged Yang Guangming, wiping the blood from his face. Yang Guangming had been waiting for this moment, and nodded in acknowledgement as he took over Xiao Bufan's position, rapidly addressing the patient's bleeding and closing the wound. With a clang, Xiao Bufan discarded the extracted iron piece into the tray, finally cleaning the blood from his face. Once Yang Guangming successfully controlled the bleeding and sutured the wound, the rhythmic beeping of the heart monitor filled the air, prompting an eruption of cheers from the medical staff. "Is it successful? Do we really succeed in the surgery? How is this possible? The iron piece is truly out. Incredible." The astonishment was palpable as they marveled at Xiao Bufan's ingenuity in employing such a method to extract the iron shard with such precision. Is this really traditional Chinese surgery? Who would believe it? Goodness, if you hadn't mentioned it, I would have thought he was an attending physician in the emergency department. Dr. Xiao is truly remarkable. Where did Director Yang find such an extraordinary physician? The focus isn't just on skill. He is only 25 years old. In that moment, the medical staff in the operating room was left utterly astonished. After suturing the patient's wound, Yang Guangming looked up at Xiao Bufan and remarked, "Incredible. Simply incredible." I never expected there to be such a method for performing surgery. It truly has opened my eyes. Yang Guangming could not help but feel fortunate for having invited Xiao Bufan to conduct this operation. Otherwise, he would have missed witnessing such a spectacular surgical process. With a smile, Xiao Bufan was about to explain himself to Yang Guangming when several attending physicians from the emergency department surrounded him, eagerly inquiring, "Dr. Xiao, if similar situations were to arise in other areas of the body, could this method be employed to extract foreign objects? Indeed, if a piece of metal can be removed from the head in this manner, could not other foreign objects in different regions also be addressed similarly? Dr. Xiao, do you believe this technique is feasible? Can the surgical approach you utilized also be applicable to other procedures?" Listening to their questions, Xiao Bufan smiled gently and replied, "The method I employed earlier is quite versatile. However, its widespread adoption faces considerable challenges due to the high level of control required. It is not something that just anyone can accomplish. Nevertheless, if the location of the foreign object does not affect vital points, it should be manageable for a general practitioner, though proficiency would necessitate extensive training." Dr. Xiao makes a valid point. "It appears we should further explore this surgical technique," Yang Guangming remarked with a smile, turning to a nearby nurse and asking, "How about it? Was the entire surgical process recorded?" The nurse promptly nodded in affirmation. "Yes, Director Yang. Everything has been recorded. It is worth noting that such major surgeries are typically filmed in their entirety, capturing the intricate details of the surgeon's techniques as well as the patient's responses. Each significant operation offers invaluable experience, and for those unable to attend in person, the recorded footage provides a valuable resource for learning from the procedure. This is one of the primary reasons for documenting the entire surgical process. Additionally, the recordings facilitate the identification of any shortcomings that may arise during the surgery. In the unfortunate event of a failure, the hospital can review the footage to ascertain whether there were any errors in the lead surgeon's actions.